Next question.
The next question is from Andrew Dunn, Business Insider. Andrew, you may begin.
Thank you. I was wondering, what do you see as to put it simply, the ultimate responsibility of states in the distribution process? Can you go over clearly what jurisdictional public health leaders will need to do as part of the campaign? And have you heard from any states or regions about a need for additional funding to actually make that happen at the state level?
Yeah, thanks. I'll start and I'll ask General Perna to add to it. This is obviously, as we talked about in our last call, there are two types of partnerships here that are involved. The first is the public-private partnership of what we're trying to do to really leverage the systems around vaccine distribution in the United States that are well-rehearsed and that work. We want to make the experience for people as close to the flu vaccination experience as possible in terms of meeting them where they are. The second is a federal-state partnership, very tight linkage between us. We have gotten the vaccine. We are paying for the vaccine. We are paying for the distribution of the vaccine. We have secured the kits that go with vaccination. That's the needles, the syringes, the diluent, the last mile dry ice, etc., to marry that up with the vaccine. We have the data systems for distributing the vaccine as well as for accounting for the immunization of individuals, the tracking of individuals to ensure they get a second dose of the same vaccine. What is the role of the states? Of course, the governors will determine distribution within their states, prioritization within their states, where to ship to. As the general has said, we can ship to 1 site or 1,000 sites in a state, depending on the governor, as long as they're enrolled in the system, and the governor tells us what he or she would like us to do. That's one. Tell us, as almost an air traffic controller, where would you like us to send or have sent the product? The second is ensure your data systems are working with ours and that you've signed data use agreements to ensure the ability of coordination of information across the United States, so that if somebody gets vaccinated with the first dose in New York and they then go down to Florida for the rest of the winter, they can get their second dose in Florida, and if it was Pfizer, it remains Pfizer. If it was Moderna, it remains Moderna. The states will obviously, if there are additional areas that they would like to ensure distribution to beyond the normal traditional mechanisms that we've worked on, hospitals, chain drug stores, community pharmacies, community health centers, public health departments, if governors feel there's a need for customized other approaches, they are fully at liberty to set those up. That is part of them being in the driver's seat on that localized micro distribution planning. We've put out $340 million for flu and COVID-19 vaccination to date. Another $140 million is going out in December. Money should not be the barrier to effective, efficient distribution of the product, working with the states, but it is important to remember just how much of this entire process is already federally funded and federally supported in partnership with the states. General?
Mr. Secretary, I am 100% agreement in everything you said and have nothing to add.
Well, thank you, General. One last question, I believe, Michael? Thank you.
The next question is from Jared Hopkins. Jared, your line is open.
Thanks. Jared Hopkins from the Wall Street Journal. Regarding allocation, previously the CDC said that besides population, local spread of COVID was going to be a factor for determining for each state. So can you explain sort of how you guys decided on each state's individual allocations within that 6 million that you mentioned earlier? Is it based on infection rates from Friday or something else?
Yeah, so Jared, you know, given the national spread of the disease at this point, and unfortunately for the foreseeable future, working and seeking consultation with the governors. We asked the governors for input on allocation methodology. We didn't receive feedback from many, but the feedback we did get was supportive of what we proposed, which was to keep this simple, and on the initial allocations to follow a per capita over the age of 18 population-based formula for distributing the vaccine. We wanted to keep this simple, first because we're seeing effectively nationwide spread and susceptibility to the disease, but also once we pass through these initial tranches where we're in much more of a scarcity situation, we're eventually going to get to the point where it would need to be per capita. And so instead of having multiple methodologies, we thought it best to keep it simple. The governor supported that from the feedback that we received. So that was the approach we took, correct, General?
Exactly right, Mr. Secretary.
So we thought that would be the fairest approach, the most consistent. I want to thank you all for this. We're going to keep doing this weekly or as much as needed. We want to make sure that you're getting your questions answered, that we're being transparent about our Operation Warp Speed work on therapeutics, on vaccines, on distribution practices. I was not asked about this, but I do want to let you know that consistent with the GSA administrator's ascertainment yesterday, last night, our top career official, Rear Admiral Schwartz, who has been leading our transition planning efforts, was last night in communication with the Biden transition team. We are immediately getting them all of the pre-prepared transition briefing materials. We will ensure coordinated briefings with them to ensure they're getting whatever information that they feel they need that's consistent with statute and past practice. I have reiterated, as I've said publicly to you all, I reiterated to Admiral Schwartz my firm commitment that transition planning and execution will be professional, cooperative, and collaborative in the best spirit of looking out for the health and well-being of the American people, and in particular, saving lives through this COVID-19 pandemic. I want to say again, just thanks to the support, unwavering and constant and personal support that this team has had from President Trump from the beginning to create Operation Warp Speed, to give us the full funding of resources and the independence to act with speed and agility. We now have phase 3 data on 3 vaccines, 3 more vaccines in active study. 5 therapeutics now are authorized or approved by the FDA to help people suffering from COVID. So much is already here. So much is on the way. As I say, hope and help are on the way. But that also means we're bridging right now. We're bridging to when we have these vaccines that General Perna is going to ensure are getting out there to our most vulnerable and to our healthcare workers and our first responders and eventually the broad American population. It means we need to bridge through our individual behaviors. We want to make sure that everybody can get to the day of experiencing the benefits of the work that that team is delivering. And that means wash your hands, watch your distance, wear your face coverings when you can't watch your distance, stay out of settings where you can't do those things. Be especially mindful of indoor gatherings, especially those where you might let your guard down, like household gatherings, overcrowded indoor restaurants, indoor bars. Especially now, as we approach Thanksgiving, I ask all Americans, please be on guard, take care of yourselves, be careful, because there is such a bright day ahead with what this team is delivering on vaccines and therapeutics. We want to make sure that everybody is here for next year's Thanksgiving. So thank you all very much, and members of the media, thank you for helping us in our efforts to ensure the American people go on this journey with us. Thank you.
What a message there, and what a moment, definitely, for America here today, learning a little bit more about the vaccines that are awaiting approval. But if everything goes according to plan, it looks like late in December, we will have some vaccines that will be able to be first pushed out to our frontline workers there in the hospitals, the doctors that need it the most, that are treating the most people there. But did you ever think that we would be talking about it within this year? A lot of people didn't think that it was going to happen. They says talking about a vaccine within the year 2020, not even thinkable. And now we're seeing that because of Operation Warp Speed, because of the great, the minds of Americans being put together at the ultimate test here in the middle of a global pandemic. We're talking all about it and just really seeing the strength of our teams, our doctors, all all scientists coming together for the very good, not only for this country, but the world, in an effort to bring down this pandemic so we could try to see some normalcy come in 2021, everybody. Hi, everyone. I'm your host, Mike Bache, as we roll on right here on News Now from Fox. Let me show you another big thing that we are monitoring right now. Yeah, it is the Dow. Oh, yeah, hitting record highs today here. You see over that 30,000 marker there. That is truly amazing there, as well as U.S. equity markets in a sharp rally pushed the Dow Jones Industrial Average to all new highs there. Vaccine optimism combined with another solid read on U.S. home prices drove a broad market rally led by Dow members General Electric, Bank of America, and Boeing. The rally was also supported by the likelihood that President-elect Joe Biden would formally appoint former Federal Reserve Chair Janet Yellen as his would-be Treasury Secretary there. So there you are seeing the Dow just popping stocks, broad range right now, all doing exceptional here as we're talking about 30,000, almost 30,100 right there. All right, we got some other election news to get to here as well concerning Pennsylvania as well. And we also have President Trump continuing to triple down, not letting go right now, as you can see on his Twitter here. Let's show you that one here. This was about 2 hours ago, this tweet. He says, remember, the GSA has been terrific and Emily Murphy has done a great job, but the GSA does not determine who the next president of the United States will be. So yesterday, President Trump let the GSA start the transition process for Joe Biden, as his team will get important updates, as well as government agencies will be better to assist the Biden campaign as well. But President Trump still holding on hope for some legal challenges to come his way here. And we will continue to be monitoring that here for you right here on News Now from Fox. The update from Pennsylvania, everyone. The Pennsylvania State Department certified the results of the presidential election in favor of President-elect Joe Biden and Vice President-elect Kamala Harris. Today, the Pennsylvania state certified the results of the November 3rd election in Pennsylvania for President and Vice President of the United States as required by federal law. I've signed the certificate for the slate of electors for Joe Biden and Kamala Harris. That was from the governor there, Tom Wolf, tweeting that out earlier. The certification comes as President Trump's campaign is appealing a federal judge's dismissal of his campaign's effort to block the certification of votes in Pennsylvania. The president and other plaintiffs filed a notice of appeal to the 3rd U.S. Circuit Court of Appeals on Sunday, a day after the judge issued a scathing order shooting down claims of widespread problems with mail-in ballots. The case was seen as a long shot to stop Biden's inauguration, but was one of the Trump campaign's best hopes to affect the election results through the courts, given the state's 20 electoral votes at stake there. Obviously, we are hearing that President Trump will be appealing this as he is sort of running now out of time in legal challenges, but continues to press on. President Trump still says that yesterday that he is going to continue the good fight, quote unquote, there for the election in hopes of really a Hail Mary sort of shot to come his way. The campaign also filed a motion on Sunday night asking for an expedited hearing as soon as tomorrow as they seek to amend the Pennsylvania lawsuit that was dismissed before the state certifies its election results there officially next month there. So we will continue to bring you the very latest as we see it right here on News Now from Fox. All of the updates, you know, we got you covered right here on News Now from Fox. Always raw, unfiltered, and live and direct here for you. Thanks to the thousands of you that continue to watch right now and continue to pick up more viewers here as we continue to roll on throughout the day. Here's what we got coming up here for you. In about less than an hour, we're going to be hearing from Joe Biden, and he will be announcing some of his cabinet picks. I say roughly an hour away because, well, some of his events always not on time there. So we always shoot for about 20 to 30 minutes late there, so we'll keep an eye on that as well here. But News Now from Fox, we always try to bring you the live feeds as they are happening, everybody, because that's one of the great things about this show is I come in I really have sort of an idea of where the day is going to take us. We have a couple of events that we have lined up here, but really it's a fun free-for-all right up here. I just kind of go with the flow and go with the feeds as they're coming in, and that's the way that we shake it out here for you. So let's show you this awesome shot. San Francisco, Golden Gate Bridge is right there. And yeah, great sight to see right there. Heavy fog, but that's awesome to see. No doubt about it. Great shot right there as we continue to roll on right here on News Now from Fox. Let's go out to Minnesota. This news conference just wrapped up, everybody. This is from the governor there, as well as some business leaders talking about the latest in the pandemic that we are all seeing in every neighborhood, in every town in the USA.
That we're on the doorstep of some of those things starting to happen. So I'm just really grateful. You're here to hear from the owners who are in the middle of this. Again, I can't stress enough how grateful I am for creating this business, creating this jobs, creating this space where we gather. This is the stuff. This is the best thing. Thank you. And these are the best things. These are the best things that we can do. But these are the folks that are dealing with it every day. And I think for Minnesotans, the reason I keep stressing this package is what I hear time and time again from business owners, how incredibly painful this is, but how they're understanding about we need to help our neighbors and keep those hospital admissions down. They've done that. So with that, Mike, Ted, and family, if you guys want to come on up.
Well, thank you. Thanks for all being here. You know, the Nook's been around since 1932. We took this place over 20 years ago. It's been our heart and soul. We put everything into this place. And to see that a package is around the corner means so much to us. You know, we in the service industry and the hospitality industry, I speak for all restaurants, all we want to do is have you come in, enjoy birthdays, celebrations, marriage anniversaries, everything. And right now we're kind of at a deadlock where we can't, because we're looking out for the hospital, the people in the hospitals. And we know what it's like to work 90-hour weeks, to wake up in the middle of the night and feel like you're still at work. And we need to give them their time to fix this thing. But we need some help from the government, right? We need some help from Minnesota. And I think that's what this package is all about. I think we're finally at the cusp where we can get some relief from the states. We've been taking a 10-month bath right now, and there usually seems no end in sight with this thing. December 18th or 19th is when they're talking about reopening. Whether it happens or not is all up to the hospitals and how people get sick. But we're so thankful right now that there's at least talk that there's going to be relief to the bars and restaurants and the whole entertainment industry. There's a lot of people, a lot of employees that we have throughout the restaurants. There's a lot of workers and people outside that contribute to our daily lives, that everything's on hold right now. And to stimulate that would be great, to keep them working, to keep them at our doorsteps, so that when we do get back to full normal, that it will be back to normal. And what a better place to kind of recover and come up with the health and safety of everybody than back in a restaurant, breaking bread, having a burger with each other, and really finding health and security and safety. That's their number one goal on this whole thing. So I'm so happy that you're looking at the Nook as an iconic place. We're happy to have it. We're happy to be part of this institution. And us restaurateurs really need this. And so I really want to thank everybody for being out there. I want to thank you for making this happen, because it needs to happen. We're on the brink of collapse in this industry, and we need everything that we can do. So I can leave some up to Janessa if she would like to talk and have some words.
You know, we just, again, really appreciate that this is something that is hopefully going to come very soon. We employ over 100 people between our two locations, the Nook here and Shamrocks, and our workers are really struggling. They're suffering. They have rent to pay, mortgage to pay. They have children. They have families. Christmas around the corner. It's big. We need help for them. We need help for our small businesses. It breaks our heart every time we see a business close, another restaurant go down. We just feel for everybody that's in this, and I just really hope that we all come together, both sides, whatever your political affiliation is, and make this thing happen. So, and continue to support your local restaurants. Please, gift certificates, takeout orders. We've had pretty good support from our community, and we thank you.
You guys take takeout starting at 11?
11 o'clock, 11 to 11, every day, yep.
Every day.
Janessa Casper, Janessa. Casper, like the ghost, C-A-S-P-E-R. So, yep.
I know we've got some letters.
Yep, we got.
Did anyone else in the family or any owner? Okay.
That's okay.
We're going to have Representative Winkler speak, and the thing that I would make note, and I think these folks have said it, where we've done some grant programs and there's been some folks in, what we're asking for this time is relief to every single one of these businesses. We're not looking at a grant, we're not looking at a lottery, we're looking at that, and I think these legislators are the ones who made it clear that that has to be a priority of what we do. Leader Winkler?
Thank you, Governor. The COVID-19 pandemic is causing pain and anguish for all Minnesotans. Today, as we speak, kids and families are trying to figure out how to manage distance learning while managing a job. Families are wondering about how to have Thanksgiving together while keeping each other safe. Business owners are worried about the future, and they're not sure that their life's work is going to survive this pandemic. And probably, and almost certainly most heartbreaking of all, family members are watching other family members struggle in the hospital while having to watch over a video conference. This is a terrible situation for Minnesota. The governor consistently has prioritized the lives of Minnesotans. People are going to lose their lives, but our priority has to be saving as many lives as we possibly can. That is why the governor has taken strong action and been consistent about making decisions about restricting our activities in order to save lives. And we have supported him in the Minnesota House and in the Minnesota Senate consistently. But as we have made those difficult decisions, the impact of the pandemic and the restrictions don't affect everyone equally. Business owners are really concerned about their future, and many have gone under. Family members are struggling through loss of jobs, and they don't know if their unemployment insurance is going to continue.
We're going to continue to listen to some of these updates in Minnesota. I just want to let you know that we're going to be taking a quick 2-minute break for some of you. Continue to stay right here with us on News Now from Fox, live, raw, and always unfiltered.
Need federal action, and while we wait for federal action, Minnesota needs to step up and provide essential relief to the people most at risk of suffering the most devastating economic consequences of COVID. That is why the package that we are proposing focuses on extending unemployment insurance benefits for 13 weeks to Minnesotans who have been on long-term unemployment. We are focused on direct aid to businesses who need help through this pandemic, through the Department of Revenue. There are 14,000 businesses affected by the governor's restrictions, and so we can provide direct aid to those 14,000 businesses very, very quickly. We need to get the money out the door fast. We also are providing a $500 MFIP cash bonus for people who are at the margin and struggling the most economically through COVID-19. Too often our federal aid packages have focused on people who have the greatest resources or are best connected. We can't continue to do that in Minnesota. We need to focus our efforts on people who need it the most. All Minnesotans are suffering, but we need to stand up for the Minnesotans whose lives are most deeply affected, whose livelihoods are most deeply affected, and whose family businesses are most likely to be harmed by this pandemic. We can step up and do the right thing in Minnesota. We can get people through a bridge to a federal program, but we do need the federal government to step up and do the right thing and help all Minnesotans survive this pandemic. Representative Noor?
Good morning. Just to reiterate what the majority leader said, small businesses have been hit very hard by the pandemic. They have gone through loans, they have gone through their savings, they've spent every dime that they have. This is a moment to ensure that we provide them the support that they need. To be clear, the scope and size of the federal package that could help us is something that we need the federal government to act quickly. As the majority leader has already stated, this is a direct support to the businesses that are struggling and making sure that the money goes directly to them immediately so that we don't have to wait for a few more months. And there are many other resources through DEED, which individuals can apply for unemployment. We're adding an additional unemployment assistance program to make sure that people can have some resources as we go through this pandemic. And for those families that we just mentioned, the $500 additional fund is something that we've already talked about, and we've already seen that it's a reserve fund that we're going to be using, not a major impact on our budget. So we have to be out there to support those who are struggling the most and to ensure that we support each other during this difficult moment. So thank you so much. And we have Representative Commissioner and also Representative Pinto.
Thank you, Representative.
Thanks, Representative. Hello, everybody. Steve Grove, Commissioner of Deed. This is important. This is critically important for our businesses. This, of course, as everyone knows, is the biggest time of year for bars and restaurants and retailers. This is the fourth quarter. This is when all the sales usually spike, and so it's really important that we do everything we can right now to help them. A bridge to that federal funding that we so desperately need is essential. We're at a bar right now. Just want to call out that the ideas we are putting forward with the legislature were created in conjunction with industry leaders. We've been talking to thousands of business leaders across the state since this all began. I want to call it in particular Hospitality Minnesota, the Minnesota Craft Brewers Guild, and the Minnesota Licensed Bar Association, who in particular has sent some very thoughtful ideas into us that have been a part of this deliberation. Critical the government and business are working together right now to make sure we're crafting the kinds of solutions that are going to help as many businesses stay afloat as possible and help those workers who need extra help. Now, this, of course, is going to be a negotiation with the legislature, and hopefully it will happen as fast as possible. But there is help today for businesses who need it. We have hundreds of small business development centers across the state that can help small businesses figure out how to optimize their online presence, shift to pickup and takeout if you haven't already, and just give general business consulting advice. We have Career Force centers across the state. CareerForceMN.com is a site you can go to if you need to look for new work right now. We've got lots of workforce development training programs in play that can help people find work where they need it. And then, of course, unemployment insurance, this system that is holding up so many workers right now. We are ready for the influx of applications. We're here to help Minnesotans who, even just for a couple of weeks, need to get some extra assistance to get through this month and beyond. We're here to help you there, too. So just excited here today to bring out some of these ideas, eager to get to work with our friends in the legislature. And I just encourage all Minnesotans during this time, shop local. Find a way to visit your Main Street businesses. Put some money into those businesses. Get takeout if you can. We're going to launch a campaign this week called Get Takeout MN, just an effort to remind folks to maybe get an extra takeout meal or two a week if you can to help these local businesses because they need it so much, and it's important right now. So I think with that, Governor, back over to you.
Thank you, Commissioner. Thanks to these reps. You can tell my eating habits. I also give a plug to Cold Front ice cream, who's right next door when you can have it. But I think Mike and the family summed it up well. This is an institution. This is what's so good about living in neighborhoods and having these types of businesses. I feel very positive, and I remind everyone once again that Minnesota was the state with the only divided legislature who got a budget done, who got a bonding bill done, who, for all the animosity out there, I have yet to issue a veto in my term. That has never happened before in Minnesota. And that's a testament to Republican and Democratic legislators trying to find a way to fix this, predicated on what these families need. So I just want to stress, we're looking and open to any of the ideas that are coming out. This is simply the package that we're putting out. I think the leaders, people have been incredibly thoughtful. We're looking at things. My big concern is we don't do anything that makes a lot of hoops to jump through, that folks have to do a lot of paperwork. We will do the accounting and the safety around these things, but I think the speed with which we move some of these things can really make a difference, both in terms materially for these folks, but I also think it sends a strong signal that we are united to fight COVID-19, because keep in mind, this is because of that hospital situation and COVID, but that we're united about getting this right. With that, we'll take some questions.
Governor, what's the total price tag for this package? And Representative Dewar mentioned that reserves all coming from the rainy day fund, or?
Yeah, let me say, it is not decided yet, because this is the way it's supposed to work. There's proposals being put out. We'll vet them through. We'll find out where that's at. I do want to note that we are going to be having a very important budget numbers come out. The November forecast will come out before we start making those decisions for January, February, when the session starts. These are the real numbers of what our situation looks like. We're going to have that briefing on December 1st, move it up a little little bit so it coincides with this. We don't know yet, but I asked Minnesota Management and Budget Commissioner Jim Showalter to brief legislative leaders, Democrats and Republicans, at the same time I was briefed. We believe that numbers will be materially better. And when I say that, I'm in the dangerous spot of forecasting a forecast, but that will give us a better idea what the pay-fors will look like, how we will do it, and what our capacity is. I think, again, the significance of this is, I want to stress, we're talking every one of these basically 14,000 businesses that we're targeting. Not a lottery for 1,000 of them to get it. We want every single one of them who's been impacted to do this. So I think you can extrapolate. This will be a fairly significant package. It will fall within Minnesota's ability to pay for it. Once again, we had some of the, if not the strongest budget situation going into the pandemic, and we'll see in the next few weeks or so where we stand going forward.
Is there like a ballpark range here, though? Is that what you're talking about?
Well, I don't know. Leader, if you want to, again, I want to be very clear. Spending originates in the House of Representatives, so I will let them speak.
We never forget that, Governor.
You never forget that.
Hypothetically, if you had 14,000 businesses affected, you could scale a program for direct relief to each one of those businesses based on a dollar amount. So if you came in at $25,000 per business times 14,000, that's roughly $350 million. The budget forecast could go up, it could go down, and so those numbers obviously can move, and the scale of relief can change for each individual business. But the commitment is that we would get the money out the door as quickly as possible through the Revenue Department and have that be a fixed dollar amount that every business would receive who is affected by COVID-19, specifically the businesses affected by the shutdown order.
Governor, just clarify, it sounded like you had said that yourself and legislative leaders have already been briefed on what the top line number is.
They've been briefed on what is coming. What happens is they put this together. There's a requirement of when they put this out, and we're briefed on it, and then it goes to the public. As they're working through the process, they can let some ideas know of where they're heading. And this is because this is an extraordinary year. We did something we hadn't done. We had a May forecast, and I asked them to stay within the realm of what they can do. Can they brief us of where they're at in the process, at least to give us a direction of where they're at? And Commissioner Showalter's words are that we're in materially better shape than we predicted in the May forecast. And so we don't have the number. December 1st, we'll release that.
Governor, can you give us some timing on this? Sorry, I just want to ask you a different way then. So is this proposal, is all this coming together, you know, all these conversations happening among legislators sort of behind the scenes, is this happening based on a number that you believe is going to be a positive number and that's a big for?
We were going to do this anyway. We just had to figure out how to pay for it. We were going to do it anyway. States are in a really difficult situation where we can't deficit spend, unlike the federal government, which allows them to do stimulus. With that being said, my direction, and I think probably the leader to his folks, we asked every agency, turn over every stone to figure out what we can do. But I think it makes sense for us as we're planning in the long run. If we can simultaneously have those budget numbers, it gives us an idea how robust this can be. So,
Governor, can you talk a little bit about the timing? First, do you expect this to be a very soon special session, or are you waiting for the emergency power session next month? That's the first question. Second question, why didn't you do this a week ago? Why aren't we up to speed on this already and giving some relief to people going into the holidays?
well, we've given over $120 million. We did $10 million last week, which we had the executive power to do. It takes these legislative folks to work together. I think through this whole thing, should we have done stuff back in March that would have made a difference today? Absolutely. I think what the recognition is as we come to where our budget situation is, when this decision was made, and this decision to make the mitigation efforts was not decided until last week. And so it was at that point in time.
And we are bringing you right now to the White House. Here, President Trump remarks.
Everybody, the stock market, Dow Jones Industrial Average. And that's just despite everything that's taken place with the pandemic. I'm very thrilled with what's happened on the vaccine front. That's been absolutely incredible. It's nothing like that has ever happened medically, and I think people are acknowledging that, and it's having a big effect. But the stock market's just broken 30,000. Never been broken, that number. That's a sacred number, 30,000. Nobody thought they'd ever see it. That's the 9th time since the beginning of 2020, and it's the 48th time that we've broken records during the Trump administration, and I just want to congratulate all the people within the administration that work so hard. And most importantly, I want to congratulate the people of our country, because there are no people like you. Thank you very much, everybody. Thank you.
All righty there. We just saw the briefest remarks there from the president talking about the 30K number there, 30,000 for the Dow, hitting a record, and then thanking his staff as well as the administration for hitting that number. But boy, that was a record. That was the shortest we saw ever President Trump talk there. So that was a new record that was just broken here today. And we watch it all right here on News Now from Fox. Bet you didn't think that one was coming. Look at the media didn't think it was going to be that quick either, as now they are funneling out there and will be giving updates to their networks as well. But yeah, the shortest one that we ever saw right here on News Now from Fox. We'll continue to roll on right here as we bring you always the updates that are happening live and worldwide right here on News Now from Fox. We're going to take a quick 2-minute break for some of you. Stay right here with us, everyone. We are just moments away from more breaking news. All right, everyone, let's continue to roll on right here on News Now from Fox. We're going to be talking about the latest with the COVID-19 pandemic, specifically right now in California. A lot of people are upset about these new restrictions, curfews that are being put in place. This is a viral moment that we're going to have. LA County Supervisor not too happy with everything that is happening in his district. Take a look at this, everyone.
Barger, she is the chair of the board. All right, you came out against this. Give us a status update on where things are at, why you're against this, and whether anything can be done at this point.
Well, the status is tomorrow we have a set item at 10:30 where we're going to ask Dr. Ferrer to come and brief us. And ultimately, as a public health officer, she has separate authority to issue public health orders. But I'm hoping that I, and hopefully some of my colleagues, can convince her that this is not the right path to take. When you look at the numbers, by the public health's own account, 10 to 15% can be traced to restaurants, and it's not a perfect science, so that's an estimate. But yet we know over 50% of those that are testing positive got it while they were at large gatherings. And I just feel that this is punishing an industry that has bent over backwards to comply.
And most of those people are young and are not dying. People aren't dying. Plus, our treatments are getting so much better. People aren't dying, and the hospitals aren't being overloaded. So, what's the hurry? Why the rush? Why the rush to further upend the mental health and the financial health of large swaths of the population? Shouldn't it be harder for her to do that? Shouldn't she have to stand up and defend her decisions based on some published science? Shouldn't other physicians have the opportunity to sort of question that? Shouldn't it be more difficult?
Well, first of all, we had 6,000 today. We are definitely, the numbers are going up. But to your point, Drew, when we reopened last time, hospitalization was a little less than where we are now, and the positive rate was actually greater the first time we reopened.
So we're actually doing better now than during this massive, sudden panic-driven, these numbers, these 4,500, 4,000, which are completely arbitrary. Many other urban centers are well above that per capita.
But make no mistake, the virus is in the community. We know that.
Yep.
So it's important for people to act responsible. And if you are in that high risk, you shouldn't be going out.
Of course.
But close down one industry based on really what you say, show me the science, based on no science, concerns me, and I feel it's arbitrary and it's punitive to an industry. You just saw, Schumann's report. They invested thousands of dollars to comply with public health, and probably have purchased a lot of food to serve for reservations. The Derby in Arcadia has purchased a lot of food and is now being told you can't have customers.
Right. So let's bring Phil back in a moment, but let me just follow up on what he asked. Who is in charge? Who makes this call? Can she make that call by herself? Does the board have to support this? Because last week we heard from Supervisor Hahn on our show that the board supported this idea of if you get 4,000 cases a day average over 5 days, that we would have this restaurant ban, and then if it went over 4,500, it would be a stay-at-home order.
Right. She sort of threw her hands up and said, well, that's what the public health person tells us.
Well, but she also said that the board supported that. So did the board support that last week, and why did they?
And that is a good question. So two things. Number one, the board did. The board said we're going to revise the public health orders, which was done. We were also going to alert the public that if we reached a certain number, these were the steps that were going to be taken. Over the weekend, Dr. Ferrer wanted to release that information saying we are going to close on Wednesday. I felt that should not be released until we have an opportunity in public to discuss this. Janice has said, the Supervisor Hahn has said the same thing, that this should be discussed in public. I personally feel that we are rushing into a situation that for many of these restaurants, it's going to be the final blow and they're not going to open. And if I did this, I would be the first to say that we need to do what's right. But in this case, everything I'm hearing is not showing me that this is in fact the right path to take. In addition to that, you know, I am now of the opinion that we need to bring in experts. We've got USC, UCLA, Caltech, people that are on the forefront dealing with this virus in real time. Maybe it's time for us to get input from people that can offer us really a holistic approach to this based on therapeutics, based on the vaccine, based on, you know, hospitalization, and actually those that are getting it that are finding themselves asymptomatic and no impact once they recover.
Phil Schuman.
So I do that. But public health, make no mistake, she is the ultimate, and it's not even her, it's Dr. Davis is the public health officer who signs all these public health orders. That is separate. They have the full authority to do that, but they do it in consultation with the Board of Supervisors.
Phil Schuman.
All right, give me a letter grade on how you think the county has handled the pandemic since the beginning, the county as a whole.
Wow, I think that early on, I would give us a B because I believe that we were navigating something that no one really knew what this virus was about. I think now we are sliding down and not being as responsive as I believe we should be, we the county, in terms of recognizing the impact it's having on businesses. But I still think that I would say a B- because we are moving aggressively forward on getting the testing out there. We are putting together protocols to get the vaccine to frontline and doing all that. So I believe we've done okay, but I know that there's room for improvement.
Well, let me ask you this. So it's shocking to me to hear you say in late November that you think we should assemble a panel of experts when you have the county public health department with 4,000 people. You have one of the top public health officials and Barbara Ferrer available, who, by the way, is not a medical doctor. She's a PhD. And you have all these other medical experts, and now you're suggesting that we need to form a panel of outside experts? Doesn't express much confidence in county public health.
So, Phil, what I will tell you is that I would love to own this idea, but actually USC came to me and offered it and felt that they had value added. And I talked to them last week about this. So this is something that was not something that I woke up and said, I think we're going to do this. Clearly, Dr. Ferrer and Dr. Davis, and you're right, Dr. Ferrer is a PhD, Dr. Davis is a public health officer, but I do believe based on the therapeutics that are moving forward, the vaccine that's coming forward.
That's right.
And, this is going to be in the community well past 2020. And it's time for us to really recognize that we need to have a long-term strategy moving forward. And I believe that bringing together experts to put us in that direction is a smart move.
And Phil, I'm telling you, there's concern in my profession about the way decisions are being made by public health, not taking into account therapeutics, the way we're encouraging hospitalizations, the profound mental health impact, the financial well-being of the population, the overall health is being ignored, and things seem very precarious and arbitrary. And so I'm delighted that a group came forward and to help the county, because we need exactly that, Phil. It's clear that that's necessary now, and I wouldn't blame the county supervisors for that at all.
But to follow up on Phil's point,
last question.
go ahead, Phil.
Okay. No, I'm just going to say one last question is that does the supervisor recognize the confusion and perhaps even a lack of confidence in our leadership on behalf of the public, on behalf of business owners, if over the weekend we have this major announcement for Barbara Ferrer, and then on Monday the chairman of the board of supervisors, who she works for, is 100% opposed to her decision? Shouldn't this discussion have been held before she made such an important announcement?
Right. I mean, Barbara Ferrer is making over $400,000 in taxpayer money. The county is spending millions of dollars to hire a PR firm to help with the messaging. Isn't this a major messaging mistake?
So in answer to Phil's question, yes, as chair, last week it was discussed, not in public, it was discussed by Dr. Ferrer bringing it to the board. Which is why I didn't want to move forward with the announcement over the weekend. I felt we needed to have this discussion because I have serious concerns. I am not a wallflower. I will not sit back. If I don't feel something's right, I will stand up for what I believe. And while I am chair, I am one of 5. And I run the board meetings and I have authority over executive authorization and all. But on this one, I'm speaking out as a 5th District Supervisor, but also as a concerned citizen who's listening to constituents and friends who are concerned about what their future is going to bring and their employees. I have one restaurant who told me he's going to have to lay off about 34 employees tomorrow, and he's not sure they're going to be able to come back.
This is upending so many lives, and I want to address what Phil and Alex both were saying. Listen, the LA County Board of Supervisors are not experts in health messaging. They're supposed to get that from the health department, and the health messaging has been so far off. It's like we've abandoned everything we know about health messaging, and I don't know why, and I don't believe that anybody on the Board of Supervisors would have known that, because you're not medical experts, you're not health messaging experts, but this is not the problem. Today is not the issue. It's been going on for quite some time.
Well, and as it relates to the public PR firm that was brought on, early on we brought them on because we had to put Safer at Home into play within less than 2 weeks. So it was important for us to get our messaging out and try to help people understand why we're doing this. And quite frankly, early on, people were very understanding and were willing to comply with that request. Now you've got COVID fatigue where people are fed up. We close, we open, we close, we open. It stands to reason numbers go down. Once you open, they go back up. So the question is, do we do messaging that educates the public about the fact that masks truly do protect you and the person you're talking to, and social distancing also does that.
Right.
And to that point, I believe, and I know that my colleagues would probably agree, we need to get messaging out there, both in English, Spanish, Armenian, Korean, Chinese, every language there is, because people are not getting it.
Phil got the message.
Phil got the message. I'm putting on my mask as well.
Mine?
We are big believers that masks work here. Supervisor, will you stay with us for the next segment? We've got more we want to talk about.
All right, that was the update there from our sister station, Fox 11 in Los Angeles. Let's show you what we are waiting at about 15 minutes away, if everything is on schedule, which I don't think it will be, but we'll wait and see on that one. Joe Biden is going to be announcing some cabinet picks during this transition process. We'll bring it to you as soon as it happens right here on News Now from Fox. Thanks again for joining us here worldwide as we bring you the live events all over as they're happening. Stay right here with us. We're going to take a quick 2-minute break. We'll be right back. In the meantime, everybody, let's go out to New York. We got Governor Andrew Cuomo from earlier talking about the very last.
My mother, who is a senior citizen, she does not admit that she is a senior citizen. My mother somehow became younger than me in age. I don't know how she did that mathematical equation in her head, but you talk to her. She's younger than I am. But she just doesn't understand it. She just does not understand it. I had to talk to her last night. She called me back this morning to go back through the same thing. I don't understand. You haven't seen your sisters in a long time. You haven't seen your nieces. You haven't seen your nephews in a long time. I don't understand it. I don't understand it. And she doesn't understand it. This is a Thanksgiving, 89 years old. It's never been a Thanksgiving like this in her life. But that's the fact, and it is hard, and it's hard to do, and it's so much easier just to say, we'll do it the way we normally do it. That's the easy way. Well, come over, we'll be careful. It's a mistake. It's a mistake. I wanted to say to Mariah, come home. I said to Mariah, I'll come pick you up. That's a long ride, Chicago. That's how bad I felt. I said, I'll come pick you up. But she said, even if I don't take the plane, then she's in a car with me for a number of hours, and then she still winds up home in front of people who she can infect. I didn't want to disappoint my mother. You know, 89 years old, she's thinking, how many Thanksgivings do I get, right? You start to think that way. But it's hard, but sometimes hard is smart. The way I try to do it in my mind to help me sleep is not a normal Thanksgiving. This is a special Thanksgiving. This is more special than the other Thanksgiving, because this is truly about giving thanks and honoring people who sacrificed for us this past year. And there are a lot of people who sacrificed to get us through COVID. There are people who gave their lives to get us through COVID. There are nurses who died to get us through COVID. There are doctors who died to get us through COVID. There are police officers who died to get us through COVID. There are National Guards people who died to get us through COVID. That's why this is a special Thanksgiving. And for that special Thanksgiving, yes, the celebration is different. But it is special. And it is in many ways more profound and more meaningful than the past Thanksgiving. So yes, it's going to look different, it's going to feel different. But in here, it's more special, it's more powerful than past Thanksgiving. I give thanks to all those essential workers who showed up for work every day so we could stay home safely. Think about that. Every day I'm standing at a briefing, sitting at a briefing, doing what I'm doing today, saying, stay home, it's dangerous, don't send the kids to school, stay home, stay home, stay home. Except you, essential worker, you have to wake up and you have to go to work. Why? So we can stay home. You have to drive the bus and have hundreds of people walking past you and put your life in danger. You have to drive the train. You have to be at the food store to keep food on the shelves, because if we don't have food on the shelves, you're going to see panic. You have to show up at the utility company, because if people flick that light switch and there are no lights in their home and there's no heat, there's going to be panic. How brave were those people? Went out in the face of danger. I give thanks for them. And that is special. So celebrate Thanksgiving. Celebrate Thanksgiving with your bigger family, your extended family. Your extended family is the family of New York. The extended family is representative of all those people who did the right thing this entire year for one another and acted as a family. When those essential workers went outside, they were your brothers and they were your sisters. And they did it out of love for you, even though they didn't know you. But because they were part of the family of New York, the family of humanity, the family of community. And they believed that. That's what they were honoring. Otherwise, they would have stayed home in bed and said, I'm going to stay safe. Just like you're staying home, I'm going to stay home. Because we acted like a family. We acted out of love. And we acted out of duty and honor and respect for one another. That's what I'm going to celebrate. So I won't have my family at the table, but I have my broader family at the table. And I am honoring them this Thanksgiving. And this Thanksgiving, as usual, we remember the less fortunate. But this is a special one, and we have to be careful. But New York set the standard for the nation in how people respond. We went from the highest infection rate in the nation to the lowest infection rate in the nation. How does a state do that? How about a state like New York? So complicated, so diverse. Black, brown, white, LGBTQ, upstate, downstate, Democrat, Republican. How did New Yorkers do that? Because we were together. We came together. We rose above the differences. We didn't focus on differences. We found the commonality. That we are all connected. You're my sister. You are my brother. You're my sister. You're my sister. And I feel that responsibility and that connection to you. And that's the family of New York. And that's what we call New York tough. We're smart. We're united as a family. We're disciplined, putting on this thing. And we love one another. We love. And we're tough enough to say we love. We're strong enough to say, I love you. I love you. And we're acting out of love. That's what New York tough means. And we have a special mask for Thanksgiving, because, you know, we're also creative in New York. We are creative, and we do things a little different. And we have a special mask. Don't be a turkey this Thanksgiving. Wear a mask. Don't be a turkey. How good looking is this mask, right? You ready? Look at that. How beautiful is that? Tell the truth. Especially good on me. Covers my nose and everything. I'm better looking with the mask. Questions?
Governor, a couple of Long Island-centric questions. First off, yesterday you announced a couple of yellow zone designations for Long Island. There's at least 3 communities, Freeport, Uniondale, Brentwood, that seem to be on the brink. Any additional cluster zone designations for Long Island?
Gary?
Yeah, Robert, you're right. There are, as you saw in our slideshow yesterday, we put up the number of the different infection rates in these communities. There are a number that are on the brink, as you said, and we've been in touch with the county executive offices in both counties. And as those meet the metrics over the 10-day period, you'll be seeing additional zone designations. You can expect to see additional zone designations, but the hope is that, of course, the numbers come down before that's required.
On the enforcement measures for Long Island, both the Nassau and the Suffolk police departments have indicated that they will enforce the 10-person designation and they will respond to complaints. However, the Suffolk County Sheriff's Office has said they won't take part in this. Your thoughts on how the sheriff is responding, and specifically Long Island as a whole? Are you comfortable with the enforcement measures that the law enforcement out here is taking?
Yeah, let me say this. The law is the law. The law is the law. The law is no more than 10 people in a home. And that's the law, and the law is the law. By the way, this is not a political situation. Trump administration, CDC, says no one other than the household that you.
All right, that was the updates there from New York. Governor Andrew Cuomo, Staten Island, they're opening up another field hospital ahead of continuing surge in some of the boroughs there in New York. Live look right now where Joe Biden will soon be giving an update on his cabinet picks. We will feature that for you live right here on News Now from Fox. Always live, raw, and unfiltered as we bring you the very latest from coast to coast as it is happening. And you can see they're getting the podium ready there for Joe Biden. We will have it for you. Once that gets going, we're going to take a quick 2-minute break for some of you. Stay right here with us as we are just getting warmed up for you. In the meantime, everybody, while we do wait for Joe Biden to make those formal cabinet picks official, let's give you really the state of COVID-19 and the state of the pandemic, an update from the Mayo Clinic in Minnesota, and then we'll keep you in double box so you don't miss anything and you're not thinking that we're not showing something when really we're just waiting on an event here. So we'll keep you in double box, waiting on Joe Biden, and we'll bring it to you as soon as we can.
Thanks for joining us. This is we'll keep this to about 40 minutes, so or 45 minutes. We'll try to wrap it up. So if you could start, Dr. Maurice, with just say and spell your name and give your title, and then go ahead and get right into your opening remarks on the state of testing.
Hi, so welcome everybody. Apologies for the brief delay in getting started here. My name is William. I also go by Bill, but William Maurice, M-O-R-I-C-E. I'm both MD and PhD in terms of my degrees. My title is I am the president of Mayo Clinic Labs or Laboratories, and also the chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic. Regarding the state of testing, because of my role as president of Mayo Clinic Labs, I've actually have been helping with the national response to COVID testing since the early days of the pandemic. Was part of a team that met with the Pence team at the White House in the first week of March of this year, and since that point in time have been very much focused on increasing the scale of in-laboratory testing available for the diagnosis of COVID-19, both for our Mayo Clinic patients and nationally as well. In terms of the current state of testing, I think that we have seen a dramatic response from both academic and private laboratories in increasing COVID testing capacity in this country to the point where we can now do 1.5 million tests per day. But we have seen with the current surge in cases that even with that, extremely impressive national testing capacity that we need, the need for COVID diagnostics for managing the pandemic is going to be with us for some time. So I think the state of testing is such that we have sufficient capacity at this moment to meet the country's needs, but we're going to have to look ahead into the rest of this year and into 2021 in providing both in-lab testing as well as point-of-care testing or at-home testing to manage the pandemic, as well as having the good tools available to guide either the use of therapies like monoclonal antibodies or convalescent plasma and eventually vaccines. So I think the state of testing is one where we have made great strides, but there's still work to be done in terms of using the clinical laboratory to manage the pandemic and to help us get through this.
All right. Do you have any statistics you can share with us in terms of our capacity now compared to the Mayo Clinic laboratory capacity, say in like March and April? And then also, I'd be interested if you could just share some overall like positivity rates, what we're seeing in the areas that we serve.
Sure. So we actually knew of the coming of the SARS-CoV-2 virus, to our country. We were aware of this back in January, that this was a growing concern in China because of our partnership with WuXi Diagnostics, which is a joint venture between Mayo Clinic and WuXi to provide laboratory testing to Chinese patients. And through that partnership, we were aware of the pandemic or at that point, I guess it wasn't a pandemic, but we were aware of COVID-19 and the SARS-CoV-2 virus, and had actually started to develop our own laboratory developed test in anticipation that we were going to need that for our practice. That was in February. So in the early March, we did receive EUA approval for our own test, as well as worked with Roche as our first major commercial vendor to grow that platform. So in the early days of March, we had capacity of a few thousand tests per day. To where we are now today, I think we've had up to 9 different testing platforms at any one point in time that we have been using in our institution for COVID testing. And on our Rochester campus, we can now provide about 20,000 tests per day. We also have testing capabilities in Florida and Arizona, as well as in the health system. In terms of positivity rates, we up until I would say the last 6 weeks, our positivity rates had been less than 10% for the majority of our sites. We had some outbreaks in southern Minnesota that had seen positivity rates climb above 10%. But in the last month or so, we have been seeing in the Midwest, the positivity rates ranging anywhere from around 10% on our Rochester campus to 20 and even 30% in some of our Wisconsin facilities, particularly in Northwest Wisconsin and Eau Claire. So it changes day by day, and I'm sure Suzanne or Ginger can get you the statistics, but unfortunately, we have been running above 10%, around 10% or slightly higher in the Rochester campus, and 20% or higher in Wisconsin and also in southern Minnesota outside of Rochester.
All right, great, thank you. So if you want to start putting your questions in the chat, that would be great. And then in the meantime, Dr. Maurice, could you also speak to, just run through the different types of tests, what they're for, and maybe any new tests on the market now. And
all right, everybody, we are getting a 2-minute warning here for Joe Biden, so we're going to take a quick break right here for you on News Now from Fox.
For the managing of COVID-19, there's really 3 classes of tests, I would say. There are those that are used for the detection of the virus itself, the diagnostic test. There are tests that are used to identify who's been exposed to COVID and has mounted an immune response, I should say. And then the third class are really the tests that are used for COVID-19 patients to try and identify those who are at risk of getting really sick with the disease, because that's really what we're trying to manage here is our patients that are getting severely ill and giving them appropriate care. So we also have tests that are now developed to identify which those patients might be before they get sick so we can intervene early. In terms of the diagnostic tests, there are 2 basic ways to approach that to detect the virus. One is to look for the nucleic acids of the virus, the nucleic acid amplification tests, of which PCR is the most, probably the most talked about. The other is to detect proteins made by the virus, which are the antigen tests.
All right, folks, here we go. Joe Biden announcing his cabinet picks right here live on News Now from Fox.
Got everybody, okay. Well, good afternoon, everyone. Today, I'm pleased to announce nominations and staff for critical foreign policy and national security positions in my administration. It's a team that will keep our country and our people safe and secure. And it's a team that reflects the fact that America is back, ready to lead the world, not retreat from it. Once again, sit at the head of the table, ready to confront our adversaries and not reject our allies, ready to stand up for our values. In fact, in calls from world leaders that I've had, about 18 of them or 20 so far, I'm not sure the exact number, in the weeks since we won the election, I've been struck by how much they're looking forward to the United States reasserting its historic role as a global leader, both in the Pacific as well as the Atlantic, all across the world. The team meets this moment, this team behind me. They embody my core beliefs that America is strongest when it works with its allies. Collectively, this team has secured some of the most defining national security and diplomatic achievements in recent memory, made possible through decades of experience working with our partners. That's how we truly keep America safe, without engaging in needless military conflicts and our adversaries in check and terrorists at bay. And that's how we counter terrorism and extremism, control this pandemic and future ones, deal with the climate crisis, nuclear proliferation, cyber threats and emerging technologies that spread authoritarianism, and so much more. And while this team has unmatched experience and accomplishments, they also reflect the idea that we cannot meet these challenges with old thinking and unchanged habits. For example, We're going to have the first woman lead the intelligence community, the first Latino, an immigrant, to lead the Department of Homeland Security, and a groundbreaking diplomat at the United Nations. We're going to have a principal on the National Security Council whose full-time job is to fight climate change. For the first time ever, that will occur. And my national security team will be coordinated by one of the youngest national security advisors in decades. Experience and leadership, fresh thinking and perspective, and an unrelenting belief in the promise of America. I've long said that America leads not only by the example of our power, but by the power of our example. And I'm proud to put forward this incredible team that will lead by example. As Secretary of State, I nominate Tony Blinken. He's one of the better prepared for this job. No one's better prepared, in my view. He will be the Secretary of State who previously served in top roles on Capitol Hill, in the White House, and in the State Department. He delivered for the American people in each place. For example, leading our diplomatic efforts in the fight against ISIS, strengthening America's alliance and positions in the Asia-Pacific, guiding our responses to the global refugee crisis with compassion and determination. And he will rebuild morale and trust in the State Department where his career in government began. And he starts off with the kind of relationships around the world that many of his predecessors have had to build over the years. I know. I've seen him in action. Tony's been one of my closest and most trusted advisors. I know him and his family, immigrants and refugees, a Holocaust survivor, who taught him to never take for granted the very idea of America as a place of possibilities. Possibilities. Tony is ready on day one. As Secretary for Homeland Security, I nominate Alejandro Mayorkas. This is one of the hardest jobs in government, a gigantic agency. The DHS Secretary needs to keep us safe from threats at home and from abroad. And it's the job that plays a critical role in fixing our broken immigration system. After years of chaos, dysfunction, and absolute cruelty at DHS, I'm proud to nominate an experienced leader who has been hailed by both Democrats and Republicans. Ali, as he goes by, is a former U.S. attorney, former director of U.S. Citizenship and Immigration Services, and a former DHS deputy secretary. Helped implement DACA, prevented attacks on the homeland, enhanced our cybersecurity, helped communities recover from natural disaster, combated Ebola and Zika. And while DHS affects everyone, given its critical role in immigration matters, I'm proud that for the first time ever, the department will be led by an immigrant, a Latino, who knows that we are a nation of laws and values. And one more thing. Today's his birthday. Happy birthday, man. Happy birthday. He's 21. As a director of national intelligence, I nominate Avril Haines, the first woman ever to hold this post. To lead our intelligence community, I didn't pick a politician or a political figure. I picked a professional. She's eminently qualified. Former deputy director of the CIA, former deputy national security advisor to President Obama, and a fierce advocate for telling the truth and leveling with her decisions with the decision makers. Straight up. Nothing unnecessary. I know because I've worked with her for over a decade. Brilliant, humble, can talk literature and theoretical physics, fixing cars, flying planes, running a bookstore cafe, all in a single conversation because she's done all that. And above all, she gets word of a threat, if she gets word of a threat coming to our shores, like another pandemic or foreign interference in our elections, she will not stop raising alarms until the right people take action. People will be able to take her word because she always calls it as she sees it. I believe we are safer with Avril on the watch. I think she can make a great contribution. And as United States Ambassador to the United Nations, I nominate Linda Thomas Greenfield, a seasoned and distinguished diplomat with 35 years in the Foreign Service who never forgot where she came from, growing up in segregated Louisiana. The eldest of 8. Her dad couldn't read or write, but she says he was the smartest person she knew. First in her family to graduate from high school, then college. The whole world literally ahead of her, as her dad and mom taught her to believe. Post in Switzerland, Pakistan, Kenya, the Gambia, Nigeria, Jamaica, Liberia, where she was known as the People's Ambassador. Willing to meet with anyone, an ambassador, a student, working people struggling to get by, and always treating them with the same level of dignity and respect. She was our top State Department official in charge of African policy during the Ebola crisis. She received overwhelming support from her fellow career Foreign Service officers. And she'll be a cabinet status because I want to hear her voice on all the major foreign policy discussions we have. And my national security advisor, I choose Jake Sullivan. He's once-in-a-generation intellect with experience and temperament for one of the toughest jobs in the world. When I was vice president, he served as my national security advisor. He was a top advisor to Secretary of State Clinton. He helped lead the early negotiations that led to the Iran nuclear deal. He helped broker the Gaza ceasefire in 2012, played a key role in Asia-Pacific rebalance in our administration. And in this campaign for the presidency, he served as one of my most trusted advisors on both foreign and domestic policy, including helping me develop our COVID-19 strategy. Jake understands my vision that economic security is national security, and it helps steer what I call a foreign policy for the middle class, for families like his growing up in Minnesota, where he was raised by parents who were educators and taught him the values of hard work, decency, service, and respect. What that means is to win the competition for the future, we need to keep us safe and secure and build back better than ever. We need to invest in our people, sharpen our innovative edge, unite the economic might of our democracies around the world to grow the middle class and reduce inequity, and do things like counter predatory trade practices that our competitors and our adversaries. And before I talk about the final person today, let me talk about this new position. For the first time ever, the United States will have a full-time climate leader who participate in ministerial level meetings. And that's a fancy way of saying they'll have a seat at every table around the world. For the first time ever, there will be a principal on the National Security Council who can make sure climate change is on the agenda in the Situation Room. For the first time ever, we will have a presidential envoy on climate. He will be matched with high-level White House climate policy coordinator and policy-making structure to be announced in December. And that'll lead efforts here in the United States to combat the climate crisis, mobilize action to meet the existential threat that we face. Let me be clear. I don't for a minute underestimate the difficulties of meeting my bold commitments to fighting climate change. But at the same time, no one should underestimate for a minute my determination to do just that. And as for the man himself, if I had a former Secretary of State who helped negotiate the Paris Climate Accord, or a former presidential nominee, or a former leading senator, or the head of a major climate organization for the job, they would show my commitment to the United States and the whole world. The fact that I picked the one person who is all of these things speaks unambiguously to my commitment. The world will know that with one of my closest friends, John Kerry, he's speaking for America on one of the most pressing threats of our time. No one I trust more. To this team, I thank them for accepting this call to service. And for their families, I thank you all for your sacrifice. You know, we could not do this without you, in my view. Together, these public servants will restore America globally, its global leadership, and its moral leadership, and will ensure that our service members, diplomats, and intelligence professionals can do their job free of politics. They'll not only repair, they'll also reimagine American foreign policy and national security for the next generation. And they'll tell me what I need to know, not what I want to know, what I need to know. To the American people, this team will make us proud to be Americans. And as more states certify the results of this election, there's progress to wrap up our victory. You know, I'm pleased to have received the ascertainment from GSA to carry out a smooth and peaceful transition of power, so our teams can prepare to meet the challenges at hand, to control the pandemic, to build back better, and to protect the safety and security of the American people. And to the United States Senate, I hope these outstanding nominees received a prompt hearing and that we can work across the aisle in good faith to move forward for the country. Let's begin that work to heal and unite. To heal and unite America as well as the world. I want to thank you all. May God bless you. May God protect our troops. And now I turn this over, this new team, starting with our next Secretary of State, Tony Blinken. Get my mask here, Tony, so I don't get in trouble. And we're going to clean off the podium.
Good afternoon. Mr. President-elect, Vice President-elect Harris, thank you for your trust and your confidence. If confirmed by the United States Senate, I will do everything I can to earn it. Mr. President-elect, working for you, having you as a mentor and friend, has been the greatest privilege of my professional life. So many people have brought me to this day, from college classmates to bandmates, my colleagues in the Clinton and Obama administrations, in the Senate, and at the State Department. I thank them all, and I ask forgiveness for my insatiable appetite for bad puns. Mostly, I'd like to thank my family, sisters and sisters-in-law, brothers-in-law, nieces and nephews, my wonderful in-laws, the Ryans, and especially my wife, Evan Ryan, and our children, John and Lila. They are truly my greatest blessings. For my family, as for so many generations of Americans, America has literally been the last best hope on earth. My grandfather, Maurice Blinken, fled pogroms in Russia and made a new life in America. His son, my father, Donald Blinken, served in the United States Air Force during World War II, and then as a United States ambassador. He is my role model and my hero. His wife, Vera Blinken, fled communist Hungary as a young girl and helped future generations of refugees come to America. My mother, Judith Pizarre, builds bridges between America and the world through arts and culture. She is my greatest champion. And my late stepfather, Samuel Pizarre. He was one of 900 children in his school in Białystok, Poland, but the only one to survive the Holocaust after 4 years in concentration camps. At the end of the war, he made a break from a death march into the woods in Bavaria. From his hiding place, he heard a deep rumbling sound. It was a tank, but instead of the Iron Cross, he saw painted on its side a 5-pointed white star. He ran to the tank. The hatch opened. An African-American GI looked down at him. He got down on his knees and said the only 3 words that he knew in English that his mother had taught him before the war. God bless America. That's who we are. That's what America represents to the world, however imperfectly. Now, we have to proceed with equal measures of humility and confidence. Humility because, as the President-elect said, we can't solve all of the world's problems alone. We need to be working with other countries. We need their cooperation. We need their partnership. But also confidence, because America, at its best, still has a greater ability than any other country on earth to bring others together to meet the challenges of our time. And that's where the men and women of the State Department, Foreign Service officers, civil servants, that's where they come in. I've witnessed their passion, their energy, their courage up close. I've seen what they do to keep us safe, to make us more prosperous. I've seen them add luster to a word that deserves our respect: diplomacy. If confirmed, it will be the honor of my life to help guide them. And so thank you all, and may God bless America.
Good afternoon, Mr. President-elect, Madam Vice President-elect. Thank you for placing your trust in me to lead the Department of Homeland Security. Thank you for the privilege of returning, with the consent of the Senate, to government service as a member of your administration. It is the honor of a lifetime. The Department of Homeland Security has a noble mission: to help keep us safe and to advance our proud history as a country of welcome. There are more than 240,000 career employees who selflessly dedicate their talent and energy to this mission. Many risk their lives in doing so. I would be honored to return to the department and support these dedicated public servants in fulfilling their responsibilities and realizing our country's greatest hopes, all in partnership with the communities we serve. For 12 years, I had the privilege to stand in a federal courtroom and announce Alejandro Mayorkas on behalf of the United States of America. The words "on behalf of the United States of America" meant everything to me and to my parents, whom I think of today and every day. My father and mother brought me to this country to escape communism. They cherished our democracy and were intensely proud to become United States citizens, as was I. I have carried that pride throughout my nearly 20 years of government service and throughout my life. My parents are not here to see this day. Mr. President-elect, Madam Vice President-elect, please know that I will work day and night in the service of our nation to ably lead the men and women of the United States Department of Homeland Security and to bring honor to my parents and to the trust you have placed in me to carry your vision for our country forward. Thank you.
Thank you. Good job.
Mr. President-elect, Madam Vice President-elect, I am grateful and even more so humbled by the trust that you placed in me for this role. I'm especially honored to be standing not only by your side, but also alongside some of the most talented and inspiring public servants this country has ever seen. I know, Mr. President-elect and Madam Vice President-elect, that you have selected us not to serve you, but to serve on behalf of the American people, to help advance our security, our prosperity, our values. That the call to service in this role is what makes this nomination such a tremendous honor. If afforded the opportunity to do so, I will never forget that my role on this team is unique. Better than that of a policy advisor, I will represent to you, Congress, and the American public, the patriots who comprise our intelligence community. Mr. President-elect, you know that I have never shied away from speaking truth to power, and that will be my charge as Director of National Intelligence. I've worked for you for a long time, and I accept this nomination knowing that you would never want me to do otherwise, and that you value the perspective of the intelligence community, and that you will do so even when what I have to say may be inconvenient or difficult, and I assure you there will be those times. And finally, to our intelligence professionals, the work you do, oftentimes under the most austere conditions imaginable, is just indispensable. It will become even more complex because you will be critical to helping this administration position itself not only against threats such as cyber attacks or terrorism and the proliferation of nuclear, biological, or chemical weapons, but also those challenges that will define the next generation, from climate change to pandemics and corruption. And it would be the honor of a lifetime to be able to work alongside you once again to take these challenges on together. Thank you so much.
Thank you.
Good afternoon. Mr. President-elect, Madam Vice President-elect, I'm humbled and honored by the trust that you have placed in me to become a member of your cabinet as ambassador to the United Nations. In the years that I've worked in government, I'm always struck by how only in America would we be where we are today, where life can be hard and cruel, but there's hope in the struggle. There's promise in our dreams, where you learn to believe in yourself and that anything is possible. Like both of you, I learned from my family. Mr. President-elect, thank you for those generous words that you said about me. My parents had very little back in Louisiana where I grew up, but they gave me and my siblings everything they had. And I know how proud they would be of this day. On this day, I'm also missing my mentor, Ambassador Ed Perkins, who served as the U.S. Ambassador to the United Nations under President George H.W. Bush and President Clinton, and who was also from Louisiana. He told me constantly, Linda, don't undersell yourself. And he would always do everything possible to lift me up. He passed away last week, but I know he's here with us today. And on this day, I'm thinking about the American people, my fellow career diplomats and public servants around the world. I want to say to you, America is back. Multilateralism is back. Diplomacy is back. Mr. President-elect, I've often heard you say how all politics is personal, and that's how you build relationships of trust and bridge disagreements and find common ground. And in my 35 years in the Foreign Service across 4 continents, I put a Cajun spin on it. I called it gumbo diplomacy. Wherever I was posted around the world, I'd invite people of different backgrounds and beliefs to help me make a roux and chop onions for the Holy Trinity and make homemade gumbo. It was my way of breaking down barriers, connecting with people, and starting to see each other on a human level. A bit of lagniappe is what we say in Louisiana. That's the charge in front of us today. The challenges we face: a global pandemic, the global economy, the global climate change crisis, mass migration and extreme poverty, social justice, are unrelenting and interconnected, but they're not unresolvable if America is leading the way. Thank you.
Thank you.
Mr. President-elect, Madam Vice President-elect, thank you. Mr. President-elect, I am honored and humbled by the immense responsibility that you placed in me of being your national security advisor. I pledge to you and to the American people that I will work relentlessly in service of the mission you have given us, to keep our country and our people safe, to advance our national interests, and to defend our values. I pledge to the exceptional national security team you see behind me and to the brilliant and diverse career professionals across our government that I will manage a humane and rigorous decision-making process that honors their work. And I pledge to my parents, who taught my brothers, my sister, and me to work hard, tell the truth, and serve others, that I will do my utmost to make you proud. Sir, we will be vigilant in the face of enduring threats, from nuclear weapons to terrorism. But you have also tasked us with reimagining our national security for the unprecedented combination of crises we face at home and abroad: the pandemic, the economic crisis, the climate crisis, technological disruption, threats to democracy, racial injustice, and inequality in all forms. The work of the team behind me today will contribute to progress across all of these fronts. You have also tasked us with putting people at the center of our foreign policy. You've told us that the alliances we rebuild, the institutions we lead, the agreements we sign, all of them should be judged by a basic question: will this make life better, easier, safer for families across this country? Our foreign policy has to deliver for these families. And perhaps most importantly, you've tasked us with helping unite America, as you said in your remarks, through our work to pull people together to tackle big challenges. My wife, Maggie, the love of my life and my partner in all things, served as a senior advisor to Senator John McCain. She and I shared this commitment to common ground deep in our bones. To the American people, I had the honor of serving as Joe Biden's national security advisor when he was vice president. I learned a lot, about diplomacy, about strategy, about policy, but most importantly, about human nature. I watched him pair strength and resolve with humanity and empathy. That is the person America elected, and that is also America at its best. So, Mr. President-elect, thank you for giving this kid from the heartland an extraordinary opportunity to serve the country I love.
Mr. President-elect, Vice President-elect Harris, thank you, Mr. President-elect, for your generous words. And most of all, thank you for the trust and the responsibility of this appointment. I will do all in my power to live up to your expectations and to this moment for our country and for the world. And I begin by thanking my family for empowering me and encouraging me to take this task on. Secretary-designate Blinken, we've worked together for many years on the Foreign Relations Committee and at Foggy Bottom, and it will be a huge pleasure to partner with you again. You will be a terrific secretary. Mr. President-elect, you've put forward a bold, transformative climate plan. But you've also underscored that no country alone can solve this challenge. Even the United States, for all of our industrial strength, is responsible for only 13% of global emissions. To end this crisis, the whole world must come together. You're right to rejoin Paris on day one, and you're right to recognize that Paris alone is not enough. At the global meeting in Glasgow 1 year from now, all nations must raise ambition together, or we will all fail together. And failure is not an option. Succeeding together means tapping into the best of American ingenuity, creativity, and diplomacy, from brain power to alternative energy power, using every tool we have to get where we have to go. No one should doubt the determination of this president and vice president. They shouldn't doubt the determination of a country that went to the moon, cured supposedly incurable diseases, and beat back global tyranny to win World War II. This kind of crisis demands that kind of leadership again, and President Biden will provide it. The road ahead is exciting, actually. It means creating millions of middle-class jobs. It means less pollution in our air and ocean. It means making life healthier for citizens across the world. And it means we will strengthen the security of every nation in the world. In addressing the climate crisis, President-elect Joe Biden is determined to seize the future now and leave a healing planet to future generations. 57 years ago, this week, Joe Biden and I were college kids when we lost the president who inspired both of us to try to make a difference. A president who reminded us that here on earth, God's work must truly be our own. President Joe Biden will trust in God, and he will also trust in science to guide our work on earth to protect God's creation. Mr. President-elect and Vice President-elect Harris, I look forward to getting to work. Thank you.
Thank you, Secretary Kerry. And congratulations, Mr. President-elect, on bringing together this extraordinary team. I have always believed in the nobility of public service, and these Americans embody it. Their lives and careers are a testament to the dedication, sacrifice, and commitment to civic responsibility that have strengthened our democracy and kept America's promise alive for more than 200 years. President-elect Biden and I have long known that when we were elected, we would inherit a series of unprecedented challenges upon walking into the White House. Addressing these challenges starts with getting this pandemic under control, opening our economy responsibly, and making sure it works for working people. And we also know that our challenges will require us here at home to overcome those issues that block our ability to proceed. Our challenge here is a necessary foundation for restoring and advancing our leadership around the world. And we are ready for that work. We will need to reassemble and renew America's alliances, rebuild and strengthen the national security and foreign policy institutions that keep us safe and advance our nation's interests, and confront and combat the existential threat of climate change that endangers us all. I take these issues very seriously. My whole career has been about keeping people safe, from serving as district attorney to California's Attorney General to the United States Senate, where I have served on the Intelligence and Homeland Security committees. I have come to know firsthand the gravity of the challenges and threats facing the United States. And over the past few months, I've also come to know the sound judgment, expertise, and character of the people on this stage. I can say with confidence that they are, to a person, the right women and men for these critical positions. And I look forward to working alongside them on behalf of the American people and on behalf of a president who will ask tough questions, demand that we be guided by facts, and expect our team to speak the truth, no matter what. A president who will be focused on one thing and one thing only: doing what is best for the people of the United States of America. When Joe asked me to be his running mate, he told me about his commitment to making sure we selected a cabinet that looks like America, that reflects the best of our nation, And that's what we have done. Today's nominees and appointees come from different places. They bring a range of different life and professional experiences and perspectives. And they also share something else in common: an unwavering belief in America's ideals, an unshakable commitment to democracy, human rights, and the rule of law. And they understand the indispensable role of America's leadership in the world. These women and men are patriots and public servants to their core. And they are leaders, the leaders we need to meet the challenges of this moment and those that lie ahead. Thank you.
All right. Thank you, folks. And there it is. No questions being taken there from Joe Biden and Kamala Harris as they introduce some cabinet nominees and appointees. We'll be right back here on News Now from Fox. Let's keep our coverage going here live on News Now. Let's now take you out to Georgia, where the governor and other state officials talking about COVID-19 coming as Thanksgiving approaches.
I want to thank Dr. Toomey, GEMA Director Chris Stallings, our Insurance and Fire Safety Commissioner General John King for being with us today. With Thanksgiving just being 2 days away, we want to provide an update to the people of Georgia on where we are in our fight against COVID-19, but also remind them to stay vigilant as we head into not only Thanksgiving, but this holiday season. On the good news front, the state continues to maintain an ample supply of PPE that can be deployed at a moment's notice to support our frontline workers and healthcare facilities. As of yesterday, we continue to have between 45 days and 2 months worth of supplies in each of our primary PPE categories, which includes masks, gowns, face shields, gloves, and other critical supplies. We've shipped nearly 8 million masks, over 287,000 gallons of sanitizing gel, more than 19,500 hand sanitation stations, and 52,000 face shields to our schools to ensure a safe return to the classroom. We are also prepared to support our local partners in the coming months as we continue our response to COVID-19. In recent weeks, we've been in constant contact with hospital CEOs throughout the state to maintain an open line of communication to hear what they're seeing on the ground. The state continues to keep hospital and long-term care facility staffing as one of its top priorities in responding to COVID, and we continue to work with Commissioner Frank Berry and the Department of Community Health to shore up staffing resources through the end of the calendar year to support our hospitals as well as our long-term care facilities. By the end of 2020, we plan to allocate a total of $250 million to staff augmentation alone. The Georgia Department of Public Health Commissioner Dr. Kathleen Toomey and the Georgia Department of Insurance Commissioner General John King and their teams have been working very hard to put together a comprehensive plan for vaccine distribution. We remain encouraged at recent developments on the vaccine front from Pfizer and Moderna, and our team has been meeting regularly for months to ensure that we're prepared to shore and ship the vaccine. I want to take a minute to commend the Trump administration and Operation Warp Speed on really an incredible work on the vaccine and how they have been able to get this vaccine ready in historic and record time. And I know that Americans and Georgians are ready for it. And as soon as that supply is ready to be shipped, the state will be ready to deploy a safe, effective vaccine. We'll also be providing updates in greater detail on our vaccine plan in the coming days. However, today we want to focus on the Thanksgiving holiday. We all know as the weather continues to turn cold, more people spend time indoors, and we've seen a rise in Georgia cases in recent weeks. In light of that, with not only Thanksgiving, but Christmas, Hanukkah, the New Year, and other holiday celebrations right around the corner, we're asking all Georgians to continue to do a few simple things to help limit the spread of the virus. The 4 things for fall that we've talked a lot about: wear a mask, practice social distancing, continue to wash your hands, and follow the guidance of our public health officials that we have outlined in our executive orders. And I know that Dr. Toomey would be very upset if I didn't mention the 5th point, and that is, if you have not done so already, get your flu shot so we can do our part to prevent a twin-demic of COVID and the flu happening at the same time. I know, like you, many are looking forward to spending time with their loved ones over the holidays. I am too. But I will tell you,
and we continue to get updates in Georgia. We're taking a quick 2-minute break here on News Now from Fox. Stay with us.
People within the same household. If weather permits, see if you can gather outside to reduce the risk of exposure indoors. If you are traveling, take extra steps to socially distance from those you don't regularly see. And please, if your loved ones are more vulnerable to COVID-19, especially the elderly and those with underlying medical conditions, consider their risk of including them in our holiday gatherings. As I said over the weekend, our fight for COVID-19 has uprooted many of the norms that we're used to, especially during the holidays. I know that people are frustrated and ready to return to normal. I am as well. But we cannot grow weary. We have to keep our foot on the gas in this fight. And as we celebrate Thanksgiving on Thursday, I think we all have plenty to be thankful for. Personally, I'm thankful for the hardworking Georgians who have stepped up to the plate in the recent months to follow the guidance, get folks back to work safely, partner with us as we fight every day to protect lives, but also livelihoods. I think about the educators who have adapted to a changing educational landscape to continue teaching our kids. I'm thankful especially for our frontline heroes, doctors, nurses, public health workers, and others who have gone far above the traditional call of duty, working long hours, spending precious time away from their family, many of whom will be away from their families on this Thursday. I hope that all Georgians will keep them in their thoughts and prayers and will continue to stay healthy. I'm also thankful for all those in law enforcement, our first responders, as well as our troops, including the Georgia National Guard. They have certainly dealt with unprecedented challenges and demands in recent months, never asking for recognition or special praise as they serve and protect. We all owe them our heartfelt gratitude. As governor, I know that we've got to continue to celebrate the good times, even in tough times like we're in now. And through the pandemic, it has brought tremendous loss and uncertainty, but I also believe it has shown the best in our state. So as we celebrate Thanksgiving and move forward in the days, weeks, and months to follow, let's continue to hunker down. Let's stay vigilant and resolve to act in the best interest of our fellow citizens. This holiday season will no doubt look different, but if we work together, I'm confident that Georgia's best days ahead are going to be safe, healthy, and continue to be prosperous. Thank you all. God bless. God bless you and your families. We wish you the best for a wonderful Thanksgiving holiday. And with that, I'm going to turn it over to Dr. Toomey for a few remarks.
All right, everybody, I wanted to go to some breaking news out of New York. Unfortunately, we are learning that two NYPD officers have been shot. This is the current look that we are getting right now from Sky Fox Chopper in New York City. As we are learning, two police officers have been shot inside a house in Springfield Gardens. in the borough of Queens. Sources tell Fox 5 News in New York that the officers were responding to a domestic incident when one officer was shot in the leg. A second officer was shot in the arm. A suspect involved in the shooting just before 1 p.m. is dead. The officers were taken to Jamaica Hospital. There is a massive police response that we are seeing right now, and you can see just everything that is happening right there. We continue to bring you the very latest here on News Now from Fox, hoping for the very, very best for these officers, learning that the suspect was shot and killed. And let me just update that lower third here for you as we continue to roll on here. 2 officers unfortunately shot just days before Thanksgiving, and this once again just proves just how unforgiving their jobs really, really are. At a moment's notice, tragedy can strike, and they can be shot at any moment, stabbed, and that is why the thin blue line is just so amazing, as we got to really respect all officers, not only in New York, but across the country, in every town, in every city, as they really do put their lives on the line. And we are seeing it firsthand right here. We're going to take a quick 2-minute break here for you on News Now from Fox. Stay right here with us as we are in breaking news. For those of you that are staying around here with us that didn't go to a break, we continue to bring you this latest development. We do see the NYPD van coming investigative unit on scene right now during this incident. That's very, very sad to report, as 2 New York police officers have been shot. We're hoping for the very best for them. Once we get some more updates, of course, we will pass that along to you right here on News Now from Fox. Welcome back, everyone, here to News Now from Fox, as we are continuing to follow this breaking news out of New York City in the borough of Queens. 2 NYPD officers have been shot. The suspect shot and killed, and now you are seeing the police response. Their investigation obviously will continue and go into the evening here, as we're hoping for the very best for these 2 officers here, as they were responding to an incident when one officer was shot in the leg. A second officer was shot in the arm here. We will continue to follow that for you, always right here on News Now from Fox. I'm your host, Mike Page. Always great to be here with you. Wish we were meeting on better terms right now, but this is what we are seeing out in New York City right now as we follow this breaking news of 2 officers shot. We do know that the suspect was shot and killed, as the officer is then taken to Jamaica Hospital. And this is the police response right now in the area of where this all happened. They say it happened inside a home, and the officers were responding to a domestic incident. Once we get some more updates, of course, we will bring that to you. Just wanted to bring that to your attention. I'll let you know that, once again, we do show things that are happening live, raw, and always unfiltered right here on News Now from Fox. Let's go back out to Georgia for that continuing update on the latest with COVID-19.
that we don't use that COVID test as a justification to go and not follow the guidelines. In the best of all circumstances, try to stay away from members of your family that aren't immediately living with you for their own protection and your own safety as well. But if you must get together, and I know it's very hard because this is a tradition that we all value so much, please follow guidelines, socially distance, even wear a mask within your family. If possible, eat outdoors. Keep silverware separate. And if at all possible, try to socially distance throughout your visit. This is the one way we can get through this Thanksgiving without seeing additional cases and what I hope will be a healthy, safe, and happy Thanksgiving. And so just as I close, to wish you all a very healthy, happy, safe, and I hope Zoomed Thanksgiving with your family members throughout the country. Thank you.
All right, well, thank you, Dr. Toomey, and certainly appreciate you and the whole team's continued efforts 24/7 as we fight the pandemic. We're going to open it up for some questions. Obviously, we've got General King here, Director Stallings, Dr. Toomey, and myself. Before I start taking questions or any of the other folks do, I'd like to briefly just make a quick statement on elections so we can stay focused on COVID before this Thanksgiving holiday. As you all know, the President and his team requested a recount in the state of Georgia. That is now underway. I continue to stand with the President, and I support his decision to ensure that every legal vote is counted. I have followed the law, and I will continue to do so. And as stated during last week's remarks, I support a sample audit of signatures, strengthening the photo ID law as it relates to absentee voting, and I firmly believe that all voting irregularities need to be fully investigated. We should follow the law, and we should continue to put Georgians first. Over the last several weeks, unfortunately, we've seen a lot of misinformation and more recently, quite honestly, baseless attacks that are absolutely absurd and accusations made against myself and my family. These are ridiculous. They only seek to breed fear, create confusion, and sow discord amongst our citizens. Now more than ever, we must stand up for the truth, and we have to unite around our shared values. We must ignore those that want to divide us and find a way to overcome the challenges that we all face together. I'm committed to doing that, so thank you, and I'll be glad to open it up for some COVID-related questions. Yes. Well, I'm glad to let Dr. Toomey speak as well on this. I would say that we have seen historically with COVID, which is not a long history, but we know that after these holidays, and especially when people let their guard down, that it creates bumps or spikes. And we're certainly, seeing a bump now. I think the good thing for us with where we are now, our guidance hasn't changed in a long time. So the guidance was the same basically in July that it is right now. So it's our people, the people of this state that did what we asked them to do. They were part of the solution, not part of the problem, to drive our numbers down, to drive our hospitalizations down. We've seen that with, as we continue to reopen our state, we had folks going back to school, more people going back to work, and we were fighting to protect lives and livelihoods, that we've seen an increase in cases. Thankfully, when you compare us to the rest of the country, I'm ecstatic that we're where we are. I'm also concerned at where we could go if we don't have people follow the guidance and best practices, especially over Thanksgiving when they're traveling, when they're going to consider having larger family gatherings. So we want to do just like we did, going into Labor Day. We asked people to follow the guidance, and we didn't see a huge spike after Labor Day. We've prepared our hospitalization plans and our responses, our PPE supply that Director Stallings has been working on. I mean, we are prepared to handle whatever comes our way. We want this to be a bump, not a spike. And that's what we're seeing right now. So we're urging everybody to stay focused over this long weekend of just be smart, use good common sense, get outside when you can. If you're having to be inside, try not to stay around people too long. Distance yourself, wear your mask, and we are very well prepared to weather whatever storm may come.
Hey, Governor, Andy with the
Dr.
Liberal
Toomey, did you have anything you wanted? You good? Okay, yes.
Governor, I have a question for Dr. Toomey about the vaccine deployment. Dr. Toomey, once the FDA approves the vaccine, what's the state's role in getting it out to the public here in Georgia about how many vaccines do you think we'll get? Who gets it first?
Yeah, no, we have been working with General King, but also with CDC very, very closely. Our plan mirrors the pandemic flu plan that we had in place in 2009, 2010 in Georgia, and we are following to the T the CDC guidelines for the priority populations, and we'll be moving in waves over time. Exactly what our vaccine amount, I think, is still to be determined, but we are prepared. We have our staff on the ground ready, and we'll be ready to go when that happens, and we hope it will be as early as mid-December.
And just one follow-up question. Once we start getting the vaccine, do you know if businesses or schools can require students and employees to get that vaccine before returning?
Well, at this point, we are not mandating this vaccine because it's an EUA. It's an emergency use authorization vaccine. And I think when it becomes a fully approved vaccine, I think that's something that will have to be taken into consideration. But at this time, that is not even on the table.
Let me just say this on the vaccine distribution plan. I had a great update meeting this week with Dr. Toomey, General King, and the rest of our team that's been, I mean, they've been working on this for months, and I just want to let General King give you a quick update from the overview of the meeting, building off of what Dr. Toomey said.
Good afternoon. My name is John King. I'm Georgia's Insurance Commissioner. And the governor has tapped me to coordinate with all the various departments in our state to make sure that we have a seamless transition between CDC and FDA and the logistical support required to sustain. So the plan, the federal government has been unprecedented. Operation Warp Speed, General Gus Perna, who's leading that part of that effort from the federal government, has been unprecedented in the level of detail. The challenge right now, our plans mirror what the federal government has asked us to do. Dr. Toomey and an incredibly talented team has submitted that plan to the federal government. CDC has approved Georgia's plan. And right now we are fine-tuning the locations across the state to make sure that we take into consideration the vulnerable groups of our community, the folks across the state. Is geographical, but also, we know we're going to have a limited number of doses initially available, and we're working through those numbers. Right now, we don't know that exact number, but we are working through the system to make sure that those vaccines are delivered so we can take care of the most vulnerable members of our communities. Those folks have been locked down since March. Please also, pay attention to what Dr. Toomey and the governor has asked us to do. Dr. Fauci recently said, when you're waiting for the cavalry to arrive, you double down. You double down in the things that you need to do to protect your force. As a cavalry officer in the military, that makes a lot of sense to me. So we can't just, because we know that the vaccine is waiting, it's coming, we can't let our guard down. And so but we have to take care of these limited doses that will initially come to us, to the most vulnerable members of our communities. So we're working with Commissioner Berry and his team, with DCH and the Public Health Department, and also our partners at GMA, who are going to be the cornerstone of our distribution plan.
And I'll just say this too about vaccine. Once we can get through the Thanksgiving holiday, we really want people to focus on following the 4 things for fall. to make sure that we don't see a big spike, that we can get on the backside of this little bump that we're having now. But we're going to continue to message on the vaccine distribution plan. So we're going to be talking a lot about that in the days and weeks to come, and you'll see a lot of John King, Dr. Toomey, myself, and the rest of our team as well on that. Okay.
This is a question for Commissioner Toomey. Commissioner Toomey, can you talk about now with the state statistics with the antigen and the PCR tests, how you are judging where we are? It seems that when you combine those numbers, that the number of infections is very high, that it has grown about 80% since the beginning of the month. But it seems like the positivity rate is no longer a useful guidepost. Can you talk about how you judge where we are?
No, we're looking at all of those things. Thanks for asking that question, because that's something that we assess, and we assess by county. As a collective, both the positive PCR as well as the antigen, which are presumptive positives. And just to be clear, those antigen positives are dealt with just like any other positive. We do contact tracing. We follow up those contacts. You may be aware, because of the increasing numbers nationwide, CDC recently came out with some additional guidance about case follow-up to really focus on some of the highest risk settings to do contact tracing. We aren't quite there yet in Georgia, but when we reach that point, we will follow those guidelines as well. But we look at the comprehensive positives, both the PCR and the antigen, and those are on our website as well, but they are followed up just like any other positive.
With that said, do you believe that positivity rate on just the PCR test has any use anymore?
We look at that by county, combining both, but they are right now calculated for the PCR. If you look at what's happened, actually, it's been interesting over the last week or so. The number of tests have gone up dramatically, and our percent positive has declined, even though we know we're having increasing cases. And what that is this Thanksgiving increase in testing and a demand for testing that I briefly talked about, that it's important that we don't get a false sense of security, that we get tested and then go off traveling. Many people will have traveled to other areas of the country with much higher rates of COVID, and again, the concern is always that they may bring that infection back. So I think it's important to look at that. We are looking at that as part of our comprehensive approach to how we graph that, and we are following the guidelines of CDC and other states to see how we incorporate those two measures together, not separately, but comprehensively look at it. I do want to say actually one more thing about the vaccine. Once the vaccine is rolled out, initially to vaccinate the vaccinators, but also for the most vulnerable, we can't stop remembering these basic public health measures that must continue until everyone is vaccinated. And I think, again, there's this false sense of hope that, oh boy, in December 15th, we're going to get this vaccine and people will start getting vaccinated, and we can just forget about wearing a mask and socially distancing and washing our hands and all the things that I know everybody is tired of hearing me say, but we have to continue that throughout the whole vaccination campaign, which will likely go through much of the spring and summer. And I am confident by this time next year, we will have we'll be in a much better place with a state that's vaccinated, and I hope we'll have the whole pandemic more under control at this point, not just here, but throughout the country.
Governor, just a quick follow-up. Sorry, I didn't know the mic was here, sir. You're doing a good job of getting the word out and getting the message of people to follow the 4 things for fall. but the airport management yesterday said they expect 1 million people to fly between now and this Sunday. How concerned are you that people aren't heeding the message and we will see a spike versus a bump?
Well, I think for the most part, I mean, it's kind of, we'll see after a holiday weekend. I know in my discussions with senior executives at Delta, I heard John Zeldin on the radio yesterday talking about the precautions and the sanitation practices that the airport's taken. People that have been traveling, you know, they're seasoned business type travelers and other folks. I don't know that we've seen, I mean, Dr. Toomey can correct me if I'm wrong, but I don't know that we've seen any problems with people traveling around the country and around the world. In fact, we've had, you know, Pat Wilson, Department of Economic Development, has been over to Europe several times on economic development missions following Dr. Toomey's guidance and testing regime before and after, and like there's been no issues with that. Obviously, when you got a lot more volume in the airport, you have the opportunity for that, which is why, you know, I said in my remarks, people have to really pay attention to socially distancing themselves if they're going through the airport. I think the airlines have done an unbelievable job on the way they're recirculating, filtering, and cleaning air and the surfaces on the airplanes themselves. Their employees have done a great job, so I'm not too overly concerned about it. I don't think it's going to be any worse than having a lot of people that were traveling, you know, over July 4th weekend or Labor Day weekend that were, you know, packing the coast or state parks or anywhere else. But people, if they follow the guidance, you know, we can help limit the spread. I mean, it's a virus. It's going to spread. We're not going to stop it until we get the vaccine, and we continue to just keep the fight for, you know, months ahead. But we can limit the spread if people are following the guidance. And I think that they'll do that in the airport. I mean, the airlines have policies on folks that are flying on their planes, and I know that the airports do as well. So I am cautiously optimistic for that. But I would urge, you know, any families that are traveling just to wear your mask, stay with your group, get in there, get out of there, and have a happy and safe Thanksgiving.
Governor, we got the latest White House Coronavirus Task Force report this morning. As you mentioned, it says we are doing better than many of our peer states. However, the trend lines look kind of ominous. And it says that now is the time to take greater steps toward mitigation. You haven't really announced any new steps that the state is going to be mandating. Why not? And do you think any are necessary? And what would need to take place for new steps to be put into place?
Well, I don't see any reason to take any additional steps right now. As I spoke earlier, we've got plenty capacity. We're in constant communication with our hospital CEOs. We're watching, you know, not just one number, but every number daily. Dr. Toomey and her team is, and I am as well. Our guidance is the same, you know, that it was in July. It's the same that it was, you know, before kids went back to school and after, when we didn't see any sort of an issue. And it's the same that we're seeing right now as we've had, you know, this little bit of an uptick. But make no mistake, we're not seeing a spike here right now, and we don't want to see one. That's why we're urging people to follow the guidance. You're also seeing, you know, other cities and states that have been locked down constantly that are also facing threats right now. Parts of New York, we're talking about San Francisco the other day. I mean, it's a virus. You know, we are taking the take in Georgia that we have good public health guidance, that Dr. Toomey and her team and a lot of other people have worked very hard on so that we can protect livelihoods, but also lives against the coronavirus. And that's what we're continuing to do in our state. And I don't think anybody on our team's at the point now that we need to consider anything other than what we have in place. Our citizens are the ones that solved the problem after July 4th, because people did what we asked them to do, and we're asking them to do that again going into Thanksgiving. If we do that, we're going to get on the backside of this little bump that we're seeing, and we're going to be closer to getting the vaccine distributed and people getting back.
All right, those are the updates there in Georgia. Just days before Thanksgiving, the governor there giving some updates and some guidelines this holiday season as we continue to roll on right here on News Now from Fox. Live look right now at the White House, at the Rose Garden. It looks like a beautiful fall day there today, and we're going to be taking a quick 2-minute break, but we are on standby right now for the official presidential pardon of the turkeys. We'll bring that to you right here on News Now from Fox when that gets going. In the meantime, everybody, we want to go and keep you in double box here, but we want to show you an exclusive that our very own Andrew Kraft got and gets you a little bit closer to corn and cob this year's 2020 White House presidential hopefuls for turkeys. Take a look at this. This is a great one.
We're joined by Ron Cardell, the chairman of the National Turkey Federation. Thanks so much for joining us here on News Now from Fox. We see corn and cob behind you. Can you kind of tell us what is the decision-making process like when picking the turkeys to be pardoned at the White House ceremony?
Well, it's been a fun trip. We built a special building for them that was not only heated but air conditioned because of the summer heat in Iowa. They came the first part of July, and we started 30 when they were 1 day old. So then over the course of the next 18 weeks or so, we would take one out because its feathers didn't look right, or we'd take one out because its personality wasn't cooperating or whatever. So it slowly got down to 4. And then this past week was when we made the decision of which 2 were going to come. It's based on their personality and their looks and all that sort of stuff.
So you kind of picked the best birds, is that what you're saying?
Oh, we picked the best of the best, you bet.
So kind of walk us through, like, you know, once the president pardons the turkeys, then what happens to them? Do they kind of go back to the farm or what?
No, these guys are 2 of the luckiest turkeys you are ever going to see. They, from after the pardoning ceremony, they are going to travel back to Iowa State University in Ames, Iowa, where they will get to live out their natural life. And there they'll be taken care of by vet students and animal science students, as well as offer an educational area for people to come visit and see how poultry and livestock are raised, and be able to touch and feel what they eat, be able to touch what they walk on, what their bedding is. And so they will be used for educational purposes for the rest of their natural life.
And also, I was kind of wondering, you know, what goes into this long tradition of the suite at the Willard Hotel, which you might be in right now, I'm not sure, but how did that get started, and you know, why is that such an important part of this tradition?
Well, it's fun. These turkeys actually walked up a red carpet when they came into the hotel. My understanding is it's been at different hotels over the years, but the Willard is great and very cooperative, and geographically it's very close to the White House, so it makes a ton of sense. And they're just it's a great facility to hold this, to be able to do things like this, and to entertain the press like we did earlier today.
And how do they get transported? Do you walk them? Do they go in a car? How does that work? Going to the ceremony?
Oh, to the ceremony, they will be transported in. They're placed in the equivalent of a pet carrier, like a dog carrier, and then they will be put in a van, and then obviously they have to go through security of some type, as well as do we, of course, and then we are allowed onto the grounds of the White House, and then they'll be removed from the pet carrier, and the ceremony takes place in the Rose Garden.
And will you be right up there with the president when he pardons them?
When he pardons them, yeah. My wife and I. My wife, Susie. Yep. Mm-hmm.
And kind of how does that work, just reaching out to the White House and with the Federation? Like, how long does the planning take? And kind of walk us through that behind the scenes a little bit.
Well, first of all, this is a White House event. And they invite the National Turkey Federation to participate and to bring the turkeys. And realistically, the plans for tomorrow started last February. So it takes a lot of time, it takes a lot of effort on a lot of people's part, and to make sure it all comes off, the birds get raised, that they get transferred here, transported here, and So no, it's a pretty much an 8-month process to get it done.
And you know, this is one of the, you know, traditions and institutions that is going forward despite the pandemic. It's really awesome to see that, you know, a lot of Americans have had to, you know, put traditions and put things aside this year, but this is still going forward, which is really cool to see.
Well, what I like to say is that this is a happy event. We've had 2020 has been a tough year, and this is a good event. It's a happy event. It covers all of Americans on an American holiday, and it's a feel-good thing in a year where there's been a lot of things that haven't quite been that way.
Yeah, can you kind of just tell us about you know, what the National Turkey Federation does and kind of their mission, and you know, what can you tell viewers about the organization itself? Okay,
the National Turkey Federation represents over 99% of the turkey industry. And by that, I mean from primary breeders to growers, to processors, to vendors, to suppliers to the turkey industry. So it represents all aspects of the turkey industry. And it's utilized based here in Washington, D.C. for the reasons of governmental affairs, regulatory issues, just to be in the forefront and close to rules and regulations that we all need to live with and deal with.
Have you noticed that, you know, I don't know if you can speak to this, but just turkey sales in general, you know, a lot of guidelines from our officials have been, you know, you shouldn't travel home for Thanksgiving, try to keep it small. Are people still buying turkeys this year for Thanksgiving?
Oh, yeah. Yeah. The concern that we always hear are, will there be enough turkeys? And the answer is a definite yes. Will there be the exact size turkey that you want? That depends on how early you shop and if you talk to the meat counter at your grocery store. But the point that I think I should make to everybody is, if there's ever a year to buy one that's way too big, it'd be this year, because leftovers are always great. And with the stay-at-home, not necessarily mandate, but situation that people are in, it's a great time to have leftovers. Freeze some, have them in a couple weeks, make different dishes out of them. It's definitely a year where, because people are staying at home, you might want some extra groceries in the house.
Yeah, and Ron, just lastly for you, I know you have to get going, but what's the naming process like? Is there, you know, a bunch of different options or ideas? How does the name get voted on for these two?
Okay,
birds?
the White House picks the names, because obviously you don't tell the White House what to do. And so this year, our local elementary school in Walcott, Iowa, I called them, and they had a contest in the school. The kids came up with several different names, pairs of names, and then the entire school voted on them. And the school came up with the names of corn and cob, very appropriate for Iowa. And then the National Turkey Federation, that was one of the pairs of names that was submitted to the White House. And so Walcott elementary school kids were great, and they got the name the National Thanksgiving Turkey.
That's so great. Well, Ron, we appreciate you joining News Now from Fox today. Maybe we can tilt down the camera just to see the birds a little bit more there before they get pardoned by the president. Oh, yeah. Beautiful birds right there, yeah. All right, corn and cob there, and Ron Cardell from the National Turkey Federation. Appreciate you taking the time today, sir.
It's good to see you. Thank you.
And our thanks to Andrew Kraft there for filing that interview as we build up to this moment live right now, right outside of the White House, as we are just moments away from the National Thanksgiving Turkey Pardons. This is a White House tradition like none other, and this year it'll be all about corn and cob, as they will be center focus for the presidential pardon. Also thanks to their Ron Cardell, who gave us that interview from the National Turkey Federation, the chairman there, and a sixth-generation turkey, corn, and soybean farmer from Walcott, Iowa. After today's pardoning ceremony at the White House, both turkeys will retire to their new home on the campus of Iowa State University. And here we go with President Trump and the First Lady, Melania Trump, about to give the official Thanksgiving tradition pardon away here.
Well, thank you very much, please. And I just want to congratulate everybody. The Dow Jones Industrial Average just broke for the first time in history 30,000. It's now, that's good. It's great for jobs and it's good for everything. And this is the 9th time that we set a record during the course of 2020, and it's the 48th time that we've set the record during the Trump administration, and there's never been anything like that. So I just want to congratulate everybody that worked so hard, the White House, but maybe most importantly, the people of our country. It's a tremendous achievement. The First Lady and I are thrilled to welcome you all to the beautiful Rose Garden, where the First Lady actually worked very hard on renovating it. It was 61 years. It was in rough shape. Very big job, actually. When you go to the wires underground, people have no idea how complex it is, but you've done a fantastic job. Thank you very much. And we're also very happy to have with us my daughter Ivanka and Jared and Theodore, Arabella, Joseph. Thank you very much for coming. They like the turkey. Thank you very much. On behalf of the entire Trump family, I want to wish every American a healthy and very happy Thanksgiving. We're here today to continue a beloved annual tradition, the official presidential pardon of a very, very fortunate turkey. Because Thanksgiving is a special day for turkeys. I guess probably for the most part not a very good one when you think about it. The first turkey to dodge the White House dinner table received unofficial clemency when President Abraham Lincoln's son, Tad, begged his father to spare his new friend. For the past 73 years, the National Turkey Federation has presented the national Thanksgiving turkey to the president, starting under President George H.W. Bush. These birds have received a formal pardon every single year. Today it is my honor to present to you this year's lucky bird, corn, and just in case we needed him, cob. Corn and cob. That's not too hard to remember, is it? These two magnificent gobblers were selected from the official presidential flock of 30 turkeys, some real beauties. They were raised by the chairman of the National Turkey Federation himself, Ron Cardell. Ron, thank you very much, Ron. Please stand up. Great job. Ron, thank you for being here, and your family, beautiful family, thank you very much for being here. Appreciate it. Like so many presidential flocks, this one started in the great state of Iowa in what can only be described as an act of blatant pandering. And by the way, I love the state of Iowa. These two turkeys sought to win the support of Iowans across the state by naming themselves Corn and Cob. After today's ceremony, these birds will retire under the care of skilled veterinarians at Iowa State University, a tremendous university in Ames. Once there, people of all ages will be able to visit them and learn about poultry science, veterinary medicine, and the noble American tradition of farming. We love our farmers, I'll tell you. And we hope, and we know that's going to happen, that Corn and Cob have a very long, happy, and memorable life. This year, our nation commemorates the 400th anniversary of the Pilgrims landing on Plymouth Rock. After arriving in the New World, the brave men and women of the Mayflower endured a bitter and dangerous winter, very, very dangerous winter. Many were sick, most were starving, and all were praying for a miracle. Thankfully, God heard their prayers. From our earliest days, America has always been a story of perseverance and triumph, determination and strength, loyalty and faith. This week, in a time that is very unusual, but in so many ways, very, very good, what we've endured and been able to endure with the vaccines now coming out one after another. It's an incredible thing that happened. One of the greatest medical achievements that this planet has ever seen. But it's time to remember that we live in a great, great country, the greatest of them all, and there's nothing even close as far as I'm concerned. Every American can be united in thanksgiving to God for the incredible gifts he has bestowed upon us, the blessings of family, community, and this exceptional, beautiful, and great country. It's greater than ever before. During this Thanksgiving, we extend our eternal gratitude to the doctors, nurses, healthcare workers, and scientists who have waged the battle against the China virus. And we give thanks for the vaccines and therapies that will soon end the pandemic. It's just such a tremendous feeling to know that they're coming, and they'll be coming probably starting next week or shortly thereafter. We send our love to every member of the armed forces and the law enforcement heroes risking their lives to keep America safe, to keep America great, and as I say, America first. Shouldn't go away from that, America first. We give thanks to the priceless freedoms that we've inherited, and we ask God to watch over and protect our nation and its people during this incredible holiday and in all of the years to come. We ask that of God. Once again, Melania and I wish to thank everybody for your incredible courtesies and also wish you a happy Thanksgiving. And now it's time for the moment of our guests of honor. They've been waiting, and in this case, he's been waiting for this. And bring him out. Look at that beautiful, beautiful bird. Oh, so lucky. That is a lucky bird. Corn, I hereby grant you a full pardon. Thank you, Corn. What a break. Okay, so you are an Iowa farm. I knew I liked you for beautiful. Happy Thanksgiving to everybody. Thank you very much.
And congratulations to Corn. They're the turkey, as it is now the official national Thanksgiving turkey, getting that pardon. And then we learned that, hey, if Corn cannot fulfill his duties this year, Cobb is the backup. Cobb is the other turkey that will get that pardon as well. They will not be on a dinner table. They will be going back now to Iowa, at Iowa State University there, to live out a long, nice life there. But great tradition always there at the White House. Corn and Cobb, the luckiest turkeys in America right now. Welcome everyone here to News Now from Fox as we continue to bring you all the live events that are happening across the country. And it's good to have some fun events, some cheerful events there after 2020 that's been like none other. I mean, all we have right now is like COVID-19, election crisis, and so much more. And it's nice to have a little fun event there every once in a while. All right, everyone. Live look at the Dow right here as the president riding high on the news of the 30,000 mark that was hit. Went just a little bit below that, but yeah, history in the making right here on News Now from Fox, showcasing you 30,000 points on the Dow as the stocks continue to rip right now. And we're going to take a short 2-minute break right here on News Now from Fox. Stay right here with us. We got more updates across the country in just a little bit. Looks like we also have right now an update from the Pentagon. This is live. Let's bring it to you here on News Now from Fox.
Here in the building, actually, that we provided for them. It allows for social distancing for 6 feet between workspaces, to include video teleconference capacities at the unclassified side and at the classified side. As you discussed, there will be many that want updated intelligence briefings and updated briefings on operational plans. Many of those, once again, by statute. One of the many changes over the last 57 years of the Presidential Transition Act is to allow the Department of Justice and the Federal Bureau of Investigation to initiate background investigations and security clearances many of the agency review team leaders. So many will come here with top secret clearances, investigated and adjudicated by the Department of Justice, reciprocated by the Department of Defense, which will allow them access to intelligence. They'll have access at the appropriate levels with signed non-disclosure agreements, because once again, the materials that they're going to review, once again, particularly if they're classified, many are not for public distribution or release, they'll be privy to and will respond to their queries, their questions, their requests for deeper dives, briefing materials, products, releases. In terms of the decision processes, we work in support of the Secretary of Defense for this operation. It is part of our alignment for a professional, efficient, effective, and transparent with the agency review team process, and we're committed to doing that while executing our national defense strategy. So we have prepared for this for quite some time, for 6 months. We are prepared to receive the agency review team. I believe that some will work in the building. I think some will do virtual. Some of the members are not in the D.C. area. We think we'll be communicating with them via video teleconferences, either at the secure side or the unclassified side, if that's the dialogue that they want to get into. And we're committed to both supporting our statutory requirements and to continuing our mission here in the department.
All right. We'll go to Scott from Fed News Network. Oh, I thought he handled the...
My outstanding question is, what is the level of approval from Mr. Muir, and what does everything have to get the Chief of Staff Patel's approval, the Secretary's approval? At what level do decisions to share information or work with the transition team have to be approved by the Chief of Staff or the Secretary?
I thought Tom's answered it there at the end there and saying that the goal here is to be professional, efficient, and transparent, and ensure that the team has the information that they need to be successful and ensure that our national security throughout this transition time is ensured. There will be decisions are going to be made on regard. I think there's some classification conversations that'll go into it, and I think part of it taken into account is the Secretary is in charge of the transition. I mean, the Acting Secretary of Defense is in charge of this transition. Tom is going to be the career official handling it. He's been working very closely with the Deputy Secretary on this. I think Tom, you said the Deputy Secretary has been ensuring that the workspace is correct and that the binders have been reviewed, is making sure that all has been done appropriately. I spoke with the Chief of Staff today, and he has assured me that Tom Muir is the lead on this, and that he's going to be working with Tom, and Tom is going to be the one working with the team today. The Chief of Staff reached out to the agency review team lead today as well to provide his contact information, let her know that if she needs anything, that she is welcome to reach out to him. His goal is to be the touch point for the Secretary and ensure the Secretary has insight into what's going on and to make sure that the transition is successful. Okay.
If I could just add in 2 quick thoughts of context. One is that we've been running a governance process in support of this, aligned with our policy for quite some time, as I mentioned. There's a senior steering group that meets monthly. In fact, we're probably going to increase that now that there's been an ascertainment, led by the Deputy Secretary and the Vice Chairman. So senior leadership in the department participates. I provide them updates every month about our current status of preparation, our plans, next steps, and the next meeting structures. We're also meeting with what we call the transition assistance coordinators. These are designated senior officials, general officers, and career senior executives in each of our cabinet agencies, each of our military departments, Joint Staff, National Guard Bureau, our Office of Secretary of Defense components. We meet weekly, just met Monday. And we discuss, and to include, the combatant commands as well, have a representative on this transition assistance coordinator process. We meet with them weekly, and we update them as to the status of both our plans, activities, next steps. There's where we're going to have the real discussion on deliverables, materials, next setup of meetings, scheduling senior leaders for interviews with the agency review team. We work these through our partners. So it's a collaborative governance structure underneath our policy structure.
All right. Let's go back to the phones. Scott from Fed News Network.
Yeah, good afternoon. So, the past few days, past week or so, we've seen really some of the largest numbers and spikes for service members being diagnosed with COVID-19. I'm curious, I realize that this is up to local commanders, but do you expect, I think you have about 60% that are open or don't have restrictions right now. Do you expect that number to go down as these cases continue to rise? And is the Defense Department as a whole considering any other sort of policies that might go into effect now that you have nearly 75,000 service members who have been diagnosed to date?
Scott, with the 60% number, what exactly are you referencing with that?
That would be the number of bases that are military installations that have eased their restrictions and gone green.
I'm not sure that number is exactly right, and if it was correct at some point in the recent past, I would expect that number, you're going to see an increase of facilities going to Charlie. I think the Navy has, across the board, has increased their level to Charlie. We've seen facilities, I think I mentioned Norfolk in the last week, facilities in the Northeast. So I think you'll continue to see that. Once again, that's going to be decisions based on local communities and the operational needs of the services and the bases. So I think, yes, we will see those closures go up. Back to the question on generally, will there be any additional DoD measures put in place? We feel comfortable with the levels that we've put in place in the past, and that we have weathered this relatively well based on the guidance that was provided back in February of this year. As Ken pointed out, the number one priorities of the department were to protect our people and ensure we continue to do our missions. And so those guidance that has been pushed out by former Secretary Esper and the continuation through the Acting Secretary Miller has allowed the commanders to make decisions they need to protect their forces. So I don't see any blanket changes in policy that are being considered. I think we'll continue to watch and let commanders make the decisions on the ground. And then we'll do things like we're doing here today, is to reiterate to our forces and to double down and let them know that take these measures seriously. There's nothing wrong with commanders and everyone stepping up to restate the need to wear masks, to do social distancing, to wash hands, and to follow through with those mitigation measures. And then at the second part, we're going to look to support the Operation Warp Speed and vaccination efforts, and hope to reach a point in the near future where vaccinations are out the door and people are being treated, and we start to see a different curve with respect to COVID. All right, we'll go to Nick from PBS. All right, not hearing Nick. We'll go to Jeff from Task and Purpose.
Thank you. Two quick questions. Will families and service members be required to get a COVID vaccine? And has Defense Secretary Miller responded to Bill Belichick's request that the U.S. confront Turkey and Azerbaijan over the war with Armenia?
Well, fortunately, I will say that there is a peace agreement in place right now between Azerbaijan and Armenia that appears to be holding at the current point. So we may be able to forestall having a summit between the acting secretary and Coach Belichick to discuss that. And then with regard to your first question, which I forgot already, please remind me, Jeff.
Sure. Will troops and families be required to get a COVID vaccine? Will it be mandatory?
I don't have information for you to share on that right now. I'm going to defer answering that question to when we give the vaccination update in the coming weeks, and we'll have a fuller conversation about what will and will not be required. But at this time, Jeff, I'm not going to be able to share that. All right, we got a couple more. Megan.
Oh, Jeff took my question.
Okay, the Belichick question.
Yes,
Okay.
that's the one I've been holding on
I know.
No, I do have a question. This was a little bit murky in your response to Tony and Aaron, but when was Acting Secretary Miller's last negative COVID test?
So we've kind of set the standard before that we're not going to get into every single negative test that a senior leader does. I can just say that in the time the secretary has been here, whether it's between testing prior to travel, testing as a result of the close contact that was reported, testing due to a White House meeting, he's been tested more than a half dozen times in the 2 weeks that he's been the Secretary of Defense, and I have no positive cases, no positive test results to report. All right, we'll go to the phones for the last one. Courtney Kuby.
My question was asked as well. Thanks.
All right. You have follow-up, Brent? All right.
Actually, do you have time for one question?
Yes, Barb.
I would like to ask the doctor something. So can you, for For people who work in this building, in the Pentagon, the issue of contact tracing is confusing to me, including reporters who work here. And I was wondering if you, or whoever the appropriate person is, I apologize if I'm asking. Well, my question is really this. So somebody is tested and they come back positive, and you might say to them, so who have you been in contact with in the building in terms of contact tracing inside the Pentagon? Well, most reporters never hear of any cases of positive because we're not told of positive cases in this building. How can you advise the news media to ensure that they have full awareness of who may be tested, who may be positive, so we're not inadvertently being unknown spreaders, asymptomatic, anything like that? Nobody's ever really explained it to us, and this is the opportunity for us to ask. How do we learn more about what's going on inside the Pentagon?
Sure. From a Pentagon perspective, we do have a very robust contact tracing program. But you're right, though. It relies upon reporting, good, accurate reporting, that if I am sick and I tell my supervisor that I was tested in my local community and that I'm positive for COVID, then my supervisor would report that into our operations center here in the Pentagon, which rolls that up to Joint Staff. From there, within 24 hours, our policy right now is to contact the person who is reported to be positive and then ask them who they've been in close personal contact with, particularly during the time period that they were symptomatic. And you're right, there are many people that are asymptomatic, they're tested and then come positive. And so we look for 48 to 72 hours prior to their, and oftentimes there's a little bit of lag in terms of testing, right? You get tested, you find the results 2 or 3 days later. Hence, the CDC guidelines ask for 48 hours before they were symptomatic, shows an opportunity to spread the COVID virus inside the workplace. So then we ask them who has been in close personal contact for more than 15 minutes. Now it's over a 24-hour period, less than 6 feet, without a mask on or with a mask on, and we identify those people by name. What helps is when they maintain, where they understand who they've been in close personal contact with, and oftentimes in a building this size with nearly 11,000 in the workplace most days, it's hard to remember who you've been in close contact with. And so we ask them to give us the names of those they're in close contact with, and then within 48 hours, we're contacting those personnel and asking them if they're feeling symptomatic, are they feeling sick, do they have a fever, have they, anybody in their family feeling sick, have a fever, showing symptoms, and then we ask them to notify their local physician and get tested. Here in the building, about a third of our workforce are military, about a third of our workforce are civilian, and about a third of our workforce are contractors. And so it's kind of a mixed demographic, if you will, for healthcare provision. And so we're relying a lot on local healthcare authorities. And then all the numbers that are positive on the Pentagon reservation, we report up through public health authorities, so Arlington County, Alexandria County, Fairfax County, PG County, Montgomery County. They're aware of any outbreaks in here. We do not, by policy and by process, notify folks, hey, there's somebody in this cubicle that was positive. However, if you're notified by a contact tracer that says you may have been in contact with a certain person that was in the building next to you more than 15 minutes in a meeting with you, we'll advise that person to get tested. Right now, the CDC guidelines does not require testing for asymptomatic, but I'll ask Dr. Payne to kind of
No, you did a great job. Almost an honorary medical degree there, Tom. No, we would not necessarily test everybody who has a contact.
So, for example, Secretary Miller comes in contact with a Lithuanian minister who later tests positive. Secretary Miller tests negative. You have no reason to inform, to tell people, including reporters that may have been near Secretary Miller, that they need to be tested.
I would say, a test is a test only at that point in time, and that's why we also recommend quarantine or isolation for those contacts, because the disease could develop over time.
Nobody ever tells you they're in contact with a reporter.
But let me because I think what Barbara's talking about is there's a chain. I think Tom hit on it there. It's contact, close contact is the CDC requirement, and then there's contact with someone who had contact. And so the question you're asking is, Why doesn't somebody tell you if you've been in contact with somebody who had a close contact?
I would like to ask that.
And I think that's not the guidance. That's not the CDC guidance, that the risk in that chain until someone is symptomatic or has tested positive, that chain is not there. And I would just say the other thing is Tom mentioned the process we have in place, I apologize, the bureaucratic process we have in place for notifying. But I think what you'll see, and people have seen the building, and is that there's the just general relationships of people in the building of if somebody tests positive, of reaching out to their coworkers and letting them know, reaching out to people that they have had close contact with immediately to let them know. I've seen that in cases recently where an individual may have tested positive, and they make it very clear because people want to know quickly, because the best way to stop the spread is to very quickly notify people. That's why we say if you have symptoms, don't come into work. Go see your doctor or your healthcare provider. The sooner the better, so that we can stop the spread. And so that we see that a lot happen in the building because we have a responsible workforce that understands the implications of having a number of tests here. So I'm just going to close up with a couple of final remarks, and then we'll let you guys out of this room. So I just want to share you, as I mentioned, we'll be back with some additional briefings on transition and on vaccinations in the coming weeks as more information becomes available. And so I'm sure Tom will be with us for that. And we'll have the appropriate people from DHA to come in and talk about the vaccination plan. So we've seen a lot of stories about the fact that with Thanksgiving, people aren't able to travel, people aren't able to be with families. And just a note of perspective for viewers and readers, and for those who are discouraged by not being able to travel this holiday due to COVID-19, and just ask you to remember that there are millions of military members who over the last 2 decades have missed many holidays in the service of the country, deployed across the globe in defense of the nation. This is not an ideal situation, but we're optimistic that with the progress of warp speed, the light is at the end of the tunnel. In closing, I want to reiterate why we're here, and that's to talk to our DoD personnel and our service members at home and abroad and encourage them to follow the CDC COVID-19 mitigation guidelines over these holidays. Take proper precautions with regard to necessary quarantines, wash your hands regularly, maintain social distancing, limit the size of gatherings, wear a mask, and if necessary, choose not to travel. And also, please make sure you observe local regulations. Finally, I just want everybody to remember that social distancing and hand washing are excellent excuses to get out of uncomfortable family conversations about politics at Thanksgiving. So just recommend everybody abuse those excuses often throughout the holiday season. And hope everybody has a good Thanksgiving. Thank you.
Happy Thanksgiving.
Good morning, everybody, or afternoon, wherever you're at across the country. I'm Daytona Everett. You're watching News Now from Fox. We're bringing you live, unfiltered, raw, nonstop news throughout the day. And have we had a morning out here in Phoenix, Arizona with News Now from Fox? We showed you some turkey pardonings, some heartbreaking news for this upcoming Thanksgiving holiday coming up on Thursday. We've got a lot more to show you. COVID-19 updates across the country. And we do have an update for you coming from the Mayo Clinic about COVID-19. They're advising against holiday travel. So we'll bring that to you, of course, here on News Now from Fox. But we're watching a live feed that should be coming up in the next 15 minutes or so. There was breaking news coming out of New York. 2 New York police officers were shot and injured this morning. They were responding to a domestic incident in Springfield Gardens, Queens. Some sources told our sister station Fox 5 out there that the officers arrived at a house just before 1 p.m. when one officer was shot in the leg. A second officer was shot in the arm. It wasn't clear if the officers were shot inside or outside of the house. So again, we should be getting a live picture of that soon. This is just kind of a live picture of Times Square right there in New York. Again, though, this shooting took place in Queens, in the Queens area, and we should be hearing from police officers, a press conference in the next 15 minutes or so. Until we bring that to you, though, we're going to send some of you off to a 2-minute commercial break just to kind of plug what we're doing here on News Now from Fox. We have a Twitter page that you can be following along with all the latest updates. The handle is @NewsNowFox. Go ahead and log on to Twitter, and you can see all of the latest headlines, all of our latest interviews. We've got some really great stuff on there. So 2 minutes, we'll see some of you. When you come back, you'll be seeing that update from the Mayo Clinic talking about COVID-19 across the country. Again, I'm Daytona Everett. Thanks for joining us.
Or Claire and La Crosse, you said. So if you could follow up, they can give you specifics on your area. Okay, next question from John Molseed. What are the challenges with the availability of reagents and kits for testing, such as the Roche Cobas 6800 and 8800? Are you expecting that to continue to limit the use of these systems, and if so, for how long?
Well, thankfully, we're actually in a much better place through coordinated efforts between the companies like Roche and Thermo Fisher and PerkinElmer, the laboratories, and with the assistance of Admiral Giroir and the federal task force. We do have much greater supply of the reagents for the in-laboratory testing than we did even earlier in the summer. So far, we have been able to manage that to manage the demand on our labs without falling behind. There is, of course, always concern when we're doing that many tests in a day. 1.5 million tests a day that we're running on average, and the ACLA, the public labs, of which Mayo Clinic Labs is a part, ACLA are running over 500,000 tests per day. So far we have all the reagents and plastics and things that we need to be able to continue to offer testing at that volume. We just keep a close eye and work in close collaboration across the industry to make sure that remains the case, just because it is putting a strain on the system to be sure to have to be running this many tests.
All right, thank you. This question comes from Tanner at WDAY in Fargo. With the popularity of saliva testing in Moorhead, and with some of that having the capability of being done at home, would you believe that would drive more people to test that way at home? If so, is it more of a benefit for asymptomatic people or symptomatic people?
Well, one of the real benefits of getting the testing at home is that, particularly if it's someone that's symptomatic, first of all, it's not only more convenient for the individual, it also prevents them from going outside the home and potentially exposing others to COVID if they do in fact have it. So there's great benefit for at-home testing for symptomatic individuals, both for them and for the healthcare system. But it's important there that if they are symptomatic and if they're positive, that they get follow-up with their provider to make sure that if they need more care, more intense care, that they get that care from their provider. For asymptomatics, there's also a great advantage in terms of we know that 50 to 80% of the transmission of this virus is spread by asymptomatic individuals. So identifying those without symptoms but that are in fact infected with the virus remains very important. So at-home testing could be even more effective in terms of preventing the spread by letting people know that they have it, even if they're not aware of it, so they can take the appropriate measures. That's where, of course, the challenge there is that is the more difficult scenario to be testing for the virus in terms of its detection. So that's why we continue to have to look at the performance of these tests and evaluate them as they're deployed to make sure they're doing the things that we need them to do for us. Saliva is another example. That's a specimen type that great strides have been made in terms of understanding if it's useful. It does appear that it is a good specimen source for detecting SARS-CoV-2, which was not known even earlier in the summer. It does certainly lend itself to easier at-home collection. The nasopharyngeal swab, which is the most sensitive specimen, clearly, if those of you have seen them, that is something that just can't really be self-administered. So having these self-administered tools for getting a specimen for COVID is really very, very helpful. Saliva is one. Another one that Mayo has been working on is the mid-turbinate nasal swab, which does not go nearly as far back. It goes into the nose, but not nearly as far back, so it can be self-administered. Because the balance is we want to make sure that the specimens if they're easier to collect, but they're also not really where the virus is living in your body and therefore less sensitive, is a trade-off we have to watch against. And that's why Mayo has not been using some of the alternative specimen types like the anterior nasal swab, just in the nostril, appears to not harbor a great deal of the virus, and therefore a negative result doesn't tell you that much. So that's where we've been trying to strike the balance there.
All right, thank you. This one came in, someone texted me this one. So what would you say to viewers, listeners, readers of these reports from this session who are planning on using testing to make decisions about their Thanksgiving plans. So I've heard some people say, I'm going to get a test and then I'm going to have my family over for Thanksgiving. What would you say? What is the pitfall of that kind of approach?
Well, the one thing I would say is that unfortunately we don't have any single test available that can give someone a stamp of approval, if you will, that they do not have SARS-CoV-2 virus. There is no 100% sensitive test out there. So unfortunately, while a negative test might give you some reassurance that you don't have the virus, it can't be used to consider yourself scot-free, if you will, or free and clear of the virus. So I would think, number one, just to be mindful on the Thanksgiving holiday about having gatherings, particularly if there's individuals in your family or in your close circle that might be at risk for more severe illness with COVID, like those with underlying health conditions. And that if you use testing, that you understand what it can and can't tell you, it might give you some measure of security that you're not going to be exposing people, but you still have to mask and socially distance and do those things if you want to be sure that you're not going to be spreading the virus, even if you had a negative test.
All right, great, thank you. So just a note for journalists, some of you are submitting questions in the chat that are specific to a location. I'm going to ask you to submit those to newsbureau@mayo.edu. Dr. Maurice is a very smart guy, but I'm pretty sure he doesn't have stats memorized from every region that he serves. So we're going to let him off the hook for that. Here is a question that does have some elements of a regional specificity, but there are some other things that you could perhaps address. So this comes from Barron, Wisconsin. As you know, we are wondering how test results are tabulated and shared. Is a percentage of positive tests available from Mayo Northland campus? Well, we can get back to you on that, Robert. And then he says, we're also aware that the National Guard has set up testing in Barron. So we're wondering if the need for testing exceeds capacity in that part of the state in Wisconsin.
So, in terms of the reporting, they're actually, for all the COVID testing, one of the things that we have had to do is build the electronic interfaces from the tests. From the test to a variety of different health agencies, both at the federal and state level, including the state of Wisconsin. So we do transmit those results so they can be distributed and used for public health purposes. The collection centers, and we've done the same in Minnesota, where working with the Minnesota Department of Health to set up collection sites, sometimes using the National Guard as well. That is one of the main bottlenecks right now, is actually individuals having access to a facility where they can have a test performed, or a specimen obtained, I should say. To date, we have been able to have sufficient capacity to run the tests within 48 hours of their receipt. I mean, that's really the goal here, is to get the testing done as quickly as possible. So we have been able to stay on top of that. And if it is, I'm not sure about the Barron facility in the National Guard, but if it is supported by Mayo Clinic Labs, what we do is we actually, if the local capacity for testing is exceeded, those tests get routed to Rochester, where we have the high throughput automated machines to run the testing.
All right, great, thank you. This question comes from Tim at Fox 9 in Minneapolis. Dr. Maurice and Mayo Labs were instrumental in developing serology tests last spring to test for immunity. The emphasis at the moment seems to be more on PCR tests. The question is, going forward, as more people get exposed to the virus, is the serology test going to be more important to allow people to return to work and school?
Well, it's interesting. The serology test will be of growing importance, and I think for two reasons. Number one is to understand who's been exposed to the virus and mounted an immune response, and how prevalent has the virus been in any community. It will probably also be helpful in terms of vaccine distribution, understanding who might need to be vaccinated when those vaccines are in limited supply. In terms of the root of your question, though, is, can the antibody serologic test be used to give someone, if you will, an immunity passport, which is one of the terms that's been used to say, well, this person's immune to COVID. That is still yet to be determined. Even with the vaccines that look like they have a high effectiveness, now there's 3. We don't know how long that immunity will last. So I don't know. I think getting serologic testing will be an important part of that, but I don't know yet if we can really say that having a positive antibody test for SARS-CoV-2 is going to be equate with a clean bill of health in terms of catching or spreading the virus.
All right, thank you. Another question from Sasha at ABC. On the issue of staffing shortage, can you elaborate further on Mayo bringing retirees to staff hospitals and redeploying staff? And if you would prefer that we defer that question, we can do that, but I know you're probably aware at a leadership level.
Yeah, sure. I can speak to it. And I think if there's specifics that you need, you certainly can follow up with Ginger or Suzanne. I think a lot of people were taken aback by the report in the press of 900 staff, Mayo Clinic staff, being diagnosed with SARS-CoV-2 recently. That's still, I think for that number, it's important to remember that that includes both employees that are working on our campuses as well as those who are working remotely. And actually only equates to about 2% or less, somewhere around 2% of our total employee base here in the upper Midwest. That being said, clearly the concerns are that we have sufficient staff to care for our patients, and the number of patients who have need care for COVID has required that we move staff around, redeploy them, and that's on the lab side as well. So we actually had the redeployment, which we had put into effect earlier in the year. We had allowed some of those individuals to go back to their regular duties, but then we had to ask them to come back and work on COVID testing because of the surge in demand. And it's been the same on the practice side. I can tell you that at Mayo, these are all highly coordinated so that we know who's available to move to different areas and also understand the impact on other areas of the practice. And I do think that might be included calling back some individuals who have unique skill sets who have retired from Mayo but who have said they would make themselves available. But I can't speak to the specifics on that. I can tell you amongst our active workforce, we have plans for redeployment of staff to meet the needs of our COVID patients, and those have been in effect.
Yep, and I can share a little bit on the retirees. So we do have retirees who are recent retirees who have maintained their credentials, and some have been called back to do things like man phone lines. We have a COVID phone line for our staff as well as for our patients. So they're doing activities like that so they can free up those nurses for patient care activities. So that's what we're doing there. Clarification on the 900 staff, just so everybody knows, once they do test positive, they are not still at work. I can promise you that. And let's see here.
Yeah, and I think the other thing, the important thing, Ginger, there to emphasize is that for all of those individuals, we have an occupational health workforce that examines those cases to determine if it was community acquired or at work acquired. It appears that over 90% of those are being acquired in the community. So again, it's a reflection of the activity of the virus in our community. And the other thing is just to really reassure patients that it's still safe to come to our campuses for care. We are taking every measure to make sure that's the case.
Yep. Less likely to get it as a patient than you are in the community. Yeah.
Indeed.
Okay, a question from Tanner. If it's an at-home test, does that mean that people would possibly wait longer for results, or does it take about the same time?
So it depends on the at-home. So the at-home collected tests, which are sent in the mail, still are going to have around the same turnaround time as for something that's done at one of the testing collection sites. So because it will still be sent into the lab and be run in the lab, and then the results returned back to the individual. Of course, that's why there's such a interest in these at-home tests that can actually be read at home, like the Lucira test and like some of the antigen tests as well. But those really have to go through, and it's important because someone asked earlier about the individuals reading these and individual variability, and that is actually part of the FDA EUA process, is to they will look at the ability, how easy these things are to interpret, essentially, that a layperson could do it. So, but that is, And we do know in terms of preventing the spread of the virus that the sooner someone knows that they have SARS-CoV-2, the much more likely they are to do something in terms of protecting those around them. So that's why the other real interest in at-home, actually self-read tests is that if you can get a result within 15 minutes, you're much more likely to act on it appropriately versus if you have to wait a couple days after an exposure, for instance.
All right, great, thank you. This comes from John Mulseed. What are you testing for to determine if someone is likely to experience a severe reaction and/or symptoms to the virus?
So basically, what you can do, so a lot of the illness with SARS-CoV-2, there's really two things that go on. Number one is, of course, the virus itself and where it infects individuals. And it goes down, it starts in the upper airways and it can go down into the lower, it does go down to lower respiratory tract, and it appears it maybe even can affect the cells that line our blood vessels. But a lot of the illness that we see in these severely ill patients is not just from the virus itself, but actually our body's response to the virus. So our immune system basically has to be activated to eradicate the virus, and not just the virus, but our own cells that are infected by the virus. It does appear that many of the...
All right, you're watching News Now from Fox. We have this update coming out of Queens with Mayor Bill de Blasio talking about those two officers that were shot. So we're going to listen in right now on News Now from Fox.
So good afternoon, everyone, and thank you. This afternoon's events in the 105 precinct serve as a stark reminder to the dangers that New York City police officers are facing on the streets every day. I'm joined here by a number of people, notably Mayor de Blasio to my left, Dr. Eli Kleinman, who's here somewhere, our chief surgeon, First Deputy Commissioner Ben Tucker, Chief of Department Terrence Monahan, Chief of Patrol Juanita Holmes, Pat Lynch, President of the PBA, and Dr. William Nugent of the Jamaica Medical Center. First, before I turn it to the mayor, and then I'll go into remarks, as always, I want to thank the doctors, the nurses, and the incredible staff here at Jamaica Medical Center for their incredible work with our two officers. Mr. Mayor?
Thank you. Thank you, Commissioner. I want to say that also, Jamaica Hospital Medical Center has really taken care of our officers today and really been great to their families as well. I want to thank them. I want to thank everyone who is here to support our officers. Special thank you to the Borough President-elect of Queens, Donovan Richards. Commissioner and I spent some time with some of the family members. And thank God, the most important thing to say up front is thank God our two officers are in stable condition. Thank God they will pull through. They have serious injuries, but ultimately they're going to be okay. And there was such a feeling of relief among the families to know that. But let's talk about what happened here today. Here you have officers who do the Lord's work. They protect survivors of domestic violence. They go into some of the most volatile, difficult situations that you could possibly imagine, some of the most difficult work that any police officers do. They do it to protect innocent people who have been victims of abuse. And here we have a situation where a woman was in danger and these officers went to protect her, only to find themselves in harm's way immediately. Thank God they're going to pull through. But I want to emphasize, when it comes to protecting these innocent people, we depend on our officers. We need to be thankful for the work they do. Domestic violence in particular is so difficult, so unpredictable. And yet we have officers who step forward and say, I'll take on that job because I want to save lives. And today they saved that woman's life. I want to be crystal clear. Because those officers were there, that woman is alive. And I say God bless them. Thank you, Commissioner.
Thank you, Mr. Mayor. So what we have again is preliminary at this point in time. I want to mention to everyone that we have a 41-year-old woman who walks into the 105 Precinct Station House sometime this morning to report a domestic violence incident that took place last night. At approximately 12:40 p.m. this afternoon, she reports back to her residence with two domestic violence officers. The location is 145 86th 179th Street here in the 105 precinct. At the time that they entered the house, the suspect was not at the residence. We believe that the officers and the victim in this case were there approximately 6 minutes. At that point in time, the subject returned to the residence, walks in the door of the residence, and begins shooting at the two officers. That occurred at 12:46 p.m. After immediately opening fire and shots exchanged, both officers are struck and injured. One in the right upper thigh. He has a fractured femur and is undergoing surgery. The other officer was shot at least one time, and we believe at this point in both hands. Both officers, who have nearly 14 years with the police department and nearly 6 years with the police department, respectively, are awake and in stable condition here at Jamaica Medical Center. Again, both require surgery for their very serious injuries, and we're hopeful for a full recovery. The suspect in this case, identified as 41-year-old Rondell Gopi, was also shot. It is undetermined how many times at this point in time, and was pronounced deceased at the scene. Multiple guns were recovered at the scene belonging to Mr. Gopi. The female victim in the case was not injured as a result of the incident. Before we open up for very brief questions, Pat, you have any words?
You know, this is a perfect example of, once again, we're saying here we're fortunate, we're lucky, we're glad when we got here to the hospital, but let's not forget that we're here at this hospital. And those that disrespect police officers, those that want to say, well, let's defund them, let's take them out of every different type of job. Here's an example. It's an example of a domestic dispute. It's an example when the police officers walk in, they get shot at. What would happen if the police officers weren't there? What would happen if we didn't have enough of them to cover all the radio runs? What would happen if a social worker was there and the police officer wasn't? So sometimes in a college classroom, sometimes in a council room, sometimes on a Zoom conference talking about policing, it seems awful easy to say, here's the script and here's what we'll do. What we see here today and police officers that surround us see all the time, there is no script. We can't be removed. We need to be there. And remember, they called us to go there. And because these two police officers put themselves at risk, professionally went to that call, there's no one else dead. The complainant's not dead. The police officers are injured. And fortunately, the person that tried to take us in a situation where you'd think it would be okay, shot at us. And unfortunately, we have to live with it. But fortunately, he'll hurt no more.
So, Terry, I think you have pictures of the two firearms that were recovered. And with that, we'll take questions.
What can you tell us about this person's status to carry a firearm, and what can you tell us about his job and criminal history?
Yeah, he, to our knowledge at this point in time, and again, this is very preliminary, based on the information we believe him to be who he is, no criminal history, and a licensed firearm handler, and currently working as a peace officer.
For CUNY?
Correct.
He does not have an arrest record then?
Not to our knowledge, but it is preliminary. Rocco?
Four previous calls to that house was listed by the citizens. What came with those, and how was he able to discuss?
Yeah, my understanding here, Rocco, is that you're correct. There were prior calls to that house. That'll be part of the investigation going forward, why he was still in possession of those guns and what happened to those prior cases. I don't think I gave a number. If I did, I know that there were prior domestic calls. How many will have to be part of the investigation.
Commissioner, was he known to have any sort of mental health problems beyond the obvious?
That's all part of the investigation. That has come up, but it's extremely preliminary, and we'll have to vet that out. That I do not have. What we know is the officers arrived there at about 12:40 with the victim of the domestic violence. They enter the residence, and after about 6 minutes, he comes into the residence and starts shooting. Whether he was laying in wait or just happened to arrive at that time will be part of the investigation. Almost instantly, he walks in the front door and starts shooting at our two officers.
How many weapons did he have on his person?
We recovered 2 weapons at the scene. This will be the last one. We recovered a 3rd weapon that he owns not at the scene. Thank you all, and happy Thanksgiving.
You're watching News Now from Fox. That was an update coming out of Jamaica Hospital in New York City. You saw Mayor Bill de Blasio out there. The latest on this case was that two New York City police officers were shot. They are in stable condition, so that's good news. This was a domestic violence incident that they were responding to, and they were immediately shot by that person involved. The investigation is ongoing, but again, good news coming from the hospital right there that those two police officers are in fact safe at this point in time, still in stable condition, being treated at Jamaica Hospital in New York City in the Queens area. So we'll continue to follow that developing story. As you saw from the police commissioner, it still is an ongoing investigation as to what exactly the motives were from that man who was involved in that domestic incident with the woman that those two officers were protecting. Again, you're watching News Now from Fox, where we're bringing you all of this live, raw, unfiltered content. All of these feeds are coming from our sister stations across the country, from New York City to right here in Phoenix, Arizona. So we're happy to have you here on this Tuesday afternoon. We've got a few things to get to. We've got COVID-19 updates from across the country right now, but we're going to go over to California, where Dr. Galley and other health officials out there are speaking about California's response to COVID-19 as those cases continue to rise. But another subject that is really being touched on by all these health officials and governors from across the country is the vaccine, what distribution is going to look like going forward. Several of them highlighting December as a possible distribution date for certain people. First, we're going to send some of you off to a 2-minute commercial break. When you come back, you will see that update coming from the beautiful state of California. Thank you so much for joining us. And we'll take that break, and then you'll come back after that.
On our hospitals, and this is something that we all have agency and responsibility to change. So as these rates of transmission continue to get stronger, I know California will too. So with that, I'll turn it back over and take any questions waiting. Thank you.
John Wolfolk, San Jose Mercury News.
Hi, Dr. Galley.
Hey, John.
Could you talk a little bit about, I noticed that in the Bay Area, San Francisco, Marin, and San Mateo counties, no movement there on your tiers, and wondering, I think San Francisco actually had feared they might go purple as early as Sunday, and that didn't happen. Do you have any insights as to what's happening in those Bay Area counties that's keeping them kind of islands in the urban parts of the states, it's not being in that purple restriction area?
Yeah, so I think each county has a slightly different story. I'll remind you that just a couple weeks ago, San Francisco was in the yellow tier. So let's not make any mistake. They've seen a significant surge in cases, and we believe that some of the tools that they put in place will be helpful, and we hope to see them hold steady where they are, but we're fully prepared that they may not. And I do think we've seen it from the beginning that certain communities, certain counties do take some of the guidance more to heart than others, and those are exactly the tools that can help us stay not just in red, but to get down farther. I'm not sure exactly if that's what's going on in those counties, because certainly they're surrounded by other counties with similar attention to detail on these COVID precautions that are already in purple. So we'll see, but I do commend them for continuing to sound the alarm, to communicate effectively through their own public health leaders and local leaders, but also community leaders. I think there's a number of healthcare professionals that I know are sounding the alarm in and out throughout the Bay Area and in those counties in particular, and that will, of course, make a difference. So, whatever they have there, I hope we can continue to spread that throughout the state, stop this surge, and get people not just to hold steady where they are, but hopefully to see these trends turn around and begin to reduce as well.
Ron Lynn, the Los Angeles Times.
Hey, Dr. Galley, thanks for taking our questions. Really appreciate it. I have several quick hit questions for you. Based on the current trends, do you suspect that the average number of daily deaths by Christmas will be worse than the greatest peak in the summer? The University of Washington's IHME model forecasts the cumulative death toll in California by March to be double what it is now. Do you think that's plausible? LA County is being hit horrifically hard by the pandemic. Do you think some kind of modified stay-at-home order is prudent for LA County? Finally, do you know whether the surge in Imperial County has begun to require hospital patients to be transferred out of the county, and are other counties in this position? Thanks so much, Dr. Galley.
Yeah, no, I'll try to go through them all as I remember them. I think that certainly the numbers of deaths will likely go up, and will likely, just as we are exceeding our highest ever numbers of cases and beginning to see our hospital systems pressed with COVID beyond where they've ever been pressed before. The idea that the numbers of deaths could exceed where we've been before is also indeed real and true, and part of the reason why we want California to be a state that exercises its alarms, its emergency brakes, well in advance of needing to see the pictures of hospitals that are overwhelmed and death numbers higher than we've ever seen before. And that's part of why we have taken the actions that we've seen and taken already. We also know that, just like you're mentioning the various models that have predictions for March, that the models have been proven wrong before because Californians come together to prove them wrong. They do things together, like follow the guidance for not gathering around Thanksgiving, looking for alternatives, making some decisions that we probably have never made before to stop the surge, that those are exactly the things, even if they don't turn things around in the next 10 days, they will certainly be the tools that allow us to turn things around for the beginning of next year and even towards the end of December. So when people ask me about the models and say, what do you think of this model or that model? I would say the model is based on inputs from today, based on our actions that are happening currently, and we have a decision collectively to change those and change the story, change the future of where we might end up. As it relates to Los Angeles, this is where I live, this is where I had worked. I know many of the leaders here are taking this very seriously. They've watched the surge in cases. They've watched the impact on the hospitals in just a small amount of time. I'll tell you, statewide, I don't believe we've ever seen as many hospital admissions increased like we did just in the past 24 hours. And I hope, but don't expect, that it will be the highest we ever have. And LA is dealing with that in real ways now. So I think it's absolutely prudent for the public health and the elected leaders here in this county to be considering what comes next. I think they put out some clear definitions of what their triggers might be, and I know that it will be important that they discuss that together, give Angelino some notice, but really move with the decision so that we can turn this around quickly. And I will tell you, every day matters. We know that regions and states that decide to delay some of these hard decisions end up having more difficulty turning things around. It takes them longer. So I'm certainly sure that they're taking all of this very, very seriously across LA County.
Brian Melly, The Associated Press.
Hi, Dr. Galley. Sort of piggybacking on that question, Los Angeles, as you know, exceeded a threshold they had set for issuing a stay-at-home order yesterday, and they are probably discussing that as we speak about whether another stay-at-home order does seem imminent. Why is the situation so much worse in LA? And as the state continues experiencing this surge, what is the likelihood of another statewide stay-at-home order, and what would be the threshold for issuing such an order?
You know, I think there's a number of different differences across California's communities. We talk, and the governor says it so eloquently, that we don't live in the aggregate here. That even within Los Angeles, that I know quite well, we have communities that are really densely populated. We know that there's a number of communities where households are multi-generational, many individuals living together, and we have to acknowledge the role of household transmission. And I want to distinguish household transmission from transmission at gatherings. Gatherings are when disconnected groups, non-household members, are coming together. But we also know that a number of essential workers go and they might be infected at work. And then they come home and they do what is a very natural thing. They take off their mask, they take down their guard, because where else can you take down your guard if not with your family and loved ones? Those that you share a dinner table with, share a television set with, share bathrooms and bedrooms with. Those are the individuals that become at risk with an asymptomatic positive COVID individual comes in, spreads it to people within their household. So in Los Angeles, because of some of the unique and broad scale characteristics of how our communities are set up, you see a perfect sort of storm of where transmission can occur. And I think that is truly happening. We saw some of that begin with the gatherings around some of these incredible, important celebrations with the Dodgers and the Lakers. And then you have Halloween, and you have the sort of movement with holidays coming up. And so it's not really surprising to see in a place as densely populated as LA, with some of its unique factors and characteristics, to see this kind of transmission. But I think the next set of actions are going to be important. Statewide, of course, we're watching the same things. We are trying to be thoughtful and more targeted with our approaches. We know that a number of communities and people are fatigued and tired. We want to make sure that any actions we recommend really allow us to do the things that are low risk without as many limitations, while limiting things that are higher risk that we know, even though we miss them and want to be doing those activities, we should do without to get this under control. So as I said previously, we're looking all at that data all the time, multiple times a day, always looking to see when our data runs for cases are going to come in, so we can share, think about that information, share it broadly, and make thoughtful decisions, maybe not statewide only, but regionally as well.
Angela Hart, Kaiser Health News.
Hey, Secretary Galley, a two-pronged question for you. You sort of touched on part of it. California's tier system is supposed to help control the spread, yet as you just talked about, we're continually hearing all kinds of warning signs that hospitals are filling up and cases are growing. So can you just walk us through, is California's tier system working as expected, and help us square sort of some of what's going on with the case counts rising? And then the other prong of that question is, one thing we're hearing from the public health community is California still has a lot of work to do on masks. So does the state need perhaps a stronger enforcement stance on the mask issue in particular?
Yeah, no, thanks, Angela, for both of those questions. So, we always, and we said this on the very first presentation of the county, the tier system, or our blueprint for a safer economy, we said clearly what the rules are for moving a county forward, what they would be when a county needs to move backwards, and then in the condition where data, and we've seen this before, we know COVID goes from 0 to 60 very, very fast, that we had this emergency brake option, and we would move counties back faster than typical in the blueprint. And so that's what we did. Certainly, we all want to keep close ties on the data, on the conditions. And so, there's no perfect system under COVID. We are continually working to improve our systems, but we believe using that emergency brake function was an important thing to do. We think that it's available in California in ways that many states don't have that option. Often a state is waiting until they can clearly show how hospitals are overwhelmed, how hospital staff are, having difficulty being at all of the shifts that they're asked to cover. And we're in California. We have a tool in the blueprint and in our ways of working with our counties to sound that emergency alarm, pull that brake sooner than in other states. And I think that's in part because we've socialized our blueprint. People are familiar with our tiers and they can understand how we continue to use them to be targeted, yes, but to be decisive as well, especially because decisive actions are exactly what's going to help us stay in front of the situation with COVID.
Kenny Chow, KPIX.
Dr. Galley, thank you for taking our questions. I was taking a look at some of the numbers recently on the DPH website, and it indicated that there were about 1,500 ICU patients due to COVID. I know you've updated those numbers, but it also indicated that there were about 2,100 or so ICU beds available right now in the state of California. So doing just some quick math, that means there's a total of about 3,600 total ICU beds in the state. It's my understanding that back in March, there were somewhere around 7,300 beds total in the state. So how is DPH determining the number of total hospital beds? And then why are we seeing that such a big difference between 7,300 back in March versus about 3,600 right now?
Yeah, so a couple of things. Remember, we have always talked about our healthcare delivery system, not just to be available for COVID. If COVID was the only thing that they had to worry about, we'd be in a different conversation. But we continue to see people who have heart attacks or strokes, who are having emergency surgery and need to be in the ICU. So when you take the collection of need and covering that need, and I commend our hospital leaders for constantly saying we need to deliver care to all Californians, not just those with COVID. You see at this moment that we are continuing to deliver that care in its fullest extent possible. Back in March, many health systems preemptively canceled some surgeries. We encouraged people to stay home, and some people stayed home when they needed emergency care. We don't want to see that happen again. So we, of course, are very cognizant of our capacity, that we know where things stand, not just statewide, but frankly, county by county, community by community, hospital system by hospital system, to make sure that they have what they need to take care of the increasing number of COVID positive patients, as well as the patients with other healthcare needs. We do know that we can bring on additional beds, not infinitely so, but many more than we have today because of our efforts to plan around surge. We have spaces identified in certain facilities that can be brought on that with additional ventilators and other equipment and with the right staffing. And I often want to point out the staffing because they are often the rate limiting step. We need to protect our healthcare staff, make sure that they're healthy and supported so they can continue to provide the heroic care that they do for COVID positive patients and others, so that we can continue to increase our bed capacity as needed. And then we have our alternative care sites, which are poised and ready to be stood up. Some are actually being mobilized now. so that we are able to meet the demand for patients throughout our healthcare delivery system. So the numbers aren't an apples to apples comparison between March and now because of some of the factors I've mentioned. And rest assured, we are constantly doing what we can to not just ask people to consider modifying their behaviors to reduce transmission, but to take care, on the other hand, of the people who need care now within our hospital systems. And we will continue to partner with leaders across the state to make sure we can do exactly that.
Anna Ibarra, Cal Matters.
Hi, Dr. Galley. I wanted to follow up on what you and the governor shared yesterday about vaccines. So we know it'll be a while longer before vaccines are available to the general public. But wondering when that happens, how much are vaccines going to cost, including for people who are uninsured? Second, will health workers be mandated to receive vaccine? And three, can you talk a bit about how exactly manufacturers are deciding how many doses a state gets? Is that just based on population? Thanks.
Yeah, I mean, really all excellent questions. Currently, there is no consideration at the state level to require healthcare workers to get the vaccine. I think we have a lot to learn about the vaccine. We continue to evaluate it and really try to understand it. So at this point, that is not a decision that is being moved forward. In terms of the cost of the vaccination, like so many essential things here in California, we're working with our insurance partners and vendors to make sure that it's covered and fully covered, that for those who are uninsured and those in the Medicaid program, they should rest assured that that's a place where the state is going to step in and support to make sure that the cost of vaccination in no way gets in the way of someone's decision to be vaccinated more than ever. But with so much healthcare, preventative care, we make this decision, and this is a very, very important one. As it relates to the allocation strategies from the federal government and the manufacturers throughout different states, as far as I know, it's likely going to be done based on state conditions led by our population and our size. So California should get a significant and even the highest amount of vaccination based on those distribution plans, but I don't yet have a firm picture of what that looks like. And remember, the timing is going to be important. Not each of these vaccines is going to come out at the same time. We aren't sure. We know that the Pfizer vaccine and the Moderna vaccine, although distributed very differently, different logistical considerations, they may be on a closer to the same timeline than, let's say, the AstraZeneca vaccination, which was announced just yesterday to be quite effective as well.
Kevin Stark, KQED.
Thank you, Doctor. Another vaccine question for you, this one on distribution. Can you clarify who in California is designated as an essential worker in terms of distribution? You have examples, but is there a list of workers who qualify? We're hearing some confusion about if teachers will be considered essential or not.
Yeah, so I think the first order of business for us is determining that 1A priority group, which is largely going to be focused on the healthcare space, individuals who work on our healthcare front lines and in some of our congregate care facilities. So then in the later priority groups, we'll be discussing other non-healthcare essential workers as well as the individuals who are vulnerable, often living in our congregate care facilities, as those initial groups to get to be prioritized and to receive vaccine or the option to be vaccinated. We expect that some of those decisions will be made over the course of the next many weeks after we get through that priority group 1A, and then will be posted to our website after all of the right conversations with our drafting guidelines work group, assimilation, and working with our community advisory group as well to make all of that public. But stay tuned. I think it's certainly a high priority, but the first order of business is to get that initial group set up, clarified, and we'll be doing that in the next many days.
Spencer Custodio, Voice of OC.
Hi, Dr. Galley. Thanks for taking our questions. Mine's kind of specific to the Southern California region. Now that the state's kind of had, some time to look at the new cases coming in this part of the state, are you able to kind of pinpoint where, the new transmission is coming from? Was it, just for instance, like shopping malls, is it private gatherings, indoor or outdoor restaurants? And then to also kind of follow up with something you said earlier, you said, the approach may not be statewide only, but regional as well. And I was just wondering, is there potential, so say if Los Angeles does a stay-at-home order, would there be potential for the state to come in and say, you know what, Southern California, the surrounding counties, San Bernardino, Orange County, San Diego, and whatnot, they will also be under some type of stay-at-home order to kind of prevent travel from one county to the next?
Yeah, Spencer, good questions. I think at the moment, as it goes to pinpointing transmission, we continue to hear from different counties, different things. They all mention that private gatherings is an important source of transmission, but not the only, and sometimes not even pinpointed as the highest source of transmission. Some mention gatherings in restaurants. In general, what we know is anytime you get together with individuals where your guard comes down, your mask comes off, you are closer than a few feet apart, there's a risk of transmission. And because of asymptomatic spread and the reality that most people who have COVID may not know it, you create a real risk. And I think so in Southern California and throughout the state, as those activities increase, we know that you're going to see transmission. And the hardest part, I think, for many people, and I've talked to some young people who have said, they didn't know they were infected and they worried they caused a loved one, an older loved one who's vulnerable to become infected. And that's absolutely a possibility for many of us, and why we've urged you to take some extra precautions during the weeks to come while we approach the period of normal family and community and friend celebrations to do those things. So I can't put my finger on the exact source of transmission. I know everybody would like me to be able to say, or any of us to be able to say, it's this and not this. The truth is, because of the way that people gather, any activity that allows for us to take our guard down essentially is going to become a potential transmission risk and a hotspot for transmission if it happens at scale in a specific county. With regards to the second question you asked, I think it's important that we communicate that back in March, we didn't have many tools in our toolbox. We didn't have the ability to think in a more targeted way, to apply some of our decisions in a targeted way. What the blueprint does in part is allow us to be targeted even in neighboring counties. But absolutely another way to be targeted is rather than say we're doing something statewide, but apply it in a certain set of counties that happen to be geographically near one another. So I don't want to say that that's exactly where the plan would go, but certainly in a period where we want to have all possibilities on the table, that we want to be targeted so that we apply these things in an effective way, but not too broadly. Certainly, certain things that you mentioned could be part of the plan, but currently that is not where we've certainly had conversations with those leaders in Southern California about doing.
Kevin Yamamura, Politico.
Hi, Dr. Galley. I wanted to ask, even in Purple Tier, you've allowed schools that are open to stay open. And I'm curious, as a doctor and the state's top health official, where you stand on school reopening and where the balance lies between minimizing risk to staff and ensuring student social, academic, and emotional health. And I have another question related, which is whether you've sent your own kids back to school, and if not, whether you would send them back. Thanks.
Yeah, I think great questions. I'm going to start with the second one. So my youngest one, who's not K through 12 aged yet, She does attend a child care center down the block from my house. I have good conversations with the people who operate that center, feel confident that they're doing following our guidelines and really reducing the risk, not just to my own child, but to all the families and the staff. And I'm very concerned and want to make sure that we do the right things for the staff. My other 3 children are in a school district that only offers distance learning options, and so they're working through that. I have a 7-year-old who's in 1st grade, a 5th grader, and a 7th grader, and they're all having their own trials and tribulations and getting through it in different parts of the house with dueling Zoom courses and people popping in and out. So, they've become accustomed, but I don't have the opportunity yet to be able to send those 3 to in-person education. But if the chance afforded us to do that, we would, because I believe that schools have many tools available to potentially be able to do that. But I would urge us to continue to look at how we keep our teachers and our staff and other staff at the school protected. We know that there are tools. We've provided a number of those tools, and I'm always interested to talk to a specific district or a set of districts about how we can create the lowest risk environment so that in-person learning can happen. But I will end by saying that this is a local decision, that I think the characteristics of each community are important to take into account. And by taking those characteristics into account, crafting a unique approach, probably using many of the same principles that all schools will use, but making sure that they're applied in a local and unique way, creates a more comfortable situation, and allowing us to have all of the tools like PPE and masks, making sure we follow many of the guidances that we put out, keeping things outdoors, making sure that we keep cohorts together so there isn't a great deal of sort of cross-classroom mixing, and making sure that those with underlying conditions or other health vulnerabilities are protected even above and beyond. So all of these tools give me confidence that working together, we can create lower risk environments in schools and, keep those that are open now, and look forward down the road as we continue to bring down case numbers, or as we look forward to bringing down case numbers, to creating more paths to address the concerns of our school community and make sure when the time is right that we bring kids back as much as possible.
Final question, Claudia Peschweda, KNX News Radio.
I have a couple of questions. So when you talk about the alternative care sites, I'm wondering where the state would get staffing for them if we start to see severe shortages throughout the state, and then, perhaps can't bring in people from other states because they're going through their own surges and shortages. Second question, since you live in LA County, there's been a lot of back and forth on suspending outdoor dining at restaurants, and critics saying that if you do that, you're going to just penalize the restaurants that are following the rules to prevent the spread, and you're going to drive up, at home indoor gatherings and just make things worse. I'd like to get your thoughts on that. And then just to follow up on the earlier question on mask enforcement, the argument I keep hearing against that sort of thing is, we can't go after everyone who ignores the rules. We need to focus on cooperation, stuff like that. But it seems like if people started getting tickets for not wearing masks, that a lot more people might comply. So I'm wondering why not try that. Thank you.
Yeah, thank you, and thanks for reminding me. I know sometimes because we get more than one question at a time, I miss a few, and I'll come back to one other about Imperial County in a minute. So thank you for reminding me of what I think was Angela Hart's other question. Certainly the question about outdoor dining is an important one. And as I said before, there isn't a single place where spread happens, but there's characteristics of activities where spread is more likely. And, outdoor dining, because it often happens with no mask, often bringing together people who maybe haven't seen each other in a while in close quarters, become concerning for spread. It is not the only area where I would be concerned, but I think that it's an important place to constantly look. The notion that potentially by limiting outdoor dining options that you'll just push people indoors, of course, we hope that that doesn't happen. We did with our limited stay-at-home order, not just limit public places or businesses, but we also said between 10 p.m. and 5 a.m. that household gatherings really shouldn't happen. And that we hope people will make the decision not just for themselves, but for their communities to not have those sort of gatherings for the next many weeks as we try to bring down these case numbers. As it relates to the masking question, remember the mask order, the statewide mask order is indeed enforceable, that some local jurisdictions have decided to provide exactly that, do fines. I'm not certain myself how many there are that are doing that and what their impact is, but that is an option on the table for locals to enforce. But as you have said, with all of public health and where we as public health leaders really lean on is that it is about education and cooperation first. And we hope that so much of the message, hopefully not just delivered by me, but delivered by you and your pens and what you write and what you communicate as well, can help break through to a number of people who maybe said, this isn't for me, but now maybe I'll do it for a little while to contribute to my own communities and reduce the spread. With a particular call out to young people, we often have called them the young and invincible. They're the ones who, frankly, don't feel like they need to wear the mask, feel like they're protected from COVID, and they may be right. Even if they were infected, they might not get sick. But the fact that they might get people in their community sick or people in their household sick, I think is an important warning. And that's why I emphasize that 40% asymptomatic statistic up to 40%. If that's really the case, and we believe that it is, it's important that we remind young people the importance of wearing a mask. So again, continuing to beat the drum of education, information, and delivering that strong message, but also recognizing that local officials, some have already expressed it, but can certainly use a fine, a ticket, or some other enforcement opportunity. Before we wrap up, I'll just end with, I know one person asked a question that I failed to answer right away about Imperial County, and certainly we are watching those numbers closely. I'm not, I believe that on a routine basis, the hospitals in Imperial County do occasionally have to transfer patients out of their county for care. I'm not sure. I don't believe that if it has happened at all, it's happened to a significant degree as of yet, but it is certainly what we are concerned about and watching closely. Sorry, before we go, getting one question to clarify. Certainly, I think, as we always, I'm asked to clarify what has been gathering guidance and Thanksgiving guidance from health officials in Los Angeles County. As we've always said, our statewide guidance is where we expect the state to take account, except when local guidance is more restrictive. And so in the case of gatherings where a health official and the guidance is to not gather outside of your household as the guidance is in Los Angeles, that we at the state will say that those in the county, so in the county of Los Angeles, should certainly be following the guidance from the local county health official, in this case, Dr. Barbara Ferrer and the Los Angeles County Department of Public Health, that if their guidance is more restrictive, that is indeed the guidance that should be applied in LA County. We at the state have the unique responsibility and task to identify guidance that works statewide when it's applied statewide, and counties themselves, as they have for years and years, decades and decades, had the ability to be more restrictive than even the state. And if that's the case, as it is here in LA County, that those are the guidance that should be followed. So with that, I know we went for a full hour. I'm grateful for your attention, for your questions, and helping me do a bit more to clarify our message. In a period of...
All right, you're watching News Now from Fox. I'm Daytona Everett. Going to cut in really quickly there. Just a few takeaways from that press conference in California. Hospitalizations in California have increased 81% over the last 2 weeks. ICU admissions are up 57% over the last 2 weeks, and state health officials say that data show about 12% of cases end up in hospitals 2 to 3 weeks later. But again, they're putting all these restrictions into place, but they're talking about more of an educational approach rather than mandating it and enforcing it with police officers out there. Again, that's in California. That was Dr. Galley, the HHS secretary. So moving to a different storyline today, U.S. equity markets pushed the Dow to a new all-time high, surpassing 30,000. You can see right there. The S&P grabbed a fresh record as well. A couple of things that they're saying are kind of pushing the stock market up is vaccine optimism. We're hearing from the CDC that a vaccine will be rolled out in the second week of December. So that is providing a lot of, again, optimism. Also, U.S. home prices are down, driving this rally as well. Chevron, JP Morgan, and IBM are pretty much leading the way when it comes to the Dow. The president this morning saying at the White House that this is a, quote, sacred number. So crazy stuff on the stock market today. But speaking of vaccines, let's talk about it really quickly. We've got a couple of different COVID-19 updates. It looks like Governor Pritzker just got off of the stage, so we're going to bring that to you live here on News Now from Fox when we get that. In fact, let's tune in really quickly. I think that he is still talking right now. If not, we do have Louisiana Governor Edwards as well updating on COVID-19. So Governor Pritzker is not on the stage right now, but I think we're still getting a COVID-19 update out of Illinois. We're going to send some of you off to a 2-minute commercial break. When you come back, COVID-19 briefings from across the nation. You're watching News Now from Fox.
In the Senate, we are able to do some Zoom hearings. So I feel honored that all of the members of my committee in the Veterans Affairs, that you all were able to make it today. And I truly appreciate our ability in the Senate to continue to be able to hold hearings. And I want to thank all of you for being on today. I know it's the week of Thanksgiving, but I imagine most people are not traveling, hopefully. And I look forward to having this again and following up with the director. And truly, any member of the committee at any time, please feel free to reach out to me. Feel free to reach out to the director, to Dr. Hart. And I look forward to holding another one of these. And to all our veterans in our homes, please, if you're watching, please stay safe and hopefully have a good Thanksgiving. Make sure you're doing Zooms with your family and friends. And with that, I don't have a gavel. So with that, I will just adjourn the hearing. And again, I appreciate all your time and efforts, especially during Thanksgiving week, of being available and coming to the hearing. So thank you all very much. And the hearing is adjourned.
Thank you, Senator.
Okay, so we're going to move from that event really quickly and go out to Louisiana, where they are talking about COVID-19 as well. I'm sorry, this is, yes, we're still in the state of Louisiana, so let's listen in right now.
In place, because what we cannot do is overwhelm our capacity, our hospital's capacity, I should say, to deliver care. So if we're going to be successful, and I believe we will, we have been 2 times before, we all need to do our part. Every day, households need to stick together, reduce interactions with others outside of their households whenever possible. Activities that do take place should happen outside as opposed to inside. We know that the virus spreads more easily indoors, and in fact, the odds of catching the coronavirus are about 20 times higher indoors than outdoors when you have the same activity taking place. In addition to the colder weather that's going to come over the winter, we're expecting rain this week, perhaps starting as early as tomorrow night, but certainly by Wednesday and staying with us for Thanksgiving and the few days after Thanksgiving. And so even if you have already planned the safest possible event at your house around Thanksgiving, intending for that to be outdoors, there's a good chance that you're not going to be able to do that. And so you have an opportunity now to adjust your plans yet again and make sure that you don't have people from outside the same household coming together, multi-generational family members coming together. That virus doesn't know and doesn't care whether the person that you are going to spread it to is a relative. Doesn't know, doesn't care whether they're 80 years old or they have high blood pressure or diabetes. And so we have to be extremely careful with this. And if you want to have the best possible Christmas in your family, where you're not seeing loved ones in the hospital or potentially worse, then you really need to do this now. And not just at Thanksgiving, but every day, is be extremely careful. The next few weeks would normally be the time for holiday parties of all sorts. Office parties, block parties, family parties, parties of different associations and so forth. Holiday parties are a recipe for disaster right now. Nobody likes a good party more than I do. Nobody likes a Christmas party more than I do. And like everybody, I'm upset that we've got so many people across Louisiana who've worked so hard and done so much good this year, whether it's with hurricane preparations or response or recovery or whether it's COVID and so forth. And boy, there just wouldn't be a better time to have a party to recognize them and to thank them and to let them have a little bit of fun than right now. But the fact of the matter is, it is too dangerous. And so I'm asking people to forego those parties. And another message that I have for the people of Louisiana is now there is a light at the end of the tunnel. And I don't believe it's a high-speed train traveling our direction. I believe that in a number of months, we're going to finally start to put this pandemic behind us once we have received and administered enough vaccine. And we could start this next month in small numbers. And it's going to take a while to get to the general population like we need to. So this attention that I'm asking people to focus on this issue, I'm not asking you to go ahead and get in your mind that we're going to have to mask up forever and physically distance forever. And in fact, I think there's an excellent chance that next Thanksgiving will be among our best ever. And we're going to have, as we always do, so much to be thankful for next Christmas as well. And so while there's COVID fatigue, and I know that it's real, it is also real that we are looking for renewed emphasis, attention, compliance for a finite amount of time. And I hope that that inspires people to do what is required, knowing that they're not going to have to do it forever. But the next several months will be critical. Today, tomorrow, critical. Just need everyone to be on this. The holidays are about showing our love for the ones that we care about. The best way to love someone right now is by not giving them COVID. So like that says up there, pass the pie, not the COVID. That's our mission. That is the mission for everybody in Louisiana. We have to follow the common sense public health measures, these restrictions and mitigation measures that we are talking about. And it's not mysterious. We know that they work. They've worked before. They will work again, but we have to do our part. And the mask mandate is critically important. Staying 6 feet apart from those not in part of your household, incredibly important. Washing your hands, staying home when you're sick, and always taking care to make sure that we do what we can to prevent the most vulnerable from contracting this disease. Those are the people who are 65 and older. Those are the people with comorbid underlying health conditions like hypertension, diabetes, kidney disease, heart disease, obesity, and so forth. Yesterday was Public Health Thank You Day. So I want to thank all the people involved in public health at the Louisiana Department of Health and all across the state and all across the country. One of the reasons, and I mentioned this earlier, one of the reasons we should all do this is because we owe such a debt of gratitude to the heroic medical professionals who've been working so hard for many months now. And they're going to continue to work hard, but we shouldn't gratuitously make it harder than it needs to be. We should all do our part. Okay, so with that, I'm going to pause and take some of your questions. Yes, sir.
Governor, epidemiologists in Louisiana seem to believe we might be getting diminishing returns here with these restrictions because of a lot of things you mentioned, COVID fatigue and everything else. Are you concerned that the drop-off that we saw after some of the previous restrictions were implemented is going to be more gradual, and the implications that might have on hospital staff?
Well, you know, I'm concerned about an awful lot as it relates to COVID-19 and this pandemic, and there's not a decision that I have made that's been easy. There's not one that bring me any joy. I am convinced, however, that if the people of Louisiana will embrace these restrictions and mitigation measures, be patient and be selfless, and ensure compliance, that we're going to flatten the curve again. That's what I know. There are no magic tricks to be worked here. I mean, the only way you stop a surge is by these restrictions and mitigation measures. And so I think with the numbers increasing here and around the country the way they are, the sense of urgency that you see coming out of leaders in Washington now. I don't know if you saw the White House Coronavirus Task Force meeting the other day with the Vice President and Dr. Birx and others. If you listen to Dr. Fauci, everybody should understand that this is a very, very serious situation, and that we have to do our part in order to slow the spread. It's got to be a collective effort, and nobody should say, well, yeah, if 99% of the people do it, that's good enough. I don't have to personally do it. That doesn't work. That just doesn't work. We all have to see it as a common effort, that we all play our part and do our part. And look, if somebody had presented me another option, a better option about flattening the curve, I would have taken it. I know we have COVID fatigue here and around the country. If there was something other than wearing masks and physically distancing and washing your hands and staying home when you're sick and so forth, man, I would embrace it. It doesn't exist. That's why you hear this coming out of Washington and all the healthcare experts, how important these measures are. So let's do it and let's flatten the curve again. And I feel very comfortable that in several months, I don't know exactly when, whether it's April, May, or June, but in several months we will have enough of our population, I believe, vaccinated that we can start to put this in our rearview mirror. But between now and then, we have to do what is necessary. And I don't know if there's another surge after this one. I pray not. But we know we're surging now. So let's do our part. Yes, ma'am.
Are you planning to change the way
enforcement has been handled on some of these issues? Because obviously part of the problem is people haven't been following the previous guidelines that you set. So are you making any changes to enforcement?
Yeah, well, we're going to continue to work with businesses of all types and all of these venues to make sure that they understand what the restrictions are and what rules they have to abide by. Individuals and businesses can get more information on opensafely.la.gov. I think I got that right, huh? opensafely.la.gov. And you'll get more information. And will there be enforcement? Yes, there will be. But I'm going to say what I said back in March and every other time I've been asked about this. If the people of Louisiana insist that we enforce our way through this, we're doomed to failure. There are 4.65 million Louisianans. There are tens of thousands of businesses. And quite frankly, we can't enforce our way through this. We're going to be asking people to comply. We're going to go and do compliance visits, and we're going to respond to complaints. And where people refuse to come into compliance, you can expect enforcement. But that's not going to get us through this surge. It's not going to protect the health of our fellow Louisianans. It's better than not doing any enforcement. But we're going to have people doing this because it's the right thing to do. And they're just going to have to embrace it. Not that it's pleasant, but at the end of the day, these are people's lives that we're talking about. And we're doing our very best to strike the right balance between lives on the one hand and livelihoods on the other. And I will tell you, when it comes to the economy and to businesses and to employers and to employees, to livelihoods, the best thing we can do is put this virus behind us. Yes, sir.
Are the rules for temporary conditional permits for restaurants or bars operating as restaurants, do those remain the same?
Yes. Yes, and we currently have 372, there used to be bars. They've received these conditional restaurant permits, and now they're operating as restaurants. So there are 372 of those out there. Now, they're not a hybrid. They're not part of a bar and part of a restaurant. They operate as restaurants if they're operating properly. And they follow all the rules for restaurants. And for the other establishments that continue to operate as bars, they need to operate the way we've outlined here today. Yes, ma'am.
What are you doing for your Thanksgiving celebration? I know you have a son who must be coming home from college because LSU is going virtual for Thanksgiving.
Yeah, I have a son who actually lives here in Baton Rouge, and he will likely be coming home to spend some time with us. I will tell you that we'll stay in Baton Rouge at the mansion. We're going to have a Thanksgiving meal that will consist of the immediate household, and you know, we're going to give thanks because even during this pandemic, which has been so tough on people, even after 3 hurricanes that hit this year, we still have so much to be thankful for. God has truly blessed us. Thanksgiving is a day to give thanks, and that's important to me and to my family, and we're going to do it. But last year, I remember my 85, well, she was 84 at the time, year-old mother came. I still have 6 siblings, and they all came with their spouses and their children and their grandchildren. I don't know, 80 or 90 people, something like that. You won't be seeing that this year, and you won't see it at Christmas either. I hope and pray that if you're with me on Thanksgiving Day in 2021, you will see that. And I believe that you will. But between now and then, we all have to do our part. Yes, sir.
Governor, did you tell legislative leaders about this, new restrictions before you came out here today? And if so, what was their
feedback? I did. And first of all, you need to know that we routinely send data and information to the Speaker and to the President. And we have complete transparency on the data that we're relying upon because we update it every day except for Saturday. We also have sent legislative leadership and I think maybe everybody in the legislature, every White House Coronavirus Task Force weekly update that we get when we get them. And then this morning, in addition to those things, we presented all of these gating criteria slides to the Speaker and to the President, talked about where we were, especially in light of our hospital capacity, and talked to them about the need to go back to a modified phase 2 in order to flatten the curve again. They asked some questions, expressed concerns that to make sure that, for example, whether it's the Fire Marshal's Office or the Alcohol Tobacco Control Office, that we are working with proprietors and bar owners to the maximum extent possible so that they know what's expected of them and they give it an opportunity, if they're operating in good faith, and the overwhelming majority are, to come into compliance. And really that has been our approach throughout. I think that was a large part of one of the previous questions we got around enforcement. We have always been over backwards to try to make sure that individuals understand what the rules are, give them every opportunity to come into compliance, and then only after persistent shortcomings and really a refusal to come into compliance, do any real enforcement actions like citations take place. So that was one of the things that the President of the Senate mentioned in particular, and something that I reassured him our approach to that would not change. Yes.
You're watching News Now from Fox. I'm Daytona. We're going to cut in really quickly there because we promised you some updates from Illinois. So just to dive right into COVID-19 in Illinois, the Chicago City Council has actually approved a pandemic budget. That's Mayor Lori Lightfoot. This budget is going to be $12.8 billion for the year of 2021. One of the council members out there was kind of against it. This is part of Lightfoot's $94 million property tax increase as well. So Mayor Lori Lightfoot is talking right now, giving an update about COVID-19. It's likely she's talking about that budget as well. That's as 9,460 new cases have been confirmed in just Chicago, with 125 additional deaths also. These are the reported numbers for today. So let's listen in to Lori Lightfoot. She's live in Chicago right now. Again, you're watching News Now from Fox. Some of you are going to be going to a 2-minute commercial break. When you come back, you'll be hearing from the Chicago mayor. Again, we want to thank you for joining us. We're News Now from Fox. We're bringing you live, unfiltered, raw content all day, nonstop news, everything you want to hear, everything you should hear ahead of the holidays. And I'm Daytona Everett. Go ahead and give us a follow at News Now Fox on Twitter. I'm at Daytona News Now. We just want to thank you for joining us on this beautiful Tuesday. We're out here in Phoenix, Arizona. No matter where you are across the country, we got you covered.
Everyone, happy Thanksgiving, everyone. Be safe.
Alrighty, I'm going to bite my tongue on that because Mayor Lori Lightfoot is just stepping off the stage. So we will get that event for you and play it out in full here on News Now from Fox. But for now, let's go back out to Louisiana, where Governor Edwards is still speaking.
For the general population to go out and get their vaccine, and they can go to their health unit, their doctor's office, to a hospital, to a pharmacy, and get the vaccine. Understand it won't be one and done. Because you've got to have a second dose within 21 days or 28 days. It depends on which vaccine you get. And more vaccines may come online over time, and some of these things may change. And I don't want the talk about the vaccine, as promising as it is and as critically important as it is. Nobody's more excited than I am. I don't want to talk about the vaccine and the fact that we may have a few doses here next month to cause people to not pay attention to what is the imperative right now. That's why you hear Dr. Birx and Dr. Fauci, Secretary Azar, Brett Giroir, all of these people talking about bridging to the vaccine and actually doubling down on the mitigation measures now. Because that vaccine is not going to be here in the numbers that we need it soon enough to reverse these numbers that we went over today. It's not going to happen. Now, I do want to mention, since you asked a question about the vaccine, I have every confidence that when the FDA issues that emergency use authorization for a particular vaccine, that vaccine will be safe and it will be effective. And I hope that my fellow Louisianans will embrace the vaccine, because a vaccine saves 0 lives. Vaccination can save a lot of lives. But the vaccination requires the vaccine, and it requires an individual to receive that vaccine through an injection. In fact, through 2 injections. So please understand, the FDA has not cut out any steps required for the safety, to evaluate the safety and efficacy of these vaccines. And in fact, the trials, in terms of the number of individuals participating, were 5 and 6 times that normally you would see in a trial, because they wanted to make sure that it was safe. And they took steps to develop these vaccines rather than taking them sequentially and causing a long period of time to elapse. They took them consecutively at the same time. And they started the mass production, for example, of the vaccines while they were still going through the trials and trying to get the emergency use authorization. So that if that authorization comes, they've got vaccine to distribute and more being manufactured, and you're not having to start that manufacturing process from the beginning. So I really want Louisianans to embrace this and to understand that the vaccines will be safe and effective once the call goes out for these vaccinations to get started. Yes, ma'am.
On that subject, in terms of the cold storage, do we have enough as a state, or is the state going to have to put some money into creating the cold storage that's needed around the state?
No, we've identified the cold storage capacity that we need pursuant to our plan to administer, and that's the Pfizer vaccine, by the way. And it's a combination of cold storage capacity and dry ice. We're going to be in good shape there, and this is why you have to have a really good hard work going on well in advance, so that working with hospitals and universities and the private sector, you can identify all the cold storage capacity that you have, figure out where it is, how much of it is available for these vaccines, and then you plug that into your plan. And so that will not be a limiting factor in terms of receiving the vaccine. It makes it logistically a little harder because you have to receive it at those sites and then distribute it from there. They're still evaluating how long the vaccines remain stable once they thaw out and that sort of thing. But we're going to be all over that and make sure that when that vial thaws out, that is administered while it is stable. And making sure that people come and get that second dose as well. Dr. Cantor, did you want to say anything about the dry ice or the cold storage? Look, I want to thank y'all for continuing to cover this. We anticipate that we will not have another press conference until next week, and I'm not sure when we will let you know. As I mentioned a while ago, despite how difficult this year has been for all of us, our families, our individually and as a state, there's a lot that we should be thankful for, and that's always the case. So Thanksgiving is about giving thanks for the blessings that we enjoy, and I would encourage people to find ways to have a Thanksgiving celebration that is safe, so that we can be thankful for the blessings that we have. But we have to be mindful of this pandemic. And there are dangers lurking if we insist on having celebrations around Thanksgiving or Christmas or New Year the way we've done them in the past. And so I just cannot more strongly encourage people to be patient. I know you're tired of this, but be patient and love your loved ones by making sure that you don't expose them to unnecessary risks. Be close to them through the phone and through FaceTime and other ways. And then let's look forward to when we can get back together without restrictions and mitigation measures, and we're all going to have good stories to tell, unless between now and then we're too risky in our behavior. And instead of telling good stories, we're going to be lamenting the fact that we didn't do what we were asked to do. And that some of our loved ones won't be with us when the time comes to celebrate in person. When that next birthday comes, when that next Thanksgiving and that next Christmas. So I encourage everybody to do your part. You've done it before. We can do it again. And I'm not asking you to do this forever. There's a finite amount of time. I can't tell you exactly when, but in several months, I believe we're going to be able to start to put this in our rearview mirror, but it is not today. In fact, not only is it not in our rearview mirror, it is right in our grill. And it is a nasty, nasty situation here in Louisiana like it is around the country. So we don't have a moment to waste. Everybody has to do their part. And if we do, and I'm sure that we will, then we're going to get through this. So I have every confidence in the people of Louisiana. They have always inspired me by their goodness, their kindness, their generosity, and I believe that they will do it again. So let's work together. Let's save lives. God bless and thank you.
It states over 100 years ago.
All right, you're watching News Now from Fox. I'm Daytona Everett. We're bringing you all of the live, raw, unfiltered, nonstop news of the day. Right now, we're kind of heading into this COVID-19 stream, bringing you updates from across the country right now as vaccine development is really ramping up. We're hearing from the CDC that the second week of December, vaccine distribution could really start taking place right now. 1 second, we'll take you to the big board. 30,000 for the Dow. This is an all-time record. Great news for the economy. We love to see that. A lot of it is optimism over those vaccines, with Pfizer and Moderna stepping up and coming up with some really, really great numbers, efficacy rates that are looking good. So we'll be hearing that from each state, what distribution is going to look like. Speaking of state by state, let's go out to Colorado. We're going to hear from Mayor Lori Lightfoot in Chicago just after that. And just to break down a little bit of a schedule for you today. Very soon here on News Now from Fox, we're going to speak with a reporter in Dallas, Texas, talking about Thanksgiving holiday travel, which, you know, CDC is saying we don't want you traveling during the holidays, but if you are, let's talk about how to be safe. So we'll hear all about that from our very own Hunter Davis. We're also going to be heading out to Wilmington, Delaware, talking about Joe Biden, the latest, what he did today, naming his cabinet, and then what he's going to be doing this week as well. We're going to talk about death row in California. That's going to be later tonight with one of our reporters at our sister station, KTVU, out in the San Francisco area. Really, really interesting investigative report coming out of there, so be sure to tune in. And then again, talking to one of our Fox reporters in Wilmington, Delaware, talking about Joe Biden and what that cabinet naming, why it was so important, what we should be looking forward to for the president-elect and Senator Kamala Harris as well. Again, you're watching News Now from Fox. Some of you are going to be going out to a 2-minute commercial break. Others of you will be seeing this update coming out of Colorado for COVID-19. Thanks so much for watching. Follow us on Twitter at NewsNowFox. Hope you're all having a beautiful Tuesday.
Show an impact for about 7 or 8 days more, and then really demonstrable after 2 weeks. Now, why? Again, somebody catches the virus. You encounter somebody, you get it. It's usually 5 to 10 days incubation period until you develop symptoms. Usually within 5 days, but it can be 7 or 8 days. Then you're likely to get tested. Then it's another day or two until you get the results back. So that can easily be 9 or 10 days, even longer if it's asymptomatic or slower onset. And then, of course, the hospitalization numbers are also what we would call a trailing indicator. That means that they go up 2 weeks after, they would start going down 2 weeks after the changes were made. So I am confident that the steps that are being taken across our state with the counties that are now in red will help turn turned the corner on reducing cases and hospital load, which is now in a very critical phase with only 25 ICU beds in Denver, 3 in Weld, 5 in Pueblo, 14 in Colorado Springs, down to very low numbers of ICU beds available. Also, there's a crunch in some of these areas in the non-ICU beds too. But there is a timing factor there, and while I expect these successful data-driven interventions will work, it takes some time. So 4,150 cases today. This is a height of infection, and Dr. Hurley will talk about this, but the state models how many people are currently contagious because they're estimating there's a 9-day window the average person is contagious. Unfortunately, usually a day or two before they get symptoms, and then a week or so after symptoms are developed, usually until those symptoms resolve for several days. The newest statistic is that 1 out of 41 Coloradans are contagious right now. That is significantly up from the prior week. It is the highest percentage of contagious Coloradans that we've ever had. So not a time to be fearful, but a time to be very cautious, because if you encounter, and you might, 40 or 50 people at the supermarket, very likely that one of them is contagious, more likely than not. Hence the importance of mask wearing, social distancing. You are unlikely to get it in an encounter where you are both masked and it is, a minute or two, like you're buying something at a store. It's possible to contract it, yes, but it is unlikely if both people are masked and you're only in the same vicinity for a minute or two. More likely, longer periods of time together, indoors, close proximity, 15 minutes or more, and no mask wearing, which brings me to what that often resembles, and that is a family gathering for Thanksgiving. Generally around Thanksgiving, you might have a larger group of people, 10 or 15 people, indoors, generally not mask wearing, and that is the kind of environment where it is very likely that transmission will occur. So if you are having a Thanksgiving of about 10 people from multiple households, that gives you about a 1 in 4 chance that somebody will be contagious with COVID. And in that Thanksgiving setting, there is a very high chance that will spread to others. Maybe not to all 10, maybe to 3, maybe to 5, maybe to 2, but it is very likely to be transmitted. So I think ultimately everybody has to live with your own. You have to live with their own. We have to live with their own conscience, our own responsibility. If you are hosting large get-togethers from different households with grandparents and uncles and aunts, you ultimately have your own conscience if something happens to one of them. But I want to make sure you're aware of what those risks are, and hopefully taking the advice of the CDC, of us, of health professionals, of doctors, to avoid gatherings of multiple households during Thanksgiving. My family, 4, 5 if you include Gia, our 10-year-old 10-pound terrier mix, 4 humans, 1 dog. We'll just be having Thanksgiving alone. That's very difficult because our family's a very close family. I have not been able to see my parents now in 9 months. We normally see each other 3-4 times a week. That will continue through Thanksgiving. My parents are both 76. We know that they are at much greater risk for the virus, not to mention, of course, Marlon and I don't want to get it. So we will just be having, and I'm going to have fun cooking. I'll be spending all day Thursday cooking. I'll probably cook a lot more. We'll be doing leftovers for days, but I'll be cooking just for our family of 4 plus Gia. And that's at the end of the day, that's because, of course, we care deeply about my parents. We care deeply about our own health, our kids' future, our aunts, our uncles, our cousins. Last year we had Thanksgiving with our cousins, enjoyed that very much. And we plan to do that again next year. But this is not the year for that. We simply love them too much, and they love us too much to put one another at risk. So I know families are making your decisions. That's what my family's doing. I encourage you to do the same. If you choose not to, if there's 10 people, 4 out of 5 times, you won't have a price to pay, but 1 out of 5 times you very likely will. Those are not terrific odds, and I think most people don't want to gamble with the lives of
particularly their elderly family members. And again, there are additional steps. If people are getting together, we encourage people to start quarantining a week ago. Obviously, there are ways to have safer Thanksgivings if people have been self-quarantining for a week or two leading up to Thanksgiving, if they get tested a day or two before Thanksgiving. None of those are perfect. None of those are as safe as simply having Thanksgiving with your household. But if you absolutely have to do this and get together, and there's folks who do. There's folks who, this might be your mom or dad's last year on the planet, and you want to gather together even with that risk. There are still ways to reduce that risk, and that includes, hopefully, it's too late to quarantine now, but hopefully people who are attending it have been quarantined, number one. Number two, mask wearing can absolutely reduce the risk. Being outdoors can absolutely reduce the risk. Those are hard to do in the family setting, but sometimes they can be done. Maybe for the social part of Thanksgiving, people wear masks and then they take them off when they eat. It's up to you. Personal responsibility, consequences. You've seen the data. You know where we are. 1 in 41. People over 70, roughly 1 in 4, 1 in 5 need hospitalization. That is a very high percentage chance of hospitalization. Overall, folks who are hospitalized, about 5% don't make it, but a higher percentage of people in their 70s and 80s don't make it than the overall 5%. So that is also dependent on age. It's not something anybody of any age wants to contract. And of course, we've lost people of all ages. We've lost 2,456 Coloradans, over 260,000 Americans, millions of people across the world. The deadly work of the virus is not yet done. There is hope on the horizon. We are just weeks away from the first vaccine dosages in our state, months away from enough vaccination to finally end all of the extra precautions that we are taking. But we are not there now. And celebrating Thanksgiving the normal way is not safe enough for my family. And I encourage you to really be thoughtful about this as well. And make sure that you have your family there for many Thanksgivings to come, and that trying to sort of force a social situation this Thanksgiving could put your future Thanksgivings at risk. And each of us will have to live with those consequences for ourselves and our family. Many of the affected Coloradans are asymptomatic. Again, while the safest thing to do is simply to gather with people of your household, another simple thing to do, if there are others, anybody with any symptoms should not come to the Thanksgiving table. Fever, cough, headaches, sore throat, they should not be there. Given the level of infection, they should of course get tested, but there's a very high chance that symptoms are caused by COVID, given where we are with COVID today. And again, one of the reasons that not having Thanksgiving is the safest thing to do is because about half of the people infected are not showing symptoms. And so it could be, a 17-year-old nephew who went on a date and contracted it, is asymptomatic, and gives it to 6 people in the family, including grandma, grandpa, and the uncle. So that this is what happens with this virus. We are hopeful that Coloradans will make informed decisions, the best decisions for them and their family. It's a responsibility, and we all will live with the consequences. So it doesn't mean we don't celebrate. We're celebrating at home with the people we live with. We will, of course, be doing Zoom and video with the extended family. And maybe I'll even put some of the food I cook, outside our door, and they can come by and pick it up if I cook enough. And look, when you're doing that holiday shopping, there's another tradition that we're worried about coming up called Black Friday. The way that normally looks is not a smart thing to do during the pandemic. Of course, the stores are open, people can shop. I hope they're having sales, but make sure to follow those social distancing protocols at the stores, right? Avoid prolonged in-person contact with others. In some of those stores, there's definitely more than 50 people, so you know that a few of them are contagious. So please wear a mask correctly and try to avoid those, try to have as much distance between you and other people as possible. You know that hospital capacity is our key indicator in this pandemic. We want to make sure, not just for the sake of people who contract COVID who need hospitalization, but people with any other condition that need hospitalization, heart attack, stroke, car accident, appendicitis. We want to make sure that life-saving treatment is there for you. And our hospitals and health facilities and staff are really experiencing a lot of stress right now. 31 hospitals are anticipating staffing shortages right now, which means many nurses are working double shifts. We are starting to approach double the daily number of hospitalizations we did in spring, and we are up against, in many areas of our state, the close to the ICU capacity. So our North Star continues to be, we want to make sure that every Coloradan who needs quality health care at a hospital gets it, and it's up to all of us to do our part. And we all thank our healthcare workers who, I would add, in addition to working long hours and stressful conditions, are absolutely put themselves at risk, which is why they will be among the very first Coloradans to receive the vaccine. It's also important that folks know that the vaccine does not confer instant immunity. You don't get the shot, and the next day you can go out and contract COVID. There's no immunity the next day. There is 2 shots. It's likely that the first shot confers some immunity, but then 30 days later there's another shot. Then 2 weeks after that you're immune. So that's a 45-day process. It's slightly different with each of the drugs. Now again, there's some evidence from one of them that the first installment might confer some, not the 90%, maybe some lesser degree. But you are really not, in effect, have that high level of immunity till about a month and a half after you receive that first vaccine. So there'll be a lot more materials around the vaccine education as that's available. I think we can all very much look forward to that, and it is just a matter of a couple weeks, 2-3 weeks, until the first Coloradans are hopefully able to receive life-saving vaccine. With that, I want to turn it over to Dr. Rachel Herlihy, and then I have a couple other announcements as well around additional steps we are taking to help kids get back to school safely in the spring semester. But Dr. Herlihy.
Great. Thank you, Governor. Good afternoon. Bring up the slides, please. All right, so this figure shows you our 7-day average of COVID-19 cases occurring in the state. And so one of the things that you'll notice is that we've seen this steep increase in cases over the last couple of months, really since early September. We've really been seeing this steady increase in cases in the state. If you look at this figure, you'll see that we're near our all-time high for number of cases when you look at the 7-day average. If you look at that peak, you will notice that in the last couple of days, we have seen a little bit of a stabilization in our counts. So we have seen a little bit of a slowing of our increase in cases. It could be our earliest indication that some of the actions that Coloradans are taking are making a difference. Again, these are actions potentially a week ago, 2 weeks ago, that we're just starting to see now. Really too soon, though, to know if this is going to be a lasting trend. It's really just a couple days worth of data, and we'd like to see several more days worth of data to know if this is going to be a lasting trend. Also, when we look at that case data, we know that with the Thanksgiving holiday coming up, we could potentially see an increase in cases again. We've experienced that previously with holidays, and with Thanksgiving being primarily an indoor holiday with multi-generational gatherings potentially occurring, that does potentially set us up to see a spike in transmission in the state. And this is again why we are recommending that individuals gather just with their own household. Next slide. We are not seeing the same level of stabilization in our hospitalization data. We continue to see a steady increase in hospitalizations in the state. You can see that we've really seen steep increases in hospitalizations day over day in the state, and this is really what, as the governor mentioned, is continuing to strain our healthcare system, our healthcare workers who are working long shifts and hard shifts to make sure that all of the Coloradans that need care, whether that's for COVID-19 or other conditions, are able to receive that care in our state. Next slide. This next figure shows you hospitalization projections over the next few weeks. So if you look at the figure on the left, that is showing you nearer term projections. If you look at the figure on the right, that is showing you longer term projections. The black line in each of these figures shows you the number of hospitalizations that have occurred in Colorado over time. And then the figures in the area in the box is showing you where we see this divergence of lines, divergence of the number of potential hospitalizations in the state based on the level of transmission control we're experiencing. So if you look at the tan line, that shows you our current trajectory in the state. You'll see that there's a horizontal line drawn at 6,460. That is our estimated hospital bed surge capacity in the state. So really our maximum hospital bed capacity in the state. You'll see that on our current trajectory, that tan line, we do stay below that maximum surge capacity in the state, but if we see transmission control decrease, so back to what it was about a week or two ago, down to 60%, so a decrease of 5%, and see that trend continue, you see that we do potentially exceed our hospital capacity in the state. Conversely, if we're able to increase the amount of transmission control in the state over the next couple of weeks, you can see that we can dramatically decrease the number of hospitalizations that occur in Colorado. Next slide. The story is a little bit different when you look at our ICU capacity. So if you look at this figure, you'll see again the black line that shows you ICU admissions in the state. And then you see those three lines diverge. The tan line shows you our current trajectory. You'll see that on our current trajectory, we are projected to exceed ICU bed capacity in mid-January. And this is really why we need to increase transmission control in the state to ensure that we have sufficient ICU capacity in the state over the next couple of months. So you see, if we're able to increase our transmission control in the state, we can follow that green trajectory and come, stay well below our ICU bed capacity in the state. Unfortunately, if we see that transmission control decrease, potentially a decrease associated with gatherings, less social distancing occurring around the holidays, that's when we have the potential to really significantly exceed our ICU bed capacity in the state, and that could happen in this figure as soon as mid-December. Next slide. This next figure shows you projections of COVID-19 deaths in the state. So the figure shows you, if you look at the purple line and where you see the branching from there, you'll see that we've had approximately 2,800 deaths to date in the state. You'll see that the number of deaths that occur are projected to occur by the end of the year, so by December 31st, really varies depending on how much transmission control we're able to implement in the state. If we stay on our current trajectory, that 65% transmission control level, you'll see that we have 6,600 deaths that occur by the end of the year. If we're able to decrease that, if that transmission control decreases to 60% transmission control, you'll see we have even more deaths. However, if we can reverse the trend and really improve our transmission control, improve social distancing, improve mask compliance, you'll see that we can really decrease the number of deaths that occur in Colorado by thousands. Next slide. So as we approach the Thanksgiving holiday, reminder to all Coloradans to do these three key things. First, do not gather with people you do not live with. That includes over the holiday that's coming up in just a couple of days. Wear a mask when outside of your home, and stay 6 feet away from others at all times. Thank you. Back to you, Governor.
So it's responsibility and consequences that you have to live with your family and your loved ones. I have another important announcement today. As you know, we've been very focused on kids being able to return to in-classroom instruction safely. Based on mounting evidence, we know a lot more than we knew in March. I strongly believe, based on what I've seen, it's the safest place for teachers, safest place for students is school, largely regardless of the level of outbreak in a community, because it is a safe environment, a regulated environment. People wear masks. Many schools have been back full-time the whole year. In fact, the majority of school districts, but not the majority of students. Those are many of our rural districts. But for many of our suburban and rural folks listening to this, it's been sporadic. Maybe your kid was back for a while, wasn't back. And if there's a classroom quarantine, that needs to be, of course, observed. But we are going to be more hands-on in working with teachers and school districts and schools and families to get kids back to in-person learning in January for next semester, to have a minimum number of interruptions. We're establishing a task force that will work closely with teachers and parents and principals and superintendents and elected school boards and health officials to really help move forward with the support that's needed for kids to return to safe in-classroom instruction. We're going to hold the first meeting tomorrow, looking at protocols, looking at examples of what works. We're going to work backwards from January to make sure we have a sequencing and timeline with what's needed. As you know, we pushed out $15 million just last week to help schools be able to have the additional safety protocols that they need to be able to meet. And schools are a reasonably safe place. I'm really excited to hear on-the-ground perspectives from parents and teachers and school boards about what's needed to be as safe as possible for as uninterrupted as possible of a second semester. And we're going to be very engaged working with all of the stakeholders, because we know that not only do parents rely on it, but frankly, we can't let the future of our kids become yet another casualty of this pandemic. And my administration will work very closely with the Department of Education, school districts, teachers, and parents and superintendents to have a safe return to school in January for as many kids as possible. It's a challenging year for everybody. Of course, most of all for the folks who've suffered the health impacts of COVID. but also for the students, for the teachers, for the parents. We're hopeful that 2021 will provide additional certainty. As we head into holiday weekend, I want to again emphasize the importance of celebrating festivities with people who live in your own household. It's an important responsibility we have to keep our loved ones safe. Ask yourself if you can live with the consequences. 1 in 41 Coloradans currently contagious. 10 people, you got a 1 in 4 chance that somebody's contagious. In that normal Thanksgiving setting would spread to 3, 4, 5 people. The light is at the end of the tunnel. We're just weeks away from the first vaccine. It's a reason to double down, to do what we need to contain this virus. I'm grateful for my family and loved ones, even though I won't be able to be with them this Thanksgiving. I look forward to being with them virtually, and of course, most importantly, being able to be with them for Thanksgivings to come. And maybe we'll have 2 Thanksgivings next year, right? Maybe we'll do one once we're all safely vaccinated, and another later next November. I'm grateful for the dedication of our healthcare workers, our first responders, but also grateful for your dedication in really being willing to take a very difficult social distancing and make it happen in our own lives. We all, if you're young and single, you want to go on dates, you want to see people, you want to go out. If you're a grandmother, you want to be with your grandkids. These are hard things to ask folks to delay. But by delaying them, we can ensure that we are able to enjoy them for many years to come. Happy Thanksgiving, Colorado. Happy to take some questions.
Hi, Governor. This is Mary Ann Goodland from Colorado Politics. I have one question for you and one question for Dr. Herlihy. Am I reading this to Dr. Herlihy? Am I reading this correctly that the number of deaths from COVID could nearly double in the next month, if at perhaps 65%? And then that's 5 weeks. That's amazing to me. For you, Governor, we still have a number of counties that are moving to red status, but have virtually no regard for actually enforcing any of the public health orders. How can people take this seriously if the state won't enforce it, or the state doesn't have the mechanism for enforcing it?
Dr. Hurley?
Sure. So unfortunately, that is the correct projection, and it really has to do with the amount of disease transmission that we are seeing right now. It's an unprecedented level. As all of you know, and you saw in the figure, the amount of disease transmission that we've seen in Colorado in the last several days is really the highest it's been since the beginning of the pandemic. And at that high rate of disease transmission, we are unfortunately going to see an increasing number of deaths occur in the state. Of course, that's a lagging indicator. So it will be, weeks until we see those deaths unfortunately accumulate in the state. But again, I think it reinforces our message that we have right now, that particularly at this point in time, gathering just with your own household for Thanksgiving is really an important strategy, especially to protect vulnerable Coloradans who might be at greatest risk of severe outcomes, including death.
We are hopeful that this model is an extrapolation of where we are today. This leads into the second part of your question, but with the majority of the population of the state now having the mitigation of being in a red county, the likelihood, the hope, and the informed belief is that the transmission rate will be affected and it will be reduced. So do you want to comment on that real briefly?
Yeah, absolutely. So that is our goal, and that's why we're showing these projections in the model. Our goal is to get to a place of 80% transmission control. We know that that's the level we need to be at to really see a true decrease in the number of cases occurring in the state. And if we can achieve that in the next couple of weeks, that's really where we have the greatest impact on outcomes in the state.
So, look, I think it's a time for every Coloradan, and that includes county elected officials, to really ask themselves, are you on the side of the virus or are you on the side of Colorado? Now, quite clearly, no matter where you operate in the state of Colorado, you're subject to state law. And of course, as has been the case throughout this health crisis and even before this health crisis, CDPHE licenses restaurants. We have Department of Revenue that licenses liquor stores. No matter where you are, no matter what commissioners think, liquor stores can't sell liquor to 17-year-olds. And also all the relevant health orders need to be followed. Restaurants can't have salmonella or hepatitis outbreaks without the proper protocols, and they can't, they have to operate under their proper COVID protocols. So it's no different than it's always been, regardless of the personal opinions of county commissioners around, you know, what age should be legal for alcohol consumption or whether salmonella or hepatitis exist or not. Simply doesn't matter. These are all licensed by the state because we need consumer confidence. Whether you operate in Weld County or Sedgwick County or La Plata County or Denver, people want to know that they have reasonable safety when they go into a restaurant. And that's what those safety protocols have been there for, are there for, and will continue to be there for.
Governor, good afternoon. This is David Clue at Denver 7. This is a bit of a follow-up to Marianne's question, but this focuses on businesses that are looking to defy en masse. In Loveland, as you probably know, nearly 100 businesses now are defying the county's move from level yellow to level red, meaning they'll continue to allow indoor dining, among other things. What is the response from you? And at the end of the day, what can or will the state do about it?
Well, every business in the state of Colorado needs to follow our laws. And whether you agree with it or not, in red counties, not having indoor dining is the law of Colorado under a temporary health order. So, of course, any type of business that violates a health order, whether it's hepatitis, salmonella, or COVID, will be, you know, could lose their license to operate at that retail outlet and lose their liquor license. That would be a devastating outcome for many small businesses, and I encourage all small businesses to implement or go above and beyond, as many have, the current baseline health requirements of the state.
Governor Steve Stager from 9 News. I want to follow up on both Marianne and David's question now. Looking at those businesses in Loveland, do we hear you correctly today that if they defy this order, that they will see their licenses at least restricted temporarily? And a second question on that, as a state, you have a lot going on right now, a lot of resources in use. Is it even useful to spend resources trying to enforce these rules when you have so many businesses looking to defy them right now?
Well, look, I think that it's always a challenge. I mean, there's, you know, liquor stores and bars, and if they serve a 17-year-old, they lose their liquor license. There's always enforcement of state rules and laws. And as I said, we even without COVID, we often have hepatitis and salmonella to deal with on the restaurant side. Now, on top of that, we have COVID associated with social proximity, not associated with food preparation, but associated with physical proximity of customers. And of course, our businesses will, you know, continue to follow the law. And it's always the case that, you know, serving 17-year-olds or illegally seating people or not removing people who have hepatitis from the kitchen. These always happens in the routine course of business that restaurants can temporarily lose their license, because it's really important that we keep consumer confidence in places being safe. And we don't want a few bad actors undermining that for the restaurant industry, especially at a time when I have called our state legislature to step up to help the good actors in the restaurant industry. And this is really unprecedented in Colorado, over $100 million really to be able to go out to help our restaurants get through a very difficult winter. And we don't want that to be undermined by just a few bad actors.
Hi, Governor. Stephen Tubbs, KNUS. I want to play devil's advocate if I can. And you've said a couple of times you have your own conscience when talking with Coloradans. I'm wondering if you have thought, wow, what if I should have shut down the state? I mean, we're talking about a holiday unlike the 4th of July, where a lot of elderly will be involved. People are still saying, I'm going over to grandmother's house. I'm wondering if you've thought about, God, am I making the right decision right now to keep this state open, or maybe leveling it out and putting it up at level purple? Thank you.
Look, I'm cautioning in the strongest possible terms that people should celebrate Thanksgiving with people in their own household. I'm doing that myself. Doctors are advising that. Dr. Fauci's advised that. CDC has recommended against travel. At the end of the day, there's no ability of any state or the federal government to monitor, nor should there be, what people are doing with Thanksgiving. That's why it's ultimately a matter of personal responsibility, but it's one that people will have to live with the consequences. And I'm hopeful that when they see that if you have 10 people over for Thanksgiving, there's a 1 in 5 chance that you're inviting COVID into your home, and in that scenario likely will spread to 3, 4, or 5 people from one, that will be a stark warning to people to do the right thing. We are, of course, coupling that with additional health precautions in the red counties, like ceasing in restaurant dining, further reductions in gym capacity, making sure that offices encourage telecommuting where they can, and have people come in where they need to. So this is a challenge across the board. It's the health challenge, it's a social challenge, it's a psychological challenge, it's an economic challenge. People value those things differently. They're all valid points, but we need to have a cohesive statewide response that really accounts for all of those factors, and we do.
Hello, Governor. I'm Jesus Carrasquel from Noticias Univisión Colorado. Gobernador, ya existen 3 posibles vacunas de COVID-19, pero se ha generado una controversia sobre por qué los mayores de 65 años y el resto de la población deben recibir la vacuna luego de los presos que están en las cárceles. ¿Por qué tomó esta decisión y cuándo tendrían acceso a la vacuna las personas en...
You're watching News Now from Fox. I'm Daytona Everett. Even during the COVID-19 pandemic, millions of Americans are expected to travel for the Thanksgiving holiday, but AAA is estimating this year holiday travel will take the biggest annual drop since 2008. Fox's Hunter Davis joins us now live from the Dallas-Fort Worth International Airport. And Hunter, this is typically one of the highest traffic areas during the holidays, right?
Yeah, Daytona, that's exactly right. The 5th busiest in the country. However, this year, officials here at the DFW airport tell me travel is projected to be down by 65% over the Thanksgiving holiday.
I need to make sure that, I'm being as safe as possible. I'm a little bit nervous to travel, but hopefully I'm as safe, trying to be as safe as possible.
Prisha Patel will be one of 50 million Americans hitting the roads and the sky for Thanksgiving. According to AAA, that number is down 10% from last year.
In addition to concerns about health care, another factor people are looking at is their employment and discretionary income. And if they're not comfortable, if they don't feel like they've got that extra money in their pocket, they're not going to make the trip.
And of those traveling for the holiday, AAA estimates 95% of them will go by car over the next 10 days. As for air travel, LAX was relatively quiet the weekend before Thanksgiving. Meanwhile, people are already piling into airports in Chicago and Miami. And in Texas, Dallas-Fort Worth International Airport is preparing for more than 1 million travelers.
This has the potential to be some of the highest volume times since the virus.
Because of that, the airport is reminding passengers things look a little different.
You may run into a robot that's out, cleaning or sterilizing. So everyone must have a mask. You'll see social distancing stickers all throughout the airport.
People traveling will also need to prepare for state-to-state COVID-19 guidelines. As of now, 12 states and Washington, D.C. have mandatory travel quarantines.
At first I was really nervous, but now I don't feel that way. I'm just okay, I have a protocol. I know what I'm going to do. I just got to do it.
Now, AAA also says peak travel times will be different this year. Instead of people making a week-long vacation out of the holiday, most are going to leave tomorrow evening or in the afternoon, and they're going to head right back home right after Thanksgiving. Daytona?
Hunter, you're at the airport right now, right? What is it looking like at this moment in time? You said people are starting to head out a little bit earlier. Is it still busy at the airport right now?
Yeah, it was kind of interesting heading over here. The airport's kind of somewhere that you avoid completely around holidays if you don't have to come over here. But, I even prepared to come here early just to make sure I could be here in time for this live shot. But there was no traffic on the way. In fact, I looked on my way up here while I was parking. There's more than 1,000 parking spots open here in the D terminal, which is typically a very busy area and likely an indication that, that travel they are expecting to be down, in fact, will be down this year.
And for people who haven't been traveling during the pandemic, are there any specific changes to really be aware of, and are they ramping those up for the holiday season? I know you touched on it just a little bit, but any specific changes?
So there's a ton of changes, especially if you have not been in an airport since before the pandemic began. You're going to notice those mask mandates, which are all too common to us at the moment. You're going to notice a lot of plexiglass. They are cleaning all high-touch areas. They've even started relying on some innovative technology, such as robots, like you heard in the package, to, make sure that all those areas are sanitized, especially in the restrooms. Everything has become touchless. You can go in, you can get your paper towels, you can wash your hands, you can even see which stalls are open without having to touch the door prior to entering it. So they're really making sure that all of the precautions that can be taken here at the airport are being taken, especially as they're expecting more people than the pandemic has seen before.
But still no tests required in order to get on an airplane, correct?
Yeah, that's exactly right. Even here at the DFW airport, which, like I said, is the 5th busiest during holiday travel season, they don't have any testing that you're going to have to go through on the way here, but they are relying on those masks, those social distancing precautions, and all of the cleaning that they're doing here to make sure people stay safe as they walk through the airport.
All right, Fox's Hunter Davis out there in Dallas, Texas. Stay safe during this holiday season, and happy early Thanksgiving.
Yeah, thanks, Daytona. You too.
So again, we're following all of your COVID-19 updates across the country. And again, we just want to mind you, CDC is recommending that nobody travel during Thanksgiving. And you heard from several governors in just the past couple of hours saying kind of the same thing. But if you are making your way out to family, stay safe. And it looks like the airports are pretty open as of right now. So that's good news. We are going to send some of you off to a 2-minute commercial break. When you come back, we'll have an update coming out of Ohio, which has really put some major restrictions on the state, including a curfew as well. So again, 2 minutes. We'll see you here on News Now from Fox. We've got a lot more to show you. We're all about live, nonstop, unfiltered, raw breaking news. And we're bringing it all to you all night tonight. Thanks again for watching. I'm Daytona Everett.
But the October unemployment in Ohio is down to 5.6% for October. That's down from previous month, 8.3%. So certainly headed in the right direction. A second good news story. We had our district reps go out throughout the state, as they've done in the past, and just randomly go into retail establishments all over rural areas, urban areas, suburban areas, and the results were great. They reported back to me last night 90% mask wearing compliance. That's phenomenally much better than it was several weeks ago. So I thank Ohioans for doing that. That matters. It makes a big difference. It means that the employees can be safe in these establishments, as well as people can feel free to go into them. So it's great news. Third piece of good news, I was on the phone yesterday along with other governors with the White House and the people who are organizing the vaccine. Looks like around December 15th, we will get our first batch. And we're very excited about that. We're in the process of planning how that will get out. It will come out to us in different batches from then on, and we will be getting it out. So we'll have more information about that as we get closer. But we have a date that looks pretty definite, pretty certain, we hope, and things are looking a lot better. This is a time, as we've talked about, when we all just need to pull back. We need to slow things down. The time between now and the first of the year is really a critical time. And each one of us in our own lives need to figure out, what can we do to pull back, to have fewer contacts. When we talk about the spread of the virus and what we can do about it, there's really two kind of basic things. One is have fewer contacts with people, and the other is to wear a mask. And those two things coming together make a huge difference. I want to congratulate our colleges and universities. I think the vast majority of them, once the students go home for Thanksgiving, they're not going to be back in person until after the first of the year. Now, some have labs and have other things, and that's great, where they need to be in person. But the bulk of the students will be going home, will not be coming back to campus. Again, an opportunity to pull back some and to make a difference, fewer contacts. Let me talk about a couple other ways. And, everybody can kind of figure out how to do this themselves and, what in their life can they pull back from. Something that Fran and I have done, we're going to Mass now online, and it's different. And, we'd like to do it in person. But our friend, Father Tom Hagen, who is in Haiti, has a school in Haiti, he does Mass every Sunday, and for people all over the country, anybody who wants to tune in, and we can be a part of that and feel like we're a part of that. So there's just different ways. So if there's a way you can, again, pull back from something, please take that opportunity. Another example, we've already seen some schools who have suspended school in person until after the first of the year. And, that's that school's choice to do that. Let me talk for a moment about sports. Some schools have suspended winter sports until January. For those that have not suspended sports, we would ask you, when you conduct winter sports, basketball games, whatever, to do so without fans. This is another opportunity for us just to pull back. It allows our student athletes to continue to play, which is, as a parent or grandparent, is the most important thing. Much as we would like to see them play, as one superintendent told me today, the idea of bringing 200 adults into our gym at this point during the pandemic with the spread that we're seeing just makes absolutely no sense. So we would ask schools to do that again between now and the first of the year. That is something that we certainly will reevaluate. But again, this period between now and the first of the year is just vitally important if we're going to keep our kids in school, if we're going to do the things that we really feel are vital and very, very important. Thanksgiving obviously is going to be different, and we've talked about that, about what Fran and I are going to do. It's going to be just different. Fran's going to continue to cook, and she's already made a lot of rolls and some pies. And but for our family that's close, they're going to stop by and pick it up, or maybe we'll deliver it. I haven't quite decided yet. We have two of our sons and their families who are a good distance away, and Fran's already sent them a pie. So we hope that'll be getting there today or tomorrow. So these are just different ways that each one of us can figure out how to pull back. Less contacts, more wearing masks makes a big difference. Eric, let's go to our data for today. We'll do this quick. The number today for new cases is 8,604. Yesterday's data was somewhat inflated because we had a couple labs that had not gotten theirs in or hadn't been able to clear into our system. And so yesterday's was artificially high. This 8,604, we think, is fairly close to where it is. We still have a backlog. We think about 6,000 cases which need to clear at some point. So today's data may be a little higher than that. But again, this is a high number. And if you compare it, for example, to what our average cases have been for the last 21 days, you can see it certainly continues to trend upwards. Deaths are 98. Hospitalization 364. Again, this is higher certainly than the 7-day average, and number of ICU admissions is 29. Currently in our hospitals, we have 4,449 hospitalized COVID patients. That's 4,449. Of those, about a fourth, 1,046, are in intensive care. Statewide, we have about 20,000 patients in Ohio hospitals. Of those, there are 4,449, as I said, who are COVID. So it's between a fifth and a fourth of our patients in our hospitals are now COVID patients. Tomorrow, we will be putting out, because of Thanksgiving, we'll be putting out some of our data early. The map will come out tomorrow without a press conference. It will just come out one day earlier than it normally does. Also, our travel advisory normally comes out tomorrow. It will come out tomorrow. And just a note, we are very close ourselves in Ohio to being at a point where we would advise people to be very careful if they were traveling to us. We're at about 14% positivity now. 15% is where our line has been, where we put on the board, on the map, a different state and say there's a travel advisory to that state. So I think that just sort of puts it into perspective where we are at this point. Let me turn to the Lieutenant Governor. John?
Thank you very much, Governor. Great news regarding unemployment numbers. We're moving things in the right direction, trying to do two things at once with having success with the economy, and also recognizing we have a responsibility to confront the virus and the complications with that as well. One piece of information that I want to make sure we shared today is a partnership we started with Jobs Ohio called Ohio to Work. This pilot project has started in the greater Cleveland area. It's seen great results. There was an October virtual job fair, 30 employers, 100 job openings, 700 job seekers. But the key there is that the program has coaches to help prepare those job seekers for the kinds of employers and the kinds of jobs that are going to be available, so that they have a greater likelihood of being successful at the career fair. The next career fair is Thursday, December the 10th. And as a result of that, please, if you're interested, reach out to ohiotowork.com. That's OHIOTO work.com to connect with the program, with the job fair, and some of the coaches that can help you out. Again, that pilot is in the greater Cleveland area because, look, we know the unemployment rate's going down. More people are going back to work. But there are still people for COVID and non-COVID reasons that are struggling. Maybe it's the technology change. Maybe it's systemic loss of the kinds of jobs that they're qualified for. And this program is designed to help with that. And while I'm on the topic of jobs, OhioMeansJobs.com, 195,000 open jobs available right now at OhioMeansJobs.com. 94,000 of them pay $50,000 a year or more. So another great resource for people who are trying to get back into the workforce. A reminder on the BWC dividends. Those will start going out on December the 10th. That's to 178,000 private and public employers. That $4.3 billion to private employers, $687 million to public employers. That will include, and I know the schools weren't expecting this, but they will receive money too, $219 million, which I know this money will come in handy for everybody during this difficult time as they try to account for their COVID-related costs. Additionally, Bar and Restaurant Assistance Fund. Governor announced $2,500 available for every liquor permit holder. There are roughly 30 types of liquor permit holders. As of right now, less than 50% of the eligible bars and restaurants have applied to get that money. You're still eligible to do that. If you have questions, go to businesshelp.ohio.gov, businesshelp.ohio.gov to see if you're eligible and how you would apply. But anybody who's a liquor permit holder, any one of those 30 liquor permit holders is eligible, and we encourage you to take advantage of the opportunity there. And then finally, we are all planning alternative Thanksgivings, at least I think most people are. That's different than usual. Remember that there are restaurants out there, caterers, people who are willing to serve. There's still time to get your order in. You can do those kinds of things to maybe relieve mom of her cooking duties, or grandma in that case. I know we're all trying to stay distant. Maybe you can send a meal to somebody, but make sure you use those Ohio restaurants if that makes sense to you. And then I wanted to amplify something that the Ohio Council of Retail Merchants announced. Buy in Ohio campaign, the Buy in Ohio campaign. This is their attempt to remind you that your local stores and retailers are available to purchase those holiday gifts. And I saw these statistics, I think were pretty amazing, that $30.5 billion is spent annually by Ohioans to buy goods outside of Ohio. And if we could just get 10% more business from Ohio consumers with Ohio businesses, that would make a dramatic impact to help our retailers during this difficult time. So the initiative with both of these, with restaurants and with retailers, is to buy in Ohio, and we encourage you to do that in the coming days and weeks as we're headed deeper into the holiday season. Thank you, Governor.
Don, thank you very much. We have 4 guests today who've experienced this COVID in different ways, but I think they kind of illuminate what our fellow Ohioans are going through and have gone through. First, I'd like to introduce you to Stephanie Marshall, a respiratory therapist at Grant Medical Center in Columbus. She's been on the front lines of the COVID-19 pandemic. She is a COVID patient. Stephanie, thank you very much for being with us today. We appreciate it very, very much. And I know you're there with your husband, Ryan, who may pick up the conversation at some point as you move forward. Can you just tell us your story?
So being a respiratory therapist at Grant, we're very busy. So for 8 months, taking care of frontline being frontline from ER to the ICU, intubating patients. We've seen all of the good and bad of COVID. And the beginning of November, sorry if I tear up, in the beginning of November, I developed symptoms of COVID, and I ended up having just congestion, sore throat, headache. Really didn't think anything of it. And within 12 hours, I was hospitalized for difficulty breathing. I'm a healthy 37-year-old. I have underlying asthma, but that's all. My asthma is under control. So I really didn't think anything, of if I got COVID, I would be okay. Well, a lot of people think that. Unfortunately, that didn't happen for me. I was hospitalized for 2 days, and then I was discharged, and I was home for 2 days, and I got really bad. I developed pneumonia in both of my lungs, and as a respiratory therapist, I knew that I was bad, and I knew what was happening to me, and that made it scarier. My husband dropped me off. Because of my husband and family, I have 2 small children. Because of them being in quarantine, they had to drop me at the door of the ER, which was the hardest thing because I knew how sick I was, and I didn't know if that was the last time I would ever see my family. And they dropped me off at Grant, where I work, and I was admitted, and they told me I would have to be intubated because I was so bad. I begged for a chance on a BiPAP to not be intubated, and thankfully that worked, and I didn't have to go on a ventilator. But I was at the hospital for 7 days. It's really hard to be a COVID patient. I've been on both sides. I've cared for COVID patients, and then I've been there myself. It's hard to sit in a room that you can't leave the room, and the only people you see are in full PPE. And you can't have family, you can't have anyone with you. This virus doesn't just affect your body, but it affects you mentally. The isolation of that is really hard. And seeing both sides of it impactful for me and the way I'll treat my patients from now on. And I now am home, thank goodness, but I am home and I'm still on oxygen. I unfortunately will be getting lumped into the long hauler crowd. And it's been difficult, but we take one day at a time. And I just want the word out there to let people know that it doesn't matter who you are, this virus doesn't discriminate. And I'm a healthy 37-year-old.
And we continue to listen to some very emotional moments here from this family talking about COVID-19 and how it affected them and their family. Let's continue to listen after this break right here on NewsNOW from Fox.
Numbers and statistics, but I think it's much more impactful to talk to someone like you who's been through it. And so how are your kids doing? Kids doing okay?
They're hanging in there. They're 7 and 1, so my 1-year-old has no idea. My 7-year-old he's learning how to adjust oxygen.
Well, maybe a nurse, maybe a doctor, who knows, huh?
I told him maybe you could become a respiratory therapist.
Respiratory therapist, who knows, right? Yeah. Well, hey, how long have you been a respiratory therapist? How long?
5 years.
5 years. Well, you've dealt with a lot of patients in that time, then.
Yeah, and I've been at Grant the whole time, and we see a lot. And shout out to all my RTs at Grant. We work really hard for not just COVID patients, but trauma patients, and they do a great job.
Well, we appreciate what they do, and we appreciate you, and good luck. Good luck and best wishes to both of you. Thank you for coming on. We appreciate it very much. Let me move now. We'll talk with Susan Norvell from Middletown. She's going to talk a little bit about her family's experience with COVID. All 4 people in her household got COVID, and we've all had different experiences. So, Susan, tell us a little bit about what your experience has been.
Certainly. Thank you, Governor DeWine. I was the person that was exposed to the COVID virus and inadvertently and unintentionally brought it into our home. Our family is comprised of myself, my husband Keith, and our twin daughters, Sarah and Allison. And it started out, I think our story is important because within our family, the 4 of us, we are just about every case that you could have with COVID. My daughter, Sarah, when she tested negative at first. And I actually had her retest because I just couldn't believe that she was negative. She's been completely asymptomatic this whole time. No fevers, no nothing. My daughter, Allison, and myself, we developed very mild symptoms. We had what sounded like chest congestion, no fevers whatsoever. We had the telltale symptom of loss of taste and smell. And then my husband, Keith, he started out kind of the same general congestion, whatnot. He typically gets bronchitis every year, and this is Ohio, so it's typical that you get some sort of respiratory thing each season. But his symptoms progressed. He started running fevers. They would be low grade, but then they would spike up to about 102, 103. Severe muscle aches, severe joint pain. And that just kind of went on for a while. And then I would say probably about day 12 or 13. And for the record, he never lost his sense of taste or smell at all, but he did have the fevers. Around day 12 or day 13, it was a Sunday. He was just having a lot of difficulty. He needed to sit up in the recliner in the living room. He was still able to talk, engage in conversation. Not long-winded stories, but nothing that would indicate that anything was amiss other than he was really, feeling pretty bad, but not terrible. His sister, Jennifer, is a nurse and brought over a pulse oximeter. So we put it on his finger, and I actually thought I put it on wrong because it registered 55%. And I was like, that can't be right. Wow. So we did it again, and it was 55%. Ooh. So our doctor, Dr. Ganser, told us to call the squad, and we did. And he walked from our living room chair out to the porch, got on the cot, and got into the ambulance, and they transported him. And when he arrived at Atrium Medical Center, his oxygen levels were at 40%. Still talking, still engaging, which I've been told by many people that they actually don't know how that's possible. While in the ER, he was diagnosed with pneumonia, which I've been told is a very common complication of COVID. So he got to the hospital, we'll say around 3:30 or 4 o'clock on a Sunday afternoon. That evening around 11 o'clock, I was called and notified that he was moved to the ICU, that he was still talking, but to get more one-on-one care, better oxygen support. By 3:30, 4 o'clock the following morning. So in the span of 16 to 18 hours, the nurse told me that she had spoken with Keith, and while he was stable at Atrium Medical Center, a wonderful facility, they had maximized everything that they could do to him, to help him, and that it was in his best interest, and he agreed to it, and he was intubated and then care flighted to UC. So he was transported in the middle of the night to UC. He is in a COVID ICU unit. He is still on a ventilator. This is 2 weeks and 2 days post when everything happened. And that's where we are. They just put in a trach yesterday to take him off of the mouth tube to prevent damage from that. And currently they are trying to lower his sedation to check his neurological levels. He wasn't very responsive yesterday, so they're doing like an EEG to check brain function, and then they're going to go around today and check that. But our house, we've had every possible scenario with COVID, and that's where we currently are right now.
Wow, that's going to be very difficult for you, your family, to go through that.
It is.
You can't see him, right? You can.
Believe it or not, I am actually allowed to visit him. I sit outside the room. I wear double masks because it's just very scary to be in the eye of the storm. But I do get to at least see him, and he has an amazing medical team. So I just sit outside and I stare at him for an hour every day.
Yeah.
Yeah.
Wow. Well, thank you for sharing the story. We certainly wish him all the best.
Thank you.
He comes out of this, and we hope he gets home soon.
Thank you. I do as well. I do.
Thank you for taking the time. We really appreciate it.
Well, thank you for having me and listening to our story.
Those were just some of the updates coming out of Ohio. The governor there giving the latest on COVID-19 that he is seeing in his state, as well as giving some warnings about holiday travel and all. Live look right now at the White House as we continue to roll on here on News Now from Fox. Just a reminder, we are live, we are raw, and oh yeah, we are unfiltered as well. The transition has begun, and President-elect Joe Biden is starting to name his cabinet as President Trump vows to keep fighting the election results, and it seems like it just keeps on going. And with more updates, we got Katie Byrne live from Wilmington, Delaware right now. Katie, how you doing today?
Hey, Michael. Well, we heard about some of Biden's cabinet picks yesterday, but today we're seeing them together for the first time. And Biden spoke at the Queen Theater here in Wilmington. Summer, he spent a lot of time with his VP pick, Kamala Harris. But today, they were joined by 6 of the people he's nominating for national security and foreign policy positions.
It's a team that will keep our country and our people safe and secure. It's a team that reflects the fact that America is back, ready to lead the world, not retreat from it. Once again, sit at the head of the table, ready to confront our adversaries and not reject our allies, ready to stand up for our values.
Alejandro Mayorkas, nominated as the Department of Homeland Security Secretary. He would be the first Latino and immigrant in that position. And this is new. President-elect Biden created a job dedicated to climate change. That would be John Kerry. Now, Biden officials say next week they'll start rolling out their economic team. And speaking of the economy, right before Biden's remarks today, President Trump held an impromptu briefing addressing the stock market. Listen.
We've never broken 30,000, and that's despite every.
Now, both President Trump and President-elect Biden did not answer questions from reporters today. And as far as next steps for Biden's cabinet, he's expected to keep announcing more of those picks all the way through December. Michael?
And Katie, speaking of these picks, how soon can they be passed through the Senate when those nomination hearings get going?
Well, this is something that President-elect Biden talked about today in his remarks. Some people have been raising questions about if the Biden team will face difficulty in confirming these nominees by January if the GOP still controls the Senate. Biden said too, addressing the United States Senate today, saying he hopes for a prompt hearing and that these nominees can be confirmed so they can move forward with this transition. Michael?
Yeah, Katie, and it was interesting today because we heard Joe Biden saying America is back. Then, of course, President Trump has been saying lately that America first. So it's something as a little juxtaposition there, no doubt about it, as one is leaving and the other one is coming in, and just seeing how that is all going to be laid out there. Katie Byrne there, live from Wilmington, Delaware. Thank you for this update. We appreciate it. And we continue to roll on right here on News Now from Fox. One more look at live look at the White House here on this Tuesday as we get you all caught up on the day's headlines. But we want to go to a quick break here. Some of you will be seeing a 2-minute break. Don't you go anywhere. News Now from Fox. We're always on the other side of that break. Don't you worry. And we do have some more COVID-19 updates here for you from around the country.
Children that don't get the care they need. So this Thanksgiving, I know it's tough, but from the medical community, please stay home, stay safe, and stay virtually together. But let's not gather in person and increase the challenges we've already got. Stay safe, Washington.
Thank you, Doctor. And what I really appreciate about your message is that we all have a stake in this. It has been such a misimpression that it's just people of age who have a stake in this. It's everybody, even if they're never going to get COVID, like you said. I'm sorry to hear about, a friend who was unable to get the defibrillator. COVID, he didn't get COVID, but COVID might have been responsible for his loss because he was unable to get treatment. And that's a situation that affects all of us, regardless of what age we have. So I really appreciate your comments. We now have Betsy Scott. Betsy, looking forward to your comments.
Thank you, Governor Inslee. Thank you for inviting me. I appreciate this opportunity to talk today. I'm a nurse and I'm on my hospital's COVID task force committee. Our committee has been meeting at least twice a month since Washington's outbreak in the beginning of the year to deal with all things COVID, from shortage of masks and other PPEs to quarantine pay and staffing issues. I don't work on the COVID unit, but I've had to face down the fear of being exposed without proper PPE protection and have almost daily conversations with coworkers who go to work every day fearful that this is the day they will get sick and take COVID home to their families. Recently, my daughter and son-in-law both got sick with COVID, and the realization that either one of them may have needed to go to the ER to receive care terrified me. And although they both became very sick, neither one had to access emergency care. Thank goodness, because I know what that experience might have looked like. For those patients that do have to go to the ER, there is overcrowding and long waits, with patients being cared for on gurneys in the hallways as they wait for a bed to come up to open up in a hospital with too few staff. I imagine my 31-year-old daughter all by herself waiting to be admitted, for families not allowed to accompany patients into the hospital at this time. She is febrile, she has body pain, she's got a horrible sore throat, a cough, she's short of breath, and she's scared, and she's by herself. Finally, she's transferred to the floor that is short-staffed and where call lights take too long to be answered. 3 nurses called in sick, 2 with possible COVID, so they will be out for 14 days, and there's no one to cover them despite multiple emails and phone calls to all the staff to come in on a day off to help out. The nursing assistant assigned to care for her has 4 other patients, 2 of whom need one-on-one help to eat. So my daughter seldom sees her. Does my daughter call me as she continues to get more short of breath, more scared? Could I sit at home when she calls me crying to tell me that she's being transferred to the ICU, that she's scared, that again, she's all alone? Could I bear it when the nurses call me to tell me that my daughter's oxygen levels are dropping? There's a terrible shortage of nurses in this country. ICU nurses, because of the difficulty of the job, are amongst the shortest. We as a state are now competing with every other state for the ICU nurses out there as this pandemic fills our hospitals across the country. Our ICU currently does not have enough nurses. When my daughter, in my nightmare, gets to the ICU, the nurses haven't had breaks. They've been picking up shifts every week, working double shifts, working with a few traveler nurses who are getting paid premium hourly wages to come help us out. And they have nurses from other units who have had some training to assist the ICU nurses in the complex technical care required of ICU staff. They've been at it for 9 months. The nurses and staff are tired. They don't always see faces anymore. I hope they see my daughter's face. This was my nightmare when my adult children got sick a couple of weeks ago. Fortunately, they didn't need hospital care, but my daughter and her husband took over a month to recover and to return to work. This scenario is a living nightmare for thousands of other families and patients every day. They are living this today in Seattle, Spokane, Boise, Missoula, and elsewhere across the country. Please wear masks, everyone. Socially distance. Stay home for Thanksgiving. Allow our nurses in our hospitals, allow us to take care of those of us who need the care, and don't overwhelm us with more patients in the hospital. Thank you so much.
Thank you, Betsy. We appreciate that heartfelt description that so many families are facing right now. And I just want to thank you and your colleagues. Doctor, thank you, your colleagues. You've been called heroes, and it's an accurate description. You've been at this for so long. And I'll just tell you the way I look at this. If we ask you to go in there every single day for months and expose yourself to COVID, frankly, the least we could do is maybe defer a dinner for a while. And I hope that the more of us who do, the more of your members are going to be able to go home safely to their families. So thank you for your efforts. I want to share some good news that help is on the way. We had a good call with the federal government's vaccine team with governors from across the country yesterday. And there is a lot of good news in this regard. Vaccines are going to be ready to go. We think there could possibly be first administrations in mid-December, perhaps later December if things slip a bit. And active plans are now in place for the distribution of that. So we know that the help is going to be here in a relatively short period of time. Now that is not going to be available to, the majority of Washingtonians for some time after that. It will be into the next year. But it is not 10 or 20 years away. We have demonstrated our ability to do well relative to other states. And if we continue to demonstrate that commitment, we're going to be in much better shape when the vaccine is generally available next year, and it will be available to those in the highest priority areas in December. So there really is good news available to us to get to that goal line if we just stick together in the next few weeks. And those next few weeks, in fact, will be critical. I'd like to close my comments by congratulating President-elect Joe Biden. And I like saying President-elect Joe Biden in making the appointment of Special Presidential Envoy for Climate, former Secretary of State John Kerry. I think this is a tremendous thing for the country in a number of aspects. One is the obvious international credibility and talents of John Kerry, who's been working on this subject for decades, who has been instrumental in some of the international work together that has happened already. But the best thing is by putting a person of this level of commitment and credibility in this internationally important post, it demonstrates that America is back. And when America's back, we've got a much better chance to beat climate change. And this also demonstrates President-elect Joe Biden's firm, unalloyed commitment to fighting climate change, to make this appointment. So I could be not more delighted in this, and I think it bodes very well for what this administration will be able to accomplish. With that, I will be happy to yield for questions. Kathy Lofi is also with us if there are questions, or Dr. and Betsy will also take questions. Fire away.
All right, so they're going into the question and answer round there in Washington. We'll check back in there a little bit here on News Now from Fox, but I do have some news that I want to report to you. This one coming from President Trump's legal team and the campaign, revolving around Pennsylvania, Arizona, Michigan legislatures to hold public hearings on the 2020 election. So let's get the very latest. This is from a President Trump campaign release saying that the Donald J. Trump for President campaign legal team today announced that the state legislatures in Pennsylvania, Arizona, and Michigan will hold public hearings on the election beginning tomorrow and next week in an effort to provide confidence that all of the legal votes have been counted and the illegal votes have been not counted in the November 3rd election. The first hearing held by the Pennsylvania State Senate will be conducted tomorrow, Wednesday, November 25th in Gettysburg, where each participating senator will give a 5-minute opening statement followed by testimony from witnesses who have filed affidavits attesting to 2020 election fraud. Tomorrow's hearing will also feature a presentation from former New York City mayor and personal attorney to President Trump, Rudy Giuliani. On Monday, November 30th, the Arizona legislature will hold their own hearing, followed by the Michigan legislature holding their own hearing on Tuesday, December 1st. Details for both hearings to follow. It says in the release, it's in everyone's interest to have a full vetting of election problems and fraud, said Mayor Giuliani, and the only way to do this is with public hearings complete with witnesses, videos, pictures, and other evidence of illegalities from the November 3rd election there. So we will definitely be keeping an eye on all of the movements that come from this, and any coverage that we have for you, of course, we'll bring that to you right here on News Now from Fox as well. So we got full updates here for you. You know, News Now from Fox, we show it to you live, raw, and always unfiltered. And when that does pop up, we'll bring it to you here on News Now from Fox. Wanted to get that big breaking news there into you right here as we continue to roll on right here on News Now from Fox, everybody. I got some other news here regarding the CDC, and potentially they might be having some news about changing the quarantine status, about the length there. So we're going to bring that to you right here with this next update, as the CDC considering shortening coronavirus quarantine period. The Centers for Disease Control and Prevention is considering shortening the current coronavirus quarantine timeline from 14 days to between just 7 and 10, according to an exclusive Wall Street Journal report. The agency reportedly hopes the change will inspire more people to comply with the guidelines. In a statement provided to Fox News, an agency spokesperson said no such changes have been finalized. CDC is always reviewing its guidance and recommendations in the light of new understandings of the virus that caused COVID-19 and will announce such changes when appropriate, the spokesperson said. Henry Walk, the agency's incident manager for COVID-19 response, reportedly told the Wall Street Journal that the new guidelines would also include a test to ensure a person is negative for coronavirus before ending quarantine. He said that once the test is negative, the probability of the person going on to develop the infection is pretty low. So as this pandemic has been going, we've been seeing several changes from the CDC as it continues. If you remember, when the pandemic was first going, there was not a mask mandate in many states, and now that is what we are seeing right now. So could there be a pullback later? Yeah, you just have to wait and see what the science says behind it. So we'll continue to follow that here for you on News Now from Fox. And a reminder, everybody, it was a big record today. 30,000 there on that Dow as it closed up. 30,046 was the final for that closing number. You know what we're going to do? We're going to take a quick 2-minute break, but don't you worry. On the other side of that break, yeah, there's more news. There's more exclusive video, and of course, we got you covered as always. Unfiltered, checkmark. Raw, checkmark. We got you covered right here on News Now from Fox, everyone. For those of you that are staying around, and we know you would, let's continue on right here on News Now from Fox. Let's take you back out to Washington. Looks like we're getting a question and answer round continuing.
Next question comes from Joe with the Seattle Times.
Yeah, question for Dr. Schlicker and Dr. Lofi. If you see cases continuing where they are for another 2 weeks, 3 weeks, what will be the situation with hospital staff across the state in terms of having enough people?
Dr. Lofi, why don't you take that first?
Sure. So I'm very concerned about the trajectory of our current outbreak. The governor didn't show you the graph that we have today of the number of confirmed and suspected patients in our hospitals. And that graph is increasing very steeply. And I'll show you that tomorrow during our press briefing. And we're very concerned about what this is going to mean for our hospitals. As you know, our hospitals have just started to, delay some non-urgent procedures. If this trajectory continues, they are going to need to probably delay most of their surgeries and really only do sort of those most critical surgeries, that need to be done right away. So I'm very concerned about that because, as Dr. Schlicker said, that means people are not getting care that they need. So that is what is going to happen probably next over the next couple weeks. And then, the other thing that hospitals are able to do is that they all have surge plans in place, and those are plans to care for more patients than they normally do. They would initially start cutting back on almost all, procedures that can wait, and then implementing those surge plans to see more patients than they usually do.
Dr. Schlicker?
Yes, thanks. Dr. Lofi laid it out quite well. What today we can hold off on that are non-emergent cases, that definition and that delay becomes so much more. And non-urgent doesn't mean not important. I can't stress that enough. Whether it's a defibrillator that we think today we can put off, eventually that's necessary. It's needed care. If it's a hip replacement or a knee surgery, those kind of surgeries are important to the people that are living with that chronic pain. And I know, Governor, you've spoken about it in the past. We know that in this pandemic, people are suffering, with chronic pain, that addiction is going up, and there are a lot of other downstream consequences. So I think it's really important that while we talk about, yes, we can buy some space by limiting surgeries, we're buying space and we're buying time for us to rally as Washingtonians to do the right thing. If we don't do that, IMHE and others predict our peak isn't until February, and eating up far more than the available space in our hospitals. So I would say that all the things we're doing now are to buy time for all of us to rally together, not to ignore the problem that's before us. So again, mask up, stay distant, have a lovely Zoom Thanksgiving, and gather next year.
Yeah, if I can add to this, the weight that is on our shoulders right now is the knowledge that unless something changes in the course of this pandemic, we will reach a situation where hospitals not only have to deny people care for a whole multiple of things, cancer treatment, defibrillators, hips, knees, you name it, but they will also have to move into a critical care situation where they simply cannot provide care for critically ill people whose life is threatened. And we'll have to move to some degree into a triage situation to see who can get that adequate care. And that will happen unless this trajectory of this disease is changed in some fashion. We cannot allow that to happen in our state. I do believe that, and we've looked, we're asking the Institute of Disease Modeling to give us more projections on this. But from my observations, in December some point, unless something changes, we very well could be in a situation that with catastrophic loss of medical care in the state of Washington. Dr. Schlicker, do you want to talk about this, the critical care decision-making situation where you move into?
Yeah, the triage and crisis standards of care is something that we have thankfully been able to avoid to date. And we've talked about it often when it comes to equipment. You know, who gets the last ventilator, who gets the last ICU bed. But I think what Dr. Lofi and all the disease modeling have talked about is that it's not just equipment, it's space and it's people. Surge plans, Ms. Scott described it so well. You know, the overworked, overstretched nurses can only answer the call light so fast. We can't multiply and divide nurses. We can't simply toss another body into the problem. We have to recognize that at some point, if we don't change the trajectory of this disease, we're going to be making choices that people are going to be uncomfortable with, that will leave a permanent scar on those that have to make those hard decisions. You know, I think all of us felt that grave concern in April when we hit our first spike, and we're grateful that we came down. But this peak is not demonstrating that it is going to relent in any way. It continues to climb and grow, and our people are just under such strain. And that triage mentality and that crisis standards of care will be something that will be hard for the people making those decisions, and will be hard on the families to hear that their loved one doesn't get something that they feel is needed. And you know, we know that's limited resources. You can take anything. ECMO, there's very few beds for ECMO in this state. Extracorporeal membrane oxygenation. You know, there's going to be tough choices to be made there. There's going to be tough choices about who gets an ICU bed. There's nothing more to say than we got to change it, or no one's going to like the decisions made.
By the way, if I may, you know, these are not easy things to talk about before we head to the joy of Thanksgiving. And there is a reason to have joy with our loved ones, even virtually. But it is necessary, and if we do look ahead, which we do so well in the state of Washington, we always look ahead. If we look ahead, we got a really good shot of avoiding those consequences. And that's why we're sharing this information with citizens today.
Joe, would you like to ask a follow-up?
Yeah, Governor, if what you described is accurate and the state faces a critical medical care shortage in December, we're talking just a matter of weeks. So what sort of plans or steps are you thinking in terms of calling in federal resources like the military to help staff medical units?
Well, all I can say at the moment is it is a potential option for us. We don't have current plans to ask for a specific number of nurses. At the moment, that is not necessary, because what hospitals are doing is starting to defer and delay the other surgery that is not as life critical. So they're dealing with this problem by denying people health care that they otherwise would have available. That's very painful to these patients right now. But they're sort of creating capacity by stopping, at least delaying some of these processes. So, you know, that can buy us some period of time, a couple of weeks, maybe 3 weeks. But at some point you have to get additional personnel into the system. So I can't tell you when or how, but it is in the future if something doesn't change.
Next question comes from Keith with Como.
Yeah, Governor, given the dire situation, is there any consideration that your 4-week period is not going to be met, that you're going to have to extend the restrictions on restaurants and the bowling alleys and gyms Or is there a possibility that you could open up some of the gyms and some of the bowling alleys, since they don't gather, like you said last week, they don't get together in close proximity?
So in answering that question, I want to refer to the data. Can we put up the graph, the graph showing the infection rate? So this is a graph showing the infection rate on a sort of a per capita basis in the state of Washington. And you see that it's almost heading straight up right now. What I can tell you is that we cannot tolerate the continuation of that straight up curve for very much longer. And what we have done is we have had targeted reductions of social interactions in the hope that we can change the slope of that curve. It is not what we proposed in March. In March, we essentially had to shutter vast swaths of our economy and ask people essentially to stay home unless they were involved in some essential activity. It worked. We actually have not done that to that extent this year or this month. We have instead had a more limited and more targeted approach to try to reduce those interactions in restaurants and gyms and bowling alleys and social settings and households, if people follow our advice and the rule right now. We've had a much more targeted approach. We are hopeful that that more targeted approach can bend that curve down. But if it does not, we will have no other option but to extend those restrictions to other parts of our economy. There will be no other option available to us. We've already adopted successfully this masking campaign. It's been very successful. It's kind of a bullet we've already fired. We've got vast swaths of people wearing masks, and we think that has helped. It's one of the reasons we're in the top 5 or top 10 states in the country to keep this pandemic at relatively low numbers. But in answer to your question, I cannot predict the future. It is possible that these could be reduced in restrictions. It is also very possible that they will be increased in the event we cannot bend that curve down, because we will not have any other option available to us. We cannot have people dying in the parking lots of our hospitals in the state of Washington. That will not be acceptable to us.
Keith, would you like to ask a follow-up?
Given the dire situation for the restaurants, is there any consideration of bringing the legislature back in for a special session to extend the amount of money that would be going to them? Oregon, Colorado, several other states are already back in special session.
I think I heard your question. As you know, we have already taken action. I already made a decision after talking to legislators to extend $135 million of benefits to some of these affected business folks. And we will also have, and this is forgotten, it's not just the business owners that are affected by these restrictions, it's the employees. For every business owner that's having difficulty, there's, 10, 20, 100 employees that need assistance. And we need to make sure those folks are cared for. And we need to look at ways to make sure that the unemployment compensation is extended and the PUA federal benefits are extended as well. And so we are talking to legislators to see what ideas they have to accomplish those ends. But we'd obviously need to have an answer to that before we call it a session. And we are also continuing to push the federal government to act, to extend these benefits, including help for businesses. So work is underway. There are conversations every day with legislators. I talk to them every day. And those options are still being considered.
Next question comes from Laurel with the Spokesman Review.
Yes, this question is for Dr. Lofi. Do you know the percentage of COVID cases that do require hospitalization at this point? And at what point will we start to see changes maybe in that data based on the restrictions from last week?
I don't know offhand the proportion of our cases that are requiring hospitalization. We'll have to get back to you over that with that information. But in terms of the time frame for seeing effects in our data after measures are put in place, I mean, it's typically at a minimum about 3 weeks. Because when you think about it, you know, the person who gets infected today, it will take another 5 days for them to develop symptoms, and then it'll take several more days for them to get tested, get a test result, and have that result come to us. And then, you know, as we've looked in our data, you know, we don't get all the data in, you know, the data from the last, you know, several days is often not complete. So generally, we need about a 3-week time frame. But sometimes we need even longer than that to really be sure of a new trend. Because if things do start to level off or things do start to go down, you know, we like to see that for probably 2 weeks to be confident that that is the new trend.
Yes, Governor, you mentioned last week the importance of not getting a test just to go to Thanksgiving. Do you know, has there been any limits on testing capacity? Are there any strains there? And have there been some of these long lines that we're seeing across the country now that we're 2 days away from Thanksgiving?
I believe there have been some longer lines at various facilities, but we are doing sometimes 30,000 tests a day. So those tests are getting done. And yes, I do think it's helpful if people don't get a test just to go to Thanksgiving dinner. It's better to have Thanksgiving dinner and communicate virtually. That is a better position. So we're asking people, if the only reason you're getting a test is to go to Thanksgiving, please do not do that. Please figure out a different way to enjoy Thanksgiving and let that limited testing capacity used by people who might have symptoms, might have the disease. We are asking people to do that, and I hope they'll listen to us. Kathy, do you have anything to add to that?
Nope, I agree. Best thing to do on Thanksgiving is to stay home and celebrate with your immediate family.
Next question comes from Simone with Q13.
Hi, Governor, and everyone. Thanks for the time. Regarding the field hospitals, Governor, as we look to see our hospitals start to reach these surge plans and reach their capacity, we're in a much different position than we were back in March when field hospitals were first brought to our state, when we were the epicenter of the outbreak in the beginning. Is there concern that we're not going to be able to get the federal help that we may need if this trend continues, considering there's so many states in more dire situations than ours?
Yes, that is a very legitimate concern, because individual states could look to other states for help or the federal government early in the pandemic. But now that this is swept across the whole country, that reserve capacity no longer exists. So that very much is on our minds, and that's why we hope people don't have Thanksgiving dinner with folks outside your household. And that's the best thing we can do right now to prevent that emergency from occurring in our state. And by the way, I want to reiterate, this is not just a prospective issue. This is happening today. There are hospitals planning to reduce normal medical procedures for us today. And if you look at these curves, we just don't have any more time to act. And by the way, if I can, just share a little bit of frustration here. I heard a woman screaming out in the street the other day in a megaphone saying that COVID is the biggest scam in American history. It's very difficult for me to understand that, given what you see in our hospitals today in the state of Washington, and look into the faces of the people who have lost their family members. I heard a nurse the other day just breaking down in tears because she'd been dealing with this pain for 8 or 9 months now. It's very difficult for me to understand people who just blow this off. I can't understand that. And I just hope that people care enough about their loved ones that they will want to have the biggest Thanksgiving celebration in human history next Thanksgiving, which you can't do if your relatives aren't alive. And I just am asking for people to think seriously about that in the next 48 hours.
Simone, would you like to ask a follow-up?
Yes, Governor, I'd like to follow up a little bit on what you're talking about, because while it may be baffling to you, there are a lot of people out there that are not taking this seriously and are not taking your restrictions seriously. Back when you first implemented stay-home orders, the biggest success of the state in being able to turn the curve in a different direction was people following those restrictions. We haven't seen that kind of response happening this time around, even though you've already implemented many of those same restrictions. What's left in your tool belt to handle this if people continue not to listen and we see really dire situations in our medical field?
Well, all is not lost. Let us remember that we have had relative success. As I indicated, the New York Times did a survey of something like 200,000 Americans and concluded that Washingtonians are the smartest, because we are going to have the fewest people who are not complying with our household gathering limits. We have the most people who are showing that they love their family members by not having big Thanksgiving dinners. So we have had actually the most compliance of any state in the United States. We ought to celebrate that. And we ought to just use that to try to talk to the other folks that, aren't quite there yet. This is new to us. It's not surprising that people find some of this work difficult. First off, it's been a long time. It is something we've never had to do before. I'm 69. I've never had to think about not having Thanksgiving dinner. That's a new experience. So it's not surprising, and we just have to keep talking to people, sharing information, and hope that the sense of love for their loved ones kick in here.
Next question comes from Austin with Northwest News Network.
Hi, Governor. Along those lines, this is really a question about who the messengers are. You've had today a doctor and a nurse. Previously, you had Mayor Durkin and King County Executive Constantine. But where are the Republicans? Where are the Eastern Washington Republican voices, perhaps, that might be more compelling to those who are not compelled by what you're having to say, and perhaps not compelled by what the mayor or the King County executive have to say?
Well, I would love to have more Republican voices helping in this, as you know. There's been a couple. County Executive Dan Meyer had some relatively gracious things to say about our last decisions. So, there's been a few Republican voices that help us. What happened early in this pandemic, we were having a lot more Republican help in this regard. Which was really gratifying. But I'll tell you what happened in this, which is very disappointing to me. The day that Donald Trump tweeted, "Liberate Michigan," when Gretchen Whitmer put some restrictions on to save people's lives in Michigan, that was then followed by allegations of people who wanted to threaten her life. The day that happened, the Republican support across the nation evaporated to help us, and it's been very disappointing. We would love to have Republican folks speak more broadly in this and offer their ideas about how we reduce this pandemic. And it has just been crickets from them, and I'm disappointed by that. I heard the Senate leader the other day say something to the effect that, this is not an emergency. I have a hard time understanding that given the nature of our losses. I talked to J.T. Wilcox. I appreciated every conversation I have with him. He said that he does look for ways to share information with people that this is a serious issue. I appreciate his comments to the extent that he has said them. But we could use a lot more Republican help to stand up and frankly support some of these tough decisions. These decisions are not easy. And it would be most gracious of them to support issues that are going to save people's lives. So I welcome it to the extent it has happened. As I mentioned, Representative Wilcox, I thank them for it. But it's not for a lack of trying. We try as well as we can to get every voice we can. Now, I'm hoping that when Donald Trump leaves the White House, as he will, that Republicans will feel more free to express what might be their personal views, that we do have to be responsible against this virus. So I'm hopeful that that will allow Republicans to step up to the plate more.
Austin, would you like to ask a follow-up?
I would, and this is kind of a related question, and it just has to do, I know you've been asked a lot about why not a special session, why haven't you called a special session? My derivative of that question is it's a balancing act question. Why, I know you need to navigate an emergency, and part of why you have executive authority and emergency authority to do that is to, when there's an emergency, not have to go through the legislative process. But it's been 269 days since you first declared a COVID emergency. That's about 3/4 of a calendar year. And you know how strongly worded our Constitution is about the consent of the governed, and that all power is inherent in the people. So how do you balance that from where you sit in terms of incorporating the will of the people and their representatives in the legislature with also the need to act in an emergency fashion?
Well, listen, I will be happy to call a special session when two conditions exist. Number one, it's necessary. And number two, we can have a belief that it will be productive. And when those conditions exist, I'm happy to call a special session. To date, it has not been necessary because we have been able to act with considerable success. Now, you've heard me say this before, but I'm going to say it because I think it's important. We are in the top 5 states in the United States in beating this pandemic, top 5. And the reason for that is that we, as a state, have made decisions to fight this pandemic rather than give it up. And, frankly, one of the parties wanted to give up. We're not going to give up against this pandemic. No, sir, we're not going to do that. So we are committed to fighting this pandemic. And so far we have been markedly successful relative to other states with the decisions. And we were able to do that. It did not necessitate legislative action. Secondly, you have to have a plan to make a session successful. And we have been able to date, there hasn't been a need that a legislative session could fulfill. And that may change. So because we had some restrictions, we know we want to help businesses and employees. And I was able, without the necessity of a special session, to bring to bear $135 million. Other governors have not been able to do that. They had to call a special session to do that. I was able to do that under the current situation. Now, going forward, we have some challenges that will need legislative action. We will need action to, in my book, help employees that have been unemployed as a result of these most recent restrictions. And there might be about 200,000 of them. And they will be losing unemployment compensation at the end of the year. And gig workers under the PUA federal plan will also lapse at the end of this year. We will need, I believe, and we're checking on this, but it is likely that we will need a legislative session to solve that problem. Now, that's not a sure thing because we are now examining some pockets of resources that might allow us to help these folks even without a specific legislative action. So it may be necessary, but at the moment there isn't a plan to do that the legislature is capable of passing that is necessary that I couldn't do myself through these actions. So those are the reasons. I will also note that to some degree, had we called a special session earlier in the year, through no fault of their own, we would have made some bad decisions because frankly, we would have made decisions. Folks wanted to cut social services to needy families, many of whom are hungry right now, in the middle of a pandemic. And it turned out we didn't need to do that because we've got better economic conditions. We've got some, we've had probably $2 billion of new projected revenue since that time. And so decisions would have been made on false assumptions economically. So the decision not to do it earlier, I think, has been vindicated largely by results. But I want to reiterate, I talk to legislators virtually every day. And if they are proposing things that can pass the legislature in a timely fashion that we can't solve otherwise, we'll continue to think about that. And that includes help for the business community as well, because we know the business community has had real significant losses as a result of this pandemic.
Next question comes from Carolyn with the South Seattle Emerald.
Hi, yes, Governor. I wanted to ask, it's obviously very difficult to enforce masking and non-gathering rules amongst individuals, but are there any plans to increase the labor and industries investigated and pursue more active enforcement rather than reactive enforcement to ensure that businesses are following masking and distancing rules?
We actually had a meeting with our 4 agencies this morning on this subject, and we have new ways to bring more efficiencies to the enforcement process. And I think you will see shortened periods of time that now are still consistent with the law. If there are businesses that are unable or unwilling to comply, there will be enforcement. It probably will be more rapid as a result of bringing some efficiencies to the enforcement action, because we really, the vast majority of businesses are complying with these rules, and it's not fair to them to have other businesses ignore the law. So you will see increasing enforcement of these actions, of these requirements.
Carolyn, would you like to ask a follow-up?
Yes, this one is for Dr. Schlicker. I was wondering, you referenced painful choices that hospitals will have to make if things don't change. What are those painful choices? Are you kind of talking about things like we saw in Europe where healthcare workers had to make some really difficult choices and not provide appropriate care or enough care for older folks?
I think that's what we've all feared since the beginning of this pandemic, and great work was done under the leadership of the Northwest Health Response Network and others to establish what's called the crisis standards of care, which says when resources, whether that be machines, people, space, or others, become limited, how do we decide who gets what care? And those are the tough choices. It's not just older folks, it can be those that may have the least likelihood of survival. And that becomes a very complex question about how do you decide if you've only got one ventilator left, one ICU bed left, one dose of a medication left, who gets it? Because I don't think any of us want to play God in this world and have to make that decision. And I'll tell you, as an ER doc, having done disasters in my career, you're always balancing the challenge of triage, of sometimes not being able to be in every room when you're the only doctor on, and the difficulty that is. But I've never had to proactively decide, no, you're not getting a ventilator. No, you're not getting this care because I only have one and I have 2 people to choose from. So it's a very different thing to go from a world where we are making hard choices, running as fast as we can because of limited resources and an unforeseeable disaster, and going into a world where we can see the disaster happening and having to make awful choices. So that's what we're talking about. We're talking about things that, will truly tear apart those that are going to be making those decisions.
Time for one last question. Final question comes from Jerry with the Everett Herald.
Governor, I wanted to ask about there's still some federal money under the CARES Act the state has to spend. I'm wondering, what are your plans for that money? How much of that might go into assisting with the contact tracing efforts, hiring of nurses, et cetera? How will you use the money?
We have not made final decisions about that. The Department of Health will have a briefing tomorrow about some of our contact tracing effort. I think you'll find that of interest. So we just have not made final decisions. I'm glad that we have held some money in reserve. Some folks wanted to spend all of that money months ago. We were criticized for not doing that, but I'm glad we held some in reserve now. I think David Schumacher's advice was really good to the state in that regard, so that we have some of this available for these needs now. So we'll make those decisions, obviously, in the next couple of weeks to make sure that that money is invested. It has to be spent out the door by the end of December, as you know. So we will make those decisions in the next several weeks. There's still, as you can imagine, all kinds of priorities for this, from assistance for hospitals to contact tracers to vaccination planning. There are many, many claims to help for businesses. We have been able to free $135 million for businesses, as you know. So stay tuned.
Jerry, would you like to ask a follow-up?
If I could, related to the restrictions, I wonder if you could tell us what your conversations have been like with the tribes. We have areas like the Quilceda Shopping Center where the restaurants are still providing indoor dining, stores are, following their rules and not your restrictions. So what conversations have you had and what are you asking them to do?
Well, I have talked about the science to make sure that they're aware of the science that any indoor person-to-person unmasked contact for length of time is a transmission risk. And I've shared with them that that is a transmission risk of significant degree. And obviously we would hope that they would join us as much as possible. But as you know, that the tribes are not subject to my jurisdiction. No matter how many times you ask me this question, it's not, that can't change. So that's what we've talked about. No, just one comment. I was thinking of Austin's question about special session. I do want you to know that if this changes, look, neither the leadership of the Senate or the House have asked for a special session at this time. They haven't seen a reason for it or an ability to produce a product at the moment. So there is not a request by the legislature to have a session that would be productive. But if that changes, we will talk to you. And as I've indicated, we do have needs that have to be met and need to be met. And we are searching for ways to do that. And that work is ongoing literally on a daily or hourly basis. So don't think that this work is not going on. It's going on, and it will reach fruition. With that, happy Thanksgiving to everyone. Take care.
All right, and that was the Washington State coronavirus briefing that we've been bringing you for about the last 30 or so minutes from Governor Jay Inslee in the state of Washington. So we'll be following a lot of these discussions and press conferences out of these states throughout the late afternoon, early evening here. We also just wanted to remind you, you're watching News Now from Fox. Everything's live and everything is raw, and it's unfiltered as well. And there's no opinion, there's no bias. We just give it to you straight here, live events as they happen. So we want to thank you for watching. I'm Andrew Kraft. We're going now into the almost 5 o'clock hour here in Phoenix, Arizona. So wanted to break it up just a little bit and take a quick commercial break. So some of you will see this, but we'll be back in 2 minutes. Stick with us. And welcome back. I'm Andrew Kraft, like I just said, and we wanted to just update some more news on the Biden-Harris transition. We're just getting some word that President-elect Joe Biden will deliver a Thanksgiving address to the American people tomorrow, Thanksgiving Eve from Wilmington. So we'll bring that to you here on News Now from Fox when it happens tomorrow. We hope you enjoyed the pardoning of the turkeys from earlier this morning at the White House with President Trump and the First Lady there. We're going to stick to some coronavirus news as well. We have not showed you the update out of Chicago, out of the Windy City from earlier today. And remember, Mayor Lightfoot issued that stay-at-home order just on the 16th for the city, just 2 weeks before Thanksgiving. And in addition to that stay-at-home advisory, excuse me, it's not an order, it's just an advisory. It's also imposing new restrictions, limiting meetings, limiting gatherings, limiting social events to 10 people, both indoor and outdoors. So we're going to hear what Mayor Lightfoot had to say from earlier today out of the city of Chicago.
Impact on our local economy, but also serves as an extension of our values and shared commitment, continued commitment to equity, inclusion, and transparency. With the passage of our 2021 pandemic budget, we have done what is right for our residents and taken a critical step in our journey toward becoming a stronger, more resilient city. I have said before, and I say again, continued commitment to equity, inclusion, and transparency. Can you turn that off, sir? Are you ready? I've said before, and I will say again, this is not Mayor Lightfoot's budget. It is a budget by and for the people, a budget created and shaped by our entire city through their individual input and through that of their representatives. I want to first thank Chairman Pat Dow for her extraordinary leadership and support over the course of this difficult year. She has been a true champion of collegiality, transparency, and importantly, listening to her colleagues, but importantly to the people of Chicago. Pat, I want to thank you for facilitating almost 600 requests for information to the chair and your tireless work and helping us respond to the request from the members. I also want to call out and thank Chairman Scott Wagasback of the Finance Committee for his leadership and helping guide and explain the challenging fiscal challenges, not only of today, but of tomorrow. I appreciate his understanding and his leadership and his fierce advocacy that kicking the can down the road is not a responsible way to govern. I want to also especially thank and acknowledge our Florida leader, Chairman Gil Villegas, Sue Sadlowski Garza, Chairman Taliaferro, Chairman Cardenas, and also Alderman Irvin, King, and Haddon, as well as those who voted yesterday. Thanks to your invaluable teamwork and a collaboration of other leaders and residents across the city, this budget will close an unprecedented $1.2 billion gap. I also want to personally thank the men and women of organized labor, and particularly Bob Ryder of the Chicago Federation of Labor, for all of your efforts. We are on a journey together that is far from over and will require us to listen to each other and find common ground on the road ahead. A special thanks should also go to our budget ambassadors who volunteered to be part of this historic process, who convened community members and friends to talk about the budget, and who brought that feedback directly back to me. Thanks to the budget ambassadors for your invaluable work on this 2021 budget. This budget was also developed with extensive community input, and I want to express my deep thanks to the scores of residents and stakeholders who spoke up to share their perspectives and ideas on how the city spends its money and hard-earned tax dollars. And this includes the two women who are with us here today. Adrienne Johnson, UCAN's Vice President of Violence Prevention and Intervention Services, and Samantha Mitchell, COO of TCA Health for Mental Health. I also want to give my heartfelt thanks to my incredible finance team. Budget Director Susie Park, Chief Financial Officer Jenny Wong Bennett, and Comptroller Reshma Soni. And a special thanks to the members of the Intergovernmental Affairs team led by Deputy Mayor Manuel Perez, who received a battlefield promotion and stood tall in this moment that challenged all of us. I also want to call out Jarrell Dawson and the rest of the IGA team members for the incredible work that you did over the course of many, many long hours, days and nights and weekends. I also want to thank my Chief of Staff, Maurice Clausen, who guided the ship of state through many difficult storms. And as he has counseled me many times, the only way forward is through. And to all of you, on behalf of the entire city of Chicago, I want to say thank you. As we've said many times, budgets are more than just math problems. Settling on a modest, budgets are more than just math problems. They are statements of our values as a city and a community of nearly 3 million people. For this budget, that meant finding solutions in the face of unprecedented challenges that were not only fiscally responsible, but also met our obligations to our families and businesses who depend on the vital services of that our city provides across many, many departments and infrastructure, across youth and senior services, across mental health, affordable housing, and so much more. Doing that in any year is a challenge, but this year required an effort unlike any that we've seen. Nearly 2/3 of our record $1.2 billion budget gap was tied to COVID-related impacts. And I want to talk about the things that we did, even in the midst of this big budget challenge, to show that we did not abandon our values. We created more than $500 million in structural solutions to build on our ongoing government efficiency goals. It's through the spirit of togetherness that we were able to take this pandemic as a once-in-a-lifetime chance to begin righting the wrongs that have prevented far too many of our residents from attaining their God-given potential, resulting in $36 million in investment towards violence prevention, $38 million investment in programming for our youth, $20 million separate funding in continued support of our mental health framework. And through collaboration, the promise of an alternative responder model that will move us closer to non-law enforcement mental health response when our residents are in need. Credit goes to the Department of Public Health, Commander Orsetti of the Chicago Police Department, and many aldermen, including Alderman Haddon and Hairston. All of us know that when we invest in our residents, we invest in our city as a whole. And these are just some of the many investments that this budget makes in our people, including our most vulnerable residents, who we can never abandon, no matter what the circumstances. Our values of equity, transparency, and inclusion shine through this budget like a beacon of hope to our residents who are most in need. What we have done this year to stand up and make sure that we leave no vulnerable resident behind continues into 2021 with the passage of this budget. We have leaned into our values and not abandoned them for more luxurious times. We have said, no, we must support our residents who are most in need, and that's what this budget does. By answering the cries of our communities and seizing this once-in-a-generation opportunity to move our city forward. That is why, despite the extraordinary challenges presented by this budget, we not only successfully closed our record budget gap, we did it in a fiscally responsible way. As we're all aware, in this extraordinary year also required us to make a modest increase in property taxes. And I've said it before, property taxes have to be a last resort. But in this last resort kind of year, we worked hard and came up with a proposal regarding the property taxes that will help us climb the necessary ramp to make sure that our pension funds are fully funded and that we keep our promise to our retirees. Even as we did so, we did this in a way that was in line with our mission to create structural solutions by tying all future property tax increases to the Consumer Price Index, a modest increase averaging about 1.8% over the last 5 years, enabling us as a city to move away from the cycle of no years of tax increase because it was too politically hard, followed by a surge in historic numbers due to the crisis of our own creation. We have to move away from those days, and with the passage of this budget, we do just that. We instead provide businesses and families with new financial stability and knowing what their budgets will look like in the years in advance in a transparent and predictable way, which is exactly what they deserve. I understand that this issue in particular was difficult for many in our city council, and you heard that expressed through the budget debate today. But I also want to thank those who did not vote for the budget. We have to move forward together, and you heard this from a number of members. We have to make sure that we continue to look for ways to find common ground, even with those that we disagree with. I spoke with throughout this process many people who we have not agreed with, but because that was the right thing to do. I said that when we announced the budget forecast on August 31st. I continue to be committed to that, even people that I disagree with. Even those who have a very different sense of the style of government, what our obligations are as elected officials. We will continue to have open ears, open heart, and open dialogue as we move forward. That's why I want to thank those city council members once again who made the difficult but right choice in voting for this budget. Now, how do we move forward? The only way is together, shoulder to shoulder, into 2021 and beyond, to take on these new challenges and find new solutions on this incredible journey to transform our city into one that is more equitable and inclusive for all of our communities. That work must continue. I said this last month. Our work for 2021 doesn't end with the passage of this budget. Now is the time for us to keep working, to make government run more equitably and efficiently, to create new opportunities for good jobs, and open more opportunities in the trades for women and people of color. We have many, many challenges that lie before us on our journey towards a more perfect union. I look forward to working with all of you to make that journey one that we can all be proud of. Public service is about collaboration and partnership. It's about sacrifice and putting country and city over self. By holding to our core values and shared commitment to the common good that has guided us through our path and will continue to light our way forward in the months and years ahead. Again, I want to thank everyone once again for continuing to stand up for what makes Chicago great, for all the challenges we have faced. I am certain that generations from now will look back on this moment with a measure of appreciation and pride. And through our passion and God's grace, we will see ourselves through the rest of this crisis and build the great future that lies ahead for all of us, for generations to come. We must stand tall and meet these challenges head on. That is what we must do as elected officials, as leaders, as stakeholders, as residents of this great city in order to move us forward. We owe this not only to this time, but we owe this for the future that we are creating for our children and for their children. Being a leader is never easy. It's particularly not easy in a time like this. But I can tell you that I am humbled every single day to be the mayor of this great city, to work in collaboration with so many brilliant and innovative people in and out of city government. What I say to all of you is onward. The journey continues. And now it's my pleasure to welcome Adrienne Johnson to the podium. Ms. Johnson, the floor is yours.
Thank you. Thank you, Mayor Lightfoot. My name is Adrienne Johnson, and I get the opportunity to serve as the Vice President of Violence Intervention and Prevention Services at UCAN every day. I'm here to commend the mayor, her administration, and the city council, the aldermen of the city council, on passing a historic budget. Sorry. This budget is more than just dollars, actually. It provides us an opportunity, people who work in community, an opportunity to give young people a way forward, right? And it also gives me at UCAN and our staff at UCAN an opportunity to give young people a youth development coach. It gives us an opportunity to do street outreach and violence interruption, as well as career development, and offer our young people and residents in our communities clinical services. So as we move this work has been done for so long, for decades, without any help from the city. So during this time, this historic budget pass is one that I'm personally very excited about, and I really believe that it will give young people in communities an opportunity to move forward, to be great, to be everything that they were created to be. And in 2019, the mayor passed an $11.5 million budget, and now for violence prevention. And now in 2021, it's a $32 million budget. And I just want to say thank you. I work in communities that have, that people kind of throw away. Young people get thrown away all the time. And so I just want to say thank you, not just to you, but to the aldermen in the city council for thinking about people who are often not thought about on a regular basis. And it not just give them an opportunity to move forward, but it also gives the residents in those communities an opportunity to feel safe. And everybody in every single community wants to feel safe. And this gives us an opportunity to do the work, to continue to do the work that we love doing every single day. And with that, I just want to thank you again. And I want to introduce Veronica Clark.
Thank you. Thank you. Thank you.
Good afternoon, everyone.
Good afternoon.
So I'm Veronica Clark, and I'm the Chief Executive Officer at TCA Health Center. Thank you, Mayor Lightfoot. And I also want to extend a thanks to, they're not here, but Matt Richards and Dr. Arway and the entire Chicago Department of Public Health for selecting TCA Health to be part of the City of Chicago's trauma-informed network of care. With the passing of today's budget, we're excited to do our part to make the City of Chicago a national leader in trauma-informed care. TCA Health is celebrating its 50th year anniversary of providing co-located primary care, behavioral health, and dental care and support services on Chicago's far south side. We're a federally qualified community health center, and we're located in Riverdale and in Chatham, two of Chicago's communities whose population are predominantly Black or African American, and they're also low income. Health disparities run deep and are among the highest in our city. And our high rate of chronic health disease, of course, and the health disparities are also affecting us. We've had even a higher rate of COVID-19 in the areas we serve. TCA Health provides integrated behavioral health services that meets the needs of residents in our service area, that are culturally reflective of the people we serve, and that are high quality and barrier-free. TCA Health serves anyone in need, regardless of their ability to pay. In addition to our two health centers, TCA operates a school-based health center located in Carver Military Academy, a mobile health clinic, 4 WIC sites, and an expansive health and wellness initiative. TCA Health beginnings were in the Otgell Murray Homes public housing community. And in 1997, our health center relocated and is now adjacent to the housing complex. With the passing of today's budget, TCA Health is grateful again to Mayor Lightfoot. Thank you. And the City of Chicago for this great award that will allow our organization to become a trauma-informed center of care. With a COVID-19 lens, TCA plans to utilize a multifaceted approach to building capacity and expansion of trauma-informed behavioral health services offered to residents in the Riverdale and Chatham communities. We plan to employ a comprehensive effort to build trauma-informed workforce by providing trauma and self-care activities for our staff. And we thought we'd start with staff first because, as you know, when COVID hit in March, our staff, they're at the forefront. So we thought we want to take care of them as they take care of other folks. So we want to continue to develop trauma-informed policies and procedures, mobilizing an informed leadership team, and to ensure organizational infrastructure is reflective of trauma-informed care. Capacity will be increased along multiple continuums. We will expand the behavioral health services offered, increase the number of patients whose needs will be met, and enhance our staff's expertise. Plans also include the addition of new positions, which we're excited about, an increased wage, which I'm even more excited about, for existing staff, including medical assistants, who will be working on the projects. And for my staff, if they're listening, that's underway. Letters were sent out to every one of our employees yesterday, so I know they're thrilled as they open these letters. This is a significant strategic undertaking for TCA Health, as it will allow the organization to become contextually responsive to the needs of the youth and adults in our service area. Again, I would like to thank Mayor Lori Lightfoot and the Chicago Department of Public Health for this phenomenal opportunity. And I'd also like to thank the aldermen and alderwomen who voted yes today to make this opportunity possible for all of us, and especially those of us who see communities who are in dire need. And I'd like to take this moment to not only thank our Alderman Scott, but also to welcome him to the podium. Alderman Scott, Wagesbaga, 32nd Ward. Thank you. Thank you, Mayor.
Thank you, Mayor. Thank you, Ms. Johnson. Thank you, Ms. Clark. Give me a second. Thank you, ladies and gentlemen. During this budget year, we've seen an unprecedented amount of transparency and accountability in the way we have managed this budget. I want to thank the mayor and all of her staff, all Chairwoman Pat Dowell and her staff, and as well as my staff, for working through in the best way possible what has been a very contentious, but also, again, one of the most transparent budgets that I've seen in my time as alderman. When you look at what has happened over the last several months with this pandemic, we have an unprecedented opportunity to change the way we structure our budgets, change the way we structure government, and the mayor has done that here. A lot of people talked about the issues that they felt were wrong within the budget, but more often than not, people came up with good ideas about how to transform the city amidst this pandemic. One of the biggest issues that I want to talk about and take a moment on is the equity and inclusion piece in this budget. What we've seen over the last several decades is an effort to push back on Black and brown communities so that they don't have a part in how government is run, they don't have a part in how our bond deals happen, and our legal teams. And what the mayor has done here with their staff today is increase those percentages to a point that I have never seen in my lifetime and that few people have. I think it goes a lot to say about how her efforts concluded today with the passage of this budget, what they mean to all of the communities in this city. The outreach that she's done, the outreach that her staff has done has been unparalleled in my time as alderman. So I think that when we look forward, coming out of the back end of this pandemic, hopefully very soon, we are positioned through the mayor's efforts in her task force on recovery of the city in her efforts in Invest in Southwest and her efforts building up through this whole budget with all the aldermen, with the officials throughout the city and other elected governments, with the women that we have here today that are benefiting from city government in a way that they have not before, to help people, to keep families working, to help those with mental health issues, to reform the police department, and a long list of things that this government has not done in the past. They are happening today. They're happening under this administration, unlike they have in the past. And I want to show my continued support for what the mayor has done here. I think that we have a long way to go. We have a long way before we get out of this pandemic. But this mayor, this council have pointed us in the right direction. We have turned this ship around, and this city is moving in a direction I think we can all be proud of. So again, thank you, Mayor Lightfoot, for all of your efforts. I think with that, I'm going to be turning it over to my colleague, Chairwoman Dowell, who again has been an incredible asset to the city by making sure that all of the people on her staff and all of the people working with her have the access to the documents they need, access to information, and access to make sure that you have an informed vote that passed this budget today. So with that, I want to hand it off to my colleague, Chairwoman Pat Dowell. Thank you.
Thank you, Scott. Thank you, Alderman Chairman Wagasback. I am incredibly proud today that my colleagues supported the 2021 budget. We have 34 members in the Budget Committee, on the Budget Committee, and every member was vigorously engaged in the whole budget process which spanned 2 weeks. We had very robust discussions. We met in caucuses, and all the caucuses met with each other. And as over time, we found the various members of the City Council advocating for increased investments in mental health or violence prevention in our youth and in homeless services. I think we realized over the course of the budget hearings that it would be really difficult to reduce a $1.2 billion deficit, close that, and at the same time make increased investments in services and programs that the people of Chicago have come to expect and what our city needs. But I think we did it. I know we did it. And today we did it with the least amount of hurt and stress to our businesses and to our residents. I want to thank Mayor Lightfoot and her finance team, Jenny, Susie, and Reshna, for their leadership. The mayor was extremely collaborative, working with us, talking to us, giving us other points of view. And I think that the budget that was passed today is a great example of the executive branch and the legislative branch working together. I am hopeful that as we move out of the pandemic, the goodwill that we have created in this process will continue as we work to solve the problems of the city and to create a more livable community, a more livable Chicago for all residents here. So I think I'll end there. I started the end of the budget meeting with a statement about now let's go make sausage. We made the sausage, and I'm very proud of the work that we've done today in the city of Chicago. Thank you.
Mayor, a few questions.
Sure.
Question from Bill Cameron. What do you think of the new proposal to put a tax on third-party package deliveries?
This is something that was introduced just yesterday by Alderman Thompson. This was an issue that we actually looked at and saw some challenges both under state law and also under federal law. But I've spoken to Alderman Thompson recently about this proposed ordinance, and we're going to continue to work together to see if there's a way through this, but there are some definitely some significant legal hurdles that have to be addressed.
Questions from Fran Spielman. Last year, you celebrated your first budget victory with a scotch and a cigar. How do you plan to celebrate this year?
Exactly the same way. And a steak.
Another question from Fran. Also, you said you don't buy votes, that you don't believe in transactional politics. Why then did you make so many concessions to get this budget passed?
Well, I don't buy votes, and I never will. But the democratic process is about compromise. It's about listening to each other, having people come forward with ideas, pulling those ideas apart to see if they make sense in the context of a larger frame. And that's precisely what we did with this budget. It was a lot of back and forth, a lot of listening, a lot of, I think, historic partnership and collaboration among a variety of different city council members, the different caucuses, and individual members. So this is a budget, I think, that really demonstrated why it's important to compromise and collaborate.
Question from Fran Spielman. Are you concerned about the narrow margin of victory and what that might mean when it comes to the equally tough decisions ahead?
I'm not at all, as I've said many times.
All right, Mayor Lori Lightfoot is taking some questions from reporters there at her press conference from earlier. So we're going to get out of this for just a moment here. I'm Andrew Kraft. We want to thank everyone for watching News Now from Fox. We bring you everything that's raw. It's live. It's unfiltered. Remember, if we can't get to something live at the moment because something else is happening, we'll play it out later after the fact for you as well. And you know, there's no opinion. This is all real. There's no bias. We give you context and analysis, but we do want to thank you for watching News Now from Fox. Remember, we have new hours on the weekdays. We go all the way to 1 a.m. Eastern and pick back up at 6 a.m. Eastern again. We now have weekend live coverage as well, starting 7 a.m. Eastern to 7 p.m. Eastern. So extended coverage here on News Now from Fox. Because we bring you everything that's live, raw, and unfiltered. I'm Andrew Kraft. We want to take a quick commercial break. We'll see you back here in 2 minutes. Some of you will see this, some of you won't, though. So. And once again, I'm Andrew Kraft here. It's a little after 5 o'clock in Phoenix, Arizona, a little after 7 p.m. on the East Coast. You're taking a live look at the White House there. We do have some news we wanted to give you just regarding the Biden-Harris transition. I don't know if we told our viewers yet. This happened just a matter of hours ago, but we want to bring this up. This is a tweet from one of FoxNews.com's political reporters, Brooke Singman. She's reporting the president-elect Joe Biden will begin to receive the president's daily brief and has been in contact with every federal agency. Just a day after the GSA, that's the General Services Administration, formally ascertained him as the winner of the 2020 presidential election. ODNI, that's the Office of the Director of National Intelligence, which prepares the presidential daily brief, said they will provide requested support to the transition team after the White House approved the ODNI to move forward with providing it as part of the support to the transition. So we are getting other reporting to suggest that Biden did not receive it today. He could possibly receive it in the next few days, possibly even tomorrow. So we'll bring you more on that as well. Remember, I said Joe Biden will be making some type of Thanksgiving address from Wilmington, Delaware, tomorrow on Thanksgiving Eve. Remember, News Now is on Twitter. We're at News Now Fox. We would love for you to follow us. We're trying to get as many followers as possible, and there you can find all of our clips from throughout the day, all the top stories throughout the day that you might have missed. If you want to follow me on Twitter, that's at Andrew Kraft. Would appreciate a follow. If you want to tell people where they can watch News Now from Fox, you can go to newsnowfox.com, and that lists all of our platform partners and our streaming partners, so you can tell people where to watch us. So in the meantime, we want to take you out now to this hearing that was out of I believe California, talking about crime, talking about those incarcerated who may have been cheating and gaming the system with pandemic relief dollars, filing for unemployment claims when they might not be eligible to receive them. So we're going to hear that now out of California.
Today's press conference will have 5 speakers. 3 of them will be speaking remotely in our new era of press conferences, and 2 are here with us today in person. The 5 speakers are Sacramento County District Attorney Anne-Marie Schubert, El Dorado County District Attorney Vern Pearson, San Mateo County District Attorney Stephen Wagstaff, Kern County District Attorney Cynthia Zimmer, and the U.S. Attorney of the Eastern District of California, McGregor Scott. So, once we're done with the 5 speakers, we'll have a short period of time to take some questions for everybody after that. So with no further ado, I'll introduce Anne-Marie Schubert, Sacramento County District Attorney.
Good morning. Let's start off with a short video first.
Beverly Hills police say over the last 2 weeks they busted 44 people for fraud and for using stolen identities. They seized 129 EDD debit cards with a value of more than $2.5 million. Investigators also confiscated several guns and nearly $290,000 in cash. They say the suspects are mostly from out of state and used the fraudulently obtained cards to rent luxury cars, dine out, buy high-end merchandise, and stay at short-term rentals.
Beverly Hills police have now busted 87 people in less than 2 weeks for alleged EDD fraud and identity theft. Detectives say they recovered 181 fraudulent EDD cards with a value of over $3.6 million. They also found $466,000 in cash and 7 handguns. Most of those arrested are not from California.
80% of the arrestees were from out of state.
It has been said that there is no honor among thieves. And there is no better example of this than the massive EDD fraud that is occurring within our jails, in our prisons here in California. Tens of thousands of inmates, local, state, and federal institutions all involved. Every type of inmate that you could conceivably think of, murderers doing life or life without the possibility of parole, rapists serving hundreds of years of a sentence or perhaps life as well, child molesters, serial killers, and other murderers sitting on California's death row. Hundreds of millions of dollars that may well amount to upwards of $1 billion having already been paid in their names. It is perhaps and will be one of the biggest fraud of taxpayer dollars in California history. And with this fraud means that victims who have been victimized by these inmates are not getting the restitution that they so deservedly have been owed. How did we get here? Is what we're going to talk about. What is the scope of the problem and how are we going to address this? Just talk for a few minutes about how did we get here. Well, we all know the pandemic started in March of 2020. We all know that there was massive unemployment as a result of that. In September of this year, just this fall, it came to light through some investigations by law enforcement, arrests by law enforcement, and prosecutions by some of the district attorneys you'll hear from today, that there was EDD fraud occurring on the streets of our communities, within the jails, and in the prison system. Beverly Hills was one of the leaders, as we heard already through that video. Well over 100 people arrested in that $3.6 million fraud scheme. And then came San Mateo County District Attorney Steve Wagstaff, who will tell you today about what they have done in their county. And then just in the last month or so, in late October, early November, state and federal prosecutors became aware of this massive problem. And as a result, just in the last month or so, we have formed a statewide EDD fraud task force so that we can tackle this massive problem. To give you a sense of the magnitude, as I call it, the behemoth of this fraud in our California state prisons, in early November, with tremendous collaboration and cooperation with the Department of Corrections and Rehabilitation, data was given both to the U.S. Attorney's Office, which was then shared to us, the task force, which was the entire list of CDCR inmate population across all prisons, across all demographics. And that list was then compared to the EDD claims that had been filed. And I keep in mind that this is only through March to August of this summer. A review of all of that data, which has just been done, quite frankly, in the last few weeks, is that the fraud is honestly staggering. And the types of inmate is shocking, quite frankly. It exists in every CDCR prison. It encompasses every type of inmate. It encompasses death row inmates. It encompasses inmates that have served or are serving life or life without the possibility of parole. Clearly individuals that are not entitled to these benefits, that are so desperately needed by the working families here in this state that have been adversely affected by this pandemic. It involves rapists and child molesters, human traffickers, and other violent criminals in our state prisons. And what we have found that many of these claims are being sent both in California but also to out-of-state addresses and individuals. To give you a sense of the magnitude of just what we know of this snapshot between March and August, there has been 35,000 claims filed in the name of California state prison inmates. 35,000. And of those 35,000, as of August, 20,000 have been paid. The highest number of claims filed on behalf of a single inmate is 16 claims. And the total amount paid out for that snapshot is over $140 million. To give you a sense of the initial observations from the data that we received, again, with the tremendous cooperation of corrections and rehabilitation, there was money sent actually to prisons, paid and sent to inmates in prison. There's evidence that true names of inmates and true social security numbers have been used to perpetuate this fraud. There's also evidence that there's been fake names and fake social security numbers. Fake names like John Doe or John Adams, or in one case, somebody had the audacity to put their name as Poopy Britches. We know from looking at the early stages of this data that there is both inmate fraud on their own regard, working in conjunction with people on the outside at a massive scale. We also know that there's likely identity theft, where people have stolen their identities and have benefited from stealing that. What do we know about death row? Just a short survey of it. There's been 133 death row inmates that have claims in their names. 133. There's over 700 people on death row. The number of claims filed by those 133 inmate names are 158, which means that some filed more than one claim. The highest single claim paid is close to $20,000. Whether that was identity theft or not is a question we all need to answer, and we will. It doesn't take away the fact that that money was stolen from the coffers of the California state government. The total amount through August that we know of is $420,000 in the name of death row inmates. Who's on that list? A lot of notorious people of names, claims filed in their names. Carrie Stainer, well-known serial killer. Wayne Ford, convicted and put on death row out of San Bernardino. Some may remember he's the individual that walked into the sheriff's station in Humboldt County with a severed breast in his pocket and confessed to dismembering and murdering 4 women. Isiro Aguirre, he's the individual who tortured and killed Gabriel Fernandez in Los Angeles County. Became a Netflix documentary. Wesley Shermantine, well-known serial killer up here. Royal Clark from Fresno, another serial killer, killed 2 young women. Rex Krebs from San Luis Obispo. In San Diego, this is not unique to men. In San Diego County, a claim was filed under the name of Susan Eubanks. She murdered her 4 children. One of them was only 4 years old. The breadth of this fraud is massive. What are we seeing, or what do we know about what's happening outside the prisons but within our jails and other detention facilities? In every county we have a jail. We have 58 counties, each has its own jail. By estimates, it's somewhere around 72,000 in local jails. That's over and above the 100,000 or so that are in state prison facilities. Reports from law enforcement on this early stages of our task force, we are talking about the same level of rampant fraud within the jails. Quite frankly, the inmates are mocking us. Even small jails are reporting losses within that small jail of over $10 million. The aggregate combined, simply by doing the math of the number of jails and the estimates within those jails, could be in the hundreds of millions of dollars of theft from legitimate people that so desperately need it. We have concerns about state hospitals and any other detention facilities where people are potentially stealing identities or using their own to calm the system. State hospitals, sexually violent predators, people that are incompetent to stand trial, not guilty by reason of insanity, and the list goes on. How could this happen? I'll talk about it a little bit. I'm sure the district attorney from El Dorado and the president of CDA, Vern Pearson, will as well. How could this happen? How could we be paying these types of claims? Well, the truth is because there is no system that's been utilized like 35 other states that already does to cross-match jail and prison data to make sure that we are not paying people that are not entitled, inmates. That's how this happens. So with that being said, the question then becomes is, we now know how could it happen. The question now becomes is, how can we stop this? And I'm going to turn it over at this point to Vern Pearson, El Dorado County District Attorney, and also the president of the California DA's Association to help address that issue. Thank you.
Good morning. And again, as Anne-Marie indicated, my name is Vern Pearson. For purposes of this spelling, P-I-E-R-S-O-N, last name. I serve as the District Attorney of El Dorado County as well as the president of the California District Attorneys Association. And I just want to give just a brief historical perspective in terms of this type of fraud. Several years ago, the DA's Association met with the then director of EDD requesting access to whether or not this type of cross-check that Anne-Marie alluded to, type of a tool existed. We were about 5 years ago. We were told that there was such a tool that existed in order to prevent this type of fraud. And essentially, all we're really doing in that case, or what the state is doing, is a fairly simple process of looking at jail public record, jail booking information, prison commitment information, and doing a entity resolution comparison of saying, are these people actively applying and receiving benefits? As we were aware that such a program did exist sometime in the past, but we're also aware that it has not been utilized here in the state of California, although it's been used throughout the rest of the United States and many other states. And we're also aware that fraud will always occur, so you have to have some type of measures to deal with that. But nothing could have told us the magnitude of this fraud. So the next speaker is District Attorney Steve Wagstaff, who will appear remotely. Back in the late summer, early September, his office, and I'll let him go into the details of it, but they identified using, looking at jail conversations, or listening to jail conversations, I should say, the number of inmates that were talking about this type of fraud. His office filed, and he'll describe that in a moment, initial case. So we became aware of that. And then a short time later, District Attorney Melissa Rios in Lassen County identified that within a state prison within Lassen County, or actually a couple of state prisons in Lassen County, the same type of fraud was occurring. I should note, before moving on, and the other speakers will talk about this a little bit, this is a very, very simple way, fraud to perpetrate. In other words, if you have relatively straightforward identifying information, a social security number, perhaps not even a real social security number, and date of birth and an address outside of an institution and occasionally inside of an institution, you can apply. Because of the CARES Act, because of the COVID-related CARES Act that went into effect, an individual was literally able to, this last summer, sitting in a custodial facility in El Dorado County, for instance, in my own county, to go online or have somebody on the outside go online on their behalf, fill out a very simple form, state that they've been unemployed since March, since the onset of COVID, and say that they previously had an income due to their self-employment that they've now lost, and then they could go back and say, I would like to be paid retroactively back to the beginning of time of this, from March forward. So you can calculate out the amount of money, say it's $200, $300, $400, depending on the income that they're stated, plus the additional $600 per week of federal funding. You can easily get up to $10,000, $15,000, or even $20,000 that would be mailed out in the form of a debit card that does not require an identification for use. What we have learned over the last several weeks is that repeatedly individuals would go to ATMs with a stack of these debit cards, removing up to $1,000 at a time. A very, very simple fraud that's being perpetrated, and it's spread, and as Anne-Marie indicated, it's open and notorious within the correctional facilities, being discussed about how everybody's getting paid and we need to get ours, things along those lines. So as we learned about this over the last several weeks, increasingly the realization of this was that this was, while a simple fraud to perpetrate, it was a difficult crime to unwind, given the magnitude of the number of people, thousands of inmates in state, local, and federal institutions applying for it. You consider that, let's say Lassen County I alluded to, having a relatively small DA's office and a vast number of inmates that potentially have engaged in this. So in recognizing how large it was, and that it is essentially in every institution in a large scale. We organized a regional task force teams throughout the state of California in order to try to wrap our arms around the magnitude of this. We sent out a few weeks ago a bulletin to every law enforcement agency in the state of California explaining what the cards look like, how easy it is to get the cash off the cards, how easy it is to apply, to notify every agency throughout the state of California. And we're continuing those efforts to do that. And then most recently, we've had a series of Zoom calls with every DA in California, as well as every related law enforcement agency, that sheriffs and chiefs of police as part of that. However, the magnitude of this is so much, and I'll just use the terminology, this is my own personal opinion, the dysfunctionality within our state EDD department to deal with this. I will just tell you, from the line level investigators, I'm told there are only 17 statewide that can aid in these types of investigations. At that line level, they've been very cooperative and very assistant with us in terms of seeing that these cases are investigated. However, as you go up the chain of command, there's been a series of resignations, retirements, and there's really just a lack of responsibility on that side. And as was alluded to a few moments ago, vastly different experience that we've had with CDCR. I was on the phone last night with Kathleen Ellison, the director or secretary of CDCR. They have been very supportive of trying to get to the bottom of this, but the magnitude, again, is so vast, and it is not just state prisons, it's federal prisons as well in the state of California and the local county jails. So much so that we reached the point yesterday that we made the determination that it was necessary to send a letter that you'll receive a copy of, but we sent a letter directly to the governor asking for the governor's personal involvement to deal with this problem and to escalate the number of resources that are being brought to bear on it and assist with a coordinated, collaborative effort to stop the flow of money going out and to assist us in investigating and prosecuting to the extent possible the people that are responsible for this enormous fraud, which, as Anne Marie alluded to, we believe at this point is the largest taxpayer fraud that's ever occurred in California history. So we sent that letter yesterday. I did speak with those of you who have followed like fires and every other calamity that might do, riots, things that took place in California. The governor's head of Office of Emergency Services, Mark Ghilarducci, had a long conversation with him today, and he had indicated that he's been tasked by the governor to do what it was that we had asked, to treat this as many other types of incidents and assist with bringing more resources to bear on the problem and do it in a collaborative, managed manner. So with that, I want to turn it over now to District Attorney of San Mateo, Steve Wagstaff.
Thank you, Vern. I appreciate that. Again, I'm Steve Wagstaff. I'm the San Mateo County District Attorney. And I want to thank you for letting me join you today. The role of my office in this was that we sort of got it started. Back in July of this year, one of my investigators, Inspector Jordan Boyd, was working on a case, and he was reviewing recorded jail phone calls of an individual in the San Mateo County Jail. The inmate started talking about a scam that he had heard about. And my inspector, rather than saying this has nothing to do with my case, I don't need to listen to this anymore, was curious. And he listened to the rest of the conversation that this inmate was having with a person on the outside about this new scam that was loads of inmates were taking advantage of here in the San Mateo County Jail and around the state. and they described it, they talked about it. And that's what caught the attention back in July here in the San Mateo County Jail of what's going on. So they followed up. My inspector followed up on this. We got that inmate. We took all the inmates' names that were mentioned in our jail, and we ran them through with EDD. Now, it took some time, but we quickly found that indeed there was loads of fraud going on in the San Mateo County Jail on the scam, stealing from EDD using false names, false ID. They were obtaining money, and it was always connected to somebody on the outside. It was a combination of somebody on the outside working with the inmates, and this had been going on for months. This had been going on really since the pandemic started. You know, idle time in our jails and our prisons gave them time to say, hey, let's see if we can make this scam work. And it did. You heard from the district attorneys in Sacramento and El Dorado the extent of it. San Mateo County, it wasn't to that same extent. However, we did determine that there were 22 individuals who had pulled this scam off. They included people, 4 of them were people who had been either convicted or were facing charges of murder. One of them was simply awaiting his transportation to prison to serve his 95 years to life in prison for a horrific murder he had engaged in. Another one had already been transported to state prison. He was at Corcoran State Prison, and he was spreading the news throughout Corcoran about this scam he had learned when he was in the San Mateo County Jail. And like any pandemic, it spread all over our incarceration facilities. And that's what was being talked about here today. Now, what's happened to those 22 individuals? Well, we filed charges on them, and we accelerated filing charges for this reason. What we learned through EDD, who was cooperative in providing us records and information, is that they could not cut these people off. The fraud was ongoing as we were investigating it. And what we were told is that under the regulations that they were all bound by at EDD, they could not cut the people off until we filed the charges. Not simply that we told them, hey, you know what, we've got the case, we're working it, we've established it, now we just have to process it. That in itself meant there was additional dollars paid out. We have prosecuted these 22 individuals. The cases are winding their way through our system. They've all been through a preliminary hearing, and they're facing trial dates, except for there are 6 of them who have been convicted, and they have been sentenced. For instance, that man facing 95 years to life in prison, he's now facing 98 years to life in prison. It's not a big ticket for what he did, but there is punishment that will be engaged there. That's what we're doing in each one of these cases. The real key here, the real thing is what has already been mentioned by DA Schubert and DA Pearson. The fraud is massive. In my county, it wasn't as massive as what you're hearing elsewhere, but we believe it accounts for probably $250,000 to $500,000 in fraud just in Little San Mateo County Jail with these 22 individuals. That's massive. Think when you multiply that by hundreds of thousands of people, that's why you get the number that was mentioned earlier, up to $1 billion. The answer is that there is money been stolen out of the pockets of every one of our taxpayers. That's money that the state could have been using to deal with the fires. That's money that we can deal with the economic problems that we're dealing with now and will be dealing with in the future. That is offensive. And that's why it is very important that the state of California, that Governor Newsom and his team join with the prosecutors, with the investigators, with the federal authorities and the U.S. Attorney to make sure that these people, number one, stop everywhere, and number two, we get restitution. We've had restitution ordered in every one of the cases where there's been a conviction so far. That will be taken out of their money that they earn while they are in prison. That restitution will be made, and that we stop this right now because it is massive. If this level of fraud can go on in a small county jail like San Mateo County Jail, you know that it's massive in other spots. Now I want to turn it over to a district attorney who has not a small little jail in her county, but somebody who has 5 prisons and a very, the fraud there, I can only imagine the challenge it will be for her. So at this point, can I introduce you to Cynthia Zimmer from the Kern County District Attorney's Office. Thank you.
Thank you. And good morning. My name is Cindy Zimmer, and I'm Kern County's district attorney. Kern County has more state prisons than any other county in California. There are 5 state prisons within Kern County, and EDD fraud is running rampant within those 5 prisons. This first came to our attention at the Kern County District Attorney's Office by state prison investigators within one of our state prisons. In late September of 2020, the accounting department within one of these prisons received numerous money orders from the outside destined for inmates on the inside. These money orders were thousands of dollars and dealt with a number of inmates. This was very abnormal and resulted in an investigation by the ISU unit from within this particular state prison in Kern County. And this investigation determined that applications for unemployment benefits were made on behalf of inmates by persons on the outside who were friends and relatives of the inmates on the inside. The inmates, their cellmates, the inmates' friends. And so these applications were made, and EDD paid them thousands of dollars in the form of bank cards to the conspirators on the outside, who cashed these bank cards, then sent money orders to the inmates within the state prison. We have one filed case, we have more that we intend to file, and we are investigating many, many more. In the last 2 weeks, we've been able to determine that 4,000 applications for EDD benefits were made in the name of Kern County inmates. That's just our county. 2,382 inmates have received benefits so far, and the fraud in Kern County alone is over $16 million. The majority of the payees outside the prisons, those that are applying for EDD benefits in prisoners' names, are payees within Los Angeles County. However, there are many within Kern County as well. For example, one address in Kern County, a conspirator on the outside who was collecting the money from EDD collected benefits in the name of 16 different inmates. In my nearly 4 decades as a prosecutor in this state, I have never seen fraud of this magnitude. I am happy to be working with our partners throughout California to stop these injustices and hold these offenders accountable. And at this point, I would like to turn over the floor or the Zoom to our next speaker, our United States Attorney from the Eastern District, McGregor Scott. Thank you very much.
Cindy, thank you very much. And good morning to you all. It's a pleasure for me to join you. Now, you say to yourself, EDD, isn't that a state agency? Unemployment insurance, isn't that a state issue? And the answer to both those questions is yes. But the reality of the fraud is really driven by the act of the federal government at the outset of the COVID crisis to supplement unemployment insurance. And that was done to the tune of $600 per week for each of the states, and then in turn handed out by state agencies like EDD. So the point of that is to say, at the end of the day, this is money, not this state money that has been the department and the universities have a vital role in the investigation and prosecution of this fraud. I speak on behalf of my 3 colleagues in San Diego, Los Angeles, and San Francisco when I say that we are fully engaged in this process and to investigate the state of California. Another measure that I would give you as indicating the size and scope of this problem. In recent days, my office has received authorization from the Department of Justice with funding to employ an assistant United States attorney devoted solely to this EDD fraud problem. And that doesn't just happen, that a U.S. attorney gets a special position to go after this. We are working collaboratively with the district attorneys up and down the state. We are very active members of the task forces that have been formed, as Mr. Pearson described. And we, several weeks ago, working directly with the Department of Labor, we issued an administrative subpoena to the California Department of Corrections and Rehabilitation, which is what resulted in the list that the Schubert referenced in terms of the inmates, so that we could cross-check that against EDD. As I speak to you this morning, we have several open investigations on the federal side. The agencies involved in investigating these crimes are several, principally the Department of Labor, the FBI, and many others. So we are ramped up and ready to roll. The last point I would make here this morning is that I served as the United States Attorney during the Bush 43 administration at the height of the mortgage fraud crisis in this country. And what we face now through this EDD fraud in terms of the number of persons and the size of the dollars that have been stolen is that's happened here. The only thing I can analogize this to is the mortgage fraud crisis that collapsed the American economy in the late 2000s. And I am proud to stand with my colleagues up and down the state of California. And I should point out as well, there's been a lot of discussion of county jails and California state prisons. We also are in possession of information that thousands of inmates at the federal penitentiaries in California have likewise undertaken this fraud scheme and are working thoroughly to investigate that and prosecute those cases when appropriate in the federal courts. So I'm pleased to be with you. We are united in this approach, and we face a manifest problem that requires action, not talk. Thank you very much.
That'd be great.
Okay, folks, we have everybody on the screen. I'll let you guys know that you're on our screen all right now, so you're aware of that. And we're ready to take some questions, and then we'll try to figure out who's best suited to answer them as we go along. So, any questions? Yes. Tell us who you are.
My name's Ananda. I work for ABC 10.
Okay.
When I talked to DA Wagstaff previously,
We have a microphone.
When I talked to DA Wagstaff previously, he said some of the inmates would just receive about a couple of years added to their sentence, and they're already serving close to life sentences. Has there been any consideration of stronger punishments for this?
What type of punishments?
Stronger punishments?
Stronger punishments.
Steve, I did not hear the question clearly. Could you repeat for me?
Yeah, the question is, since a lot of, or at least some of these people are already serving massive sentences or will serve large sentences, is there any consideration for stronger punishment than just adding 3 years or so onto their sentence?
Yeah, there's two answers to that. California law right now doesn't permit a greater punishment unless they have. Some of the people we've charged have prior strike convictions, and we are enhancing their sentences for that. But the core crime of conspiracy is a 3-year max under California law. And of course, we as district attorneys would do believe that there should be greater punishment for this type of fraud. However, the difficulty is that our legislature in recent years has not, in California, hasn't been receptive to increasing punishment. We're hopeful that perhaps in this arena, they might have a different viewpoint. But right now, the limit exists, and there's no moving outside it on a state level.
Can I speak to that as well?
Yeah, yes.
So on the federal side, and this is again why it's vital that we are part of this process, we have a crime on the federal side called aggravated identity theft. So what we all think of as stealing someone's identity for fraudulent purposes, which carries a mandatory minimum 2 years in a federal penitentiary. No probation, no break, 2 years mandatory minimum. And oftentimes with these types of cases, we will also charge and convict persons of other crimes on top of the aggravated identity theft. So we start with 2 years and then it only builds from there. So I just want to throw that in there.
Any other thoughts on that question, guys?
No, thank you.
Okay. Further questions?
Hi,
Yes.
Vicki Gonzalez with KCRA. It's twofold. The first one is, has there been a response, or what kind of response from EDD about this fraud? And then the second question is, you mentioned friends and families on the outside were cooperating with inmates on the inside. Is there any ties to criminal organizations, or are these just kind of lone individual instances that are as an aggregate total nearly $1 billion?
Okay, thanks. I put the two questions right here. Anne Marie's going to answer that.
The first question was about the response from EDD. I would say, and I think Mr. Pearson said this earlier, it's been slow if non-existent, at least to the task force. I would give credit to the investigators who are working very well, but we've made a number of efforts to reach out to their top level management and haven't really had any response from that. As to friends and family, some people call them one-offs. Is it one-offs? There's a lot, a combination of both. There's very, very organized rings that are perpetuating these frauds, very, very extensive. Multiple cars sent to individual addresses, both across the jails and the prisons, and likely from the outside. So this is some very, very organized theft rings to the tune of millions of dollars.
Any other questions?
Is there anything, sorry, Jessica with Fox 40. Is there anything being done to recuperate the money that's already been paid out? Can anything be done?
Anybody want to take a shot at that one? I'm sure it's something that we will be wanting to do. There are limits on what we can do at this point.
I think there's two parts to it, and remember there's dozens and dozens of investigations ongoing right now. But there's two parts to it. There's people on the outside ripping off the system, and there's people on the inside that are participating in that ripoff. And so while we may not get much more out of a death row inmate, you can rest assured that we're going to do everything we can to quite frankly, nail those people on the outside. And there's ways that EDD, as well as the criminal justice system, whether it's like Mr. Wagstaff said, seeking restitution, but EDD has their own tools of being able to garnish wages and things like that. But remember, like I made this comment before, every inmate in state prison that has victimized a person has left somebody behind, and in many of those cases, they are owing restitution to those victims. And so we're just further damaging them because they're not getting what they're entitled to as well.
Let me add something to that too. As a taxpayer, all of us need to be really angry about this. As has been alluded to, we're talking about not an insignificant amount of money. Statewide, we're talking about, at a minimum, hundreds of millions of dollars, as much as $1 billion of fraud. And because that system and the EDD department is so dysfunctional, there has been a backlog. There continues to be a backlog of many, many thousands of people who have, because of the pandemic, because of the lockdowns and others, have lost their employment, and they're unable to get money because they don't know the system the same way the inmates do. And they don't know how to go through the process and to get these things done. And one of the things that we've seen through the stages of investigation is that typically these types of claims get paid out very quickly because they know that they communicate with each other and they say, this is how you fill the form out, this is the information, you have to make sure that it's in there. So yes, and to your point directly, we are owed as taxpayers, both at the state level and individual level, we're owed hundreds of millions of dollars. But the practical reality is, when you're talking about thousands of convicted felons that are engaged in this behavior, despite best efforts, the practical reality is the vast majority of this money will never be repaid. And I think it's important to note that. And yes, we were going to try to do, as DA Wagstaff said, try to get orders, try to go after it. But I mean, think about it from the standpoint he's saying, someone that's already serving essentially a life term, who's ripping off the taxpayers, and there's no practical way that money's ever going to be repaid by him. And these are criminals committing crimes. So that the limitations are there despite the best efforts to recover restitution for that.
All right, you're watching News Now from Fox. Just wanted to cut in really quickly there and kind of break down what's going on and tell you what to be looking forward to in about the next 30 minutes or so, a little less than 30 minutes. We'll have a live report with Henry Lee with KTBU in the San Francisco Bay Area. He's going to be breaking down this investigation that's underway in California. So what we're watching right now is a team of prosecutors from 9 different counties. This was a press conference this morning. They announced a massive fraud investigation involving inmates at California prisons and jails and death rows who successfully filed tens of thousands of jobless claims, including high-profile names such as Scott Peterson and Carrie Stainer and others on death row. Authorities said between March and August, 35,000 inmates filed unemployment claims while they were behind bars through the state's Employment Development Department. And mind you, we're in the middle of this pandemic where millions of people are applying for unemployment right now as well. So, of course, the investigative unit out there, led by Henry Lee, is going to break it all down for us, what's happening right now and what is going to be happening. Again, that will be happening in about 20 minutes or so here on News Now from Fox, but just wanted to cut in and say hello. We're bringing everything to you live, raw, and unfiltered, nonstop news throughout the night from across the country. This is what we do best. So that was a recorded press conference from earlier this morning. I'm going to play out the rest of it for you here on News Now from Fox, but some of you are going to be going out to a 2-minute commercial break. When you come back, you'll see the rest of that press conference, and then we'll have that live report coming out of California.
Of convicted felons that are engaged in this behavior, despite best efforts, the practical reality is the vast majority of this money will never be repaid. And I think it's important to note that. And yes, we were going to try to do, as DA Wagstaff said, try to get orders, try to go after it. But I mean, think about it from the standpoint he's saying, someone that's already serving essentially a life term, who's ripping off the taxpayers, and there's no practical way that money's ever going to be repaid by him. And these are criminals committing crimes. So that the limitations are there despite the best efforts to recover restitution for that.
I think there's one other thing that is really important for folks to understand. Mr. Pearson mentioned it earlier. It's not just about the money that's been stolen. It's about the fact that we need to turn off the spigot, which means that we should not continue to pay these convicted felons who are in prison. And that's part of the letter that Mr. Pearson references, that we have asked and implored the governor to get involved himself to turn the spigot off. Because right now, there is no cross-matching between the incarceration data and EDD on a routine basis like it's being done in 35 other states. And if we have that spigot shut off, we're going to reduce the amount of money that's flowing to these individuals, these criminals, these murderers, these rapists, in a very short order. It is time to turn that off.
Any further questions? Okay.
Dennis from CBS 13, Sacramento. Any comment on the ADD still sending out Social Security numbers in their mailings?
I don't think we'll be able to comment on that. I know it's tangentially related, but not directly, so sorry about that. We have another question? Yes. Follow up.
So when I reached out to EDD, they said that the IDV system would help stop this. Have you noticed that? has that helped at all, or are you still continuing to see inmates still getting paid out for this?
Just to understand this, so as EDD was learning that the magnitude of the fraud and what was going on in the last several months, there was some outside assistance from other people looking into it and trying to advise them on what to do and how easy the fraud was to perpetrate. And just to answer the question, in terms of there was a system put in place that was supposed to help stem some of this, and that basically what it would do is require a photograph or an identification to be submitted as part of that. And I think that's a significant improvement and a significant help. The problem is, what we know is from listening to jail communications and prison communications, in other words, people that are in custody in jails, and their phone calls are recorded. And we know that they're talking amongst themselves about how easy it is to defeat that and how to do a workaround. So then they will call to somebody on the outside, get a driver's license, get some other type of identification, and then the money continues to flow. So it is an improvement, but it's certainly not an overall fix to the problem.
Any other questions from people inside? I think we might have some questions from folks who are listening in remotely.
Yes. So Anita Shabria from the Los Angeles Times, and looks like the same question came from Sean Hubler from New York Times. Can the DAs confirm that a claim was made in the name of death row inmate Scott Peterson?
That's true. There was a claim made in the name of Scott Peterson.
Stephanie Sierra from ABC7 Los Angeles. We've heard from elected leaders there is fear this fraud is being perpetrated from help by people inside the EDD. Is there any evidence to suggest that may be true?
Well, we would not be able to comment on that, even if whether it's true or not. So I think I'll just leave it at that. Sorry about that.
Adam Beam from the Associated Press. How many people have been arrested and charged? And of those, how many are outside of the prison system?
I don't know if we have a direct number, but of the folks here, Steve or maybe Cynthia could give us some help on that.
I only know the numbers for San Mateo County. There are 22 people charged. 21 of them are either in custody or facing it. And of that number, 6 were outside helping the ones inside. And again, out of our 22, 4 of them have been convicted so far. The others, their cases are pending.
And I know, Cynthia, you mentioned a few. Yes. Go ahead.
Yes, thank you. Most of our cases are currently being investigated. Of the one case that we have filed and that charges are pending in court, 2 are outsiders out of Los Angeles County that were helping inmates within Kern County.
And I could just add to that that there's literally dozens of investigations going on statewide, and it's just going to continue to grow. But as far as actual cases filed, that's probably most of them at this point.
Steve, if I could,
yes.
If I could chime in there. So we have indicted a handful of people, actually formally been indicted by the grand jury in Sacramento and Fresno thus far, and we have lots and lots of open investigations right now. And the people we have indicted to date were not inmates. These were just people out on the street perpetrating this fraud.
Okay, great, thank you. Any more questions from inside the room or outside? It looks like maybe a couple more from remote.
Yes, thank you. Sean Hubler from New York Times has a follow-up question on the Scott Peterson question. He wants to know if anyone can verify how much fraud was associated to him.
I think we know the number at this point, but we're not going to bring that. That could be an active investigation at some point, so we're going to have to decline to answer that one.
We have a question from Astrid Kassemeyer, Bay City News. Is there any evidence that people on the outside were coerced into assisting inmates with
with filing fraudulent claims, or were they acting independently?
Does anyone want to speak to that? I think we don't necessarily have evidence of it, but the investigations will probably reveal whether people were actively involved, willingly, unwillingly, whether some of the people who were inmates were not involved at all, but their identifications were stolen or coerced from them in the facilities. We don't know that yet, but we'll be finding out soon.
Okay, we have Wes from the Sacramento Bee, and the question is there a specific action that Governor Newsom can take to, quote, turn the spigot off, as you said, and stop paying these claims?
I think the immediate action that needs to happen is that we need to adopt what other states are doing. I don't think any of us are naive enough to believe that a massive governmental organization will take some time, but there are vendors, companies that have been doing this. Just speaking from a county, we cut off welfare benefits to people that are in our county jail, and we have a system in place. It's not, I don't want to say it's a simple process, but turning the spigot off means that we expedite the imposition of this system that exists in other states to do exactly what we're asking to be done.
And then I have another follow-up question from the SACB. Can the U.S. Attorney talk a little bit more about the source of the money that has been stolen? Was it federal or state funds?
Did you get that, McGregor?
The source of the money that's been stolen, is that right?
Yes, federal or state funds.
Yeah, so it's a mix of the two, but I feel confident in saying that the very strong majority of that money came from the federal government, largely in the form of the $600 per week supplemental unemployment insurance that was passed by the Congress back at the advent of COVID in March. So that I don't have a dollar number around that. I don't know what those numbers are, but this is federal money at the end of the day.
Okay, thank you. A follow-up question from the New York Times. Are you working with other states on any of these fraud cases, and if so, which ones?
Are you asking McGregor Scott that question, or all of us?
It should be to the panel, to all of you.
The panel. I don't think we are.
Can I just,
Anne-Marie.
I'll try. Let's be honest here. This is as the words I've used, is behemoth. This is a massive amount of work that needs to be done. The information that we are relaying today was really just evaluated in the last couple of weeks. And yes, there's money going out of state. There's money going out of this country in the names of individuals that are in prison. And so those investigations will be undertaken in the most organized way we can. Obviously targeting individuals that have the largest amounts of money, the most structure, and those of that magnitude. But it is to underscore the complexity of this fraud. There's no description of how complex it can be. But the answer to that question will be dependent upon every jurisdiction on where the money goes and what they choose to do with those investigations.
Hey, Steve?
Yeah. That's McGregor.
Steve?
Yes. McGregor Scott.
I just want to provide one additional point about the source of the money. And I said this at the outset, but I want to make sure we're clear on this. Yes, it was federal money, but the way this works is the federal government passes it to the states, and the states are responsible for the actual distribution. And in California, that's EDD. So this fraud problem is one that rests at EDD, not with the feds. I just want to be clear on that.
And just to finish up the one question about working with other states, I wasn't sure myself. And I don't know that we're actually working with any other state agencies and groups at this time, but we're aware of the fact that there is fraud in other states. And so if that opportunity arises, I'm sure we'll be doing it.
And as Steve began, I'm sorry to interrupt, but the Department of Justice set up a nationwide task force to deal with this. And each United States attorney in the nation has been asked to designate a coordinator within his or her district. And my folks are the regular participants in that process. So there, from that perspective, there is multi-state coordination.
Thank you. One more question back there.
There's a follow-up question from the LA Times. Can the San Mateo DA clarify if he has filed on 21 or 22 cases?
Steve?
I need your help, Steve. I couldn't hear it.
How many cases did you file on, 22 or 21?
We filed on 22 people. One person's at large. He posted $1 million bail. We think at least a portion of that was with ill-gotten gains from EDD fraud. But the other 22, we charged are in court. The other one, he has $1 million arrest warrant out for him.
Thank you. Looks like someone's texting one in. No? That's it? Anything else, folks? Do you want to finish off? Okay, that's it for the press conference. Thanks a lot.
We'll send out the letter. Just the letter was sent to the governor will be distributed.
Okay. We'll distribute the letter that was sent to the governor shortly. Thank you very much.
All right, you're watching News Now from Fox. I'm Daytona Everett. Like we promised, we have a live report coming up for you, kind of spurred out of that press conference right there to update a lot of you who are just joining us. California paid out more than $140 million for fraudulent unemployment claims made in the name of inmates in its state prisons and in county jails. That's according to the state and federal prosecutors who have been investigating the fraud for months now. This all kind of spurring from the pandemic. Right now, we have crime reporter Henry Lee from Fox 2 out in the Bay Area. He's going to kind of break down what's going on right now and what the investigation is going to entail going forward. Henry, how are you tonight?
Good, Daytona. Thanks for having me on. So, when the pandemic first started, we only heard of, maybe a smattering of these kinds of cases. But today at that news conference, we have confirmation from the DAs that all counties in California, all 58 counties and many state prisons, if not all state and federal prisons, are involved in this scheme with prisoners getting money actually delivered to them in the form of debit cards to their jail cells. So right now, EDD did respond to me and said that they are working now with state cybersecurity experts, and they will now be comparing lists of inmates with claimants.
So for people who don't really understand the story quite yet, how did this happen? Because it seems like it's kind of wild when you think about it.
Yeah, it is, Daytona. It looks like that, just like every single legitimate person who is out of work and needs money desperately, these inmates or their friends outside of jail gummied up the system. They gin up the system, fill out the forms, and EDD, the state agency, apparently had to take everything at face value. They didn't check their addresses. Some of these debit cards were sent right to prisons and jails. They didn't look at the names. Some of these were aliases like John Doe or John Adams, and in one case, someone wrote Poopy Bridges. So they were not checking everything for due diligence, just kind of willy-nilly sending out money in the form of debit cards.
And officials right there are calling on Governor Gavin Newsom to take action. Can you explain what could be coming from the governor's office soon?
Well, the governor's office has spearheaded a person or directed a person who is with the state OES or Office of Emergency Services to take charge of this issue. I did speak to a state assemblyman who said that this all lies on the governor's feet, Governor Gavin Newsom, because he is the top state leader. He needs to take hold of the situation. So between the DAs, Governor Newsom, and EDD, hopefully there'll be some kind of solution. But one thing is clear, Daytona, the money that's been sent to these inmates and prisoners can't be recouped.
Can we talk dollar amount? I know that we briefly mentioned it, but there's a lot of numbers in this, the amount of inmates, how much money was given out. So what was the loss for California in the end of this?
Right now, definitely millions of dollars have been shelled out, and they might very well approach $1 billion in fraudulent claims.
That's amazing. Is California the only state that's dealing with this right now? Are there other states that could be involved in schemes such as this?
Yeah, that's a good question, Daytona. We know that some funds also went out of state beyond California. But here's the linchpin. According to the DAs we spoke to today, 35 other states already have a system in place where they have lists of inmates that they compare against people seeking claims for their respective state EDDs. So in California, that wasn't done until recently.
Was this just because of the pandemic, or could this have happened in previous years just when it comes to unemployment claims, or because it was so easily available for people who were out of work? Is that why they were able to take advantage of the system, or what are they saying about that?
Yeah, there have been scams and frauds of all kinds going back probably to the beginning of time, Daytona. But in this case, because of the pandemic, with dire straits, people being very desperate, these inmates and prisoners took advantage of a very shaky social situation to enrich their own pockets. So I think it's a fraud and scam that we've seen before, but magnified to a much larger scale.
I'm going to show really quickly, Henry, on my screen. You tweeted out a picture earlier today of the 21 implicated in the scheme. Are these the only people who are being tried right now, or there's an arrest warrant out for someone else? Can you explain what's going on with that?
Well, the Brady Bunch series of pictures only has to deal with San Mateo County inmates that have been charged. That's just one of 58 counties, and I will say that other counties throughout California have charged similar people in this case, but that group of people is only for 1 out of 58 counties. And again, like we spoke to Kern County DA, she has the most state prisons in the state with 5. They are trying to get their hands around this entire situation. So we got this situation times 58 for each county, and of course there's federal and state levels as well.
Alrighty, again, crime reporter Henry Lee out there with Fox 2. Thank you so much for joining us. It seems like this will be an ongoing story, so I'm sure we'll hear from you again.
Thanks, Daytona.
All right. Again, you're watching News Now from Fox. We appreciate you joining us on this Tuesday night. We're talking everything right now. Investigations going on in California. Indirectly about the pandemic, but definitely a situation that they have in the state of California right now. We're bringing you all of these feeds, live, unfiltered, and raw, nonstop news going on all night. So we do want to take you out to Chicago. We briefly showed you earlier Mayor Lori Lightfoot kind of explaining what Chicago plans to do going forward with a new pandemic relief plan, investing millions of dollars into the economy out there. But let's hear from the governor of the state, Governor Pritzker. He's going to be talking about not only addressing the COVID-19 pandemic, but distribution of vaccines as well. We're going to send some of you off to a 2-minute commercial break. When you come back, you'll be hearing from Governor Pritzker. Again, thanks for joining us. You're watching News Now from Fox.
Plexiglass dividers and more. We're still seeing far too many local governments not taking the necessary action to claim their funds. Remember, this is money that Congress provided for the state of Illinois to support local COVID-19 response for downstate government entities. Cook and the Collar counties are not eligible for these dollars and instead received direct support from the federal government. At the beginning of this month, we announced that we sent out over 390 payments to local governments, and we're waiting on more than 500 local government units statewide to submit their requests. In the weeks since, we've moved through new applicants efficiently and effectively with more than $118 million paid out or on the way. But we still have more than 350 local government units that have not taken the simple yet necessary steps to claim their dollars. Funding which could help with offsetting basic costs for payroll and PPE and contact tracing and other essential costs for their emergency response. Remember, this is a $250 million program, and I want every downstate community to get its fair share. Last week, DCEO issued a reminder to all the eligible governments around Illinois that we need them to provide their use of funds by December 1st, 1 week from today. That's on top of all the work that DCEO has done to help local governments recoup the maximum amount of reimbursement allowed under their coronavirus relief fund eligibility. Launching a user-friendly website, fielding thousands of calls, conducting dozens of webinars, and standing up dedicated office hours to provide step-by-step instructions on submitting eligible costs over the phone with its team of experts. That's what DCEO has been doing to assist our local government. I also want to thank the Illinois Municipal League and the Illinois Association of County Board Members and other county and local leaders around the state for their partnership in implementing this program and getting the word out to their communities. You know, historically, downstate Illinois hasn't gotten the attention or the support that it deserves from the state. And I'm very proud of the work that our administration is doing during this pandemic to reach out to and support communities downstate that have too often been left out. This is another urgent call today to downstate communities to claim the dollars that we've made available for you. I want to encourage not just mayors and county board chairs, but also residents to visit the DCEO website to find out if your community hasn't yet registered for its reimbursements, and then call on your local elected leaders to make sure that this gets done. We know just about every community in the state has had to deal with new costs this year related to the COVID-19 response. This program ensures that the funds to support those efforts don't have to cut into local school budgets or road work or environmental cleanups or cause your local taxes to increase to cover those costs. Now, I also want to remind small businesses that are experiencing unforeseen costs and hurdles to apply online for business interruption grants. It's a program that we created to support specifically businesses all across our state. To date, we've awarded $140 million in grants to more than 5,500 businesses statewide. This funding has been deployed to businesses in more than 520 communities, including to businesses like restaurants and retail, event spaces, arts venues, hair salons, museums, and much, much more. Still, for every big grant recipient, we know there are many more out there in need. And that's why we're encouraging businesses to apply for funding before it's too late. Grants are made available in amounts ranging from $5,000 to up to $150,000, depending upon the losses that they've incurred. And while there's no deadline for this program, the $129 million remaining will be issued on a rolling basis until the funding is exhausted, sort of first come, first serve. Similar to the local cure program, our DCEO team is providing technical assistance to help small businesses obtain this funding as quickly as possible. Before I turn it over to Dr. Ezike, I want to remind everyone that our hospitals are still under siege by this latest upswing of COVID cases. And with the latest mitigations not expected to show up in the numbers for at least another week or 10 days, Thanksgiving this year needs to be different. For those who have already altered your usual plan to keep your relatives and your friends safe, thank you. And to those who haven't yet changed your plans, the doctors are asking all of us to skip the big group dinner this year. The vaccines that seem to be on the horizon can't help you if you get sick now. It appears it may just be a matter of months, not years, before it's safe for all of us to gather with extended family and friends again. Let's keep each other safe until then. It's not too late to change your plans if you haven't already. Let's all do our part to keep our loved ones safe and healthy this holiday season. And thank you all very much for following the mitigations and listening. It's very important for us to make changes this holiday, and I am somewhat certain that in the next few months that we'll start to see things really change. And next year, we'll be able to have that robust Thanksgiving that everybody loves to have. So now I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Thank you so much, Governor, and good afternoon, everyone. Let me start with the numbers. In the past 24 hours, more than 97,000 COVID tests have been reported for a total of now almost 10 million tests since the beginning of this pandemic. Today, we are reporting 9,469 new COVID cases, and unfortunately, reporting 125 additional lives lost to COVID-19. That brings the total number of cases in Illinois to 674,089 and 11,677 total lives lost. As the governor mentioned, we're looking at the hospital numbers across the state. 6,134 individuals were in the hospital with COVID, and of those, 1,203 were in the ICU and 668 were on ventilators. We often talk about the pandemic in terms of the physical impact of the disease, in terms of the newly diagnosed cases, the individuals who are actually infected with the disease, the people who end up in the hospital, and of course, the ultimate sacrifice in deaths. Even if you haven't been directly touched by loss related to COVID-19, even if you are among the almost 12 million who have not been diagnosed with infection, there is still a heavy mental impact that is taking a toll on you. It's taking a toll on all of us. There is fear, there's anxiety about this novel disease and the illness that it can cause and that it has caused. There's stress about our financial situations due to job loss and even the complete loss of a business. And there's depression and there's loneliness due to the social distancing. Any or all of these things can cause short-term and maybe even long-term mental health difficulties. The signs of mental distress can be visible, but there are probably so many more who are suffering in silence. Please don't underestimate how far a smile or a kind word can go, or an offer to pick up carryout from a restaurant and leave it on someone's doorstep, or simply provide an ear to listen to someone talk about their day or their frustrations. There are many resources that can help the people of Illinois so that they don't have to suffer, including the Illinois Free Emotional Support text line, where you can speak with a mental health professional. Text TALK, T-A-L-K, to 55-2020, or hablar, H-A-B-L-A-R, for Spanish, to that same number, 55-2020. The Illinois Department of Human Services also has mental health resources on its website, including how to work on your emotional well-being and self-care, and how to navigate anxiety caused by COVID-19. This pandemic is a truly difficult time for everyone, but we can get through it together by offering support and compassion to those around us, and by wearing our mask, and by watching our distance, by washing our hands, and by getting our flu shot. This will result in us protecting one another instead of infecting one another. And so that leads me to another plea to please make the responsible decision to celebrate Thanksgiving virtually this year, as the governor has already implored. Without even knowing it, you could be putting your friends and family or yourself in grave danger. Please stay home this year. Let's save lives together. Thank you. Buenas tardes a todos. En las últimas 24 horas se informa más de 97,000 pruebas de COVID-19 fueron hechas para un total de más de 9.9 millones. Hoy informamos 9,469 casos nuevos y 125 vidas adicionales perdidas a COVID-19. Eso eleva el número total de casos en Illinois a más de 674,000, incluyendo más de 11,600 muertes.
All right, you're watching News Now from Fox. That was an update coming out of Chicago. Obviously, they have gone into Spanish right there. So I want to bring you kind of a fun story that we have been watching here at Fox. Let me play out this video for you. So take a look at this. This gleaming metal structure was spotted from the air by a helicopter pilot and wildlife workers last week. The workers were
They've cut it
in the area counting wild sheep and were so surprised at the discovery, they landed the chopper to see it up close.
And went and checked out this, what we now know is a stainless steel monolith, some type of art installation that someone has actually put into the red rock there in that location.
Yeah. Yeah. This is wild. Huh.
This
yeah,
is
I've heard everything from did this fall from the sky, you know, did it and kind of implant itself there? Is it otherworldly? You know, without looking at it close and seeing that there are in fact human-made rivets that put this thing together, you could definitely let your imagination run wild.
Okay, so just to explain a little bit more, this is a growing mystery in Utah. State workers recently found this massive metal tower in a remote area of the Red Rock Desert. The Utah Department of Public Safety says they're now investigating. They believe the metal monolith was taken to the area and constructed on site. The task was likely not easy due to the remote location and how tall the structure is. Pictures show the tower to be taller than the two men who put it together.
I mean, obviously, we don't want people going out there and digging into our red rock on public land and placing stainless steel objects. We take it very serious when things are defaced or you know, painted out in our public lands, and this would be taken as seriously. We are in contact with our Bureau of Land Management partners. We do have plans in the future to show them this installation, and then they'll make the decision as to, you know, potential impacts it has on wildlife and the land there in that area, and maybe make arrangements for its removal or maybe not. Who knows?
So again, this is just an interesting story. Public safety workers are not revealing the exact location of the tower. They don't want people getting lost or stranded trying to find it. It's just amazing how big it is, though. Really something to stumble across on a random day in Utah.
They've cut it in?
So again, you're watching News Now from Fox. Kind of fun to bring you those interesting stories that, you know, who knows what's going on in Utah. They're just finding towers everywhere. People may be getting a little bored right now trying to do some artistic, creative art, I guess you could say. We're going to send some of you off to a 2-minute commercial break. When you come back, we're going to go back to that COVID-19 press conference coming out of Chicago, where Governor Pritzker is explaining what to expect for all of those Illinois residents out there and really urging them to apply for all of the economic relief that they have for the pandemic. Thank you so much for joining us.
And when the first ones come, we hope to be prepared because of all the work that we've been doing, frankly, since the very beginning of the pandemic. I think in April is when we started to put together at least the sketch of what a plan might be for distribution. But when you don't know exactly how many shots you're going to need or what the temperature is, it makes it all the more difficult to get prepared. But we're getting closer. The CDC is helping. The FDA, no doubt, will have its advisory as well. And, you know, we'll be ready to go, we believe, as soon as those vaccines hit the ground.
All right. Kelly Bauer at Block Club. With demand surging across the country for healthcare workers, what is Illinois doing to keep doctors and nurses here in the state?
So let me just remind you that it's the healthcare providers themselves, mostly private hospitals, some public hospitals, other medical centers that are doing the hiring. They're the ones who reach out to the independent contractors that can provide teams of nurses and doctors that are independent that can be brought in to augment existing staff. It is a difficult time, there's no doubt about it, because there's demand all over the country. People who were independent contractors here in Illinois might have been hired to work in a state nearby or a state far away, may have been offered 2 or 3 times what they were offered originally in Illinois. So it is a difficult moment. So what can we do to help those institutions? That's really what we do. I think if you look back in April, many of the things we did in March and April to help augment staff are the things that we continue to do today. You know, we've offered licenses for people who've retired to come back into the workforce. Those folks are making themselves available. We helped the nursing students and other students who were on the verge of graduating when we had a stay-at-home order. We made sure that they could get the credits that they need and get graduated so they could get to work. So all those things are still in place. And then we're talking to all the hospitals about what we can do to be of assistance. Each one needs a little bit different kind of help, but they're the ones who are on the front lines and going to be deciding the level of staffing that they'll need and how we can be of assistance to them.
Cole at WCIA. Mahomet School District in Champaign County is still in-person learning, and the local teachers union says there are schools who are not enforcing Tier 3 distancing rules. Should county health departments step in and enforce mitigation rules at public schools?
Well, that is, the county public health departments play a very important role locally in advising our schools about what the best practices are. Schools that aren't quite getting it right need to reach out to their local public health departments, and the public health department should step in and advise the schools on best practices. We've also provided, the IDPH and the ISB have provided guidelines for all the schools to follow in order to make sure that they're safe being in school. So in terms of enforcement, what we've asked is that local school boards work with the local teachers, the parents, and of course the students to determine what's safest in that community, and then make sure that that gets implemented, again, with the help of local public health officials.
Amy Jacobson, Governor Pritzker, I've been watching IDPH and IDVA Senate hearing, and 2 things. Director Chapalavia just said she didn't notify you when it was clear there was an outbreak, and it appears some workers, due to short staffing, were allowed to work after testing positive. Will Director Chapalavia be reprimanded or fired?
Well, I expect all facilities to follow all the public health guidance that we give, and if there are instances in which that's not happening, I expect answers about why. An infection team was sent in to the LaSalle facility, and any additional resources that are needed will be provided. And we've already, based upon the investigatory work of our VA and federal VA, there have already been a few changes of a certain nature, not major, but minor changes that were recommended. If our investigation, and that we implemented an IG investigation today, if our investigation determines that there was wrongdoing by anyone, then we'll take appropriate steps to respond.
Looks like Marnie Pike at the Daily Herald is our last question. Despite precautions, lots of Illinoisans are traveling now, as seen by the lines and crowds at O'Hare. Are you concerned about people not social distancing at the airport?
Yes, of course. And I'd like to turn over to the doctor to finish up this answer, but I'll just say that if you are planning on traveling, it is Tuesday. Thanksgiving is just 2 days away. If you are planning to travel right now, I urge you to rethink that. Just to decide that maybe this year you could do it by Zoom. It's not as much fun. I get that, but it's different. You might try something different this year, and it certainly will be much, much safer for you because you won't be traveling with other people packed into whether it's an airplane, a bus, or some other, transportation. And you won't be bringing it to your family or your friends that you were going to meet, or they won't be giving it to you. And then finally, for those people who, if you decide you just can't change your plans, and please change your plans if you can. If you can't change your plans, you feel like you absolutely have to go, let me encourage you, please wear your mask, even when you go to someone else's house and you think that, this is somebody that you love, it's a friend of yours, you want so badly to be close to them. Wear your mask and keep some distance. I believe it's the only year you're going to have to do this. And I just urge you to do the right thing. If we can keep our infection rate going, at least somewhat plateaued, even going in the right direction during this holiday season and shortly after, we see that people have done the right thing. I mean, we're going to see a lot of progress before the Christmas holidays. So please follow those mitigations, and I'll turn it over to Dr. Ezike.
Just let's think about what was just said. The governor of Illinois is telling people not to travel and be with their family on Thanksgiving. I know that sounds crazy, but that is 2020. This would not happen in any other year. We have to accept what we're dealing with, a global pandemic, the likes of which no one has seen before. That does deserve a change from the norm. So we can't just try to honor, tried and true traditions, family traditions. I know people will say, this is the first time in 60 years that I'm not going to be with my family. I'm sorry, but that's what it is now, so that we can have our traditional Thanksgiving in 2021. And of course, I know that there are people who are listening who are not going to follow this. So in the theory of harm reduction, we give you these other tips. Again, they're not the same as and not as safe as doing it virtually. But if for some reason you think it's too late to change your plans, and I really think it's not, have a conversation with your guests. Everyone might be too timid to bring up the conversation and say that they're really having second thoughts and that they're really thinking about what the CDC and what all the public health officials are saying. Have that conversation. If you're bringing these people into your home or you're going into their home, I'm sure these conversations should be had. And if you really decide after all the guidance that this is the right thing, and I'm arguing that it's not, really commit that you will separate households within that space. Commit that if you're not actively eating or drinking, that you will have a mask on in the house. Commit that if the weather allows, you will move everything outdoors. Even as you're moving through the airport, that you will go out of your way to keep distance, that you will not take your mask off if you're in the plane. You will not take your mask off for any reason, that you will minimize any kind of extra movement around, that you will carry hand sanitizer to be able to clean your hands if you can't use soap and water. These are things that can help decrease the risk. They won't take it to zero, but I just urge you on the front end, if it can be canceled, I know that airlines are refunding or giving credits. I know that that's not the issue. Please, we just don't want this Thanksgiving to be a tragedy, and that every Thanksgiving after that will mark the anniversary of when a loved one was infected, and maybe even worse. We don't want that memory to be our Thanksgiving memory. Let's do it different in 2020, please.
All right, thanks, Dr. Ezike. Thank you, Governor. We'll see you all tomorrow.
You're watching News Now from Fox. I'm Daytona Everett. We've got some more great stuff to get to tonight, talking about COVID-19. looks like we are going to have a live report. I just want to break down some stuff that's going on in California. Just recently, California has imposed some really strong restrictions. That includes a curfew for people out there in California between 10 p.m. and 5 a.m. You have to go home. But this is really an issue for those restaurants out there. Today, just to kind of update you, a judge has refused to block LA County outdoor dining ban despite a plea from the California Restaurant Association. We've got a live report coming from Fox 11's Phil Schuman. He's going to kind of break down what this is all about, what that lawsuit about, and what we can look forward to. Phil, how's it going on out there?
Los Angeles County, where there are some 30,000 restaurants, and they're talking about laying off people once again, whether or not they'll be able to survive, because what's happened is that the public health department has ordered that outdoor dining be prohibited as of tomorrow night. Now, remember, everybody went on the shutdown back early in the pandemic in March, April, and then in May and June, outdoor dining was permitted, and that's been the case until now. But because of this huge spike in COVID-19 cases, increase in hospitalizations, increase in positivity rates, the county Department of Public Health has said that one thing they can do is limit people gathering from different households in restaurants, even though it's with social distancing and with strict safety protocols. So as of tomorrow night, no outdoor dining at all, just takeout and delivery.
So what are you hearing from the California Restaurants Association? Are they going to continue to pursue litigation? What's that going to look like?
Well, today they asked a judge for an emergency order banning this prohibition on outdoor dining from going into effect, and the judge declined, saying that from the limited amount of information he had, the county health department was within its rights to issue this, what they call the county public health order. However, he did invite the Restaurant Association to come back at a future date, TBA, to present maybe further evidence and further their case for reopening. Right now, this is a 3-week shutdown in an attempt to turn these numbers around. Just in Los Angeles County, to give you some numbers, there were 51 new deaths today, almost 4,000 new cases. The 5-day average is over 4,500 new cases a day, almost 1,600 people in the hospital, which is double the amount 2 weeks ago. And the positivity rate, the number of tests which come back positive, is now at one of the all-time highs, which is 10%. So a very critical time to try to turn these numbers around as we enter the holiday season.
So what has to happen in order for these restaurants to reopen? Is there a possibility of like a downward trend that could maybe reverse that and they could reopen in time for the holidays? Because that's peak season.
Well, not in time for Thanksgiving, maybe in time for Christmas. Again, this is a 3-week ban. However, this is a very fluid situation. Today, the Los Angeles County Board of Supervisors, which is 5 elected officials governing about 10 million people in the county, they had a pretty vigorous debate on this issue on the phone. The public could listen in or watch it, but they voted 3-2 to uphold this ban. Feeling that though there's no science necessarily that backs up that a spike in COVID cases is due specifically to outdoor dining, it is something that they can control. And because the numbers are so alarmingly high, they felt that they had to take this action, although they understand that there's a lot of pushback and frustration among restaurant owners who are fighting for their survival. Remember, Daytona, there's no PPP money this time, which on major restaurants gave them a payroll boost in excess of 6 figures. Well, there's no money like that rolling in this time, so they're looking at depleting their savings if they have any left, or the very real possibility of going out of business.
Yeah. We're a national outlet. Where are you right now? Can you explain where you're at? And before they had to close down, was it pretty busy?
Yeah, we're in downtown Los Angeles.
Okay. Was it busy
We're in downtown
tonight?
Los Angeles, a restaurant. Well, this happens to be a restaurant that's closed on Monday and Tuesday. It's named Rosa Blue. Just on the other side of me, another restaurant that's open. We're in the fashion district at downtown Los Angeles. If people are familiar with that area. That restaurant, ironically, had a tent just installed today. The manager telling me that that had been in the works for months, and they figure at some point they're going to be reopened for outdoor dining, so they decided to go ahead and install the tent. But this covers all of Los Angeles County, as I mentioned, about 10 million people with like 30,000 restaurants, and you multiply that by all the employees that are going to be laid off. For example, this restaurant we're at had about 70 employees at its peak time, and now they're looking at a skeleton crew to maintain takeout and delivery of maybe half of that, and maybe even further cuts. So it takes a real toll, not just on the restaurant owners, but of course all the waiters and waitresses and support staff that are employed by the restaurant industry.
Yeah, did you have a chance to talk to any of those restaurant owners today? Did they say it's very likely they're going to have to lay people off right before the holidays?
Well, they're already doing it. I was at a restaurant yesterday in Sherman Oaks, California, in the San Fernando Valley, Casa Vega. They're going to go from about 50 people to literally a skeleton crew to maintain takeout orders of maybe 3, 4, 5 people. I spoke with a waitress there who makes $15 an hour plus tips. Not sure what she's going to do. Obviously, jobs are very tight right now. The owner of this restaurant, Rosa Blue, in downtown Los Angeles Fashion District, as I mentioned, they had 71 employees in the good times. Now they're down to about 30, and they may go down even further. They're fortunate enough to have some savings. They own a couple of restaurants to keep things going. They said they can survive for 3 weeks, but beyond that, they don't know. And so many restaurants are small mom and pop operations. They may just have to shut down either temporarily or permanently. It's a very difficult, frustrating, and dangerous situation. And nobody thinks this is a perfect solution. One doctor I spoke with today used the term threading the needle. Public health policy people are trying to make the best decisions they can to save lives while causing a minimal amount of economic harm. And that's a story that's being played out across the country, of course.
Sure. And, going out to eat is kind of one of the only things that people can do at this point right now. Are Californians frustrated about this situation as well?
Oh, everyone you talk to has pandemic fatigue. Again, they understand that these are very dangerous times, and because these numbers are spiking, they're going up instead of going down. If numbers had continued to go down like they were at the end of the summer, we wouldn't be having this discussion. The question is, what do you attribute it to? Is it rallies left over from the presidential election, even going back further when the Dodgers and the Lakers right before that won the World Series and the NBA championship, and people were out on the streets? Remember, there's a lag of at least 2 weeks between someone being exposed to the virus and then positive results in the test. So they don't quite have a handle on exactly what's causing this spike. Restaurant owners say they're being unfairly scapegoated. County Public Health says this is something we can control, so we're going to do it.
And still nothing coming from Congress yet as far as stimulus goes. So, no clear future for any of these restaurants out there in Los Angeles, sounds like it.
No, and so they can't count on that. They just have to, do what they can to hang on. But, you talk to people in the restaurant business, even at 50% capacity, which was what the rule was on the outdoor dining, that was very difficult to survive. And no restaurants think that they can survive on just takeout and delivery only.
Yeah, maybe if they provide some Thanksgiving meals for the holidays, who knows, tough situation out there. Phil, last question for you. Anything else to keep our eye on this week? Any more developments for this case specifically?
Well, yeah, one of the concerns that most of Southern Californians had was the reinstitution of what was called the stay-at-home order, which is a fancy term for keeping everybody inside. Remember, that was in effect in the early stages of the pandemic, and then things gradually reopened. All but essential workers essentially told to stay home. There's some fear because of this huge spike in numbers that the county was going to reinstitute that stay-at-home, safer-at-home order. That has not yet happened. But if this ban on outdoor dining doesn't slow these numbers down, and the encouragement for people to stay home, cancel any travel, cancel plans to visit loved ones or friends on Thanksgiving, if that doesn't turn these numbers around, then there's a very real possibility that they'll order people to stay home once again, unless you're one of those essential workers, and nobody wants that.
Okay, I promise. Last question, Phil. You've been great. Thank you so much for all the great information.
Now you can ask as many questions as you'd like.
You guys are all the experts out there. I mean, I lived in California. What happens if a restaurant stays open even though they're not supposed to be open? A lot of these sheriffs are not really mandating this.
Yeah, that's an excellent question. That's an excellent question. The sheriff's departments, the police departments have said, hey, we're not the COVID police. If a restaurant stays open past the 10 o'clock shutdown, of course, that's not really an issue right now because after tomorrow night, they're not supposed to be open for outdoor dining at all. But should they open in violation of that health order, then the police would be called. They would generate a complaint, essentially, and refer it to county health for any possible action. They're not like they're going to come in and arrest people and shut restaurants down. And just to give you some perspective, the county health said today that, as I mentioned, they got about 30,000 restaurants in Los Angeles County alone. They have about 300 inspectors to cover all of those. So they're really hoping for voluntary compliance.
Okay, and that's what we've been hearing about compliance as far as mask wearing goes and the curfews in general. So good to know out there in California, Los Angeles, California, downtown LA. Beautiful time out there. Happy holidays, Phil. Thank you so much.
All right. Thank you.
Again, you're watching News Now from Fox. We appreciate those live shots coming from across the country. It seems like we're kind of on the California beat right now, talking about all of those restrictions in the state. And we'll, of course, bring those to you throughout the week as well. I'm not sure if we'll be hearing from Governor Newsom tomorrow. We did not hear from him today. We heard from Dr. Galley, who's one of the main health officials out there. He gave some guidance on what to be expecting for COVID-19 response, those cases, weekly briefings, and of course, vaccines. So let's talk about vaccines really quickly. We have a story coming from our sister station out in Houston, Fox Houston, talking about vaccines. They spoke with a specialist out there to kind of break down what we should know going forward. But first, we're going to send some of you. We have a Twitter account at NewsNOW Fox, where you can find all of our interviews like we just did there with Phil Schumann, and also the ones from all day today as well, and any big events that happen. We're following a rocket launch, a SpaceX launch that should be happening in the next 15 minutes or so. So we'll bring that to you live. But first, we will take you out to this story from our sister station in Houston about vaccines.
First of all, talk to me. What we're hearing about AstraZeneca is it's a more traditional vaccine in that it doesn't have to be frozen. So do you like what you're seeing in terms of the research results that you've seen so far?
So thank you for having me. So we're very excited to have kind of 3 vaccines coming out all very, very closely in time. And the AstraZeneca one is exciting for 2 reasons. One is that it is a very traditional method of vaccine. We use an adenovirus. It's one that a technique that we understand well, has been in place for a long period of time. But also, very importantly, it is similar to vaccines made all over the world. So the ability for worldwide production to turn on and make this vaccine in multiple different countries and then distribute it is perhaps a little easier than the 2 new vaccines from both Pfizer and Moderna, which use newer technologies. Mm-hmm. Also, the fact that the AstraZeneca does not need to be kept at such cold temperatures makes global distribution and consider rural distribution far, far easier than we would expect from the two other candidates that are now available or soon to be available.
So can I ask you, because you are a doctor here, we've been getting kind of like conflicting information that we don't understand as lay people. So there's been reports that it's 90% effective, which puts it up there with the measles vaccine, but we also hear it's 70% effective, which puts it at the flu level. So it looks like, and correct me if I'm wrong, that Oxford is saying that the smaller doses seem to be more effective?
Yeah, so it's interesting, right? It's important to remember we're seeing just the first wave of data coming out of this trial, and there will be many more patients that we'll have the data from as the trial progresses, and we'll get a better understanding of it. But specifically, there were 2 treatment arms, one that used 2 what they called full doses a month apart, and the second which used a smaller initial dose followed by a larger dose a month apart. And those 2 trials did have different results, or the 2 arms. The one with the smaller initial dose seemed to generate an effectiveness of 90%, And the 2 higher doses was more like 62%. So a blended average of about 70% effectiveness amongst the 2. There's some plausible reasons why the lower dose may be more effective in the way it activates your immune system a little more subtly. Then with the second dose, your immune system is better ready to mount a robust response. But we're going to need to wait till we see more patients in both those treatment arms to be sure we have a full understanding for what's happening. But there was a definite difference between the 2.
Okay, thank you.
There's so many different scenarios with this, but what about a lot of younger people who are saying, I'm healthy, I don't need it? What would you have to say and recommend about that frame of mind?
Well, I think you can look to everyone who's young and healthy and ask them if they really like the way they're living their life right now. And I think the answer to most of them is no, right? And the way we get back to some semblance of what we used to do is to have a large portion of the population immunized and protected against this virus. So we need them all to cooperate and participate so they can all get back to doing the great fun stuff they like to do.
Now that will probably get everyone's attention. That sounds so nice, doesn't it? It's hard to even fathom that sometimes. Now, what about the number of people getting it? Will the vaccine work better? Will we receive that herd immunity that we all hear about faster if more people receive these vaccines?
So absolutely. The more people we get vaccinated, the more we will be able to prevent the spread through the community. And it's every sort of immunized person we put next to someone who's not provides some degree of protection. But we need to really get up north of 80% to really have that kind of effectiveness now we need. Now, there will be some immunity that people have generated from clearing their own infections. We don't know how long that will last, but that will at least provide some temporary protection. But we're going to need to get a lot of people immunized. And that's why all 3 of these vaccines are so promising, exciting to have multiple routes of distribution, multiple different vaccines, and we will be rolling them out methodically through the healthcare community, through vulnerable populations, and then to the general public.
Well, I know that a lot of people are just anxious to find out what that vaccine is going to look like. Will all of them be multiple doses? And then how important is it to make sure that if you decide, yes, I'm getting this vaccine, that you get both doses? Would one do you any good?
Yeah, so those are great questions. And so really all the vaccines that we have currently available or soon to be available, the Pfizer, the Moderna, and AstraZeneca, all of them require 2 doses. We haven't seen any data about how effective they are if you only get the single dose. So that would be preliminary for me to speculate with. But I imagine when the full data becomes available, as they go through the FDA process, we will see the early data that showed a single dose just did not provide sustained immunity. And that's why the 2 doses will be recommended. And we're going to be doing everything we can to ensure that when you get 1 dose, you then do get the second in the appropriate time, because we don't want to waste this valuable resource.
Oh, no, we definitely don't want to do that. Now, you were painting this beautiful picture earlier of what it will look like when we can all get back to a normal life. In order to do that, once you get the vaccine, is it going to be suggested that people still stay socially distanced? They still wear that mask for a while until we see what happens? Or what does that picture, do you think, look like?
So absolutely, masks and social distancing and hand washing, the cornerstone of what we're doing right now, will remain an essential part of our behavior for the next several months until large numbers of the population can be vaccinated. One of the concerns we do have is that with the number of people who still are unvaccinated and the number of people who silently spread, that the virus will continue to go through the community if we relax any of those efforts. And I think importantly, we don't want to have a kind of mask test that you got vaccinated, you don't have to wear one. So everyone wondering, did you get vaccinated? Is that why you're not wearing your mask? We need everyone to continue to wear masks until we're sure that we've effectively vaccinated a large portion of the population.
Wow, that makes complete sense when you put it that way. Dr. McCarthy, thank you for your expertise and time from Memorial Hermann today. Great conversation.
You're watching News Now from Fox. That was coming out of our sister station, Fox Houston. We appreciate them, and we're really going to be tracking this vaccine development. The CDC releasing that in the second week of December. We should be seeing some distribution of those vaccines. Pfizer and Moderna are the ones that we are really keeping our eye on. So We're going to stay on COVID-19, but some of you are going to be taking a 2-minute commercial break. We will see you when we come back, but when you come back, we will be out in Milwaukee talking about COVID-19 out there. They're seeing a rise in cases, but they're also seeing a rise in trying to get more testing too. So that's good news out there. We'll play that out for you here on News Now from Fox. And just in the next hour or so, we'll be keeping our eyes on a SpaceX rocket launch, which is always exciting. And then Andrew Kraft will be doing a live report from Wilmington, Delaware, talking about what to expect for Joe Biden and that transition team as he has been confirmed the president-elect. That big announcement coming this week from the GSA saying that they are ready to do that formal transition with Joe Biden and him electing his cabinet today. We'll play that all out for you here on News Now from Fox.
Crowley. Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management. Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. And Beth Ridley, founder and CEO of the Brimful Life, will be joining us to share her story of recovering from COVID-19. Please note, Mayor Barrett will be departing after his statements this afternoon due to a prior commitment. Mayor Barrett, you're starting us off today.
Thank you very much, Sydney. And the prior commitment, just so you know, is a call with the incoming intergovernmental relations team from President-elect Biden's office. They're reaching out to a number of mayors throughout the country. And I'm sure the county executive will be getting a call when they do the county executives. So they're starting the outreach, and I like it. And David's smiling too, so I'm sure he's going to like it just as much. But good afternoon. And I think it's really important today to mark a special day. Public Health Workers Day was yesterday. And I think there is no year more important for us to thank our public health workers than 2020. And the fact that yesterday marked Public Health Thank You Day leads me to want to take a moment to recognize all of the dedicated individuals who work every day to protect our health and safety, especially as we fight COVID-19. Your efforts save lives. We are so grateful for the tireless work of every single doctor, nurse, public health leader, public health worker, and healthcare provider. The people in the trenches, the people who work as orderlies, the people who clean the rooms in the hospitals and the nursing homes, the people who go out and make the house calls for us. They have been working nonstop to care for our community despite extraordinary challenges. And we can see this around the nation right now with the shortages in healthcare facilities, with the shortages in nursing homes, with the pressure that's being placed on our public health workers. And we've seen it. We've seen it firsthand with our public health workers who are out there working to basically enforce our public health orders and some of the treatment that they have received. This is a time to thank these public health workers, not to castigate them, not to give them a hard time, but to work with them. So I especially want to shout out all of our Milwaukee Health Department workers by recognizing their extraordinary research and responsibility to public health threats and emergencies. They have done an outstanding job of working with community organizations, healthcare providers, and businesses, and most importantly, with the residents of our city on dealing with issues like COVID-19 testing, care, and best practices. So again, a big shout out. If anybody you know is involved in delivering healthcare right now or working as public health right now, they deserve a big, big virtual pat on the back. Not a real pat on the back right now, a virtual pat on the back. So I want to now segue to Thanksgiving. You have heard us talk about Thanksgiving and the importance of staying home and avoiding gatherings. You may be thinking to yourself that joining extended family for a Thanksgiving meal cannot be that dangerous. I know that's what I think. I know that's what my wife thinks, but we also have just taken the time to make the decisions. But let me lay out a hypothetical scenario to help illustrate the importance a little better. Suppose someone was exposed to COVID-19 at work through a friend or someone in the community. A few days later, that person feels perfectly healthy. Just to be safe, they get tested for COVID-19 before the holidays. This happened to me. The test comes back negative and everyone has peace of mind. A few days after that, they enjoy a Thanksgiving meal with 20 family members. A few more days pass and that person starts feeling ill. They get tested for COVID-19, and now they find out that they are positive and that they were contagious while they were around their family members, many of whom are high risk. Could this be? Well, remember, it can take up to 14 days after exposure to show symptoms and to test positive. That's where we run into a lot of problems. People test negative and they assume they're out of the woods. That negative test is a snapshot. It's a good snapshot to have, but it's simply a snapshot. So just because you feel well doesn't mean that you're in the clear. COVID-19 is spreading faster around our community and across the nation. This holiday season, it's really better to be safe than sorry. So show your gratitude for family by protecting their health. Opt for a small meal with members of your household and consider a virtual meeting or a phone call with extended family. I know the holidays look different this year, but this won't be forever. Please do your part and help us stop the spread. Now I want to turn to our community testing numbers. Again, a busy week here in Milwaukee on testing. On Monday, we had 2,568 people tested at Miller Park. That's a lot of people going through that parking lot. We also had 634 on the Northwest Health Center. Again, a lot of people. And on the South Side, 488. So a total of 3,690 just in one day this holiday week. As a reminder, all 3 community testing sites will be closed in observance of Thanksgiving on Thursday, November 26th. The Miller Park and the Miller Park site only will reopen on Friday, November 27th. But the Northwest and South Side centers will remain closed on that day. Now I want to talk a little bit about 16th Street because they have been such a great partner to us. This morning I joined Commissioner Jackson to share some great news about our COVID-19 efforts here in the city on the South Side in particular. We were able to allocate grant money supplied by the state of Wisconsin as part of the COVID-19 aid package to our longtime super partner, 16th Street Community Health Centers, for 2 separate structures. One for drive-through COVID-19 testing and another for additional clinic space to expand patient care capacity. 16th Street was chosen because of the volume of testing and patients served. It is very, very culturally competent to serve the South Side, where we continue to have very, very many issues with high percentage of people being tested who are positive. Throughout the pandemic, we have seen the crucial role that community organizations play, and 16th Street in particular, and the need for testing and care in the neighborhoods who have suffered the most.
All right, this is Andrew Kraft here with NewsNOW from Fox. I want to thank everyone for watching. Just a little bit after 7 o'clock here Mountain Time. We have a great rocket launch in store for you. There's it looks like 3.5 minutes until launch. This is from SpaceX again, and I'll read some of the description of what this launch is for, but we want to put it on the screen for you now. It's going to happen momentarily, so we want to just listen into this. I'm going to read a bit of the description that we have for you. This is the launch of its 16th Starlink mission. It will launch 60 Starlink satellites, and this is coming to you from Cape Canaveral in Florida at the Air Force Station. Slated to launch at 9:13 Eastern and 7:13 our time here at night in Phoenix, Arizona. So let's listen into the SpaceX commentators there. I believe there's some audio so we can hear, and then I'll put the graphic up and we can watch this live. It'll be a nice Tuesday night viewing.
The big watch item right now is the winds. They were projected to dip right around the launch window, again, about 2 minutes away from now. Keeping an eye on those, making sure that we don't violate any launch commit criteria. Wide shot there of locks close out. Wide shot there of the pad and the call from the prop team that stage 2 LOX loading is complete, but that propellants are fully loaded on Falcon 9. Coming up here, we will have a pretty large white cloud of venting coming from the transporter erector. That's the truss structure next to Falcon 9. and it provides power, cooling, and propellants, as well as communication to Falcon 9 until liftoff. So coming up, transition to startup on Falcon 9.
Falcon 9's in startup.
So again, that means from here, Falcon 9 will begin to pressurize those tanks, the first stage and second stage tanks with our pressure in for flight.
LDs go for launch.
Great news from the launch director.
Stage 2, press for flight.
Giving their go for flight. So with that, just 30 seconds to go. Vehicle looking healthy. Looks like we may have just squeaked in under the wind.
30 seconds and counting.
Starlink satellites also continuing to look healthy. Why don't we listen in and watch terminal count?
T-minus 15 seconds. Falcon 9 is configured for flight. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Ignition and liftoff. Pitching downrange. M1D chamber pressures are nominal.
Seconds into flight, Falcon 9 successfully lifting off from pad 40 at Cape Canaveral Air Force Station.
Nominal.
Carrying those 60 Starlink satellites into orbit. This particular booster lighting up the Florida coast for a 7th time. Now, we just began throttling down those Merlin 1D engines for maximum dynamic pressure, or max Q. That's the point when the stresses on the vehicle are the highest from the combination of the vehicle speed and the density of the atmosphere.
Max Q.
And now that we're through the point of maximum dynamic pressure, the loads on the vehicle, the structural loads, are going to drop off as the density of the atmosphere continues to decrease. And Falcon 9 continuing to speed up. We're about a minute away from 3 events. First of those is main engine cutoff, or MECO. That's where we'll shut off those 9 Merlin 1D engines. You can actually see the plume expanding from them on your camera. We shut those down.
Engine chill started.
In preparation for stage separation. That's where the first and second stages will separate from each other. First stage continuing on a parabolic arc to make its way back to the drone ship, while the second stage continues on to the third event, second engine start number 1. We actually just heard the call out there for MVAC chill-in beginning. So during that third event, second engine start 1, we'll ignite the Merlin vacuum engine that'll propel the second stage along with the Starlink satellites into an elliptical orbit. And we chill in those turbo pumps with liquid oxygen just to get them ready for ignition.
And MECO. Stage separation confirmed.
Left-hand side of your screen.
Ignition.
First stage separating, second stage ignition. Love that green glow from the T-tab ignition. Both vehicles back on their way. Coming up shortly, we'll expect to see fairing deployment off of the second stage. Look for that on the right-hand side of your screen.
Fairing separation confirmed.
Beautiful shot there of those Starlink satellites finally getting to see space directly. We now that we're outside of the atmosphere, we don't need those fairing halves anymore, so we'll jettison them back to Earth to recover them. As a reminder, we do have our recovery ships Miss Chief and Ghost Searcher waiting at the Atlantic to scoop up both of those fairing halves.
On the left-hand side of your screen there, we saw the very last remnants of night lights visible off the Florida coast. It was a pretty awesome sight there as Falcon 9 lifted off. Now there we can see second stage with a healthy glow there on the MVAC engine. As second stage heads towards its targeted drop-off orbit, the first stage will execute 2 burns in order to make its way back to Earth. Now, if you happen to have followed along with our most recent launch on this past Saturday, where we launched out of Vandenberg Air Force Base, Bermuda, we performed 3 maneuvers in that instance because we were returning to launch site where we were landing the first stage back on land. Tonight, we are landing on the drone ship, as Shiva said before, of course, I still love you. So we only need to perform 2 maneuvers because we are continuing the arc trajectory of the first stage. So that first burn is the entry burn, and we will reignite 3 of the 9 M1D engines at the base of the first stage. And this will help to slow that stage down as it re-enters the upper part of the Earth's atmosphere. And then the second burn is the landing burn. This is a single engine burn that brings the vehicle speed down rapidly in order to make a soft landing
on a nominal trajectory
on the drone ship. So we heard there that the vehicle's on nominal trajectory. That's good news there. At this point in time, the first stage has reached apogee and is now starting its trip back down to the ocean. Our drone ship is parked a couple hundred miles off the coast of Florida in the Atlantic Ocean. It is, as you saw, a nighttime launch, and unfortunately, we can't really see anything. So we don't have very good first stage footage to show you at this point in time. But we will bring that back in once we get some landing burn action, re-entry burn action. Checking in on second stage, everything continues to look good. The 60 Starlink satellites that are on board today are joining the constellation of nearly 900 that we've already placed on orbit. These satellites are designed to provide high-speed, low-latency internet to folks like us here on Earth. And this is especially helpful for places where good internet is hard to access. First stage is continuing to coast, and it uses nothing but grid fins for that steering, as well as occasional nitrogen gas bursts for attitude control.
Stage 1 FTS is saved.
So on your left-hand side of the screen, yes, we will see the entry burn beginning.
Entry burn startup.
And entry burn has begun. And this will last for about another 20 seconds. Again, this is the first of 2 maneuvers that the first stage will perform tonight.
Stage 1 entry burn shutdown.
And shutdown of first stage entry burn. So
Stage
that
2
burn
continues to follow a nominal trajectory.
That burn was designed to slow the booster down significantly as it re-enters the upper parts of the Earth's atmosphere. The next maneuver will be the landing burn, and it is the final one where we reignite just one single Merlin engine to make a soft landing on top of the drone ship. As we mentioned earlier, this is the 7th.
Stage 1 entry transonic.
We just heard that the booster is now transonic as it is re-entering the Earth's atmosphere. As I was saying, this is the 7th successful launch for this booster, and that will make this the 7th recovery attempt. Everything's continuing to look good there on the second stage. The
Stage 2 terminal guidance.
MVAC engine has begun to throttle down.
Landing burn startup.
There we heard the call out that landing burn has begun, so we should see that come into the screen here just momentarily.
Stage 2 FTS is saved.
Stage 1, landing leg deploy.
Landing legs have deployed. Here it comes. All right. And for the 7th time, this Falcon has landed. This marks our 61st successful recovery of a Falcon 9 first stage.
And we have Seco.
And as the smoke clears, we can get a good view there. And we just heard the call out that we had Seco 1, or second engine cutoff 1. So at this point in time,
Insertion.
and there we heard the call out that we have good orbit for that second stage. So now that stage 2 is, it's going to coast in this orbit for a few minutes. During this time, it will start to spin along its central axis, giving the Starlink satellites the momentum that they need to space themselves out over time as they deploy. So we're going to take a quick break here, but we will be returning at T plus 14 minutes, so stick around.
Expected loss of signal, Cape.
All right, so on News Now from Fox, we're always so happy to bring you these awesome feats of human achievement, especially these SpaceX rocket launches. And as you just saw a minute ago on your screen there, the booster lands on the landing pad at the ship docked out in the Atlantic, according to the SpaceX astronauts who were walking us through that and what we were seeing. So it was really great commentary. But just to rehash and kind of summarize, what that was and why the launch was happening. This is a Starlink mission, and they launched 60 Starlink satellites. And like you heard, these satellites improve and increase our Wi-Fi capabilities here on Earth. So that's what they're up there for. And they said, I believe it was the 7th or 9th successful landing of that booster back upright on the landing ship there, docked in the South Atlantic. So truly something spectacular to see each and every time we can bring these to you. We love to do so and kind of break up the news here, especially on a Tuesday night with so much coronavirus news, so much political news. So we hope you enjoyed that here on News Now from Fox. Remember, everything is live and everything is raw and unfiltered. So like you just saw, we wanted to bring you all of that live, and sometimes we can't get to everything live that's happening. There's so many things, so we'll show it to you after the fact as well. We do want to go out and switch gears here. We're going to probably take a quick commercial break. We'll see you back here in 2 minutes. Some of you will see this and some of you won't. And like I said, in the meantime, we are going to transition now ahead of some of these live reports we're going to bring you in just about an hour's time out of Wilmington, Delaware, giving you all the updates on the Biden-Harris transition. A lot of news happened on that front today, but earlier, Joe Biden, the president-elect, introduced his national security team, the people he chose, that he picked to lead national security going forward in his new administration. So we want to play that out for you now. These are figures and people that Joe Biden picked himself, and it was a priority for him. National security was the first in this slate of announcements amongst cabinet and cabinet-level picks for his incoming administration. So let's listen to the president-elect right now out of Wilmington, Delaware, introduce these people to the public.
Everybody, okay. Well, good afternoon, everyone. Today, I'm pleased to announce nominations and staff for critical foreign policy and national security positions in my administration. It's a team that will keep our country and our people safe and secure. And it's a team that reflects the fact that America is back, ready to lead the world, not retreat from it, once again sit at the head of the table, ready to confront our adversaries and not reject our allies, ready to stand up for our values. In fact, in calls from world leaders that I've had, about 18 of them or 20 so far, I'm not sure the exact number, in the weeks since we won the election, I've been struck by how much they're looking forward to the United States reasserting its historic role as a global leader, both in the Pacific as well as the Atlantic, all across the world. The team meets this moment, this team behind me. They embody my core beliefs that America is strongest when it works with its allies. Collectively, this team has secured some of the most defining national security and diplomatic achievements in recent memory, made possible through decades of experience working with our partners. That's how we truly keep America safe, without engaging in needless military conflicts and our adversaries in check and terrorists at bay. And that's how we counter terrorism and extremism, control this pandemic and future ones, deal with the climate crisis, nuclear proliferation, cyber threats and emerging technologies that spread authoritarianism, and so much more. And while this team has unmatched experience and accomplishments, they also reflect the idea that we cannot meet these challenges with old thinking and unchanged habits. For example, we're going to have the first woman lead the intelligence community, the first Latino and immigrant to lead the Department of Homeland Security, and a groundbreaking diplomat at the United Nations. We're going to have a principal on the National Security Council whose full-time job is to fight climate change. For the first time ever, that will occur. And my national security team will be coordinated by one of the youngest national security advisors in decades. Experience and leadership, fresh thinking and perspective, and an unrelenting belief in the promise of America. I've long said that America leads not only by the example of our power, but by the power of our example. And I'm proud to put forward this incredible team that will lead by example. As Secretary of State, I nominate Tony Blinken. He's one of the better prepared for this job. No one's better prepared, in my view. He will be the Secretary of State who previously served in top roles on Capitol Hill, in the White House, and in the State Department. He delivered for the American people in each place. For example, leading our diplomatic efforts in the fight against ISIS, strengthening America's alliance and positions in the Asia-Pacific, guiding our responses to the global refugee crisis with compassion and determination. And he will rebuild morale and trust in the State Department, where his career in government began. And he starts off with the kind of relationships around the world that many of his predecessors have had to build over the years. I know. I've seen him in action. Tony's been one of my closest and most trusted advisors. I know him and his family, immigrants and refugees, a Holocaust survivor, who taught him to never take for granted the very idea of America as a place of possibilities. Possibilities. Tony is ready on day one. As Secretary for Homeland Security, I nominate Alejandro Mayorkas. This is one of the hardest jobs in government, a gigantic agency. The DHS Secretary needs to keep us safe from threats at home and from abroad. And it's the job that plays a critical role in fixing our broken immigration system. After years of chaos, dysfunction, and absolute cruelty at DHS, I'm proud to nominate an experienced leader who has been hailed by both Democrats and Republicans. Ali, as he goes by, is a former U.S. attorney, former director of U.S. Citizenship and Immigration Services, and a former DHS deputy secretary. Helped implement DACA, prevented attacks on the homeland, enhanced our cybersecurity, helped communities recover from natural disaster, combated Ebola and Zika. And while DHS affects everyone, given its critical role in immigration matters, I'm proud that for the first time ever, the department will be led by an immigrant, a Latino, who knows that we are a nation of laws and values. And one more thing. Today's his birthday. Happy birthday, man. Happy birthday. He's 21. As a director of national intelligence, I nominate Avril Haines, the first woman ever to hold this post. To lead our intelligence community, I didn't pick a politician or a political figure. I picked a professional. She is eminently qualified. Former deputy director of the CIA, former deputy national security advisor to President Obama, and a fierce advocate for telling the truth and leveling with her decisions with the decision makers. Straight up. Nothing unnecessary. I know because I've worked with her for over a decade. Brilliant, humble, can talk literature and theoretical physics, fixing cars, flying planes, running a bookstore cafe, all in a single conversation because she's done all that. And above all, she gets word of a threat, if she gets word of a threat coming to our shores, like another pandemic or foreign interference in our elections, she will not stop raising alarms until the right people take action. People will be able to take her word because she always calls it as she sees it. I believe we are safer with Avril on the watch. I think she can make a great contribution. And as United States Ambassador to the United Nations, I nominate Linda Thomas Greenfield, a seasoned and distinguished diplomat with 35 years in the Foreign Service who never forgot where she came from, growing up in segregated Louisiana. The eldest of 8. Her dad couldn't read or write, but she says he was the smartest person she knew. First in her family to graduate from high school, then college. The whole world literally ahead of her, as her dad and mom taught her to believe. Post in Switzerland, Pakistan, Kenya, the Gambia, Nigeria, Jamaica, Liberia, where she was known as the People's Ambassador. Willing to meet with anyone, an ambassador, a student, working people struggling to get by, and always treating them with the same level of dignity and respect. She was our top State Department official in charge of African policy during the Ebola crisis. She received overwhelming support from her fellow career Foreign Service officers, and she'll be at cabinet status because I want to hear her voice on all the major foreign policy discussions we have. And my national security advisor, I choose Jake Sullivan. He's once-in-a-generation intellect with experience and temperament for one of the toughest jobs in the world. When I was vice president, he served as my national security advisor. He was a top advisor to Secretary of State Clinton. He helped lead the early negotiations that led to the Iran nuclear deal. He helped broker the Gaza ceasefire in 2012, played a key role in Asian-Pacific rebalance in our administration. And in this campaign for the presidency, he served as one of my most trusted advisors on both foreign and domestic policy, including helping me develop our COVID-19 strategy. Jake understands my vision that economic security is national security, and it helps steer what I call a foreign policy for the middle class, for families like his growing up in Minnesota, where he was raised by parents who were educators and taught him the values of hard work, decency, service, and respect. What that means is to win the competition for the future, we need to keep us safe and secure and build back better than ever. We need to invest in our people, sharpen our innovative edge, unite the economic might of our democracies around the world to grow the middle class and reduce inequity, and do things like counter predatory trade practices that our competitors and our adversaries. And before I talk about the final person today, let me talk about this new position. For the first time ever, the United States will have a full-time climate leader who participate in ministerial level meetings. And that's a fancy way of saying they'll have a seat at every table around the world. For the first time ever, there will be a principal on the National Security Council who can make sure climate change is on the agenda in the Situation Room. For the first time ever, we will have a presidential envoy on climate. He will be matched with high-level White House climate policy coordinator and policy-making structure to be announced in December. And that'll lead efforts here in the United States to combat the climate crisis, mobilize action to meet the existential threat that we face. Let me be clear. I don't for a minute underestimate the difficulties of meeting my bold commitments to fighting climate change. But at the same time, no one should underestimate for a minute my determination to do just that. And as for the man himself, if I had a former Secretary of State who helped negotiate the Paris Climate Accord, or a former presidential nominee, or a former leading senator, or the head of a major climate organization for the job, they would show my commitment to the United States and the whole world. The fact that I picked the one person who is all of these things speaks unambiguously to my commitment. The world will know that with one of my closest friends, John Kerry, he's speaking for America on one of the most pressing threats of our time. No one I trust more. To this team, I thank them for accepting this call to service. And for their families, I thank you all for your sacrifice. You know, we could not do this without you, in my view. Together, these public servants will restore America globally, its global leadership, and its moral leadership, and will ensure that our service members, diplomats, and intelligence professionals can do their job free of politics. They'll not only repair, they'll also reimagine American foreign policy and national security for the next generation. And they'll tell me what I need to know, not what I want to know, what I need to know. To the American people, this team will make us proud to be Americans. And as more states certify the results of this election, there's progress to wrap up our victory. You know, I'm pleased to have received the ascertainment from GSA to carry out a smooth and peaceful transition of power, so our teams can prepare to meet the challenges at hand, to control the pandemic, to build back better, and to protect the safety and security of the American people. And to the United States Senate, I hope these outstanding nominees received a prompt hearing and that we can work across the aisle in good faith to move forward for the country. Let's begin that work to heal and unite. To heal and unite America as well as the world. I want to thank you all. May God bless you. May God protect our troops. And now I turn this over, this new team, starting with our next Secretary of State, Tony Blinken. Get my mask here, Tony, so I don't get in trouble. And we're going to clean off the podium.
Good afternoon. Mr. President-elect, Vice President-elect Harris, thank you for your trust and your confidence. If confirmed by the United States Senate, I will do everything I can to earn it. Mr. President-elect, working for you, having you as a mentor and friend, has been the greatest privilege of my professional life. So many people have brought me to this day, from college classmates to bandmates, my colleagues in the Clinton and Obama administrations, in the Senate, and at the State Department. I thank them all, and I ask forgiveness for my insatiable appetite for bad puns. Mostly, I'd like to thank my family, sisters and sisters-in-law, brothers-in-law, nieces and nephews, my wonderful in-laws, the Ryans, and especially my wife, Evan Ryan, and our children, John and Lila. They are truly my greatest blessings. For my family, as for so many generations of Americans, America has literally been the last best hope on earth. My grandfather, Maurice Blinken, fled pogroms in Russia and made a new life in America. His son, my father, Donald Blinken, served in the United States Air Force during World War II, and then as a United States ambassador. He is my role model and my hero. His wife, Vera Blinken, fled communist Hungary as a young girl and helped future generations of refugees come to America. My mother, Judith Pizar, builds bridges between America and the world through arts and culture. She is my greatest champion. And my late stepfather, Samuel Pizar, he was one of 900 children in his school in Białystok, Poland, but the only one to survive the Holocaust after 4 years in concentration camps. At the end of the war, he made a break from a death march into the woods in Bavaria. From his hiding place, he heard a deep rumbling sound. It was a tank, but instead of the Iron Cross, he saw painted on its side a 5-pointed white star. He ran to the tank. The hatch opened. An African-American GI looked down at him. He got down on his knees and said the only 3 words that he knew in English that his mother had taught him before the war. God bless America. That's who we are. That's what America represents to the world, however imperfectly. Now, we have to proceed with equal measures of humility and confidence. Humility because, as the President-elect said, we can't solve all of the world's problems alone. We need to be working with other countries. We need their cooperation. We need their partnership. But also confidence, because America, at its best, still has a greater ability than any other country on earth to bring others together to meet the challenges of our time. And that's where the men and women of the State Department, Foreign Service officers, civil servants, that's where they come in. I've witnessed their passion, their energy, their courage up close. I've seen what they do to keep us safe, to make us more prosperous. I've seen them add luster to a word that deserves our respect, diplomacy. If confirmed, it will be the honor of my life to help guide them. And so thank you all, and may God bless America.
Good afternoon, Mr. President-elect, Madam Vice President-elect. Thank you for placing your trust in me to lead the Department of Homeland Security. Thank you for the privilege of returning, with the consent of the Senate, to government service as a member of your administration. It is the honor of a lifetime. The Department of Homeland Security has a noble mission to help keep us safe and to advance our proud history as a country of welcome. There are more than 240,000 career employees who selflessly dedicate their talent and energy to this mission. Many risk their lives in doing so. I would be honored to return to the department and support these dedicated public servants in fulfilling their responsibilities and realizing our country's greatest hopes, all in partnership with the communities we serve. For 12 years, I had the privilege to stand in a federal courtroom and announce Alejandro Mayorkas on behalf of the United States of America. The words, "on behalf of the United States of America," meant everything to me and to my parents, whom I think of today and every day. My father and mother brought me to this country to escape communism. They cherished our democracy and were intensely proud to become United States citizens, as was I. I have carried that pride throughout my nearly 20 years of government service and throughout my life. My parents are not here to see this day. Mr. President-elect, Madam Vice President-elect, please know that I will work day and night in the service of our nation to ably lead the men and women of the United States Department of Homeland Security and to bring honor to my parents and to the trust you have placed in me to carry your vision for our country forward. Thank you.
Thank you. Good job.
Mr. President-elect,
Madam Vice President-elect, I am grateful and even more so humbled by the trust that you placed in me for this role. I'm especially honored to be standing not only by your side, but also alongside some of the most talented and inspiring public servants this country has ever seen. I know, Mr. President-elect and Madam Vice President-elect, that you have selected us not to serve you, but to serve on behalf of the American people, to help advance our security, our prosperity, our values, that the call to service in this role is what makes this nomination such a tremendous honor. If afforded the opportunity to do so, I will never forget that my role on this team is unique. Better than that of a policy advisor, I will represent to you, Congress, and the American public, the patriots who comprise our intelligence community. Mr. President-elect, you know that I have never shied away from speaking truth to power, and that will be my charge as Director of National Intelligence. I've worked for you for a long time, and I accept this nomination knowing that you would never want me to do otherwise, and that you value the perspective of the intelligence community, and that you will do so even when what I have to say may be inconvenient or difficult, and I assure you there will be those times. And finally, to our intelligence professionals, the work you do, oftentimes under the most austere conditions imaginable, is just indispensable. It will become even more complex because you will be critical to helping this administration position itself not only against threats such as cyber attacks or terrorism and the proliferation of nuclear, biological, or chemical weapons, but also those challenges that will define the next generation, from climate change to pandemics and corruption. And it would be the honor of a lifetime to be able to work alongside you once again to take these challenges on together. Thank you so much.
Good afternoon, Mr. President-elect, Madam Vice President-elect. I'm humbled and honored by the trust that you have placed in me to become a member of your cabinet as ambassador to the United Nations. In the years that I've worked in government, I'm always struck by how only in America would we be where we are today, where life can be hard and cruel, but there's hope in the struggle. There is promise in our dreams, where you learn to believe in yourself and that anything is possible. Like both of you, I learned from my family. Mr. President-elect, thank you for those generous words that you said about me. My parents had very little back in Louisiana where I grew up, but they gave me and my siblings everything they had. And I know how proud they would be of this day. On this day, I'm also missing my mentor, Ambassador Ed Perkins, who served as the U.S. Ambassador to the United Nations under President George H.W. Bush and President Clinton, and who was also from Louisiana. He told me constantly, Linda, don't undersell yourself. And he would always do everything possible to lift me up. He passed away last week, but I know he's here with us today. And on this day, I'm thinking about the American people, my fellow career diplomats and public servants around the world. I want to say to you, America is back. Multilateralism is back. Diplomacy is back. Mr. President-elect, I've often heard you say how all politics is personal, and that's how you build relationships of trust and bridge disagreements and find common ground. And in my 35 years in the Foreign Service across 4 continents, I put a Cajun spin on it. I called it gumbo diplomacy. Wherever I was posted around the world, I'd invite people of different backgrounds and beliefs to help me make a roux and chop onions for the Holy Trinity and make homemade gumbo. It was my way of breaking down barriers, connecting with people, and starting to see each other on a human level. A bit of lagniappe is what we say in Louisiana. That's the charge in front of us today. The challenges we face, a global pandemic, the global economy, the global climate change crisis, mass migration and extreme poverty, social justice, are unrelenting and interconnected, but they're not unresolvable if America is leading the way. Thank you.
Mr. President-elect, Madam Vice President-elect, thank you. Mr. President-elect, I am honored and humbled by the immense responsibility that you placed in me of being your national security advisor. I pledge to you and to the American people that I will work relentlessly in service of the mission you have given us, to keep our country and our people safe, to advance our national interests, and to defend our values. I pledge to the exceptional national security team you see behind me, and to the brilliant and diverse career professionals across our government, that I will manage a humane and rigorous decision-making process that honors their work. And I pledge to my parents, who taught my brothers, my sister, and me to work hard, tell the truth, and serve others, that I will do my utmost to make you proud. Sir, we will be vigilant in the face of enduring threats, from nuclear weapons to terrorism. But you have also tasked us with reimagining our national security for the unprecedented combination of crises we face at home and abroad: the pandemic, the economic crisis, the climate crisis, technological disruption, threats to democracy, racial injustice, and inequality in all forms. The work of the team behind me today will contribute to progress across all of these fronts. You have also tasked us with putting people at the center of our foreign policy. You've told us that the alliances we rebuild, the institutions we lead, the agreements we sign, all of them should be judged by a basic question: will this make life better, easier, safer for families across this country? Our foreign policy has to deliver for these families. And perhaps most importantly, you've tasked us with helping unite America, as you said in your remarks, through our work to pull people together to tackle big challenges. My wife, Maggie, the love of my life and my partner in all things, served as a senior advisor to Senator John McCain. She and I shared this commitment to common ground deep in our bones. To the American people, I had the honor of serving as Joe Biden's national security advisor when he was vice president. I learned a lot, about diplomacy, about strategy, about policy, but most importantly, about human nature. I watched him pair strength and resolve with humanity and empathy. That is the person America elected, and that is also America at its best. So, Mr. President-elect, thank you for giving this kid from the heartland an extraordinary opportunity to serve the country I love.
Mr. President-elect, Vice President-elect Harris, thank you, Mr. President-elect, for your generous words. And most of all, thank you for the trust and the responsibility of this appointment. I will do all in my power to live up to your expectations and to this moment for our country and for the world. And I begin by thanking my family for empowering me and encouraging me to take this task on. Secretary-designate Blinken, we've worked together for many years on the Foreign Relations Committee and at Foggy Bottom, and it will be a huge pleasure to partner with you again. You will be a terrific secretary. Mr. President-elect, you've put forward a bold, transformative climate plan. But you've also underscored that no country alone can solve this challenge. Even the United States, for all of our industrial strength, is responsible for only 13% of global emissions. To end this crisis, the whole world must come together. You're right to rejoin Paris on day one, and you're right to recognize that Paris alone is not enough. At the global meeting in Glasgow 1 year from now, all nations must raise ambition together, or we will all fail together. And failure is not an option. Succeeding together means tapping into the best of American ingenuity, creativity, and diplomacy, from brain power to alternative energy power, using every tool we have to get where we have to go. No one should doubt the determination of this president and vice president. They shouldn't doubt the determination of a country that went to the moon, cured supposedly incurable diseases, and beat back global tyranny to win World War II. This kind of crisis demands that kind of leadership again, and President Biden will provide it. The road ahead is exciting, actually. It means creating millions of middle-class jobs. It means less pollution in our air and ocean. It means making life healthier for citizens across the world. And it means we will strengthen the security of every nation in the world. In addressing the climate crisis, President-elect Joe Biden is determined to seize the future now and leave a healing planet to future generations. 57 years ago, this week, Joe Biden and I were college kids when we lost the president who inspired both of us to try to make a difference. A president who reminded us that here on earth, God's work must truly be our own. President Joe Biden will trust in God, and he will also trust in science to guide our work on earth to protect God's creation. Mr. President-elect and Vice President-elect Harris, I look forward to getting to work. Thank you.
Thank you, Secretary Kerry. And congratulations, Mr. President-elect, on bringing together this extraordinary team. I have always believed in the nobility of public service, and these Americans embody it. Their lives and careers are a testament to the dedication, sacrifice, and commitment to civic responsibility that have strengthened our democracy and kept America's promise alive for more than 200 years. President-elect Biden and I have long known that when we were elected, we would inherit a series of unprecedented challenges upon walking into the White House. Addressing these challenges starts with getting this pandemic under control, opening our economy responsibly, and making sure it works for working people. And we also know that our challenges will require us here at home to overcome those issues that block our ability to proceed. Our challenge here is a necessary foundation for restoring and advancing our leadership around the world. And we are ready for that work. We will need to reassemble and renew America's alliances, rebuild and strengthen the national security and foreign policy institutions that keep us safe and advance our nation's interests, and confront and combat the existential threat of climate change that endangers us all. I take these issues very seriously. My whole career has been about keeping people safe, from serving as district attorney to California's Attorney General to the United States Senate, where I have served on the Intelligence and Homeland Security committees. I've come to know firsthand the gravity of the challenges and threats facing the United States. And over the past few months, I've also come to know the sound judgment, expertise, and character of the people on this stage. I can say with confidence that they are, to a person, the right women and men for these critical positions. And I look forward to working alongside them on behalf of the American people and on behalf of a president who will ask tough questions, demand that we be guided by facts, and expect our team to speak the truth, no matter what. A president who will be focused on one thing and one thing only: doing what is best for the people of the United States of America. When Joe asked me to be his running mate, he told me about his commitment to making sure we selected a cabinet that looks like America, that reflects the best of our nation. And that's what we have done. Today's nominees and appointees come from different places. They bring a range of different life and professional experiences and perspectives. And they also share something else in common: an unwavering belief in America's ideals, an unshakable commitment to democracy, human rights, and the rule of law. And they understand the indispensable role of America's leadership in the world. These women and men are patriots and public servants to their core. And they are leaders, the leaders we need to meet the challenges of this moment and those that lie ahead. Thank you.
Thank all of you for accepting. We appreciate it.
Thank you.
All right. Thank you, folks.
Well, there you have it. That was from earlier this morning in Wilmington, Delaware, and the Vice President-elect Kamala Harris finishing off the round of speakers there in Wilmington. That was President-elect Joe Biden's announcement of his national security team. So there you saw his picks for Secretary of State Anthony Blinken, his pick for the Department of Homeland Security Alejandro Mayorkas, his pick to lead the ambassadorship to the United Nations, Linda Thomas Greenfield, his pick to lead the intelligence community, Avril Haines, and also he created this new position under the National Security Council to focus just on climate policy and climate change, and that's going to former Massachusetts Senator and former presidential candidate himself, John Kerry. We do want to kind of get more into these cabinet picks in just a little bit here. And then, like I said, we're going to have a live report from Wilmington from Fox's Madeline Rivera, breaking down all the things happening in the Biden-Harris transition going forward. First, we do want to take a quick commercial break. So we'll see you back here in 2 minutes. Some of you will see this, some of you will not. So stick right here on News Now from Fox. And like I said, I'm Andrew Kraft. Remember, everything on News Now from Fox is live. It's all raw, it's all unfiltered, and we try to bring you everything in its entirety. But, you know, lots of things are happening all the time. And if we can't get to something live when it's happening, we'll play it out for you right after the fact here on News Now from Fox. If you want to follow us on Twitter, go to @NewsNowFox. Would love to get more followers on our Twitter account. And there you can see all the clips from out the day on the biggest stories throughout the day as well. Also, go to NewsNowFox.com if you're looking over the holidays to tell anyone about us and where they can watch us. We'd really appreciate that too. If you want to follow me on Twitter, that's @AndrewKraft. Also appreciate that as well. So we're going to take a live look at the White House here. We do have some breaking news tonight to get to, and so we want to start off with some reports that Fox has confirmed that President Trump is telling allies he plans to pardon Michael Flynn. Now remember, Michael Flynn was his first national security advisor, and several sources have told Fox that based on the president's thinking, a pardon would come as part of a series of pardons he plans to issue in his remaining days in office. This has been confirmed as well here by Fox White House correspondent John Roberts and Kevin Corke as well. We just want to pull up this tweet for you on the screen here, if I can get to it. I don't know if I can here. Here we go. And as I said, Michael Flynn was the president's first national security advisor, only lasting in the job about 2 or 3 weeks from what I remember. He was embroiled in this controversy, which is what the pardon is for, really, when he was caught in intelligence intercepts speaking with the Russian ambassador, Sergei Kislyak. And we want to just bring this up here. We got this tweet from John Roberts just a few moments ago, confirming through sources familiar with Donald Trump's thinking that he plans to pardon Michael Flynn. And remember, this legal drama has been ongoing for the last 3 years. Flynn pleaded guilty to lying to the FBI. He's never been sentenced. The Justice Department has tried to dismiss the case outright. It's gone through appeal after appeal after appeal. A prosecutor tapped by the Attorney General Bill Barr to review the charges has recommended that they be dropped. But like I said, an appeals court sided with the previous judge's decision in the case to not drop those charges. And so this could be a final end to Michael Flynn's legal saga coming in the next few days or so as the president enters his lame duck period in his administration. This is quite normal, I will add, when presidents have very, very few remaining days left in office. They issue a number of pardons to allies, to people. They grant clemency amongst sentences for people. So this isn't unique to Donald Trump. It's only unique in the fact that Michael Flynn used to work for him in his administration. So it'll be interesting to see if this comes within the week or next week after Thanksgiving. The White House issued a schedule for tomorrow, for Wednesday, Thanksgiving Eve. The president has no events tomorrow on his public schedule, but that always remains to be seen. Things could change throughout the day, so it could be things are added later, but as of right now, no public events on the White House schedule for President Trump tomorrow. We also we're following, all these election lawsuits going on around the country, and as states certify their election results, we're bringing that to you here on News Now. We're getting word that right now the state of Minnesota has certified its 2020 election results. Remember, the president really made a play for that state this time around. After he lost it in 2016, he did not win that state in 2020, and the Board of Canvassers in the state of Minnesota, we're just learning through the Associated Press tonight, has certified their election results for 2020, and the former Vice President Biden, now President-elect Biden, will get those votes from the Electoral College there in Minnesota. And in the meantime, we do want to take you out now to look more in depth into these cabinet picks from Joe Biden, what they mean, who these people are, and how they will lead these agencies going forward next year. So let's look at that right now. This is from Fox 13's Craig Patrick out of Tampa, Florida.
Our political editor, Craig Patrick, is here with a closer look at the nominees, why they were chosen, and how they plan to lead.
Well, hi there, Linda. We'll start in terms of how and why they were chosen. The president-elect said he made his choices, his first picks, the first round of cabinet selections, nominees based on a combination of diversity, experience, expertise, and empathy and intellect. He said those are common threads. And he said there also is another common thread on his emerging team, and that is that they all place a very high value or emphasis on improving our relations with our allies.
America leads not only by the example of our power, but by the power of our example.
President-elect Biden says his nominee for Secretary of State, Tony Blinken, starts with relationships around the world that took his predecessors years to build.
America, at its best, still has a greater ability than any other country on earth to bring others together to meet the challenges of our time.
Biden said he picked Alejandro Mayorkas to lead Homeland Security for his experience and perspective.
My father and mother brought me to this country to escape communism. They cherished our democracy and were intensely proud to become United States citizens, as was I.
Biden said he picked Avril Haines to lead national intelligence based on her intelligence and candor.
You know that I have never shied away from speaking truth to power, and that will be my charge as Director of National Intelligence.
Biden chose Linda Thomas Greenfield as UN ambassador based on her 35 years as a diplomat and her empathy for others.
I want to say to you, America is back. Multilateralism is back. Diplomacy is back.
Biden said he picked Jake Sullivan as his national security advisor based on his intellect, experience, temperament, and vigilance on enduring threats.
But you have also tasked us with reimagining our national security for the unprecedented combination of crises we face at home and abroad. The pandemic, the economic crisis, the climate crisis, technological disruption.
And Biden chose former Secretary of State John Kerry as presidential envoy on climate for his resume and passion for the environment.
The road ahead is exciting, actually. It means creating millions of middle-class jobs. It means less pollution in our air, ocean. It means making life healthier for citizens across the world. And it means we will strengthen the security of every nation in the world.
Now, in terms of the leadership structure, John Kerry will have a seat, have a place as a principal of the National Security Council. And with that, it is a clear sign that President-elect Biden equates the climate crisis with a national security threat as well. That's a position that does not require Senate confirmation, as national security does not either. The other four we just walked you through do, in fact, need Senate confirmation if they are to get their positions the president-elect has picked them to serve in. Also, Biden noted that his UN ambassador would be considered designated a cabinet-level official. Linda?
So when can we expect a decision on other key positions like Secretary of Defense?
Well, last week, the Biden transition said cabinet picks would be rolled out over the next 2 weeks. That was 1 week ago. That would take us logically into tomorrow, not likely the Thanksgiving holidays, or sometime next week when the remaining picks will be named. Secretary of Defense is one particular position where we keep hearing that the president-elect has not settled on a nominee at this time, and he's still looking at his options.
All right. Craig Patrick reporting live for us. Thank you. President-elect Biden just introduced his first picks to serve on his cabinet.
All right, so that was Fox 13's Craig Patrick breaking down all of the so far announced picks from Biden. He was just focusing on national security and the economy at the moment. So we're still awaiting a number of posts yet to be announced. And we do know Biden's schedule tomorrow. He's having some type of Thanksgiving address that he'll deliver from Wilmington, Delaware. And we'll bring that to you here on News Now from Fox Live as well. We do want to go back to Craig Patrick from Fox 13 Tampa. He interviews Senator Marco Rubio very frequently, obviously, this one of the state senators. So he was getting Marco Rubio's take on these choices from Joe Biden and what they mean and how they're going to fare with Republicans. Now, remember, just because Joe Biden chooses these people doesn't mean they don't have a long fight ahead of them, possibly in the Senate, for those people who need to be confirmed by the Senate. So let's listen to that conversation between Craig Patrick and Senator Rubio.
Secretary of State and Florida's own Senator Marco Rubio. Rubio has had some sharp differences with Anthony Blinken over U.S. policy with Cuba, and that could set up for a rocky confirmation hearing. Joining us now to explain all this is our political editor, Craig Patrick. Craig?
Hi there, Cynthia. Let's go back 6 years in time. It was 2014. Tony Blinken was in his confirmation hearing at the time to be Deputy Secretary of State. And in a couple of moments, he was not forthcoming with the Senate. He knows it. Senators remember it. And that's something that could certainly cost him. And I can take you back to the particular moment when Blinken says he now regrets saying some things and not disclosing what he should have. It all started when Senator Marco Rubio asked Blinken at the time if President Obama planned to thaw relations with Cuba.
At the end of his term, the president may seek to make some changes, perhaps even unilaterally, towards U.S. sanctions and policy towards Cuba. Is that being contemplated absent real democratic opening?
It depends on Cuba and the actions that they take. And what we've seen, as I just alluded to, are actions in exactly the wrong direction.
In 2014, Tony Blinken said Cuba was not behaving in line with what we would expect before thawing relations.
When you say you want to improve relations and you're unjustly imprisoning an American, never mind what you're doing to your own people, that's usually problematic.
Senator Rubio pressed him on that point because he heard grumblings President Obama was planning to ease restrictions on the Castro regime. And Blinken assured him that would not happen without full consultation with the Senate.
Do you anticipate during the rest of the president's term that there will be any unilateral change or any change in U.S. sanctions or conditions against Cuba absent them meeting those conditions of democracy, human rights, and those so forth?
And anything that in the future might be done on Cuba would be done in full consultation with the real meaning of the word consultation that I just alluded to with this committee.
Blinken was confirmed December 16th. Then, one day later, December 17th, President Obama unilaterally eased restrictions and thawed relations with Cuba.
The United States of America is changing its relationship with the people of Cuba.
That led to this tense and awkward follow-up.
Or who did the administration consult with on this committee before it announced the changes on the 17th of December?
Senator, I regret that I did not live up to the standard I set during that hearing. I could have done a better job in engaging with you and consulting with you.
That grew more awkward from there.
If I could interject, I assure you that I was not consulted.
Mr. Chairman, you were the chairman at the time. Were you consulted?
Well, no.
So Blinken's confirmation hearing next year could swing on how he explains his regrets from 6 years ago. And when you look back at the back and forth discourse, Blinken acknowledged that he knew talks were going on. He knew what was happening, and he chose not to disclose it in his confirmation hearing. And that's the big issue that could conceivably trip him up. Of course, there are differences in policy. There are inevitably differences for sure, as there are with Cuba and the policy toward Iran, but Rubio and others have made the point it becomes a matter of trust and transparency. While differences inevitably exist, Cynthia, the concern has been raised that Blinken may not be fully transparent. That's been a controversy going back years. Bet that it will come up again. That said, Rubio and, for that matter, Senator Rick Scott have not specifically said at this point where they stand on Blinken's status as the nominee for Secretary of State.
And back in 2014, he was ultimately confirmed. How many votes did he get, and how many does he need this time?
Well, 6 years ago, the vote was 55 to 38. You need a simple majority. He had a few votes to spare 6 years ago. The indications are this time it could be tight either way.
We'll have to wait and see. I know you'll keep us apprised. Thank you so much, Craig. There could be...
Well, that was Fox 13's Craig Patrick breaking down the, I apologize too, he didn't speak to Senator Rubio, but he was breaking down this rift possibly that was going on between Senator Rubio and Tony Blinken, Biden's Secretary of State pick for a previous post that needed Senate confirmation back in the Obama administration. But we do want to now give that live update. We've been previewing about the Biden-Harris transition from Wilmington, Delaware. We're being joined by Fox's Madeline Rivera, and she's been following all the updates from the Biden-Harris transition there. And, you know, Maddie, a lot of these choices that he's making, especially regarding national security rather, are interesting, but I'm kind of been following what the critics have been saying about this, and they are liking it to picks from a so-called Obama third term. What can you tell us about that?
On that, this is going to be very different from the Trump administration. Biden picked a lot of choices that have several years of experience. They are veterans and they do have ties to the Obama administration. So certainly there will be a lot of return to those policies, perhaps a lot of return to the Washington establishment, if you will. So I don't know if they're particularly wrong on that front, but there has been some criticism, particularly from Senator Tom Cotton and Senator Marco Rubio on on Biden's policies on China. They are saying that he could be soft on China, so that's one of the main criticisms that they have of him so far, Andrew.
And Maddie as well, has there been any, like we've mentioned, some pushback from his choices? And I'm kind of curious as well, going forward, we've been hearing talk if Biden's going to pick people who are currently serving in the House and the Senate for these cabinet posts. Does he have any idea on that, if that's a likelihood or if that's a good strategy on his part and the team's part?
Well, I'm going to take your first question. As for pushback, I mentioned Senator Cotton and Senator Marco Rubio, who have criticized his position on China, but there has been a lot of pushback from progressives. There has been a lot of talk about that progressives have been wanting Biden to pick more left-leaning members for his cabinet. They haven't really voiced pushback or any criticism, particularly when it comes to climate change. They seem to be very happy with the choice of former Secretary of State John Kerry, showing that Biden is taking his fight against climate change seriously. And when it comes to your second question about whether it's a good strategy to pick members of Congress, I believe that's what you were asking, Andrew. Correct me if I'm wrong. I'm having trouble hearing you a bit. But is that what you were asking me about? And I can kind of answer that question based on that question.
Betty, yeah, that's right. If you can hear me now. Was just kind of curious about, if the strategy is taking existing members in the Senate and the House, because that would, interfere with the majorities and the minorities at the moment. If that's something that can be expected or not.
Certainly, that is a concern, but Biden has picked, obviously we know about Congressman Cedric Richmond being chosen to serve as a member of his senior staff. That's not, I guess, pushing Biden to not choose any members of Congress if they do meet his requirements, if they are qualified for that position. But there is that level of concern, especially due to the Senate runoffs in Georgia. We don't know who will determine control of the Senate, whether Democrats will take control or whether Republicans will maintain their control of the Senate. So there's a lot with that situation that could be a little, I guess, concerning for Democrats if they do lose a lot of members in the Senate. So certainly that is a point of concern, but I don't think at the end of the day Biden is going to, if that's going to be a big factor in Biden's decision at the end of the day, I think he's going to make his decision based on their requirements, based on their expertise and their experience, and that's ultimately what's going to lead him to make his decision, Andrew.
And Maddie, there's been some news today from earlier today that Biden will now get access to the presidential daily brief, which is something who follow this have kind of been wondering when that would happen. Do you have any idea of when he'll get those first briefings? And now that the GSA has formally ascertained his victory, what are the next steps? Will a lot of sharing be happening amongst federal agencies and the like?
Well, that's the hope. And now that the General Services Administration has signed the letter of ascertainment, that opens up a lot of doors for Biden. He can now access federal sources and transition funds. He can get classified briefings. And he did say today that he will start receiving classified intelligence briefings from the presidential daily brief. His team also says that they've been in contact with every federal agency. So certainly you're starting to see some movement there, starting starting to see a little more of a smooth transition process, Andrew, and that's what we expect over the next several weeks, several months. But one thing to note, though, Biden certainly hasn't been waiting for the GSA to ascertain him as the winner of this election. Biden has been moving forward. Obviously, he met with his COVID-19 task force last week, has been speaking with governors, local leaders, trying to find out what they need to fight the COVID-19 pandemic. And so that's what he's been doing during the absence of an ascertainment last week. He was trying to move forward with those at least issues and starting to get a head start, so that way he's not really caught back with the whole handling of the coronavirus and the economy whenever he gets into office, Andrew.
And Maddie, I thought it was interesting, something that he mentioned just briefly to pool reporters. I think a reporter asked him, if he would meet with President Trump before inauguration, and he had an interesting answer. I don't know if you saw that. You must have.
Yes, he did say that he would be open to talking to President Trump if he's open to it. So I think we'll have to see what happens there, whether or not this actually materializes. We haven't heard a lot from President Trump over the last 2 weeks. He obviously gave some remarks today when it came to the stock market, but we haven't seen him publicly and making any sort of lengthy remarks for quite some time, Andrew.
Yeah, that's right. And, now going into Thanksgiving Eve tomorrow and the Thanksgiving holiday, the White House has announced no public schedules for the president, no public events, rather, for the president tomorrow. But what is President-elect Biden doing going into the Thanksgiving holiday? Is he working? Is he possibly taking a few days off? What's the schedule there?
Well, tomorrow he'll be delivering remarks with regards to Thanksgiving, but I assume that he will be busy over the next several days. I'm sure that he wants to spend Thanksgiving holiday with his family. He's had a very busy week, very busy several weeks, and very busy several months. So I'm sure he's looking forward to spending time with his family, his grandchildren. But there is a lot on the table that he still has to accomplish. Again, we talked about coronavirus. We talked about the economy. These are pressing issues, that people need answers on right now, and he still has a lot of cabinet positions to fill that we've heard from the Biden team that they could be continuing to roll out these announcements all the way up until December. So, we're going to start to see a little bit more of his team fill out. He could be announcing members of his economic team next week. So there's a lot to, keep our eyes peeled on, and so I don't really think that he's going to get a completely down few days. I think he'll still have to work behind the scenes there, Andrew.
All right, Fox's Madeline Rivera live for us in Wilmington, Delaware. Always great to talk to you, Madeline, and we hope you get some rest, hopefully, on Thanksgiving. We'll talk to you then.
Thanks, Andrew. I hope you do too.
Later. And that was a great live report there, just breaking everything down going on in the Biden-Harris transition. Still awaiting these cabinet picks for all these positions. Still in the days ahead. We did want to kind of pause here and just take a quick commercial break. Some of you will see this, some of you won't, but we'll be back in 2 minutes here on News Now from Fox. And remember, here on News Now from Fox, everything is live, everything is raw and unfiltered. There's no bias, there's no opinion. We try to offer all the context we can, all the analysis we can, but we go over the top stories of the day. That's all we do here. We play things out in their entirety. If we can't get to something as it's happening live because something else might be happening live, we'll get to it later after the fact. But we want to thank everyone for watching. And now we want to play for you, still based on kind of an intersection of politics and the coronavirus, but officials from Health and Human Services and the Department of Defense had a briefing today discussing Operation Warp Speed, the rapid progress that has been made, and the plans for distribution of that vaccine. In just a matter of weeks, we're told the first vials, the first supplies of that vaccine will be available in the United States. So we're going to play that out for you right now. This was from earlier today from DOD and HHS officials.
Dr. Matt Hepburn. This was a technical level briefing with governors. This, of course, is in addition to the almost weekly briefings that the Vice President chairs with our governors, where Operation Warp Speed and vaccine and therapeutic distribution have been a regular topic of discussion. The past several days have seen a continuing torrent of good news around COVID-19 vaccines. On Friday, Pfizer submitted data for an emergency use authorization by the FDA, which means that we could begin distributing millions of authorized vaccines in just a few weeks. Then, yesterday morning, AstraZeneca announced promising data from its trials in the UK and Brazil. Through Operation Warp Speed, we have purchase agreements for up to 300 million doses of the AstraZeneca vaccine for the American people. As all of these pieces come together, we want to try to give Americans the best sense of when our most vulnerable will start receiving vaccines. As many of you know, the FDA has said it will consult with its independent Vaccine Advisory Board before making a decision on emergency use authorization for a COVID-19 vaccine. And they have now scheduled a meeting for December 10th. If all goes well, we could be distributing vaccine soon after December 10th. As General Perna has shared, we believe we can distribute vaccine to all 64 jurisdictions within 24 hours of FDA authorization. Then, we hope administration can begin as soon as the product arrives. One of the private sector partners we've enlisted, CVS Health, has said that they expect to be vaccinating residents of nursing homes, one of the top priority groups, within 48 hours after FDA authorization. To ensure all of this can happen on such incredibly tight timeframes, OWS and our partners have been running not only tabletop exercises, but actual field exercises for the shipment procedures. This week, for instance, we will be making test shipments with the ordering system that states will use, that is, performing shipments that don't contain actual product in order to ensure that all goes smoothly. These are the kinds of procedures you put in place to ensure a seamless logistical operation. And we're so grateful for the expertise that the U.S. military and our private partners have brought to this task. While much of our briefing today is focused on vaccines, I want to note that Operation Warp Speed continues to charge ahead on therapeutics, and our therapeutic options continue to expand. We have already distributed more than 120,000 courses of Eli Lilly's monoclonal antibody treatment through state health departments to more than 2,400 treatment sites across America. We've allocated another 50,000 courses, which will ship this week. Then, following FDA's authorization of Regeneron's antibody cocktail this past weekend, we began distribution of the first 35,000 doses of that product today. This means we have 2 new options for Americans who aren't hospitalized with COVID-19 but are at risk of progressing to severe disease. I encourage everyone to spread the word. If you test positive for COVID-19 and are over 65 or have underlying conditions that put you at high risk for severe disease, you may have access to a treatment that can help you, and you should get in touch with your healthcare provider or state health department. Toward the end of last week, FDA also granted an emergency use authorization for the use of baricitinib, an anti-inflammatory drug, in conjunction with remdesivir for hospitalized patients. This was based on results from NIH's Act II trial, coordinated with Operation Warp Speed, which found that there was a statistically significant reduction in hospital stay for that drug combination versus remdesivir alone. This is a product that is already widely available in the United States. Over 250,000 people have received convalescent plasma. It's critical that we keep our supplies up to meet demand. Please ask your viewers, readers, and listeners, if they are within 3 months of recovery from COVID-19, please consider giving the gift of life this holiday season. Go to coronavirus.gov, thefightisinuS.org, contact your local American Red Cross or your local American Blood Center to be a donor. All of this good news should encourage all of us to continue keeping ourselves, our families, and our communities safe. Remember the 3 W's. Wash your hands, Watch your distance. Wear your face coverings when you can't watch your distance, and avoid settings where you can't do those things. With Thanksgiving this week, I encourage Americans to consult CDC's recommendations and guidelines to understand the risks around gatherings and how you can reduce those risks. I know that the possibility of not being able to see family and friends over the holiday is heartbreaking for all of us. But because of the President's support of Operation Warp Speed, because of the incredible work of the U.S. military, public servants at every level of government, and the brilliance of American scientists, we have an end in sight, and we have much happier holidays in the near future. The American people can be confident that hope and help are on the way. With that, I'll hand things over to Dr. Moncef Slaoui to discuss updates on vaccine development. Dr. Slaoui?
Thank you, Mr. Secretary. Maybe just a few words very quickly. We'll then answer your questions after also General Perna gives you an update. A few words about the AstraZeneca phase 3 trial. These have been very interesting and encouraging data. The fact that one part of the trial has demonstrated 90% efficacy further reinforces the observations with Pfizer and Moderna vaccines that this virus can be very, very strongly protected against, and I think that's very important for everybody to understand, and hopefully will help the majority of the US population to stay with an open mind in terms of accepting to be vaccinated, stay to listen to all the data that will be shared transparently through the FDA reviews with its advisory committee of the Pfizer vaccine, as Mr. Secretary said, on December 10th, and of the Moderna vaccine more or less a week later. And hopefully these vaccines will become available. The AstraZeneca phase 3 trial had also more intriguing data in that a certain particular schedule of immunization in terms of dosage has yielded an efficacy that was somewhat less, 62%, and when the two combined together, an average of about 70% protection has been achieved. These observations and data were generated from clinical trials run in the UK and in Brazil. We have a phase 3 trial running here in the US. It has already recruited more than 11,000 subjects into it. Unfortunately, the pandemic in the US is progressing so fast that it is very likely that this trial, not long from now, may have enough evidence generated within it to assess the efficacy of the vaccines as administered here. We are, of course, also reviewing in depth with the AstraZeneca and Oxford teams all the specifics of the data generated to understand what difference there is between the schedule that gives a 62% efficacy and one that gives 90% efficacy. On the therapeutic side, I'd like to also add one element of information to the information that Mr. Secretary gave, which is an important one, I think, in the sense that Merck, a large US pharmaceutical company, has acquired a small biotech company called OncoImmune that we have identified about 7-8 weeks ago as holding data with a particular program in their portfolio that are really impressive in that in the interim analysis of their phase 3 trial that was ongoing, they had over 50% relative reduction in the risk of mortality in patients that had severe hospitalized but not yet intubated condition with COVID-19. This acquisition is something that we have participated to make happen in connecting the company, the small company that has 10 people working in it with Merck, as a mean to help accelerate the development of this therapeutic, important therapeutic for US patients. And finally, the last point I'd like to make is to invite as many volunteers as possible to please come and participate into the vaccine trials if you are healthy, and particularly if you correspond to the at-risk populations over the age of 65 with comorbidities, or if you are parts of the rich diversity of populations in the United States. It is through your generous participation in clinical trials that we are able to generate and understand the performance of our vaccines and help us make them available faster and better for all of you. Thank you. I'll pass on now to General Perna for a brief update.
Thanks, Dr. Slawi, and of course, Mr. Secretary, thanks for the opportunity to be a part of this. So, good morning, everybody. Want to say thanks for participation. As both my Secretary and Dr. Slawi said, it's really just important that we're able to get the message out on a routine basis. So, thank you for that. Last week, I talked about our distribution and our method. Just as a recap, we chose a whole of America approach in distribution for two reasons. One, we wanted the experts who know how to do this to help us plan and be a part of it to ensure that we had the right capability and capacity. So from Pfizer, Moderna, McKesson Trucking, through FedEx, UPS, down to the pharmacies such as CVS and Walgreens, and many others. The intent was to integrate, synchronize, and capitalize on known professionals who know how to execute this. Our cornerstone is the CDC. These experts know how to distribute vaccines. They do it annually, and we were able to take all their lessons learned over the years and apply them into the plan. Second reason we chose this whole of America approach is we wanted the American people to have confidence in the process, not to be afraid of or enamored by all the grandiose schemes, but yet just know that the common names of America are distributing the vaccine to them, and that when they have the vaccine administered, it'll be in locations that they're comfortable with, local hospitals, doctors' offices, local pharmacies such as CVS and Walgreens, or private pharmacies supporting rural areas. So again, it was about making sure we had the capability and capacity, and two, giving the American people the confidence that the vaccine will be delivered on a timely and routine manner. So today, with that said, I'd like to talk about three things. One, our allocation strategy. Two, the Pfizer testing that they've been doing in moving their product around the nation in their containers. And then three, how are we actually managing ultra cold storage? I think 3 points to highlight that would help you see the specificity of the things we're doing. So first, allocation numbers went to the 64 jurisdictions and 5 federal agencies last Friday. In fact, we hit the button at 11:35 p.m. or 23:35 military time. And that information went out to all the jurisdictions and 5 agencies through Tiberius. Each received their allocation of the vaccine so that they can plan and figure out where they want the vaccine to be distributed to. As a reminder, we are able to distribute the vaccine to any location in any jurisdiction that has been enrolled as a provider. We are not constrained by numbers. It could be 1, it could be 1,000 or beyond. As long as they are an enrolled provider and the state approves them and they have the minimum requirement of the vaccine, which is 975 doses by Pfizer and 100 doses by Moderna, we collectively, with this whole of America approach, can deliver anywhere in America to that end. Second, we have maintained a minimum safety stock, but only to assess the initial distribution of the vaccine to ensure that everybody understands the process, understands the clarity of requirements for ultra cold storage, and understands how to utilize and administer the vaccine. But once we are confident that the jurisdictions are confident, then we will release the safety stock to ensure maximum use in the country. We have provided, and we are working with each of the administration or jurisdictions right now, methods to plan and then figure out allocation within the states through the system we call Tiberius. We have been working with the jurisdictions for quite some time now, partnered at the CDC level on how to run scenarios to actually determine where they put their allocation of vaccine to the best advantage in following FDA, EUA guidance, as well as CDC, ACIP guidance. This way that leadership of the state has the maximum capability and capacity to plan, look through different scenarios, and then make a final decision to best impact the people of the United States. Really powerful system to help us lead our way through execution and not react. We will be sending, after we send the initial push of the vaccine here, pending EUA, then we'll be on a steady drumbeat of sending allocations to the jurisdictions every week, right? We'll allocate vaccines. Jurisdictions will be allowed to go in 24/7 and order and distribute the vaccine to where they want it. And then the following day, we'll be able to get it to the locations that they designate. Really hard work, great collaboration with both HHS, Department of Defense, and industry to get this right. But I'm very, very confident that we have a solid plan and that we have the ability to observe, watch, monitor, adjust to meet the requirements as been specified through the states. So very difficult challenge. We're working on this constantly. We work rehearsals of different scenarios to make sure we're capturing all the nuances of the delivery, but each and every week we get stronger. It's not lost to anybody listening. We're 1 week closer to distributing the vaccine. We're 1 week closer to refining to the exactness that we need to have to do this, and I'm very confident in that process. So the second thing I'd like to talk to you about is the Pfizer-initiated tests. Really remarkable. You know, we do this all the time in the Department of Defense. It's one of our strengths. We know how to plan. We know how to rehearse. I was equally excited to watch Pfizer and Moderna go through similar processes to make sure that their product is right to begin with, but most importantly, we can get it where it needs to be when it's time to get it out to the American people. Pfizer is really implementing a very aggressive approach to figuring out how to get their product out to the administration sites as designated by the states. They're running dry rehearsals, as we like to call it in DOD. This way, they run through the actual process of registering product through a jurisdiction. Then they deliver the product. Then they walk the administration sites through the actual opening and how do they manage the product out of the container. Really powerful to watch and see people learning. Pfizer is capturing lessons learned and they're putting it in training product fact sheets, as well as creating YouTube-like videos for everybody to observe and monitor. We started small at 4 locations. We recently expanded to 10 locations. We are going to go to the remaining 54 locations to ensure that everybody has an understanding of this. What we have found in general is initial hesitation once the product is received, but as Pfizer has walked the administration sites through the execution, we see growing confidence in everybody that's using it. And that has been the story throughout every rehearsal so far. Again, we have to walk through everybody to make sure everybody's confident in it, but I personally have gone through the process. I've actually put my hands in the box, I've pulled trays out, I've watched and I've timed myself in execution. It is a very, very doable process. Our professionals, both medical, at the medical level and then at the pharmacy level, are very well versed on how to do this. It is not the first time, and I feel the confidence in the reinforcement through our rehearsals, our training products, and then actual execution will create a steady level of confidence for the final, full, and complete administration of the vaccine. So well done by Pfizer and Moderna getting ready to do similar acts accordingly. So last but not least, it is about the ultra-cold storage. of the vaccine. We've all heard Pfizer vaccine has a requirement of minus 80 degrees, right, at ultra cold storage. This freezer is important, but not to a limiting end. In other words, Pfizer has created a container which is augmented with dry ice that maintains the vaccine at the appropriate level. In doing so, they've enabled the extension of vaccine storage at the to maintain the right stability for up to 20 days. Really a tremendous effort, as I just described in the training that they're doing, to ensure that the vaccine is available and stable and appropriate for administration. And we feel confident that if states plan to the right dosage at the right locations, that the drumbeat, the cadence, the administration of vaccine to the minimum amount, which is 975 doses, is very doable within the 20 days. Clearly, we have to have a plan. Clearly, we have to hold ourselves accountable to administering that, but it is a plan that can be done, and we feel confident in talking with the jurisdictions that they've worked through these details to ensure that the vaccine is used appropriately and without any waste, which is the biggest important factor for us. So, a challenge, yes, but it should not hold us back from administering a very good vaccine to the American people. Moderna is a different case. They're at minus 20 degrees. Minus 20 degrees is equivalent to a normal kitchen refrigerator freezer, or a freezer that is most commonly found in most pharmacies, etc. It has greater stability in that it can go into the refrigeration for up to 30 days. Yes, so it becomes a vaccine that its administration becomes easier to do, and it will enable us to get to many places throughout the country, as we've talked about before, from inner city out to rural America. It produces an advantage to that end. But I will tell you that I believe the jurisdictions are ready. They've been well informed on the information of both vaccines, both requirements for cold chain storage. They have added capability and capacity as required. They have trained people to administer it. They have contacted pharmacies for support like Walgreens and CVS to help them. And we are well on our way to successfully administering both vaccines to the American people in the near future. So, Mr. Secretary, that concludes my comments.
Thank you, General. And at this point, we'll take questions from the media.
As a reminder, this call is recorded. If you would like to ask a question, please press *1 from your phone, unmute your line, and speak your name clearly when prompted. Your name is needed to introduce the question. Please limit to one question so we can try to address all questions today. If you would like to withdraw your question, please press *2. Again, if you would like to ask a question, please press *1. One moment, please, as we wait for any questions. Our first question will come from Helen Branswell. Helen, your line is open.
Thanks very much. This is probably a dumb question, but can you talk us through the logistics of how this will work? Somebody, a hospital in, say, Reno gets 995 doses of the Pfizer vaccine. Are they meant to then try to vaccinate 995 healthcare workers as quickly as they can, or are they supposed to reserve half of that tranche so that they can give that group of people their second vaccine later? If not, how can they be assured that they're going to be in the right place in the line to get the second dose when those people need their second dose?
Okay, so what we're working with is the states have really worked their micro plans on the final distribution, and that's what they're actually putting into place over the next 2 weeks in preparation for EUA. And they're specifying, they've identified amounts of providers. Providers can be everywhere from local hospitals, doctors' offices, pharmacies, etc., As long as they're enrolled, we can distribute to them. In their plans and with their identified priorities, they will specify how they want to administer the vaccine. So in your example, let's say one tray from Pfizer vaccine goes to a hospital. It has 975 doses in the tray. Vials can be taken out of the tray, right, every single day and brought down to room temperature for administered. It's not a requirement to do all 975 in one day or 1 week. They have, as I talked about, up to 20 days to really administer those 975 doses to ensure that they can get the right people in the right places at the right time. Currently, right now, our plan is to initially distribute the first dose vaccines to the states, and then on a second delivery at 21 days for Pfizer and 28 days for Moderna, the states will receive the vaccine for the second dose. There is methods from very simple, here's your card, come back on this day for your second dose, to very elaborate automated plans at both the state and national level to ensure reminders are sent and the vaccine is available for the persons. We are continually to assess the manufacturing of the vaccine, and we think that once we have a really steady, confident cadence in manufacturing in the very near future, there's potential to just vaccinate at maximum allocation because we have confidence that the second dose will be available accordingly. We're just starting this way initially to ensure that everybody understands the process and we can be accounted for. Thank you.
Next question, please.
The next question is from Zach Brennan, Politico.
Hi, thanks for taking the question. So can you talk a little bit about the timing with the ACIP recommendation after a possible EUA? Will states be able to adjust where the first round of doses will go based on the ACIP recommendations, even if you're shipping, within 24 hours after the EUA?
Yep. So, Zach, I think it's important to understand the nature of ACIP's role. This is for other members of the media. This is the Advisory Committee on Immunization Practices, which is an advisory committee set up under statute that's used by CDC Connected, usually the Vaccine for Children's program. The ACIP has, of course, a very important role in that when they make a recommendation for a group to be vaccinated, that they say essentially that the efficacy outweighs safety risk for vaccination and they recommend vaccination, that triggers various reimbursement mechanisms in our system once there's an ACIP recommendation. As we have with the National Academies of Science, we've worked with the Advisory Committee on Immunization Practices in addition to their statutory obligation on that binary recommendation to vaccinate. We've also sought any insight, input, et cetera, around when dealing with a scarce quantity vaccine, which groups, which cohorts to prioritize. At the end of the day, that is a decision, though, of the U.S. government to make, which is where to recommend the prioritization. And in the final say, it will be our nation's governors in implementing the distribution plans to tell us, as General Perna has repeatedly said, where to ship, and they will decide whom the vaccine is given to. We hope that our recommendations will carry weight with them, but at the end of the day, they will make that decision. And so we are not dependent on any delay for ACIP in terms of helping to advise states on that prioritization. We received some information just yesterday from ACIP. We had received the National Academy's input previously, which is still going through some public comment with them. We will work, we are working expeditiously to formulate our recommended prioritization for vaccine distribution based on where we can secure the maximum effect under whatever the current epidemiological circumstances are in the United States at that time. Thank you. Next question, please.
The next question is from John Cone. John, your line is open.
so much. The company has been less than transparent about how the half dose occurred, and I'm wondering whether they explained to you what happened, and also whether you have plans to switch to half dose as the prime for the AstraZeneca Oxford trial.
Yes, so we have been made aware of what's called now the half dose at the time it has happened. This was a change in the way the quantity of vaccine, the amount of vaccine put in a vial was tested. And when they realized that there was an error or a change in the approach, in the technique used, they corrected it. And in the meantime, about 3,000 subjects were recruited, half of them in the placebo and half of them in the vaccine group. And that's the cohort that has shown 90% efficacy. That's, I would say, the fact in terms of what has been inputted into the vaccinees. What we are now looking to analyze is what immune response has been induced in those who have received the half dose and the full dose versus those that have received twice the full dose, and understand whether there are differences in the immune response induced. You should also know that there are also differences in the age brackets present in the cohorts, in that the first cohort that received the half dose and full dose, followed by a full dose, had a cap on the age at the age of 55, when there are older people included in the study that received full dose and full dose. So there are a number of variables that we need to understand, and what has been the role of each one of them in achieving the difference in efficacy. Once we understand, then we'll make a decision as to whether to, for instance, modify in part the ongoing phase 3 trial here and introduce, for instance, a half dose and full dose, or any otherwise. But we want it to be based on data and science, because we understand the input, but we don't understand the consequences of the input. I should just say, for completeness scientifically, that the 90% efficacy group and the 62% efficacy group are overlapping statistically, so it is still possible that that difference is a random difference. It's unlikely, but it's still possible that it's a random difference. So we need to understand what's behind it scientifically.
Thank you. Next question.
The next question is from Carl O'Donnell. Carl, your line is open.
Hi, this is Carl O'Donnell from Reuters. You mentioned that you had given some guidance to the states in terms of the general size of the initial allocation of vaccine that they're going to get to help them prepare. Do you have a national figure at this point for the amount of vaccine, that'll be distributed overall to the different states and jurisdictions? And what is that figure? And are you confident that we'll still get to the 40 million figure overall by the end of the year?
So yes, I do feel confident that we're going to get to as close as we can to 40 million at the end of the year. I mean, snap the chalk line, what exactly comes off, we'll know at the end. But I do feel confident, and we've planned scenarios to that end, and we've worked with the jurisdictions for the total amount through December. The initial amount, as we were speculating on when EUA would come out, because we're not involved in that process, literally on the whiteboard, we're trying to figure out when that decision might be made. I finally made the decision Friday night, late Friday night, to snap the chalk line so states could prioritize based on amount. That amount that we allocated to the country was 6.4 million doses of vaccine. And then what will happen if there's more available after the initial push, then it will go out in the following weekly cadences of distribution accordingly. But yes, 40 million by the end of the year.
Next question, please.
Next question is Dan Bergano, BuzzFeed News.
Thanks very much. I'm wondering if you have any concern that the general population will be disappointed when they figure out the prioritization is going on, that it's going to healthcare workers and nursing homes, that sort of thing, and not to sort of the general public, until it sounds like months from now? Months have been discussed, like April to June, thereabouts. If you had any guidance on that as well, that would be great. Thanks very much.
Well, Dan, we've been very transparent throughout for the American people and for you all about the timelines as we best understand them at each step of the way and potential prioritized groups. Of course, we have not announced recommended prioritization. We've talked about some core groups that make some fairly obvious sense, especially in light of the National Academy's input and the Advisory Committee on Immunization Practices focus. Those, of course, are those in nursing homes, as you mentioned, our most vulnerable citizens, our healthcare workers who are on the front lines, our first responders. Those are some of the broad groups we've talked about. And we've focused and we've said that we expect by the end of December to have enough vaccine to vaccinate those who are most vulnerable, just by way of sizing and scaling. That by the end of January, we think we would have enough to vaccinate our senior citizens as well as our healthcare workers and first responders. And then, as the general has talked about, progressively, week after week, just more vaccine keeps coming off of the production, gets quality controlled and released into the system, additional prioritized groups, or eventually just general vaccination availability, to the point that in the second quarter of next year, we believe we'd have enough vaccine from all sources to be able to make that so that anyone who wanted to get a vaccine in the United States would be able to get that. But that's a progression, a constant progression. And so we've been very clear for months, really, about that sequence. And that's the best we can do, is just to use forums like these and others to educate in that regard.
We have time for 3 more questions.
The next question comes from Tom Howell, Washington Times.
Hi, thanks for doing the call. This question is probably for the Secretary. Earlier in the year, there were some polls that showed some people were leery of taking a vaccine. Some of that was tied to campaign timelines. Now that the election is over, and now that some data is coming in that shows these shots are quite effective, how confident are you that people will be eager to go take up the vaccine, and what are you doing to ensure, to alleviate any skepticism, especially among minority populations? Thank you.
Yeah, thank you very much, Tom. Excellent question. You're right. We saw ever-increasing numbers of potential vaccine hesitancy in previous months. Unfortunately, there was a lot of rhetoric out there that was not helpful in terms of inspiring confidence in the process. The President and I have been clear that politics would play no role in the development, the manufacture, the distribution, or approval of a vaccine. I think the proof is in the pudding there, that we have all of these various checks on independence in the system. I've talked about 5 separate checks. The Data and Safety Monitoring Board that determines even if the drug company gets to see data. The drug company's own ethical checks, where they determine if they even find the data to meet their ethical standards to submit for approval. The fact that the FDA has laid out both final biologic license as well as EUA guidance on what standards they would hold a vaccine applicant to. The fact that the FDA would hold a public advisory process with their Vaccine Advisory Committee that is an independent, transparent, public process. They've already announced on Friday that December 10th will be the date for the Pfizer Advisory Committee. And then finally, the fact that FDA career scientists, career leaders, will make the ultimate call on whether a vaccine meets FDA's data, scientific, evidentiary, and legal standards for authorization or eventual approval. We have seen, since the Pfizer and Moderna data have come out with such exceptional results, and of course, with the passing of the election, we have seen in public polling increases in vaccine acceptance among people. We obviously remain concerned, especially in various underserved communities, about any issues of vaccine hesitancy. The CDC, our Assistant Secretary for Public Affairs, as well as all of our public health leaders, are working on a public service announcement campaign that would work to educate the broad population regarding the need to be vaccinated, the safety of the vaccine, the efficacy of the vaccine, the importance of getting vaccinated if you're in one of the target prioritized groups. And we'll keep doing that. And I think progressively, as more and more people get vaccinated over time, the prioritized groups moving forward eventually to general vaccination, hopefully, there's a positive experience for individuals, and that by word of mouth, in addition, of course, to all of the education efforts, we continue to reduce vaccine hesitancy and continue to increase support among people to get vaccinated. I've told you, I certainly will have complete confidence in the process, and I will get myself vaccinated as soon as I will be allowed to be vaccinated to demonstrate to the American people my complete confidence in the independence and integrity of the process and the quality of any vaccine that I would make available to the American people. Next question.
The next question is from Andrew Dunn, Business Insider. Andrew, you may begin.
Thank you. I was wondering, what do you see as to put it simply, the ultimate responsibility of states in the distribution process? Can you go over clearly what jurisdictional public health leaders will need to do as part of the campaign? And have you heard from any states or regions about a need for additional funding to actually make that happen at the state level?
Yeah, thanks. I'll start and I'll ask General Perna to add to it. This is obviously, as we talked about in our last call, there are two types of partnerships here that are involved. The first is the public-private partnership of what we're trying to do to really leverage the systems around vaccine distribution in the United States that are well-rehearsed and that work. We want to make the experience for people as close to the flu vaccination experience as possible in terms of meeting them where they are. The second is a federal-state partnership, very tight linkage between us. We have gotten the vaccine. We are paying for the vaccine. We are paying for the distribution of the vaccine. We have secured the kits that go with vaccination. That's the needles, the syringes, the diluent, the last-mile dry ice, et cetera, to marry that up with the vaccine. We have the data systems for distributing the vaccine as well as for accounting for the immunization of individuals, the tracking of individuals to ensure they get a second dose of the same vaccine. What is the role of the states? Of course, the governors will determine distribution within their states, prioritization within their states, where to ship to. As the general has said, we can ship to one site or 1,000 sites in a state, depending on the governor, as long as they're enrolled in the system, and the governor tells us what he or she would like us to do. That's one. Tell us, as almost an air traffic controller, where would you like us to send or have sent the product? The second is ensure your data systems are working with ours and that you've signed data use agreements to ensure the ability of coordination of information across the United States, so that if somebody gets vaccinated with the first dose in New York, and they then go down to Florida for the rest of the winter, they can get their second dose in Florida, and if it was Pfizer, it remains Pfizer. If it was Moderna, it remains Moderna. The states will obviously, if there are additional areas that they would like to ensure distribution to beyond the normal traditional mechanisms that we've worked on, hospitals, chain drugstores, community pharmacies, community health centers, public health departments, if governors feel there's a need for customized other approaches, they are fully at liberty to set those up. That is part of them being in the driver's seat on that localized micro distribution planning. We've put out $340 million for flu and COVID-19 vaccination to date. Another $140 million is going out in December. Money should not be the barrier to effective, efficient distribution of the product, working with the states, but it is important to remember just how much of this entire process is already federally funded and federally supported in partnership with the states. General?
Mr. Secretary, I am 100% agreement in everything you said and have nothing to add.
Well, thank you, General. One last question, I believe, Michael? Thank you.
The next question is from Jared Hopkins. Jared, your line is open.
Thanks. Jared Hopkins from the Wall Street Journal. Regarding allocation, previously the CDC said that besides population, local spread of COVID was going to be a factor for determining for each state. So can you explain sort of how you guys decided on each state's individual allocations within that 6 million that you mentioned earlier? Is it based on infection rates from Friday or something else?
Yeah, so Jared, you know, given the national spread of the disease at this point, and unfortunately for the foreseeable future, working and seeking consultation with the governors. We asked the governors for input on allocation methodology. We didn't receive feedback from many, but the feedback we did get was supportive of what we proposed, which was to keep this simple and on the initial allocations to follow a per capita over the age of 18 population-based formula for distributing the vaccine. We wanted to keep this simple, first because we're seeing effectively nationwide spread and susceptibility to the disease, but also once we pass through these initial tranches where we're in much more of a scarcity situation, we're eventually going to get to the point where it would need to be per capita. And so instead of having multiple methodologies, we thought it best to keep it simple. The governor supported that from the feedback that we received. So that was the approach we took, correct, General?
Exactly right, Mr. Secretary.
So we thought that would be the fairest approach, the most consistent. I want to thank you all for this. We're going to keep doing this weekly or as much as needed. We want to make sure that you're getting your questions answered, that we're being transparent about our Operation Warp Speed work on therapeutics, on vaccines, on distribution practices. I was not asked about this, but I do want to let you know that consistent with the GSA administrator's ascertainment yesterday, last night, our top career official, Rear Admiral Schwartz, who has been leading our transition planning efforts, was last night in communication with the Biden transition team. We are immediately getting them all of the pre-prepared transition briefing materials. We will ensure coordinated briefings with them to ensure they're getting whatever information that they feel they need that's consistent with statute and past practice. I have reiterated, as I've said publicly to you all, I've reiterated to Admiral Schwartz my firm commitment that transition, planning, and execution will be professional, cooperative, and collaborative in the best spirit of looking out for the health and well-being of the American people, and in particular, saving lives through this COVID-19 pandemic. I want to say, again, just thanks to the support, unwavering and constant and personal support that this team has had from President Trump from the beginning to create Operation Warp Speed, to give us the full funding of resources and the independence to act with speed and agility. We now have phase 3 data on 3 vaccines, 3 more vaccines in active study. 5 therapeutics now are authorized or approved by the FDA to help people suffering from COVID. So much is already here, so much is on the way. As I say, hope and help are on the way. But that also means we're bridging right now. We're bridging to when we have these vaccines that General Perna is going to ensure are getting out there to our most vulnerable and to our healthcare workers and our first responders and eventually the broad American population. It means we need to bridge through our individual behaviors. We want to make sure that everybody can get to the day of experiencing the benefits of the work that that team is delivering. And that means wash your hands, watch your distance, wear your face coverings when you can't watch your distance. Stay out of settings where you can't do those things. Be especially mindful of indoor gatherings, especially those where you might let your guard down, like household gatherings, overcrowded indoor restaurants, indoor bars. Especially now, as we approach Thanksgiving, I ask all Americans, please be on guard, take care of yourselves, be careful, because there is such a bright day ahead with what this team is delivering on vaccines and therapeutics. We want to make sure that everybody is here for next year's Thanksgiving. So thank you all very much, and members of the media, thank you for helping us in our efforts to ensure the American people go on this journey with us. Thank you.
Thank you all. You can send any follow-up questions to our press office at media@hhs.gov. Thank you.
Well, we're glad we could show you that again here on News Now from Fox. This is Andrew Kraft. And you'll notice something interesting to note at the very tail end of that briefing, where the Health and Human Services Secretary, Alex Azar, unsolicited, brought up the fact, because none of the reporters on the call asked him about the transition to an incoming Biden administration, but he brought it up himself and said that HHS and deputies there who serve under him have been in touch with the Biden transition about how this vaccine distribution will work. So it was quite interesting there with a quite explicit acknowledgement of the Biden transition from the president's own Health and Human Services Secretary, Alex Azar. We do want to just kind of reset here. We only have about an hour and a half left of live coverage tonight here on News Now from Fox. But as you know, as I say a lot of the time, just to remind you that the point of News Now from Fox is we show everything live. We all show everything raw. We show everything unfiltered as well. So that is what you get here, live events throughout the day. If we can't show something live because something else is happening live, we'll show it just after the fact or later in the day in the rundown of things. But remember, no bias, there's no opinion. We just want to show it to you as it's happening with some context, some analysis, and some facts. So we want to thank everyone for watching. I'm Andrew Kraft. It's about almost 9:30 here in Phoenix, Arizona, Mountain Time, almost midnight there on the East Coast. And if you want to follow us on Twitter as well, go to @NewsNowFox. We clip especially a lot of these segments with the reporters in the field that we talk to. We clip those for people to watch back. We also clip live events in their entirety as well, just so you can watch them later. If you want to go to newsnowfox.com, also, remember that's where you can find everywhere to watch us, so you can tell your friends and family about where they can find us on News Now from Fox. So in the meantime, let's take a quick commercial break. This will be 2 minutes long. Some of you on the stream won't see this, but others will, so stick with us here. And we just want to show you some of these great scenes that we get from a lot of the cameras Fox has around the country. At the moment, we always love to show you 6th Avenue in New York City, right across the street from Fox News World headquarters. There you can see Radio City Music Hall. The Christmas lights are on the trees there. And then we have great scenes from the nation's capital with the White House, the lights still on, Christmas wreaths on every window there. And remember, we showed you just yesterday, Melania Trump, the First Lady, welcoming the White House Christmas tree, coming in on that carriage, if you'll remember, if you were watching, and the U.S. Capitol Dome. Senators have gone home for the holiday recess. They'll be back, I believe, November 30th to see if they can pass a spending bill. Remember, the government runs out of funding in December. They have to deal with that. They also have to see if they can muster up enough political will to get another round of coronavirus relief. All of that remains to be seen. Now going into about the last month of the year, 2020, almost over. We want to take the time as well to almost Thanksgiving Eve here. Hope everyone has a very safe Thanksgiving holiday. We'll have shortened hours of live coverage on Thanksgiving. We'll be ending at 10 p.m. Eastern. So if you're not watching sports or you're not watching football and you want to hear the headlines of the day, remember, breaking news never stops. There's always news, even if it's a holiday. So if you want to watch News Now from Fox on Thanksgiving, feel free to do so. And in the meantime, we want to take you out now to some of the great content that our Fox affiliates put together for us throughout the day. Remember, we've been showing you these from about the 9 to 11 p.m. hours here on News Now. At night, there are interviews with celebrities, there are Thanksgiving cooking tips, there are Thanksgiving travel tips, there are coronavirus news, what have you. So a really great miscellaneous offering of content, and we're going to start now with an update. You might remember that mass shooting at that Naval Air Station in Pensacola, Florida, just last year. There's been an update in that case, and we're going to go out to Fox 13's Craig Patrick with that story right now.
Released new details about the deadly mass shooting last year at Naval Air Station Pensacola. An investigation by the U.S. Navy reveals how and why a lot of red flags were missed. Our political editor, Craig Patrick, is joining us now. And Craig, you've looked closely at this report. Tell us what you found.
Well, the Navy in this investigation determined that the Saudi lieutenant who carried out the shooting rampage did so because he communicated with terrorists, identified with terrorists, and he self-radicalized. But the report also repeatedly notes that a number of red flags were missed in the course of this due to lapses in management and or oversight. And it also notes that there was a number of situations, in fact, that may have aggravated the situation due to a toxic training environment at Naval Air Station Pensacola. Last December, this Saudi Air Force officer killed 3 and wounded 8 others at Naval Air Station Pensacola before responders killed him. The U.S. military was training him for the Saudi military as part of an international program. The Pentagon said the shooting spree was a terrorist attack and that the Saudi killer was motivated by terrorist ideology. The Saudi killer was in direct contact with al-Qaeda, and he posted a message on social media on September 11th stating, quote, "The countdown has begun."
The evidence we've been able to develop from the killer's devices shows that the Pensacola attack was actually the brutal culmination of years of planning and preparation.
Well, the Navy just made its 267-page investigation public. Parts of it are redacted, but what we can read explains how warning signs of a looming attack were missed. For example, one instructor knew the killer tried to buy a gun but did not know Navy policy banned such a purchase. And the Saudi military did not have a liaison on site to keep watch. And the killer reported to 5 different commands, which affected oversight. And they did not examine or know about his radical posts on social media or his unauthorized travel. Also, the Navy investigation found a toxic training environment for the international students that may have increased the likelihood of the attack. The investigation found international students were subjected to homophobic remarks, and they were taunted. For example, some were told they smell bad and were given demeaning nicknames. An instructor gave the Saudi killer the nickname Porn Stash, which deeply offended him. He filed a formal complaint about that resulted in the instructor formally apologizing and the killer refusing to accept the apology. And in the findings of the Navy's internal investigation, it equated those actions and others, too, to abuse of the international military students. Well, the Navy has responded to its own internal investigation, acknowledging the concern. Specifically, it states the Navy takes the findings seriously and needs to ensure that its core values are integrated into daily business. The statement goes on to note that it is now looking for additional ways to make sure that similar actions do not occur in the future, Kelly, and that includes surveys and continuous feedback from the international students.
All right, Craig Patrick, thank you so much, Craig.
First of all, talk to me. What we're hearing about AstraZeneca is it's a more traditional vaccine in that it doesn't have to be frozen. So do you like what you're seeing in terms of the research results that you've seen so far?
So thank you for having me. So we're very excited to have kind of 3 vaccines coming out all very, very closely in time. And the AstraZeneca one is exciting for 2 reasons. One is that it is a very traditional method of vaccine. We use an adenovirus. It's one that a technique that we understand well, has been in place for a long period of time. But also, very importantly, it is similar to vaccines made all over the world. So the ability for worldwide production to turn on and make this vaccine in multiple different countries and then distribute it is perhaps a little easier than the 2 new vaccines from both Pfizer and Moderna, which use newer technologies. Mm-hmm. Also, the fact that the AstraZeneca does not need to be kept at such cold temperatures makes global distribution and consider rural distribution far, far easier than we would expect from the two other candidates that are now available or soon to be available.
So can I ask you, because you are a doctor here, we've been getting kind of like conflicting information that we don't understand as lay people. So there's been reports that it's 90% effective, which puts it up there with the measles vaccine, but we also hear it's 70% effective, which puts it at the flu level. So it looks like, and correct me if I'm wrong, that Oxford is saying that the smaller doses seem to be more effective?
Yeah, so it's interesting, right? It's important to remember we're seeing just the first wave of data coming out of this trial, and there will be many more patients that we'll have the data from as the trial progresses, and we'll get a better understanding of it. But specifically, there were 2 treatment arms, one that used 2 what they called full doses a month apart, and the second which used a smaller initial dose followed by a larger dose a month apart. And those 2 trials did have different results, or the 2 arms. The one with the smaller additional dose seemed to generate an effectiveness of 90%, and the 2 higher doses was more like 62%, so a blended average of about 70% effectiveness amongst the 2. There's some plausible reasons why the lower dose may be more effective in the way it activates your immune system a little more subtly. Then with the second dose, your immune system is better ready to mount a robust response. But we're going to need to wait till we see more patients in both those treatment arms to be sure we have a full understanding for what's happening. But there was a definite difference between the 2.
Okay, thank you.
There's so many different scenarios with this, but what about a lot of younger people who are saying, I'm healthy, I don't need it? What would you have to say and recommend about that frame of mind?
Well, I think you can look to everyone who's young and healthy and ask them if they really like the way they're living their life right now. And I think the answer to most of them is no, right? And the way we get back to some semblance of what we used to do is to have a large portion of the population immunized and protected against this virus. So we need them all to cooperate and participate so they can all get back to doing the great fun stuff they like to do.
Now that will probably get everyone's attention. That sounds so nice, doesn't it? It's hard to even fathom that sometimes. Now, what about the number of people getting it? Will the vaccine work better? Will we receive that herd immunity that we all hear about faster if more people receive these vaccines?
So absolutely. The more people we get vaccinated, the more we will be able to prevent the spread through the community. And it's every sort of immunized person we put next to someone who's not provides some degree of protection. But we need to really get up north of 80% to really have that kind of effectiveness we need. Now, there will be some immunity that people have generated from clearing their own infections. We don't know how long that will last, but that will at least provide some temporary protection. But we're going to need to get a lot of people immunized. And that's why all 3 of these vaccines are so promising, exciting to have multiple routes of distribution, multiple different vaccines, and we will be rolling them out methodically through the healthcare community, through vulnerable populations, and then to the general public.
Well, I know that a lot of people are just anxious to find out what that vaccine is going to look like. Will all of them be multiple doses? And then how important is it to make sure that if you decide, yes, I'm getting this vaccine, that you get both doses? Would one do you any good?
Yeah, so those are great questions. And so really all the vaccines that we have currently available or soon to be available, the Pfizer, the Moderna, and AstraZeneca, all of them require 2 doses. We haven't seen any data about how effective they are if you only get the single dose. So that would be preliminary for me to speculate with. But I imagine when the full data becomes available, as they go through the FDA process, we will see the early data that showed a single dose just did not provide sustained immunity. And that's why the 2 doses will be recommended. And we're going to be doing everything we can to ensure that when you get 1 dose, you then do get the second in the appropriate time, because we don't want to waste this valuable resource.
Oh, no, we definitely don't want to do that. Now, you were painting this beautiful picture earlier of what it will look like when we can all get back to a normal life. In order to do that, once you get the vaccine, is it going to be suggested that people still stay socially distanced? They still wear that mask for a while until we see what happens? Or what does that picture, do you think, look like?
So absolutely, masks and social distancing and hand washing, the cornerstone of what we're doing right now, will remain an essential part of our behavior for the next several months until large numbers of the population can be vaccinated. One of the concerns we do have is that with the number of people who still are unvaccinated and the number of people who silently spread, that the virus will continue to go through the community if we relax any of those efforts. And I think importantly, we don't want to have a kind of mask test that you got vaccinated, you don't have to wear one. So everyone wondering, did you get vaccinated? Is that why you're not wearing your mask? We need everyone to continue to wear masks until we're sure that we've effectively vaccinated a large portion of the population.
Wow, that makes complete sense when you put it that way. Dr. McCarthy, thank you for your expertise and time from Memorial Hermann today. Great conversation.
Usually when kids are coming home from college for Thanksgiving, it's a time of joy when the young people are able to, of course, reconnect with friends from high school and families are able to be together. And like everything, COVID-19 has taken a bite out of that. But joining us is Brooke Bendix. She's a therapist with Therapyology, here to talk a little bit about what people can do. But let's talk first a little bit about the stressors themselves. And we're talking about some really unique ones. Usually these young people coming home, it's a good thing. But Brooke, we're talking about some really hard parts to this homecoming. Talk about that.
Coming home from the holidays, especially after your first semester of college, when you're away for the first time and you have independence and you're on your own, coming back for the first time can mean a lot of things. Your independence is not necessarily there anymore, especially given the fact that there is a pandemic and we're under more restrictions, meaning we're staying home, we're not seeing our friends, we're not being able to have those same reunions that we normally would have.
Yeah, so they're not getting those reunions that they're used to getting. As you point out, the Wednesday before Thanksgiving is a big social night, usually not something we're going to likely see this year. Also, there's a lot of doubt about where these students have been. These parents and grandparents and uncles and aunts, they don't know where these college kids have been, and they may be worried about their whereabouts.
It does bring this element of frustration and additional social isolation too, that when they return, what is life going to look like for the family as a whole? And also for these college students that are so used to being independent and on their own, that now they're all under one roof with their parents. And there's going to be a little bit more rules, guidelines as to how the family is going to handle these next couple weeks with the holidays.
All right, Brooke, so how would you recommend these young people and these parents and grandparents get through this time?
And I think it's really important to be on the same page as a family, that you have to have open and honest communication. There may be family members that are immunocompromised, and there may be other family members that are elderly that are living in the home. So I think you really have to communicate well with each other and know that it has to be a whole family unit as what's best for that family. So if that means that you're going to be under strict quarantine rules and not see any family or any friends outside of your immediate household, then that's what each family has to kind of adhere by. So in order to kind of reduce stress, that communication has to be key.
Yeah, just because you're home doesn't mean you have to be in front of each other for 24 hours a day, 7 days a week. So there is that separation that maybe needs to be built in a little bit. Brooke, let's talk for a moment about the other cases where young people are being told don't come home. That can be a tough conversation to have.
That has to be really tough. And we're seeing that all across the country, that Thanksgiving plans have changed. And what we're telling these families and college kids is that this is temporary, but illness and death, it's permanent.
All right, Brooke Bendix with Therapyology. Good to see you. Thanks for joining us. For more information or for a list of resources or to connect with a therapist like Brooke at Therapyology, just go to therapyology.com.
Hi, turkeys. Gobble, 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 gobble.
They're answering you. Raising gobblers and trotters since 1948.
They started it with 50, then 100, then 500.
The owner of Roperti's Turkey Farm on 5 Mile near Farmington in Livonia, Christine Roperti, says despite this ongoing pandemic, business is good.
Now we sell 4,400 in 4 days.
Many folks canceling Thanksgiving this year or choosing to go virtual, having food exchanges or much smaller gatherings. But Roperti says her customers are loyal.
I have the best customers, and they always come back.
And with surprise, more new customers this year. Thousands of these T-birds have already been claimed.
They're fed corn, they're not pumped with anything, and then they're killed for you the day before you pick up your order.
Over a 4-day period, Roperti, with the help of her son and a crew of 45 others, they processed thousands of birds.
We worked from from 6 in the morning till 12, and they're done with 1,000 turkeys at 12.
Some of these birds can get up to 30 pounds, believe it or not, but this year during COVID, they want 10 to 12 pounds.
A lot of people are just ordering 18 to 20 pounds. Some of my customers, being that there's just 2 or 3 of them, they'll take the 18 to 20, and then I'll cut it in half for them. And then they have half for Thanksgiving and half for Christmas.
The price, $3.79 a pound, and Ruperti's so busy, likely only taking more orders until Friday.
Because we're almost sold out.
So however you plan to spend your Thanksgiving holiday, Ruperti hoping everyone enjoys it safely.
Have a real happy Thanksgiving and gobble gobble.
In Livonia, Erica Erickson, Fox 2 News.
Feel like I'm isolated and lonely. Yes, it's been real hard.
Like many seniors, Joyce Pace is going through a tough time. The 66-year-old who lives at American House for Seniors in Pontiac has been unable to see family and friends in person for nearly 8 months. She's only been able to speak to them by phone, but that's about to change.
It'd be the best thing, like having another person in your apartment.
Once my contacts are in, I could say something as simple as, Alexa, call Dad.
Commissioner Kristen Nelson heads up an Oakland County task force working to combat senior isolation during COVID-19. Using the federal CARES Act money, they are now getting ready to launch the Oakland Together Lifeline pilot program.
At the end of the day, this is one step forward in making sure that we're helping our seniors bridge with that technology gap and making sure that there are other means for them to connect to one another.
100 seniors are each getting an Amazon Echo Show set up and training for this touchless technology that will allow them to connect with family, friends, and so much more. Sherry Keegan, head of enrichment at the senior living facility, calls this a game changer.
Seeing the newborn babies being born, seeing the great-grandchildren coming in, and then when they approached me about the Echo, I pretty much couldn't contain myself. I was so excited that I immediately said yes, and I really didn't even know what I was jumping into, but I said yes. As soon as we show them how it works and the user-friendly of it, I think all the fears are going to go aside.
There's so many different things that a senior could ask Alexa. I could ask her to tell me a joke. I could ask her to sing to me. I could ask her to, maybe I have a favorite song. I could ask her to play Frank Sinatra. The other cool thing is I could essentially say, Alexa, show me cookie recipes.
With no end to this pandemic in sight and colder temperatures keeping them inside, seniors are mentally struggling more than ever, increasing their risk of heart disease, diabetes, anxiety, and depression.
Alexa, call Dad.
But a simple voice command will now provide that human interaction they desperately need without risking their health.
It would help me out a lot, myself and the resident.
The lives of Christy Lizette and her husband, Chris Smith, are now filled with piggyback rides and playing at the park near their Commerce Township home. Here, 2-year-old Melody definitely knows how to keep her parents on their toes.
She loves to do stuff by herself. She loves to try new things. She gives me a few heart attacks playing around here because she's fearless.
Since February 2019, they've waited for the day when they could officially call Melody their daughter. That day came at the end of last month when Melody's adoption was finalized.
I just started screaming and jumping up and down. It was just the most amazing moment.
When your mission is to help children and their families all the time, you don't even think about keeping going, you just keep doing it.
For Judith Fisher-Wallach from Wolverine Human Services, moments like this make working through the COVID-19 pandemic much sweeter. The child welfare organization's world turned upside down in March when the state and courts closed.
Foster care workers and adoption care workers weren't going into the homes. So once a month, we're supposed to be in the homes seeing eyes on the child. So that changed. By now you could do it by Zoom meetings, you could go to windows and look at the children.
Now Wolverine Human Services is behind by 6 months. They have PPE and make sure social workers ask the right questions to ensure kids are safe. As for Melody's parents, the pandemic pushed back their adoption by a few months, but for them, it was well worth the wait.
That little 5% nagging in the back of your head of something might happen, something might go wrong, something might change, is gone. And so you feel like a weight is off of you a little bit. So everything's just a little bit more fun. Everything's just a little bit more easygoing.
The family says they're thinking about adopting another little one. They hope their story inspires others to come forward. If you want more information on adopting or being a foster care parent, we'll have that on fox2detroit.com. In Commerce Township, Veronica Meadows, Fox 2 News.
Bubble in Orlando. Thanksgiving, a time for togetherness. With the pandemic, families across southeastern Wisconsin downsizing traditional plans. Aaron Maben is live tonight with the impact the scaled back holidays having on one local business. We're talking turkey tonight.
We definitely are. Not only turkeys, you will see that in a moment. You know, Tower Chicken Farm here in Milwaukee, they had a big day today, selling a lot of turkeys, a lot of birds, and they found out that there is a big demand for smaller birds this year. Inside Milwaukee's Tower Chicken Farm, owner Greg Schmidt carries a tune and a turkey.
19 1/3.
With Thanksgiving days away, it's the busiest bird buying week of the year.
I got empty pallets and empty pallets.
There was a long line Monday morning as people prepared to purchase poultry.
They're all fresh birds.
Back inside the shop, workers rushed to fill orders.
There goes Susan carrying another sold bird.
The CDC urging families to stay home and stick to smaller gatherings this Thanksgiving as the coronavirus surges throughout the country.
I have too many big birds. I need to get rid of them.
As customers picked up their smaller turkeys,
you're all set.
They shared their scaled back plans.
This year it's going to be us and then my stepfather, who's been locked in the house since March 2.
Cassandra O'Neill had to trim her guest list.
Oh, definitely. I'd already planned on it since June or July.
A decision so many are struggling with the holiday on the horizon.
You're either going to take an 11-pound or you're going to get a 20-pound.
Schmidt plans to fill whatever demand comes his way.
A lot of large roasting chickens are going out the door.
The best he can.
They're still buying the bigger bird because everybody wants to take something home.
So we took you inside, but I wanted to show you the outside, this massive refrigerated truck where they are keeping the turkeys. They wrapped up for the night, but they will be back open at 8 o'clock in the morning, and they expect to be busy again Tuesday and Wednesday. Reporting in Milwaukee, Aaron Maben, Fox 6 News.
Poor chickens, they thought they had the week off, but they're hot at them too, huh?
Yeah, right.
Sweating it out. Aaron Maben reporting live, thanks.
Well, Thanksgiving is a time when flowers play a big role in creating a warm and inviting home. And here to help us create a centerpiece arrangement for our tables, Calvert Crary, the executive director of Flower School New York and LA. He shows Good Day's Caitlin Pratt anyone can make an arrangement that wows.
Master florist Calvert Crary, thank you for talking with us this morning. I am just loving your new book. It's called Flower School. Okay, so how did you get started as a floral designer? It's not a move you planned, right?
No, actually, the best way to get started to becoming a professional florist and do it as a career is maybe take some classes. So I started at Flower School and I am now the executive director. So I've actually come up in the ranks both professionally and as an educator.
I love it. I mean, loving flowers is for everyone. Take us through how to make a professional looking bouquet arrangement, though, because it's such a point of pride and a point of notice for people, especially around Thanksgiving.
Yeah, so I think that I try to get over all the steps in the book. And if you follow all of these steps, you're bound to come up with something that's reasonably professional looking. First, a lot of people just say, well, it's just going to happen. It doesn't happen. You have to think about it. It's like cooking. You have to purchase the materials. So some guys were purchasing. You have to condition the materials. For example, I have a couple of unconditioned flowers here. This is what all flowers need to have all of their foliage removed or else they die really quick. These flowers are bred for longevity, so they should last a long time. So there's like, for example, there's a strip method where you just strip the foliage off of your flower. Or if you have a flower like a rose that has thorns on it, you may need a tool. I'm going to use a little knife here, and I'm just going to go down and pull all the foliage off. What I recommend to people who are having trouble with their flower arrangements is they typically have the wrong vases. Vases that look good for decoration in your home on a shelf are not necessarily good vases to use for making flower arrangements. The reason is because a rose, for example, you don't necessarily want to see it from the side. You want to see it from the top. So you need a vase that has the correct angle. Those vases are typically short like this. And I'm going to make something that is a tinge on the modern side with a little color blocking, okay, but also a little bit more organic. So I'm going to grab some of these roses. Now I have some other spray roses here, and I can just very simply just put them together. Okay? Now that would be a very sort of modern look because it has no foliage, but I like it to be a little bit more gardeny. So maybe I will put in some other of these green berries. These are hypericum berries. And I can put in some berries here and some berries there just to kind of give it a little bit of color. And then some foliage, because if you're doing flowers meant to be seen as like a little bit organic, and if it doesn't have any foliage because you've removed it so that it lasts longer, it doesn't look good. So I can take my twine and I'm just going to wrap it around a couple of times just to bind everything together so that it holds tight. And I can kind of splay them out and open them up a little bit. And if they're too long, you see how there's kind of a hole in the center, that means that the stems are too long. So I need to cut them a little closer to the binding. You can see the roses very well.
I love it. And I also enjoy what you say in the conclusion of your new book. If it brings you joy, it's perfect.
That's true.
Thank you for sharing your advice with us, and happy Thanksgiving, Calvert.
Some fantastic tips. And to help the loveliness last, Calvert recommends changing the water regularly to make sure bacteria doesn't grow. Flower School, a practical guide to the art of flower arranging, is now available for purchase.
Hi, everybody. We're right here at the Mozzarella Company, and I'm going to make a dish that is a fabulous dish for Thanksgiving or Christmas. It's called zucchini rotolini. Rotolini mean little rolls. First, we're going to cut the zucchini, then we're going to make the filling. We're going to spread it on the zucchini, roll them up, bake them, and then put them on some tomato sauce. So, first of all, I'm going to cut the zucchini. And so I'll cut off the stem end, and then this is my mandolin. You can just cut the zucchini like this, and you have your slices completely ready, and they're just perfect. After we cut the zucchini, I'm going to place them on a baking dish and paint them on both sides with olive oil. So they'll look like this. And then I put them into the oven and bake them at 400 under the broiler until they turn nice and brown on both sides and they're nice and pliable. So once I get that done, I make my filling that goes in my zucchini rolls. So I have cachota, which is a semi-soft cheese that I have grated, and I have some ricotta, egg, basil, oregano.